Dr. Girar of the U.S. Public Health Service, Dr. Hahn, and Seema Verma. We'll make a series of presentations to update the American people on the status of the coronavirus pandemic in the country, and then be available to take questions. But we very much appreciate the attendance of all who are here and all of you who have made time to tune in. As we reported today, we have now more than 2,500,000 Americans that have contracted the coronavirus. And sadly, we've lost more than 126,000 of our countrymen to this disease. And I know I speak for the President and for every American when we express our sympathies and our deepest condolences to all the families who have lost loved ones. Despite those losses, since the end of our 45 days to slow the spread and the beginning of efforts to open up America, thanks to the cooperation of the American people, the efforts of governors and state health officials, efforts, I want to proudly say, of the entire federal team under the leadership of President Trump, we have made truly remarkable progress in moving our nation forward. We've all seen the encouraging news as we open up America again. More than 3 million jobs created in the last job report. Retail sales are rolling. And of course, the extraordinary progress in New York, New Jersey, Connecticut, and New Orleans, areas that just a matter of a month ago were struggling under the weight of this pandemic, and now have arrived at a very, very different place. As we stand here today, all 50 states and territories across this country are opening up safely and responsibly. But with cases rising, particularly over the past week throughout the South, President Trump directed our task force to brief the American people on several topics. First, we want to share with you, as Dr. Birx will, what we're seeing in the rise of new cases that today surmounted 40,000 new cases in a single day. Secondly, we want to speak about what we've done and what we are doing at the federal level to support state efforts, particularly in the states where we see rising cases. We'll talk today about how this moment in the coronavirus pandemic is different than what we saw 2 months ago, to better equip the American people to respond. And ultimately, we will speak about what every American can do to play their part in reducing the spread and the impacts of the coronavirus pandemic. For our part, also, I've spoken to governors in Arizona and Florida and Texas in the last 12 hours. And Dr. Birx and I will be traveling on Sunday to Texas, on Tuesday to Arizona, and I'll be traveling to Florida on Thursday of next week to get a ground report. And of course, on Monday, we will conduct what will be our 26th weekly call with the entire White House Coronavirus Task Force and all of the nation's governors as we meet this moment. Now, as I mentioned, it's important gathering today, I think, that we take a step back and think about how far we've come as a country. When the President tapped me to lead the White House Coronavirus Task Force, he said we had one mission, and that was to save lives. President Trump's decision to suspend all travel from China in January, to stand up the White House Coronavirus Task Force, in February to declare a national emergency, to halt travel from Europe and amend travel from other places around the country, all contributed to giving our nation time to stand up a broad-based response, the whole of government response that we spoke about so many times at the podium throughout this pandemic. The State Department also coordinated the repatriation of some 95,000 Americans. And then came the moment when we brought this chart to the President of the United States, on the council of our very best scientists. The President was presented with a decision that if we did nothing, no intervention, the possibility existed at that moment in time that we could lose between 1.5 million and 2.2 million Americans. But with intervention and with mitigation, by calling on the American people to embrace the mitigation efforts, social distancing, that were called upon, first in the 15 days to slow the spread, that would become 45 days to slow the spread. Our best scientists believe that we could reduce the number of American fatalities to a number ranging between 100,000 and 240,000. The President made that decision, and we unveiled the 15 days that became the 45 days to slow the spread. And inarguably, as we see where we are today as a nation, because of what the American people have done, because of the incredible work of our healthcare workers, because of a partnership with governors in every state, we did just that. We slowed the spread. We flattened the curve. We saved lives. In the midst of that, we exponentially scaled testing capacity, partnering with private sector, commercial laboratories. We've now reached some 30 million tests across the country, conducting some 500,000 tests a day. In that partnership with governors also, the President directed us to make sure that states had what they needed when they needed it. And at this point, I'm pleased to report that the federal government both delivered and facilitated the delivery of billions of supplies, of face shields and gowns and gloves and masks, and we continue to be on track to construct more than 100,000 ventilators in 100 days. And as I spoke to governors last night, they confirmed to me again what FEMA's reported. We have no outstanding requests from any state at this time for personal protective equipment or medical supplies. Let me say that again. In the affected areas, particularly the states down south that are seeing rising cases, we have no outstanding requests. But as I told the governors, we are ready at a moment's notice to surge personnel, to surge supplies, to expand capacity, and to support their healthcare response. In the midst of all of that, I think it always bears saying that because of the great work of our healthcare workers and because of American manufacturing, no American who required a ventilator has ever been denied a ventilator in the United States. And I consider that nothing short of a national accomplishment. We also surged hospital capacity in areas of the greatest anticipated need. We sent military and National Guard personnel. These charts showing the progress that we've made in New York and New Jersey and New Orleans all demonstrate the efforts of the people of those states in cooperation with federal government and all the great healthcare workers to show the progress that we made in areas that were once deeply impacted. And we extend our thanks to the people of each of those states for the sacrifices that they made during those great and challenging times. But at the close of that 45 days to slow the spread, we unveiled a plan to safely reopen America again. And now all 50 states and territories are moving forward. And as I said, we're seeing America go back to work. And in much of the country, we're seeing jobs expanding and economic activity expanding. But our focus today is very much on the advent of a rising series of new cases across the American South. But where our first mission was to save lives, once we came out of the 45 days to slow the spread, what our task force has been focused on over the course of the past 2 months is to partner with states to save lives and safely reopen. In fact, we've had some 17 meetings of the White House Coronavirus Task Force in the intervening days since we began the process of opening up America again, and we've been working very closely with states to move that agenda forward. But as the President has made clear, we want to open our economy up. And we want to move America forward, even while we take and continue to take the steps necessary to protect lives and the health of the American people. We stand here today because with the rising cases among southern states, President Trump asked us to brief the American people, to give details on what we're seeing, what we're doing, and how it's different from 2 months ago. As you may recall, after seeing overall cases drop from a 30,000 a day average in April to 25,000 a day of average in May, the first few weeks of June actually saw cases averaging roughly 20,000 new cases a day. We now have seen cases begin to rise precipitously across the South. In fact, 34 states, let me make sure I've got my numbers exactly right here. As we reported early on, 34 states across the country, though, are experiencing a measure of stability that is a credit to all of the people of those states. Now, when we speak about stability, we are talking about not necessarily states where there are no new cases, but these would be states where there are either no new cases and no rising percentage, or no combination of those two things. There may be states across the country that are seeing a modest increase in cases, but their percentage of positive rates is remaining very stable. But nevertheless, there are 16 states with rising cases and rising percentages. We'll be focusing on those states today. The first thing we'd share with the American people is that while there is a penchant in the national debate to use a broad brush and to paint an entire state one color if there are rising cases in a portion of the state, this is actually a better picture of the data that we literally analyze every single day. Dr. Birx will take a few moments to unpack the specific outbreaks in Texas, Florida, Arizona, and California. But the first thing we would convey to the American people is that from this new positive results in the last 3 days, you can see the concentration of new cases in specific parts of states, and of course, very specifically in parts of the country. Secondly, we want the American people to understand it's almost inarguable that more testing is generating more cases. To one extent or another, the volume of new cases coming in is a reflection of a great success in expanding testing across the country. As I said at the top, we're testing more than ever before, some 500,000 people a day, and perhaps we could go to that testing chart if it's there, just to show you the acceleration of testing that's taken place over the course of this pandemic in the United States. It's truly been remarkable, and it's been a public and private partnership from the very outset. One of the things that we're seeing among the cases, and we hear this in Florida, and we hear this in Texas and elsewhere, is that roughly half of the new cases are Americans under the age of 35, which is at a certain level very encouraging news, as the experts tell us, because as we know so far in this pandemic, that younger Americans are less susceptible to serious outcomes of the coronavirus. And the fact that we are finding more younger Americans who've contracted the coronavirus is a good thing. And so we'll speak about the testing, and Admiral Brett Giroir is here and can detail any questions that you might have about testing going forward. Thirdly, we'll talk about what these new numbers mean and how we can address them. And Dr. Fauci will speak about that in just a moment, particularly in the affected areas. And the other area that we spend a great deal of time thinking about is hospitalization. Not only do we track new cases every day on a county-by-county basis, but we also track hospitalization. And the map on the left of your screen represents how this moment. But as Dr. Birx may well reflect as well, we are encouraged that where 2 months ago we were seeing some 15% of new cases being hospitalized, now that number is averaging roughly 5% around the country, which is also encouraging news, to say the least. And so while we have 16 states that we're focusing on, again, I would just reiterate to the American people, the most useful thing to know is where it's happening so that you can take the steps necessary to do your part. But rest assured, in our conversations with governors in all of the most impacted states, we continue to be assured that hospital capacity remains strong, and they know the federal government stands ready to provide them with the personal protective equipment or supplies or even expanded capacity and personnel to meet any moment. But at this point in time, we are told that in all of the states most deeply impacted, that hospitalization remains very, very broadly available. Finally, I want to speak about the progress that we've made as a country on the most difficult aspect of this. I said at the beginning that our hearts and our prayers go out to the families who've lost loved ones in the course of the coronavirus pandemic. And I know I speak on behalf of everyone in this country when I extend our sympathies to the more than 126,000 families that have lost loved ones. As the President has said many times, one life lost is too many. But nevertheless, I believe at this point in the course of the pandemic, we can still take some comfort in the fact that fatalities are declining all across the country. There literally was a day 2 months ago this week where we lost 2,500 Americans in a single day. This week, because of the extraordinary work of our healthcare workers, because of the availability of new medicines like remdesivir, new treatments like steroids, and because of the cooperation of the American people, heeding the guidance that we gave at the federal level and state and local officials gave, this week there were 2 days where we lost less than 300 Americans. And you can see from this chart what has been a precipitous decline from some of the worst moments of this pandemic as it impacted areas of New York and New Jersey and the Northeast. Again, I have a heavy heart anytime I recite these numbers, but the fact that we are making progress, reducing the number of Americans that we have lost and are losing, I hope is an encouragement. Because as we see new cases rising, and we're tracking them very carefully, there may be a tendency among the American people to think that we are back to that place that we were 2 months ago, that we're in a time of great losses and great hardship on the American people. The reality is we're in a much better place with the efforts President Trump mobilized at the federal level, with the efforts of this team, this whole of government approach, the efforts of governors across the country, our incredible healthcare workers, and the cooperation of the American people. We're in a much stronger place. The truth is we did slow the spread. We flattened the curve. We were able to stand up the resources and the capacities in our healthcare system to be able to meet this coronavirus in a way that would put the health of all of our country first. We also cared for the most vulnerable and continue to focus resources and testing and supplies on the most vulnerable, seniors with serious underlying conditions. And I too believe with all my heart that we've continued to save lives. We've created a solid foundation for whatever challenges come, either in the days ahead or in the months ahead. And that's a credit. That's a credit, I believe, to our president, to our federal team, to our state partners. But mostly it's a credit to the American people and our healthcare workers. And so we stand here today, we believe we've made progress. But as we are reminded as we see cases rising across the South, that we still have work to do. And so we say to every American particularly those in counties and in states that are being impacted by rising cases. Now's the time for everybody to continue to do their part. And I think you'll hear from this podium today a particular message to younger Americans across the Sun Belt, and the role that you can play in protecting the vulnerable and making sure that while the coronavirus doesn't represent as significant a threat for a serious outcome to a younger American, none of us would want to bring the disease back to our parents or grandparents, moms and dads, and an elderly friend or a friend.
All right, folks, we are going to our first live event here of the day on coronavirusnow.com. Take you out to New York City, Mayor Bill de Blasio.
Because this crisis has caused us to focus on the basics, to make sure that every New Yorker knows that we're going to protect them, protect their safety and health, make sure they have the basics to get by, their families have the basics to get by, while we restart our recovery, our economy, while we bring our livelihoods back. We have so much to do in this city to help people and bring back the vibrant life of this city. But right now, our singular focus has to be on those four basics. So I say this in general, and I say it because today is the day before our budget deadline. And we have been working for weeks now with the City Council on next year's budget. And to say the least, this has been the toughest budget that we've had to do as administration here at City Hall. We're in a whole different situation, in fact, than New York City's ever faced in our history. A healthcare crisis, an economic crisis, a disparity crisis, a budget crisis, all wrapped into one and on a massive, massive scale. So we keep coming back to the fact that we've got to focus on those basics: health, safety, food, shelter. But while we've been trying to do that, we have been dealing with an extraordinary loss of revenue. $9 billion has evaporated in the course of the last few months. Revenue that used to be plentiful because of such a strong economy, it's gone. So what does that mean? Billions of dollars of cuts have happened already in our city budget. More cuts coming because we have to live within our means. Now, I want to note that while we, New York City, has been doing everything possible to address this pandemic, to protect people's lives, to keep our hospitals together, to magnify and maximize testing, to get people food, 1.5 million meals being delivered every single day, all the things that this city is doing, we are doing alone. We asked repeatedly for the federal government to help us with the stimulus. It hasn't come. And there's no sign when it will. We have been the epicenter of this pandemic, and yet the federal government cannot manage to get New York City the help it needs, nor so many other cities and states. So the federal government side has been, in so many ways, missing in action. I went to Albany over the last few weeks, asked for help to help us through this incredibly difficult time with long-term borrowing. I want to thank the State Assembly. They were ready, willing, and able. The State Senate, however, has not acted. And I'm certainly disappointed, and I think New Yorkers are as well. But we're going to persevere. We're going to move forward. But it's not going to be with a vision of let's endlessly cut everything, because we know what that means. It will hurt human beings if we have to keep cutting and cutting. It will hurt families. It will hurt our workforce, the people we depend on. Their families depend on them. Austerity is never the way to go. We have to find a way forward that includes continuing to focus on what matters most in our city. And we'll do that with everything we possibly can as New York City. But again, at some point, if Washington doesn't act, if Albany doesn't act, then we end up in a very tough situation. So as we're in negotiations with the City Council, as we speak, what's clear is we will have to put into our budget labor savings. And I hope and pray we'll find a way to address this situation with labor unions, and especially hope and pray that Washington will act on the stimulus. But we're going to be ready for any eventuality and make sure we're going to serve New Yorkers no matter what. Now, at the same time, we have an unprecedented opportunity to change some things. And there has been a very intense detailed, focused discussion over the last month on how we change policing, how we focus more on young people and the needs of communities, how we address disparities, how we redistribute. And I have to tell you, it's been a very productive conversation. So over this weekend, City Hall, here at City Hall, my office presented to the City Council a plan that would achieve $1 billion in savings for the NYPD and shift resources to young people, to communities, in a way that would help address a lot of the underlying issues that we know are the cause of so many problems in our society. I'm excited to say that we have a plan that can achieve real reform, that can achieve real redistribution, and at the same time ensure that we keep our city safe. And we make sure that our officers are on patrol where we need them around this city. So that's something that I think is so important to the future, to strike that balance the right way. Reform, justice, redistribution, but always safety. Now, at the same time, we want to shift resources more and more into young people in particular, into youth centers. We want to shift resources more and more into public housing. So the plan we presented has over $500 million in the shift in capital funding to youth recreation centers, to NYCHA developments, to help where the need is greatest. Look, we can do this, we can strike the balance, we can keep this city safe. So negotiations continue. I think they've been very productive. I'm very hopeful where we're going. But I wanted the people of this city to know where I stand and what we believe we can do for the future of this city. And while we're talking about reform, while we're talking about the future, I want to talk about a very troubling situation and one that reminds us of what we need to do more in the future. We have to look at the entire criminal justice system, and that means our jails as well. That means our Department of Correction. You know, we've made a lot of changes. We have the lowest level of incarceration since the 1940s. I want people to understand that. There are fewer people in jail in New York City today than at any point since World War II. And that's something everyone should be proud of. We had 180,000 fewer arrests in 2019 than the last year of the Bloomberg administration. By driving down unnecessary arrests, we're driving down incarceration. And of course, we're going to close Rikers Island and end that bad history. But there's still an outstanding issue, and it's solitary confinement, also known as punitive segregation. Look, we ended it already for young people. And New York City led the way in this nation in addressing the fact that we should not have young people in solitary confinement. We all remember the tragedy of Khalif Browder, and we acted on the lesson of that tragedy. He did not die in vain. But then we saw another tragedy recently, Layleen Polanco. Layleen Polanco should not have been in Rikers to begin with. Layleen Polanco should not have been in solitary confinement. And Lord knows she deserves justice. Her family deserves justice. The transgender community deserves justice. We have to right the wrong. We can't bring her back, but we can make change so that no one else goes through such a tragedy. There has been accountability. 17 correction officers have been disciplined, 4 suspended without pay, and this is just the start of the disciplinary process. But we need to make changes immediately in how people who are incarcerated in our jail system are handled, and we need to make sure they are safe. So effective immediately, people with underlying medical conditions will not be subject to punitive segregation or solitary confinement. There already have been some prohibitions in place, for example, for serious mental illness or pregnancy. We're expanding the list. There's a list on your screen right now. Every medical condition you see on your screen would be a cause for a prohibition of any individual being put into solitary confinement. That's important. We're doing that literally starting today. But we have to go farther. So let's take the next step. Let's end solitary confinement altogether. We have proven that we can keep jails safe with much less use of solitary confinement, punitive segregation. Now, there's a lot to do because the jails are still not safe enough. Let me hasten to make the point. We have a lot to do to create more safety for people who are incarcerated and for our correction officers and employees alike. but we know there are ways we can do this without punitive segregation. So I'm appointing a 4-person working group, and they will get to work on a plan to end punitive segregation, to end solitary confinement in New York City once and for all. 4 members of the group will be the Vice Chair of the Board of Corrections, Stanley Richards, the Commissioner of Corrections, Cynthia Brand, the President of Just Leadership USA, Deanna Hoskins, and there will be a representative from the union that represents our corrections officers, COBA. This group will have a simple mission, a simple mandate: find a way to end solitary confinement, and tell us all the things it's going to take, because it will take other measures and new approaches and innovations to keep everyone safe. I'm expecting a report back in the fall with whatever recommendations are there, and then we get to work on making it happen, because we can make this change in New York City. Now, I'm going to switch gears in a very big way. I want to go back to the health front. I want to go back to talking about the coronavirus, the issue that pervades everything we talk about. So we're going to go over the indicators in a moment, and the good news is our indicators, our health indicators, continue to be strong, continue to be positive. Phase 2 has been going very well in New York City. And that means as we see progress, we're able to do more and more things to help New Yorkers. And here's a nice one. We're going to be able to open up the barbecue areas in our parks for this coming weekend, for the July 4th weekend. So folks can enjoy barbecuing. I want everyone to remember to be safe, still practice the appropriate social distancing, still wear the face coverings, but it's time for barbecuing to come back in our parks, and they will be opened in the coming days for this weekend. And again, that's because of the hard work that so many of you have put in. The New York City story is pretty damn good when it comes to the comeback we're making from the coronavirus, the continued progress in fighting back the virus and keeping us healthy. The rest of the nation, I don't need to tell you, is looking more and more troubling. And that is causing us to think about each step we're taking and to examine what we're seeing from around the country. So a number of cities and states, unfortunately, have been moving in the wrong direction, and we do see a nexus to a particular problem. We all love indoor dining, but we also see problems related with indoor dining. So in East Lansing, Michigan recently, 85 patrons tested positive for the coronavirus, all linked back to a single restaurant. In Texas and Florida, we've obviously seen, it's gotten a lot of attention, record number of cases, clusters being tied back to bars and restaurants. California had made great progress. They're now unfortunately slipping back, and they are changing the rules regarding bars and restaurants. So we're paying attention to this lesson. My team spoke with the governor's team yesterday, said we're increasingly concerned. I know they are as well. We are now going to re-examine the indoor dining rules for Phase 3. The rest of Phase 3 is moving on pace for Monday, July 6th, this coming Monday. But the indoor dining element is now in question. We're going to work it through with the state, figure out how we want to approach it, if we want to pause that piece for a while or modify it. We'll have more to say in the next couple of days because we want restaurant owners to have that information right away. But the most important thing is to keep us healthy and safe and not allow a resurgence. So I've said all along, there'll be ups and downs, there'll be modifications. This is now, after steady progress, a point where we're saying, look, in this one piece, we may need to slow down and think it differently and approach it differently. But what is clearly working is outdoor dining. And I think the big message I keep getting, I've talked to our healthcare people about it, is outdoors is working across the board, meaning the disease does not spread anywhere as much outdoors. Face coverings are working. Outdoor dining is working. We want to double down on outdoor dining. So we talked about the outdoor dining that will start to open up on our open streets. Now we want to go farther with the open restaurants program. Now, right now we have 6,100 restaurants who have already applied and gotten that certification to go over just the last 2 weeks. So they can do the outdoor dining. It's been such a hit. It's been so positive. It's bringing people back to work. We want to go a lot farther with it. So we're going to reach out to every single restaurant that qualifies but has not yet applied and help them to apply. We're going to work with BIDS. We're going to work with the Hospitality Alliance, Chambers of Commerce, everyone. Let's get every restaurant into outdoor dining. Let's maximize their revenue, bring back their workforce, but keep it outdoors primarily while we figure out the indoor piece. We also want to remind all the restaurant owners, please, it's been a great success so far, but be careful with the outdoor dining areas along the street. There are specific rules of how to keep them safe and a specific approach you need to take to make sure there's separation from the traffic. We're going to send inspectors around and ambassadors around to talk it through and make sure restaurant owners really get that part right, because it's going great. People love it. It's super productive, but we have to keep it safe. Okay, let's talk about our indicators. Number one, daily number of people admitted to hospitals for suspected COVID-19. The threshold is 200. Today's report, 51. Daily number of people in health and hospitals ICUs, threshold of 375. Today's report, 297. And most important, percentage of people testing citywide were positive for COVID-19, threshold of 15%. Today, again, 2%. So we're holding at that number, which is really, really good. Quickly in Spanish, este presupuesto será el más difícil de nuestra administración, pero vamos a proteger la salud, seguridad, comida y vivienda de la ciudad. Vamos a seguir demostrando que la seguridad y la justicia van de la mano en esta ciudad. Y lo vamos a hacer todos mientras seguimos combatiendo al virus fase por fase. With that, we will turn to questions in the media. Please let me know the name and outlet of each journalist.
Hi, all. Just a reminder that on the phone today, we have Small Business Commissioner Doris, Chair of the Board of Correction, Jennifer Jones-Austin, and Senior Advisor, Dr. Jay Varma. With that, I will start with Marcia from CBS.
Good morning, Mr. Mayor. How are you on this day before the budget?
Day before the budget. Marcia, you and I have been through a lot of budgets together. I'm okay. How you doing?
Okay, so one of the questions I had was this. You apparently have struck out in Albany in terms of trying to get them to allow you to borrow money. But I also was told that you were willing to raise property taxes if they would agree to it. Are you still willing to raise property taxes if the Senate will go along and give you borrowing power?
That's just wildly inaccurate. No offense, Marcia, that's totally inaccurate. I said, in fact, in writing to everyone in the legislature, we will never raise the property tax rate. No intention to do it. The Assembly, Marcia, the State Assembly was there with us every step of the way. I want to thank Speaker Carl Hastie and the members of the Assembly. They were ready to come to the aid of New York City in our hour of need. The Senate was not. So we moved forward, and I told everyone I spoke to in Albany, if we don't get borrowing authority, which, again, Marcia, you remember, the Assembly and Senate gave borrowing authority to the city of New York after 9/11 with basically no strings attached, no debate. They just knew it was the right thing to do. Since they haven't done it, we now have to go ahead in this budget and put $1 billion of labor savings. Hopefully we can find a way with labor to avert layoffs. It's not a given. If we can't find a way, then October 1st is when that would begin.
So my second question has to do with the cuts that you've agreed to, the $1 billion in cuts to the NYPD budget that you've agreed to with the City Council. There are published reports that it would involve moving school safety agents out of the NYPD, some homeless outreach services out of the NYPD, and canceling the July police class. Can you comment on that?
So, Marcia, I'll give you a very broad picture because, of course, budget negotiations are continuing. We have to resolve by tomorrow, so I'm not going to get into a lot of detail. What I can tell you is we have found a plan that will keep the city safe, will achieve the $1 billion in savings, will allow us to redistribute money to youth programs and to communities that need it most. Everything was with an eye to safety. So we will be able to ensure the patrol strength we need. We will be able to ensure that school safety can do its job. The school safety issue would be addressed over several years, and we'll have more details again as we work on an agreement. But what I can tell you is, from the beginning, I said, I need to believe if we make this changes, I have to see evidence, I have to feel in my heart and soul that the city will be safe. You know I'm very concerned about the uptick in shootings. We have to make sure we can handle that. And we have to make reform. I came here to make reform. We have to make reform the right way. And I am convinced we have now struck that balance.
Next, we have Michael Gartland from the Daily News.
Hey there, Mr. Mayor. How you doing?
Good, Michael. How are you?
I'm good. So a couple of questions. One, Governor Cuomo was on New York One this morning talking about, some anxiety about phase 3 reopening of indoor dining. And I was wondering if you could kind of address what he said today on New York One about that, just having to kind of take this nice and easy.
I think he's right. I mean, I didn't see his interview, Michael, but I think he's right. Look, I've said the state and city have been highly aligned throughout this process. Not every single time, because we're human beings and there's differences, but overwhelmingly aligned. I am enthusiastic that phase 1 has gone so well, phase 2 is going so well, and phase 3 is right around the corner. But we're also constantly looking at the facts. The facts have been worrisome. In the course of this week, it got worse and worse around the country, and it got worse and worse with this nexus to bars and restaurants. We saw it, the state saw it, everyone started talking and saying, hey, we have an issue here. We're always going to make adjustments. So we'll have more to say in the next day or two to clarify. But Michael, my view is we can go into phase 3 on all the other fronts. We can do that effectively. We can do the outdoor dining on a much bigger scale. But the indoor, we really need to examine closely and come to a decision in the next couple of days.
Michael, do you have a follow-up?
The other question I had was on 50A. And I was wondering, have you ordered FDNY and the correction department to post disciplinary records online, as you've done with the police department?
Michael, I have not yet, because our focus obviously has been on the police issues and the budget, but I will. I want transparency across the board.
Next, we have Henry from Bloomberg.
Hello, Mr. Mayor. I'm multitasking here, so give me a
You
chance
can do it,
to
Henry. I have
collect
faith in you.
I don't know. It's tough. I want to get back to these savings in the police department and how you're accomplishing that. You said something about capital expenses. Is that part of this $1 billion, or is that separate from it? Where are
We
you
will
cutting
get
from
you-
the police department?
Yeah,
that's,
there's
enabling you?
I'm sorry, I couldn't hear the rest, Henry. I apologize.
Where are you cutting that's enabling you to make these cuts?
Yeah. So again, we are in the middle of negotiations, so you're going to forgive me if I keep it a little broad. The capital piece is separate from the billion. The capital piece is crucial, and this is something I want to do. I want to take money that was going to go to the NYPD for capital, but as projects that can appropriately be delayed when we think about the vast needs of young people, the vast needs of our residents in public housing. Everyone wants to see a focus on those folks hardest hit by the coronavirus, and particularly on our young people. We can do that. NYPD has worked very productively with me, my team at City Hall, Office of Management and Budget, to find savings, to find different approaches. And I want to thank Commissioner Shea and his team for that, because we found a way to focus on young people. So we're going to take that capital money and shift it into creating youth recreation centers. We're going to take that capital money and shift it to needs at public housing. And I think that will be so important for people who will benefit, and also important for our communities overall, and for safety, and part of how you improve the relationship between police and community. The Commissioner Shea has talked about the NYPD playing a bigger role, a more positive role in the lives of young people. This is his central strategic feeling. We're going to do that now with the NYPD saying we want to contribute. And I give Commissioner Shea credit. He said it coming out of the box. When I said weeks ago we will take money from the NYPD and put it into youth services, he said, look, no one ever wants to lose money out of their budget, but if I had to, I would want it to go to young people. And that's what we're doing.
Yeah, I remember all that, and I understand what you're doing. I understand the rationale for it. I'm just wondering, where are the cuts in the NYPD? Where are they going to sustain cuts in spending?
Right, and so Henry, again, I'll give you the broad answer, but until we have a formal budget agreement, we're not there. The bottom line was we asked for a lot of savings. We asked for creative redeployments. We asked for every conceivable way to do things differently that could free up money for these things we need. And to think about things like school safety, but not as an instantaneous transition, but one that was done smartly over time while focusing on safety and reform at the same time. So, when we get to a final agreement with the council, we'll show you all the specifics and how we got there. But I have been a real stickler, Henry. I've been every moment of the way, and I've been deeply, deeply involved in the details. I've said, show me it can keep everyone safe. Show me we can move a reform agenda and help young people. Show me we can do both in a balanced fashion. And I'm convinced that we have now hit that moment.
Next, we have Sam from The Atlantic.
Hi, Mr. Mayor, can you hear me?
Yeah, Sam, how you doing?
Hi, I'm doing well. So at the end of next month, the $600, the extra $600 in unemployment money is going to wear off, and New Yorkers will no longer be receiving the extra 600. What do you think the effect of that will be on evictions when the eviction moratorium is lifted August 20th? And how bad will things be?
I'm very, very worried. I think it'll be very bad. I'll tell you, Sam, I've been out all over the city in recent weeks and just showing up unannounced in different communities. Primarily the communities that have been hit hardest by the coronavirus. People have a lot of different concerns, but I can guarantee you the number one concern has been economic. The number one concern has been from people saying they're running out of money. They either never got their check from the federal government, they're still waiting for it, or they know it's not enough, or they got it and they're using it up. I think this is the central challenge. The fact that there's no stimulus scheduled. There's literally no vote scheduled in the US Senate for a stimulus right now. There's no new money coming. I think it's going to be devastating for a lot of New Yorkers. We will be there to help them with food. Anyone needs food will be provided for free. Obviously, healthcare through our public system, through health and hospitals. Whatever we can do to help people. But this is why I said on Friday, we need to go back to this eviction issue. If someone cannot pay the rent, they should not be evicted. They should be given the right to go on a payment plan for the future, pay it over a longer period of time. We just can't see evictions that people can't pay. If someone can pay the rent, as always. But for folks who literally have no choice, we gotta do better. So I think the state needs to reconsider and expand for those who cannot pay, stretch out that eviction moratorium, and give people, by law, the right to go on to a payment plan that doesn't exist right now. It should be created as a matter of state rule or state law.
And last week, council members Mark Levine and Vanessa Gibson, they said they were drafting legislation about the expansion of right to counsel to include basically everyone. Do you support that, and is that possible given budgetary constraints?
Look, right to counsel is one of the things we did with the city council that was extraordinarily effective. We have driven down evictions, illegal, unfair evictions in the city intensely. I'll get you the last statistics, but I think we're somewhere in the neighborhood about half as many evictions before the coronavirus as were happening previously, and intending to go farther and farther because we're giving people lawyers for free to stop evictions. And we've done things like rent freezes and other ways of supporting people that help people pay the rent and avoid eviction. So I'm proud of the fact that we've had a consistent policy to stop evictions in this city. Now, right to counsel is a great idea, but I do think we have a profound question about how far we can go with it financially and what's the right approach to it. So I have not seen their legislation. I want to work with them. I respect them both, want to work with them, but I do think we're going to have to recognize that this is not the way to handle the eviction crisis. It's for the state to act and give people the ability to have those payment plans. If they don't, we're just going to be in an absolute contradiction where people don't have money, they can't pay, and they end up out on the street, and that's not good for them or their landlord who will never get paid. There's got to be a smarter way.
Next, we have Katie from the Wall Street Journal.
Hey, good morning, Mr. Mayor. I have two questions. They're very different. I'll start with perhaps the sillier one, given that we're almost nearing a budget, but it's about the Macy's fireworks that are supposed to start tonight in surprise locations. So I was just curious, given the fact that I understand it's important for Macy's and for New York City to some degree to have this nationally televised fireworks show on the 4th of July, it signals to people outside of New York how the city is doing. But since they're pre-taping fireworks around the city, again, people can't even see them because we don't know where they're going to be. Couldn't they have just aired old fireworks shows, maybe with a new performance? I mean, do you know? I've asked Macy's, did they have these fireworks already? Were they going to go bad? What's the deal? I mean, people, as you've heard, people have had surprise fireworks shows for weeks and they haven't really been happy with them.
So, Katie, look, I think, I don't know if fireworks go bad. It's actually a really interesting question, but I can tell you this much. I made this decision a couple of months ago because to me it was about saying that, you know, we're still here, we're still fighting, we're still standing. And that was in a much tougher time, but I had confidence that New York City would find our way through. It is a message to the nation of the strength of New York City. It's also an opportunity for us to celebrate our country as our country's in crisis and have a moment of something positive and something respectful. Macy's was ready to do this. They were ready to go ahead, and I thought it was the right thing to do. So we're going to have locations that give people an opportunity to see something very brief. A lot of people will be able to see them from just wherever they live. We don't want crowds. We don't want a lot of commotion. It's a simple approach in a very imperfect world to give something special to people, but do it with a lot of sense of security and safety. And, you know, look, folks will know at the last minute the broad area, and they'll get a sense to look out for it. I think that's the right approach, and then it'll be packaged together in the show for July 4th. So in a world of imperfect options, I came to the conclusion with Macy's that this was the best approach.
Thanks. And my second question is involving the budget. Right now, I guess as you're here at City Hall, outside at the occupied City Hall, there's a protest from Teens Take Charge, people pushing for the restoration of the summer youth employment program. So I'm curious, you know, I know there's still a decent amount of summer left. There were some programs you announced that would address that, but I think I'm curious if there will be a better plan and a larger plan for so many the teens in New York City who don't have much else to do.
Yes, absolutely, Katie. This has been one of the central discussions over the last few weeks. The council feels it deeply, and I do too. We have to find a way to give our young people positive options this summer. Look, when we did the budget back in April, we did not know at all what the summer would look like, and we feared there would be honestly no possibility of any kind of programming except potentially online. We didn't know if people would be able to go outdoors or do anything. Things are a lot better now. On Monday, we're going to be able to open up a lot of the sports areas and parks. We obviously have said to summer camps that operate in the city that they can be operating in our parks. We're in a much, much better situation than we were in April. So now we're going to do a number of things to ensure that young people have options, including still some online options, because the traditional summer youth is going to be hard to reconstruct, but we can do other versions of it. High priority for the council, high priority for me. We said weeks ago money would go from the NYPD to youth programming, and summer youth employment is obviously a central part of that.
Next, we have Dana from the New York Times.
Hi, Mr. Mayor.
Hey, Dana.
I'm curious if you have any thoughts on why it is that the state might be willing to give borrowing authority for operating costs to Nassau County, to the MTA, and to itself, but not to New York City.
It's a great question, Dana. I want to again say the State Assembly was ready from moment one and has said continually they support borrowing authority for the city of New York. Look, we are the engine of the entire state economy. We are where the revenue for New York State comes from. I think this should be an all for one for all moment. You know, like we're all together here. And I talked to a number of senators, and they said, in fact, they are concerned to have borrowing authority for their localities. And I said, I agree. We should. Everyone who needs it should use it to get through. Use it judiciously. Use it carefully. Avoid layoffs, avoid cutting services, and get through to a better day. So I think that's the right way to go. I commend the Assembly. I'm disappointed with the Senate. And I think if the Senate thought it was right to give borrowing authority to the state, the MTA, then of course they should give it to the place that is 40% of the state's population and the economic center of the state. It's only the right thing to do. You have a follow-up?
And to follow up, when you raise this issue with the governor, what does he tell you?
Look, I'm not going to get into private conversations. I'm only going to say that the bottom line logic I've never heard anyone speak against. The state gave itself the authority, as you said, MTA. The city got the authority in 2001, unanimously, no strings attached, used that borrowing authority over the last 20 years, judiciously, carefully, helped us come back from 9/11. No one The New York City bond ratings went up in the last 12 months, for God's sakes. This is not the 1970s. So I have not gotten a coherent answer as to why it's just not the right thing to do. And again, we're going to keep working on it, but I am unfortunately obligated to say that by October 1st, unless we get borrowing or stimulus or some kind of different approach from our labor colleagues, we do have to look down the barrel of something no one wants, which is layoffs.
Last two for today. Next, we have Rich from WCBS 880.
Mr. Mayor, good morning.
Hey, Rich, how you doing?
Okay. Listen, are the cuts against the NYPD punitive?
No, not at all. Rich, every agency has had to go through a lot of cuts to begin with. Remember, we're talking about between the executive budget in April and this budget now, billions of dollars of cuts across all our agencies. Everyone's been going through the exercise. The NYPD did a hell of a good job of saying, okay, here's a bunch of things we could do while still keeping this city safe. So no, it is a moment where we have to address profound issues. We need to redistribute revenue to communities that need it the most. We know our young people are hurting. It's been a horrible time for them. We know a number of communities have been very hard hit by this virus. We need to redistribute resources toward them. We need to go at the root causes of so many of the problems we're facing. There is a way to do both. And Rich, I was skeptical at first and wanted to see how it could all come together. But a lot of painstaking work occurred to figure out the right way to do things, to focus on both safety and social justice and young people and redistribution. We found a plan that we felt good about, and this weekend presented that to the City Council to say, here's a way we can all move forward together.
If I could follow up, is any other agency being cut the same amount as the NYPD?
I'll get you the final numbers when we get to a final agreement. The NYPD is being treated clearly in a specific manner. A number of agencies are being cut quite a bit, but we're dealing with a specific reality with the NYPD, unquestionably. And that is because it's important to show that we are going to make changes in this city, that we're going to refocus our efforts on young people in particular, and that we can do that while changing the approach to the NYPD. The NYPD is a very well-run organization. They're good at finding ways to make things happen and finding ways to be as efficient as possible. That's what CompStat is all about. So this is a particular moment, and there is a particular need to show that we will redistribute to young people, to communities, but it's being done in a smart, safe manner. And I know the NYPD can handle it effectively. So that's how we approach this, Rich. And again, I set a high bar. I had to be comfortable that we could do this in a manner that would keep this city safe, and I am.
Last one for today. Next, we have Nolan from the Post.
Hey, Mr. Mayor, can you hear me?
Yes, Nolan, how are you?
I'm doing all right. A couple of questions. First, gets back to something that you referenced earlier this morning. Shootings in the city are nearly double in this June what they were in the last June. Murders for the month are also up significantly. Both metrics are tracking well above their 2019 numbers. You've said a couple of different things. One, that the problem is particularly bad in North Brooklyn and parts of the Bronx, and that until the court system gets up and running, there's really, what can be done about it is somewhat hamstrung. Can the city really not do anything to tackle the shooting surge we've seen so far this month? And do you think that cutting youth employment has contributed to the uptick?
Nolan, absolutely the city can do a lot, the police can do a lot to address this. I think we have to look at the sheer magnitude of what's happened here. A court system that still is not functioning. The reality of months and months of people's lives being disrupted, people have lost their livelihood, the pain that people have gone through, the loss of life, the frustration. We're in a very particular moment. There's no parallel in New York City history, Nolan. So there's a lot of factors coming together, but I do think the fact that literally the underpinning of the whole concept that if someone's arrested, they go to court, if they need to be incarcerated, they're incarcerated, that whole thing has broken down. It can be restored. I'm hopeful if we can keep the health situation together, it can be restored very soon. I want to see the state bring the courts back as quickly as possible, as fully as possible. But that doesn't mean we stop doing the work we do, and the NYPD continues to. There's still a huge number of guns being taken off the street. There's still a huge amount of work being done to keep people safe, and that will continue. And the work of ComStat, refocusing energy and resources in the commands that need the help the most. So that will all continue. Summer youth employment, Nolan, was only slated to begin next week, even if it had begun. So I think by definition, that has not been a contributing factor up to now. And remember, it's a meaningful number of young people, but by no means the majority of our young people. But again, we're now going to do something I'm very hopeful we'll come to an agreement with the council and be able to do something really good for young people, including a robust summer youth employment effort this summer.
And then I guess on the second piece of this, to the $1 billion cut proposal from the NYPD. The department spent, give or take, $700 million on overtime last year. Is that spending going to be significantly reduced? And can you guarantee that the headcount of the department will remain at its current 36,000-ish?
So, Nolan, again, in the middle of negotiations, I'm not going to go into a lot of detail. I'll say, and I want to be responsive to your question. We're looking at all of that. Overtime is always an area where we want to do better. And this has been well before current realities. I've been in many a budget meeting where we've pushed the NYPD and other agencies to reduce overtime. So that's an area we always want to do better, especially in the middle of an unprecedented fiscal crisis. Our budget is $8 billion smaller, $8 billion smaller than the one proposed in February. So we're cutting everywhere we can, smart savings, smart efficiencies, reducing overtime makes a lot of sense. Whatever we do in terms of headcount has to keep the city safe. So we'll have more to say on that if and when we get to a final plan with the city council. Everyone, as I conclude, look, first of all, a lot going on, so many important issues, but I want to say once again that amongst the other announcements today, the vision of ending solitary confinement, ending punitive segregation once and for all in New York City. This is something that could be a signature moment for change and reform and for a humane approach to rehabilitating people and turning around their lives. I know we have on with us, and I just want to thank her, even though questions were not directed her way, Jennifer Jones Austin, Chair of the Board of Corrections, someone who I honor so much for all you do for New York City. And you helped us build this administration from the beginning. And Jennifer, I know you're going to help us to find a way to a plan that really will work and profound reform in our correction system. So I just want to take a moment to thank you publicly, Jennifer, for the work you are doing and will do.
Thank you, Mr.
Yeah, you will have plenty to do, Jennifer. You will never lack for important work to do. So, everyone, to conclude, look, we're at a watershed moment for the city of New York. We have to get it right. We have to get the approach to health right. We have to keep beating back this virus. We're going to make adjustments all the time. We're going to be really open to you about when we see a need to make an adjustment. But we're also going to be very, very focused on the progress we're making and what that allows us to do. So far, New Yorkers are doing great. We have to be smart to keep focusing on what works. And when we see a problem, like the concerns we're having about indoor dining, we have to address them. But as we conclude the budget for the year, hopefully in the next 24 hours, again, I come back to where I started. Our singular focus will be on you and your family, your health, your safety, keeping food on your table, keeping a roof over your head. That's what you need your city to do for you, and that is exactly what we will do. Thank you, everybody.
And that was the update from the mayor, Bill de Blasio of New York City. You're watching coronavirusnow.com while we wait for some more live events. Let's show you coverage from around the country.
For all of the phases. When we put out the guidelines to open up America again, we laid out at the outset guidance for responsible reopening, and states across the country, as I mentioned, are doing just that. 34 states are reopening safely and responsibly and seeing low and steady cases and not seeing a rise. in the percentage of positives. And in the 16 states that are being impacted, particularly those that we'll focus on here today, we would just encourage every American to follow the guidelines for all the phases. Continue to practice good hygiene, wash your hands, avoid touching your face, disinfect frequently. People who feel sick should stay home, and when it comes to businesses, social distancing, protective equipment, temperature checks, testing and isolation. These are the guidelines for all of the phases, and they are good practices to implement if you're in a community that's affected, or even if you are not, because we're all in this together. And the progress that we made, that you saw illustrated in those charts in places like New York and New Jersey, Connecticut and New Orleans, was a result of the American people stepping forward, heeding the guidance of federal, state, and local authorities. And we encourage you to continue to do just that. But for those in the areas most affected, we just want to encourage you to listen to and respect the guidance of your state and local authorities. Recognize that this is different than 2 months ago, both in our ability to respond and in the nature of those that are being infected, and that younger Americans have a particular responsibility to make sure that they're not carrying the coronavirus into settings where they would expose the most vulnerable. And lastly, as I prepare to bring Dr. Birx to the podium, I just encourage every American to continue to pray. Pray for all the families that have lost loved ones. Pray for our healthcare workers on the front lines. And just continue to pray that by God's grace, every single day, will each of us do our part to heal our land. With that, I'll introduce the coordinator of the White House effort on the coronavirus, Dr. Deborah Birx.
Thank you, Mr. Vice President. Thank you for that great introduction. Just to remind everybody where we have come from in the last 4 months, we have a great deal of understanding now about the differential disease. Differential infections, no. We believe everybody is susceptible to infection. But we know infection leads to a spectrum of disease, and we have much better details about who is vulnerable and why they are vulnerable. And as the Vice President said, at one time, we were diagnosing people in the ICU after they came into the emergency room. And thanks to the millennials who have been heeding our guidance, they have been coming forward and getting testing. And so whereas before we told them to stay home, now we are telling them to be tested. And this is a great change for us because it allows us now to find the asymptomatic and the mild diseases that we couldn't find before. As Dr. Redfield talked about yesterday, from the serology test, we have a great understanding of what was happening in March and the number of asymptomatic and mild conditions that led to individuals to have antibody but never come forward with significant disease. We now know who's at risk for significant disease, and we now know it's particularly the elderly, individuals over 80, and individuals with comorbidities. And remember, those comorbidities span the entire age group. We do know that we have people in the younger age groups with significant type 1 diabetes, and may also have individuals with significant obesity. We know that those are risk factors, and so risk factors go with your comorbidity, not necessarily with your age. And so as we call on individuals to protect one another, by passing someone on the street, you don't know what comorbidities they have. And this is why we've been focused on trying to protect one another. We also know who's at risk for the highest mortality, and because of that, we've been able to, the clinical care has dramatically improved. And I want to thank NIH, who has been working constantly to update the clinical guidelines. So physicians around the United States and frankly around the world who are using those have the most updated information about how to actually improve disease courses of those that are in the hospital. We, of course, have improved treatment in the hospital that we didn't have in March and April, with improved methods of oxygenation, which is really quite important, improved treatment of acute respiratory distress, that's the individuals on the ventilator. We know now will respond quite well to steroids. And then research that is ongoing on what we call the acute cytokine storm. That is when often in that later stage when people are on ventilators, they're seriously ill, may need steroids and other items, and that's being researched. And the work that's being done on clotting research by the NIH. We also have new therapeutics that have been used both as compassionate use like convalescent plasma, and now remdesivir, that we just reallocated and ensured it was available to these states that are facing the increased hospitalization, as well as the monthly allocations that we have been sending out. If we can go to the first slide, please, and start where the Vice President left off. Really, this disease is tackled community by community, testing at the community level and working with community groups to understand the spread in those communities. And so we've spent the time to really map this epidemic and new positives down to the level of communities to understand where spread is occurring so that we can match our prevention interventions to those areas. Next slide, please. As we discussed, and it's difficult for you to see on this graphic because the top line is New York. And we should remember where we were and that slope, that early slope that you can see in the case of the New York cases, that rapid acceleration. On the same slide, you can see California. That is the blue line that is just passing the orange line. And also on the slide is Texas in green, Florida in orange, and Arizona at the bottom. As dramatic as these slopes are, they are not equivalent to the original acceleration that we saw in New York. That doesn't mean that we aren't absolutely focused on working with the governors in those communities to stop the spread of the virus in those 4 states. Next slide, please. This shows you through the entire country that we're tracking state by state. Now, obviously, this axis is vastly different than the one on the prior slide because that slide included all of the cases in New York City. But you can see on this slide that we've been tracking very closely North Carolina. A team's been in with North Carolina working with the state and local public health authorities to really respond to the changes there, as well as the South Carolina at the bottom. Next slide, I'll just go quickly through these so you can see Oklahoma's at the bottom of this slide. And next slide, you can see on this slide Idaho and Oregon. Those are the ones in the light blue and the dark green where you see an inflection in their slopes. These inflection points and understanding when they occur and why they occur are critical for understanding how to prevent the spread. Next slide. Now, what the Vice President talked about is we've created an alert system that brings together what we just talked about, rising cases with an understanding of test positivity. And so this chart, which is difficult for you to see, those states on that far side that have the highest test positive that you can see at the higher level of the graph, those are the states that we have concerns about because of the rising number of cases and the rising test positive. This explains the extent of community spread. In states that have increasing cases but falling test positives, it tells us that they're getting into the communities to find the asymptomatic cases. And so these are the things we put together to understand the full picture. Next slide, please. So this really puts on one slide the states that we have that we've been talking about across the South where we have our greatest concerns. The 2 top states with the largest increase in test positives are Texas and Arizona, followed by Florida, Mississippi, South Carolina, Alabama, Georgia, Louisiana, Nevada, and Utah. Those last few states are under still 10%, but we're tracking them closely as we look at that individually. Finally, next slide. You can see on this slide, we are tracking, and this is when you hear about we have a certain 2% or 3% of the counties under specific alerts. So it doesn't matter the size of the county, we're tracking the increase and the rate of increase of new cases at the county level. We currently have about 130 counties out of the 3,100 in the United States in that category. Next slide. Metro level, this shows you the case positivity by the metros. and the number of tests that have been done. Next slide. And then this shows you specifically the change over time of test positivity in the largest metros where we have concerns, and this is Austin, Phoenix, Houston, Dallas, San Antonio, Tampa, Orlando, Miami, Riverside, California, and Atlanta at the bottom. And so this is how we continue to integrate data on cases, data on testing, and data on hospitalizations so that we can work with the states for a comprehensive integrated response. Next slide. I know many of you would be interested in seeing how high the test positivity rate became in April and March and April. So that top line is New York City Metro, and you can see it reached over 50% on a series of days for almost 2 weeks. 50% of the tests were positive for COVID-19. Underneath that, you see New Jersey and Minnesota and a whole series of individuals. Detroit is the second large mountain. Next slide. So quickly to show you how we look at this at the state level and work with the governors and the local health authorities. So this is Florida. We track testing, it's done, the number of test positives that are in the blue line, the total number of cases seen in the black bar, and what we call the syndromic presentations of early respiratory diseases and pneumonias. Next slide. This then, we look at the county level to look for changes in the slope of the number of new cases. So you can see that top county that has the largest increase in slope in cases is Miami, Miami-Dade, followed by Broward and Palm Beach. All the other counties are much lower in their daily case increases. This allows us to focus resources and testing along with the state into these specific sites. Next slide. That all comes together to create this graphic so that individuals can understand and we can understand precisely what the rate of growth is and where the rate of growth is occurring by the shading of the boxes. Now I'm going to quickly take you through Texas because it's the same story. Next slide. So this shows you the exact same graphics now shown for Texas, showing a continued rise in the daily tests performed, but also a rise in the test positivity, the blue line. You can see throughout May, after opening, their test positivity continued to decline as their testing increased. It was in the last 2.5 weeks that we saw this inflection of rising test positivity along with rising testing. But it was the increase in test positivity that alerted us, along with the increased cases, that this was becoming an alert. You can see in the red boxes, everything is heat mapped. So at a glance, you can tell those 2 boxes that are in the middle that are red. That's the heat map showing that this has rising cases and rising test positivity. Next slide. But even in Texas, next slide, please. And this gives you a map of Texas, or shows where the cases are and where they're rising the most rapidly. And finally, I'm just going to go through Arizona very quickly along with California. So next slide. Same situation that we're showing here with Arizona, rising number of tests being performed, but also rising test positivity, rising cases. Next slide. Arizona is unique, and they have essentially one county that is primarily represented by the depth of the new cases, and this is in the Phoenix area. Next slide. Then next slide. So this is California. And so you can see California over the last week has had that increase in test positivity. You can see that dramatic increase at the end of that bar in the blue line, along with still increasing testing that has been done. And we just want to thank all of the governors and all of the work at all the laboratories that has allowed us, along with HHS and Brett Gerard, who ensured that the supplies were there to really increase these orange lines. You could see in each of these cases, these orange lines have dramatically gone up over the last 4 weeks. Next slide. And like New Mexico, the primary infections right now in California at the highest level are in the LA area. But because LA is a large metropolitan area, next slide, you really need this kind of more specific and local graphic to really show that it's also increasing in the Central Valley. And this gives us the ability to focus resources among agricultural workers to improve testing and isolation for those who become positive. So I just wanted to take you through how we've been looking at data, how we consolidate that data, and then Monday report it out to the governors. We hope over the next week to be able to really have this data available in real time on the White House website so that everybody across the country can see where the cases are. Because in the end, we really want to call to action. When we started talking about what can be done, we said the most important thing that would change the spread, and I'm going to turn that over because I know Tony's going to talk about it, is really individual behavior and our respect for one another through social distancing, wearing a mask, and ensuring that we're protecting the most vulnerable that may be in multi-generational households. And I just want to end by thanking again the millennials who have come forward. And I know during the protests we asked a lot of them to go forward to get testing, and we see those testing rates really improving in the under 40 age group. That is going to be important to continue to accelerate testing among the under 40 age group, because that's the age group most likely to have asymptomatic spread and be spreading the virus unbeknownst to them. And I want to really make it clear, no one is intentionally spreading the virus, but they don't know that they're positive, they don't have symptoms, and need to be tested in order to have that awareness. And so we really want to thank them again for coming forward and really enriching the amount of testing that has been done in the under 40-year-old age group. And to our older population, you know if you have comorbidities, you know if you're over 80. We ask you if in the hot spots in these states that are having expansion in cases to continue to shelter as much as you can and use your grandchildren to go and do your shopping.
Thank you very much, Dr. Birx, and thank you, Mr. Vice President. So I want to extend just for a couple of minutes some of the comments that were made both by the Vice President and by Dr. Birx, and it has to do with the situation that we find ourselves facing right now. It's very clear from the maps that you saw that there are certain areas in the country, states, towns, cities, regions, that are doing very well, that have followed the guidelines and are opening up in a prudent way that's been effective. However, as you can see, we are facing a serious problem in certain areas. Now, when you look at the map, it's very interesting because you see some dark parts of the map and some light parts of the map. We have a very heterogeneous country, but heterogeneity does not mean that we are not intimately interconnected with each other. So what goes on in one area of the country ultimately could have an effect on the other areas of the country. So let's take a look at this problem that we're facing now, this resurgence of cases. I don't think there's time enough now all day to try and analyze and figure out the multifaceted elements that went into that. You know, everything from maybe opening a little bit too early on some to opening at the right time, but not actually following the steps in an orderly fashion, to actually trying to follow the steps in an orderly fashion, but the citizenry did not feel that they wanted to do that for a number of reasons, likely because everyone feels the common feeling of being pent up for such a long period of time. So we're not going to say blame, we're not going to try and analyze it, but there is something that's very important about it that I'd like to get a message to the country in general. When you have an outbreak of an infectious disease, it's a dynamic process that is global. So remember, what happened in China affected us. What happened in Europe affected us. What's happening here is affecting others. We can't get away from that. It's interconnected. So therefore, if we are an interconnected society, we've got to look at the fact of what our role is in trying to put an end to this. Because everybody wants to end it, everybody wants to get back to normal, and everybody wants the economy to recover. I think we all are pretty common in that. That's a given. So what can we do? What I think upon talking to a lot of people and reflecting on it, we have such an unusual situation because of all of the decades that I've been involved in chasing infectious diseases. I've never seen anything that is so protean in its ability to make people sick or not. There's no other infectious disease that goes from 40% of the people having no symptoms to some having mild symptoms, to some having severe, some requiring staying at home for weeks, some going to the hospital, some getting intensive care, some getting intubated, some getting ventilated, and some dying. So that depending on where you are in that spectrum, you have a different attitude to this particular thing. But anyone who gets infected or is at risk of getting infected, to a greater or less degree, is part of the dynamic process of the outbreak. And I know, because I can understand when I was at a stage in my life when I said, well, I'm invulnerable, so I'm going to take a risk. I think what we're missing in this is something that we've never faced before, is that a risk for you is not just isolated to you. Because if you get infected, you are part, innocently or inadvertently, of propagating the dynamic process of a pandemic. Because the chances are that if you get infected, that you're going to infect someone else. And although you may feel well, and because we know, if you look at the numbers that you'll probably hear later on, the overwhelming majority now of people who are getting infected are young people, likely the people that you see in the clips and in the paper who are out in crowds enjoying themselves, understandably. No blame there, understandably. But the thing that you really need to realize, that when you do that, you are part of a process. So if you get infected, you will infect someone else who clearly will infect someone else. We know that happens because the reproduction element of the virus is not less than one. So people are infecting other people. And then ultimately you will infect someone who's vulnerable. Now that may be somebody's grandmother, grandfather, uncle who's on chemotherapy, aunt who's on radiation or chemotherapy, or a child who has leukemia. So there is what I call, and again, I just want to bring this out without making it seem that anybody's at fault. You have an individual responsibility to yourself, but you have a societal responsibility. Because if we want to end this outbreak, really end it, and then hopefully when a vaccine comes and puts the nail in the coffin, we've got to realize that we are part of the process. So when the Vice President went back, pulling back a couple of months ago, when we showed about the guidelines to safely reopen the country, we've got to make sure we drop back a few yards and think about that this is part of a process that we can be either part of the solution or part of the problem. So I just want to make a plea with people when they understand the stress that they're under as we try to tackle not only those states, but the light-colored part of the country. Even though they've done well, they may have gotten hit badly like New York and then came down, or they may not have got hit badly at all. They are vulnerable. If we don't extinguish the outbreak, sooner or later, even ones that are doing well are going to be vulnerable to the spread. So we need to take that into account because we are all in it together, and the only way we're going to end it is by ending it together. Thank you.
Well, first, thank you all for joining us here at HHS to update the American people. I want to begin by thanking everyone around the country working to defeat this virus. All of the healthcare providers on the front lines, those working to reopen our economy safely, the American people who have sacrificed so much in this fight, and the incredible members of our HHS team who've been working tirelessly to protect the health and well-being of all Americans. Before covering today's topic, I want to mention a major milestone for global health yesterday. The end of the second largest Ebola outbreak in history in the Eastern Democratic Republic of the Congo. We congratulate the Congolese government and all of the healthcare workers and community members involved, some of whom I had the chance to meet and thank in the DRC last fall. Under President Trump, the United States was proud to play a bigger role in this major public health victory than any other single nation. And now, thanks to the President and the Vice President's leadership and the hard work of our team, America has never been readier to combat COVID-19. We've built up our readiness under the strategy we developed to address surges, save lives, and in time defeat the virus. We're in a much stronger position to support states, hospitals, and individuals as they fight back. There are 6 parts to the strategy: surveillance, testing, containment, healthcare capacity, therapeutics, and vaccines. First, we've been strengthening surveillance so that we can be aware of and respond to surges. That means, for instance, being able to track more cases among younger Americans that we never would have caught earlier in the pandemic. Second, we have the world's greatest testing capabilities, enabling us to confirm the presence of the virus when it crops up, and we're confident that capacity will continue to rise in the coming months. Third, states are building the capacity to track and contain outbreaks of the virus. With federal help, many states have substantially expanded their own capabilities and we're deploying knowledgeable, experienced CDC and HHS public health teams to the areas now seeing increases, with a focus on community testing and community-based interventions. Fourth, we're helping healthcare systems secure sufficient capacity and supplies. We've dramatically expanded American manufacturing of PPE, and the FDA has authorized new technologies to sterilize equipment for reuse. We've spoken with hospitals and states that are building up their own PPE reserves, many of them getting up to 60 or 90 days of supplies. Through the Strategic National Stockpile, we have far more visibility into the supply needs across the country, including centralized coordination capabilities that we lacked just a few short months ago. Visiting healthcare providers around the country, I've seen how they're adapting to bring patients back while taking appropriate precautions. America's hospitals are ready to get back to business while maintaining their readiness for COVID-19. The fifth and sixth elements of this strategy are thanks to the President's Operation Warp Speed. We now have promising therapeutics that are benefiting tens of thousands of American patients and in all likelihood have already saved thousands of lives. We've identified two very promising pharmaceutical treatments, remdesivir and dexamethasone. As of today, we've allocated more than 120,000 courses of remdesivir to all of the 50 states. We've added dexamethasone, a very low-cost steroid, to our treatment guidelines, and we believe it's reasonable to assume that other corticosteroids, which may be more readily accessible in some places, would have similar immunological effects. Another promising therapeutic, convalescent plasma, has been used to treat more than 25,000 Americans in nearly 3,000 sites across the country. There are no certainties in science, but with more than 140 clinical trials underway in the U.S., it's a pretty safe bet that more good news on therapeutics is on the way and on the way soon. Finally, we've announced large investments to support 3 different vaccine candidates all the way through to manufacturing. These candidates are now in human clinical trials, some with the potential to start delivering safe and effective doses before the end of the year, and we'll be adding support for several more candidates. We're expanding manufacturing capacity and already making the vials, needles, and syringes that we may need. Our capabilities have grown exponentially in the time allowed by the patriotic sacrifices of the American people. We have a much better grasp of the virus, as Dr. Birx said, and much more data with which to model it. With that data, as you've heard today, we can focus on local trends. We have some very concerning hotspots, and we can track when other hotspots emerge, as we expect they may. We're focused on the states and the counties within those states, just 3% of counties that represent hotspots. It's important for the American people to be aware of this variability and variation across the country. Americans need to understand their local trends because we want to help people make the right decisions for themselves. Making decisions for yourself has to be based on 3 axes of risk, as our Surgeon General taught us in March. You want to assess where you are, who you are and whom you live with, and what activity you're thinking about doing. There are gradations of risk within each of these axes. Going to an outdoor restaurant in Montana is a great deal different from a crowded indoor bar in Houston. When you interact with fewer people in an activity, when you interact with them for a shorter period of time, your risk is reduced, and individuals can balance these kinds of factors. What I've laid out today is remarkable progress by the President's administration, and a particular credit to the team here at HHS. We've got a lot of work ahead of us, but Americans can be confident that we have a rock-solid foundation to help us get safely back to work, back to school, back to worship, and back to health care, while we tackle surges of the virus where they occur. Thanks to President Trump's leadership, we've got the capabilities, the knowledge, and the strategy to protect Americans' lives and their livelihoods at the same time. And every American should feel proud of that. Thank you.
Great. Great.
Thank you, Mr. Vice President. I wanted to add some comments. Once again, I want to stress and thank all Americans to embrace the importance of social distancing recommendations to slow the spread of COVID. As I've said before, we're not defenseless. These are, in fact, very powerful weapons, and it's our collective responsibility to recommit ourselves to put them into routine practice. Again, to stay 6 feet apart from each other as much as possible, to wear face coverings when we're in public, and to practice vigorous hand hygiene. And to commit to do so, as we've heard today, to do our part to protect the vulnerable. I also want to appeal to the millennials and those that are under 40. It's really important that this group really commit themselves to these practices to protect those at risk. And it's not just the elderly that are at risk. Many of us may have friends and colleagues that are younger that may not advertise their underlying comorbidities, as the case would be with, say, type 1 diabetes or an underlying immune deficiency. So again, asking this team of millennials and younger people in this country to come and commit themselves. I agree with Ambassador Birx. We're very thankful that the group is now coming forward to get tested, but I also want this group to put into vigilant practice the importance of our social distancing. The one thing that I wanted to stress, though, is that there are differences in what we're experiencing today than what we all experienced in March and April and May. And one of the things I want us to focus on is not the cases per se, but the consequences, the impact of those cases. It wasn't long ago, probably within 2 months ago, it's hard to believe, I don't think many people realize, that 27% of all deaths that occurred in the United States actually died of a pneumonia. That was a pneumonia, could have been influenza, could have been COVID. 27%, 1 in 4 of all the deaths in the United States just 2 months ago was caused by pneumonia. I'm happy to say today the deaths to pneumonia in this nation is back to baseline. It's about 7%. It's a big difference. A lot of those pneumonias that were dying were actually COVID-infected individuals that were the elderly, nursing homes, and individuals with comorbidities. We are seeing, despite these increased cases, we have seen a progressive decline in deaths. The last, say, 2-week average deaths in the United States now is around 650, and as you heard the Vice President, it wasn't long ago that sadly we were losing 25,000 individuals a day. So I think it's critical that we continue to focus on that, the consequences. And it's part of that why it's important that we continue also to look forward to how we deal with and contain and control the COVID infection, but as we also change the consequences of the impact it's had on education in this country or as an economy and business. So again, as I close, I want to just re-emphasize how important for now, for individuals to really think seriously, as Tony said, about the responsibility to others that we have, because this infection pathogen really does have the capacity to cause quite serious illness in individuals at high risk, and embrace our nation's recommendations that the Vice President put up again, that we have for all phases of reopening America. Again, I also want to thank the younger groups for stepping forward and getting tested. Clearly what we're seeing now is this age group is much more likely to be asymptomatic, and again, to make that commitment to do their part to protect those of us that, whether we're young or old, have a comorbidity and would be more vulnerable to serious illness from this virus. Thank you very much.
Thank you, Dr. Redfield. Questions?
Mr. Vice President.
Yes, please.
All of the experts here within the task force are stressing the importance of social distancing and also the threat of crowds. Yet your campaign has held 2 massive rallies, no social distancing, no masks. Can you tell me, even Dr. Fauci has talked about not gathering in large crowds. Can you tell me why you continue to do this, why the campaign continues to hold these rallies?
Well, the freedom of speech, the right to peaceably assemble is enshrined in the Constitution of the United States. And we have an election coming up this fall. And President Trump and I believe that taking proper steps, as we created screening at recent events and giving people the very best counsel that we have, we still want to give people the freedom to participate in the political process, and we respect that. I was pleased to see that now the better part of a week since we were in Oklahoma, I think their positivity rate is actually declined as of today, and that's a great testament to the fact that people are using common sense. They're being responsible. They know and understand what's happening in the community in which they live. And our emphasis today is really to say that we think it's most helpful if the American people understand that what we're seeing across the South today is really outbreaks. There are outbreaks that are in specific counties. In some cases, there are outbreaks that are in specific communities. And we've surged CDC personnel, HHS personnel. I didn't mention before, but 3 weeks ago when we were seeing similar activity in North Carolina and Alabama, we sent personnel into those states, and we've actually seen declining numbers beginning in both of those states. So the important thing is that not one size fits all. The overall guidance to every American to practice good hygiene, to practice the measures that we recommended at home and at work stand. But our focus today is to make sure that in those areas of the country where we're seeing a significant not only increase in cases, but an increase in positivity level, that the American people know just how important it is to listen to what their state and local health officials are directing them to do. Please.
I was curious, it seems like the wearing of masks has kind of become a political statement, or I guess the decision not to wear a mask. Are you concerned about that? And is there a message that you would like to send to people about the importance of wearing masks?
Well, we think that the first principle is that people ought to listen to their state and local authorities. I mean, I have to tell you, President Trump and I couldn't be more grateful for the partnership we forged with governors around the country. I spoke to the governor of Florida, of Arizona, of Texas, just within the last 12 hours. And I told them that from this podium today, we would remind their citizens to heed the guidance and the direction of state and local officials. In some cases, there's statewide guidance with regard to facial coverings and with regard to events and gatherings. In other cases, there are specific countywide or citywide directives. And we just believe that what's most important here is that people listen to the leadership in their state and the leadership in their local community and adhere to that guidance, whether that have to do with facial coverings, whether it have to do with the size of gatherings. And we'll continue to reinforce that message. Please.
I have two questions, actually. You just mentioned the importance of listening to state and local authorities. What is the correlation between the spike in cases that we're seeing in states like Texas and Florida and the way those states handled their reopening? Was it too much too soon? And secondly, I wanted to ask Dr. Fauci, you said in an interview that, quote, something is not working. What isn't working? And did you all in your meeting today come up with a plan to fix whatever isn't working?
Well, let me respond first, and then I'll let Dr. Fauci address it as well, and Dr. Birx may as well. I think there will be a temptation for people to look at these Sun Belt states that have been reopening and putting people back to work, and suggest that the reopening has to do with what we're seeing in the last week or so. But frankly, in the case of each of these states, they reopened, in some cases, almost 2 months ago. And their test cases, their new cases that from testing was low and steady. Their positivity rate was low. What we're observing today, and I've heard this from Florida, I've heard this from Texas, and some other states along the Sun Belt, is that we're seeing more and more young people under the age of 35 who are testing positive. In many cases, they have no symptoms, but they're coming forward and confirming that they have contracted the coronavirus. We're working with the states. And you speak about our plan. We've got CDC personnel embedded in every state in the union. We're surging more CDC personnel as requested to each of these states to help them unpack what the data is suggesting. I know the governor of Texas announced some new measures this morning, which we fully support. But what we're going to continue to do is give our state leadership the very best information, the very best counsel that we have. And if there's one message that comes through today, I hope it is saying to younger Americans in these states and in these counties in particular that they are a big part of the numbers that we are seeing in new cases. And while they're
All right, folks, we are now going out to New York here for Governor Andrew Cuomo update, live on coronavirusnow.com.
The rate of increase is only getting worse, and a number of excuses have been made for this over the past weeks to further the denial. First, they said, well, it's because they're doing more testing, and that's why the number of infections are going up. Not true, because the number of hospitalizations are also going up. People don't go into a hospital unless they're sick. That is a fact. Or because they think they're sick. So it's not a question of the numbers going up in the testing. It's the number of hospitalizations that are going up. So you know that the virus is increasing. And this has been getting worse. It's not getting better. And you look at where the United States is now, globally, Europe, that got hit first before us, we didn't know it, but the virus went from China to Europe, came to New York from Europe. That's why we had that big spike. But America now trails Europe in the recovery from coronavirus. The White House has been saying reopen fast because that's good for the economy. And we have to get the economy going. Yes, we have to get the economy going, but reopening fast was not good for the economy. What has been happening is when that virus spikes, the market goes down, not up. This was not a smart policy to rush reopening. It did not help the economy. It's the exact opposite. The volatility, the instability, the concern about the path of this nation has roiled the markets. And at the same time, from a public health point of view, the number of deaths is increasing. IHME, the model that the White House follows, just increased by 10,000 their death prediction, number of people who will die. Why? Because they're extrapolating out from the increase in infections and the increase in hospitalizations. The White House has been saying, well, it's up to the states, it's up to the states. But the president didn't really leave it up to the states. The president has been pressuring states to reopen quickly. Liberate your state, liberate New York, demonstrations that I've been dealing with all across the state, pressuring governors to reopen. The denial by the federal government of the severity of this virus was followed by the federal government's abandonment of responsibility. If you don't believe it's a problem, you don't try to find a solution. And that's what happened with the federal government and coronavirus. They never believed it was a problem, so they didn't believe they needed to solve it. The key barometer in all of this has been testing. Everybody said that from day one. Every federal official, every state official. Get the testing up. Get the testing ready. How many testing sites across America has the federal government set up and operated? 41. Well, is that a lot or a little? Well, for comparison, you know how many sites we have in the state of New York? 750. Federal government has put up 41 sites, FEMA and HHS, that they operate. How can that be? Because from day one, they told you they didn't believe it was a problem. They started day one, it's like the flu. If it's not a problem, you don't try to solve it. And they didn't try to solve it. And as a matter of fact, they have been advocating from day one, reopen the economy, reopen the economy. And now we see the results. It just plain hasn't worked, and it has been a failure. Will Rogers, when you find yourself in a hole, stop digging. Not a New York quote, but it's right. Where are we in New York? We've been smart. We didn't do this politically. We followed the facts. We followed the data, and it works. We have the lowest level of hospitalizations since this nightmare began, 853. Amen. We have the lowest 3-day average death total. We're down to 8 deaths yesterday. We remember the 8 in our thoughts and prayers, and we don't want to lose anyone in this state. But you look at where we are compared to where we have been. You remember at one time we had 800 deaths per day. Today we have 8. We do more testing than any state in the United States. We did 46,000 tests yesterday on a Sunday, and the infection rate was 0.8. When you're below 0.1, that's our goal. And 0.8 is lower than it was some points last week. You look at all the different regions, the numbers have been good all across the regions that are opening, going through phased reopenings. The numbers are all constant. You look at New York City. Within New York City, we study the boroughs because there's a wide variance in the infection rate. It tends to be worse in the outer boroughs, but you can follow that day by day, and that's good. We have a very elaborate tracing system so that when we find a positive case, we trace it back. That has been working very well because we have found traced back to clusters of cases. Westchester County graduation, where there was a young man who apparently came up from Florida and attended a graduation that generated 13 cases. There's an aluminum factory in Montgomery, 500 employees, 74 positives. Washington County, a slate quarry, 12 cases that we traced back. Oswego Apple Factory, 82 cases. This is actually good news. It means the system works. You find the positive, you trace it back, you find the common denominator, and that's how you stop the spread. You look at our curve compared to the rest of the country, you see the rest of the country is going up and we're going down. As we continue to test, we continue to trace, we have the data, we're continuing on our reopening plan. Phase 4 is ready for Western New York tomorrow, so we're excited about that. In New York City, we have complications that we are studying now. New York City is currently in phase 2. Phase 3 would begin on Monday. But there are issues that we have to think through. One is there's a lack of compliance with social distancing in New York City. You can see it in pictures. You can see it if you walk down the street. You can see the crowds in front of bars. You can see the crowds on street corners. It is undeniable. That is partially the responsibility of citizens not to do it. It's also the responsibility of the local governments to enforce compliance. We ask everyone to comply, but we ask the local governments to enforce the compliance. And I've said from the very outset of this to all the county executives, all the mayors across the state, look, the state is more than doing its part. The responsibility for the local governments, help with testing, help with tracing, but do the local compliance of the socially distanced and mask wearing. That is a complication in New York City. The other complication is the spread across the nation is also problematic for us. We are not a separate country, New York. Some people think we are, but we're really not. And we're not an island, right? People from the other states travel to New York, and New York is a hub. If other states have a high infection rate, probability is they're going to wind up increasing the spread and the infection in New York. We learned that the hard way. Why did New York have that big spike when we started? Why was New York so different from every other state? Because the virus came from Europe. When the federal government was telling us the virus was in China, it had left China, it went to Europe. We had 3 million people come in from flights from Europe, January, February, March. That's where the virus came from in New York. Likewise, we're bringing the rate down. Other states, it's going up. People get on planes in the other states, fly through New York, fly to New York. Probability is they're going to bring the infection. One of the issues we're working on in New York City, indoor dining has shown that it has been problematic, that a virus spreads in closed indoor areas that have air-conditioned systems. So we know that indoor dining has been problematic. Outdoor dining has worked very well all across the state, New York City included. The state's going to be reviewing the data and consulting with stakeholders in New York City. I've started speaking with restaurant owners, business owners about the risk-reward on indoor dining. We've been speaking with Controller Scott Stringer, who raises a lot of good points about the risk of indoor dining. The Speaker Corey Johnson, the same thing. The mayor, the same thing. So I'm talking to business owners about it. We're going through the data, but this is a real issue. Our reopenings have worked very well. We're not going backwards, we're going forwards. A lot of these other states actually have had to go backwards. They started to reopen and they had to stop. But we want to study this issue primarily New York City on indoor dining. And we'll have a final decision by Wednesday, so people who operate those types of businesses will know what we're doing. But the increasing viral spread across the nation is also a problem, especially in New York City. New York City is where most of the flights come. New York City is where most of the travelers come. We have offered help to any state that is experiencing a spike. We have personnel who know this better than anyone in the United States. We learned it the hard way. We have equipment. We have testing capacity. So any state that needs help, we stand ready. I will never forget how good this country was to New York when we needed help. And the door swings both ways in life. Relationships work both ways. When I asked for help, we had 30,000 people from across the country, healthcare professionals, who volunteered to come to New York at our peak. I mean, that was an amazing sign of generosity. So we don't forget as New Yorkers, and we'll be there for other people. A few additional announcements. The Video Music Awards are going to be held Sunday, August 30th at Barclays Center. There are air filtration devices, air filters, that can actually help with the COVID virus. And NASA has studied these. There are HEPA filters, which are high efficiency particulate air filters that can actually filter out the COVID virus. The COVID virus is 0.1 microns. There are HEPA filters that can filter out 0.01. So any malls that will open in New York, large malls, we will make it mandatory that they have air filtration systems that can filter out the COVID virus. For many of these systems, it depends on what filter you install, called the MERV rating of the filter. But they have different filters that filter out different size particles. And they have filters that can actually filter out and catch the COVID virus. For large mall reopenings, which we haven't done yet, but we're going to make this mandatory. I would recommend, the state recommends, for all businesses and offices, they explore the potential for their air conditioning, air filtration system, adding a filter that can filter out the COVID virus. We have been looking at this issue because you look around the country and you're seeing malls, you're seeing air conditioning systems, indoor spaces that have been problematic. And we think this offers promise. Also, I'm a Queens boy, and I want to remind New Yorkers that fireworks are dangerous and fireworks are illegal. Fireworks are illegal. Some nights in New York City, it sounds like the Wild West with all the fireworks going off. I've never heard it like this before. They're disturbing, they bother people, and they are dangerous. And children, people get hurt every year. It is illegal. You can't do it. It is illegal. And the police department needs to enforce the law. But the state police are going to start a fireworks enforcement detail. We're going to try to prevent the fireworks from coming into the state in the first place before they get distributed. And I want to thank the state police, and the first deputy is here and the colonel is here. The primary supplier for New York State is the state of Pennsylvania. Not the state itself, but fireworks companies within the state of Pennsylvania. And we're going to be focusing on that route for the transmission of the fireworks. We'll also be helping local governments deal with this issue, but I need the local governments in this state to take it seriously. I know there's a lot going on a lot of levels, but this is illegal and it's dangerous, so we have to stop it. And to the president, because if we're going to turn this around in this nation, it's going to take the White House. And to the president, I say today, if you want to help stop COVID-19, then they should start telling the people of this country the truth. And this truth starts with how large a problem this is and how real a threat COVID is. It's the leadership to stand up and tell the American people, look at the increase across the country, look at what's happening to this country vis-a-vis other countries, look how it's hurt the economy. It is a real threat. And to start simply, the president can do two things. First, sign an executive order directing everyone to wear a mask. How we're at this point as a nation, and we still haven't done the simple, easy, minimal step of saying you must wear a mask when you are in public. And the president doesn't have to pass a piece of legislation, doesn't have to call the Congress, just sign an executive order saying wear a mask. We did it 2 months ago in this state. The other states are just starting to do it now. States that were recalcitrant, governors who said, we don't need to do this, masks don't work, all the political nonsense we heard. Now they're doing a 180, and you have the same states now wearing masks. Let the president have the same sense and do that as an executive order. And then let the president lead by example, and let the president put a mask on it. Because we know it works. We've proven that it works in the state of New York. And the president can still be New York tough and New York smart and united and disciplined and loving. I want to show you one other thing that makes the point. For a second. This come down or does it go up? This, do we know what this is? This is the mountain. What is the tallest mountain in the state of New York? Mount Marcy. This is the mountain that New Yorkers climbed. You know, I keep showing the curve. This is the curve. It's actually proportionate. We started on day one, and the numbers kept going straight up for 42 days. 42 days, New Yorkers dealt with that increase. Why did we have the spike? How did we get to day one? Because the virus came from Europe and nobody told us it was coming from Europe because the federal government didn't know. We dealt with it. We paid the price. And we dealt with that spike and we climbed right up the mountain. We got smart. New Yorkers stepped up. We wore masks. We socially distanced. We closed down. And we stopped the curve. We plateaued. You look at the projections, they all projected that this spike would continue, killing tens of thousands more people. New Yorkers came together and they turned the curve. And then we plateaued on day 42, and then we had to reduce the infection rate, and that decline went from day 42 to day 111. This was the trajectory of COVID in our state. We don't want to climb this mountain again. We don't want to climb this mountain again. And that's why the phased reopening, staying smart, staying disciplined, and that's why the spread across the country, that if that spread comes to New York, we could have to do this all over again. That's why we put in place quarantines. That's why we're offering help to all the other states. That's why we're saying the president has to step up, because doing this once in life is enough. We don't need to climb another mountain. One mountain was enough. We don't want to climb a mountain range. One mountain is enough. We don't want to do it again. Questions?
Governor, several more states might be added to the quarantine in the next few days. Has there been any concrete data on how many out-of-state visitors are already subject to quarantine, or how many have perhaps even been fined for your executive order?
Let's just remember how the quarantine works. It does not name a state, any state. There's nothing to do with politics. There's nothing to do with I like Minnesota or I don't like California. It's an equation. It's a set of numbers. If your infection rate is above X, then when you come here, please quarantine, just because we don't want the infection to spread, and you don't want the infection to spread. I do not have numbers for you, Zach. We just put it in place, but as soon as we get numbers, I can get them to you.
Governor, the outbreak in Chappaqua, what's your level of concern about that outbreak? The school district there says they followed all the protocols and had them in place. The superintendent put out a message to the community saying, unfortunately, at the event and despite police presence, numerous individuals failed to follow our protocols. So what is the takeaway from this experience?
Look, you know, there are certain facts that are undeniable. A mask only works if you wear it. It only works if you wear it. Socially distancing only works if you do it. And then there are two ends of the equation. I've asked New Yorkers numerous times to comply, and by the way, the compliance rate has been fantastic. It has been fantastic. You look around Manhattan, you go to any city in this state, I will bet you it's 95% of the people are wearing masks. And just think how extraordinary that is. No state is doing what New York is doing. California just went to masks as mandatory mask wearing a couple of weeks ago, literally. I think it was even last week. We were doing this 2 months ago. And this is a different kind of behavior. It was never done before. I laid out the facts to New Yorkers, and they did it. God bless them. God bless them. And they've saved lives. But 95%, it's the 5% who don't do it because, for whatever reason, social distancing, except the 5% who don't do it. Local governments need to do the enforcement. They need to do the compliance. I talk to mayors all day long, and I make this point. Well, compliance is difficult. Why? Well, because people don't like to wear masks, and then we have to tell them to do it, and they don't want to do it. I understand. Enforcement of compliance is difficult. But it's the law. And look, I said, blame me. It's my law. I'm guilty. Let the police go up to someone and say, I'm sorry, you have to wear your mask. It's not the mayor. Governor Cuomo says you have to wear the mask. Blame me. But they have to enforce the compliance because it only takes one. All these clusters, it was one person. 1 to 13, 1 to 80, 1 to 70. New Rochelle, Chappaqua in Westchester. We learned this lesson in Westchester. It was one person in New Rochelle. We had the first hotspot in the United States. One person led to hundreds of cases. One person. So 95% is great. Yeah, but one person in that 5% can infect dozens. That's why the local governments have to be diligent on the enforcement. Luis? You know, Luis, it depends on the combination of factors. And again, nobody has been here before. So literally, this nation, this state, you're figuring it out as you go. My MO has been get all the information you can, study the other states, see what's happening, and then make a decision. It's not just indoor dining alone. It's indoor dining in New York City, where you already have issues with high congregations. You already have issues of people clearly violating social distancing. And you now have an added factor of viral spread all across the nation and a high likelihood that those people will come to New York City. It's that combination of facts that is precarious. And we don't have a decision. I want to take today, tomorrow, talk to everyone. We'll announce a decision on Wednesday. But all of these decisions are just for that period of time. You know, anyone who says, well, what's it going to look like in 2 weeks? What's it going to look like in 3 weeks? I wouldn't believe any of those answers. You have to look at what is the viral spread across the country. What's the viral spread in New York City? We trace it every day. But it would be all of these are short-term measures.
And in terms of the New York City budget, the state budget allowed the state government to borrow billions of dollars because of the emergency. It allowed the MTA to borrow billions of dollars because of the emergency. What's the difference between allowing New York City and the MTA or the state government to borrow billions of dollars because of the emergency?
Well, you have a couple of issues. First, any municipality in the state that runs into financial trouble, who pays if a municipality gets into trouble? The cities are created by the state, right? They're created by state law. If a city or a county runs into financial trouble, the state steps in. New York City went virtually bankrupt in the 70s. The state had to step in. Yonkers, a city in Westchester, was virtually bankrupt. The state had to step in. Nassau County was virtually bankrupt. The state had to step in. Erie County, where Buffalo's in Erie County, was virtually bankrupt. The state had to step in. So whatever you allow the municipality to do, the state is ultimately going to be financially responsible. So you allow a locality to borrow. If that is imprudent, then it's going to be a state liability. So the state borrowing, it's our responsibility and we would pay. A city borrowing, it's a state responsibility ultimately if it goes bad. What all these localities have to figure out, and what we're trying to figure out is, I want to borrow X. Well, how do you pay it back? And when do you pay it back? And what do you think the revenues are going to be next year? And what do you think the revenues are going to be the year after? And how fast do you think business activity is going to increase? How fast do you think businesses are going to be back at full capacity and residents are going to be back at full capacity? So it's a very complicated economic equation. And then you have the big question of what is the federal government going to do and how much are they going to provide? You want to make a point?
Yeah, if I could just add, the debt that the state allowed ourselves to take out during the budget was short-term debt. So when the federal government moved the tax filing date from April to July, it deferred billions and billions of dollars for New York. And so we took this out as a way to get through to July, because as a result, we had to move the state tax date. So this was a short-term situation for New York State, and we've committed to paying it back by the end of the fiscal year. So this is not talking about long-term, so we're talking apples and oranges. And on the MTA wasn't given carte blanche to do borrowing. They were given the ability to issue debt. However, it has to be approved by the New York State Budget Director and by the MTA board, and they have not issued any debt to date. So there was a backstop, and there's fiscal watchdogs who are going to make sure that anything that they do, that it's being done fiscally responsibly. So they're not similar situations.
Governor, around day 42, you talked about why we were so dependent on PPEs coming from Asia and China, and you charged the let's take care of it home. There's now concern that our prescription drugs also coming from Asia and from Europe. Have you had any conversations with any of your fellow governors along the Northeast region about seeing what we can do to address this problem?
Yeah, we have had conversations, but we didn't form a regional coalition yet on the drugs. You're right, it is an issue. We have done state purchasing. We have municipalities within the state where we do cooperative purchasing for the entire state. But you're right, it's a national problem where it's not just PPE, gowns, masks, et cetera. It's also the availability of pharmaceutical drugs, and it's something we're looking at.
Governor, more of the city economy is reopening every day. There are more and more workers who are worried that 24/7 subway service won't come back ever. It'll make their commutes worse. They'll be stranded late at night. Would you guarantee that full 24/7 subway service will come back?
Yeah, we always said that when we were stopping the subway service for several hours in the middle of the night, right? When you say 24/7, it sounds like it's not a 7-day system. It operates 7 days. It's closed from like 1 a.m. to 5 a.m. Do you remember the hours? 1
Yeah,
a.m.
it's 1
to
a.m. to 5 a.m.
1 to 5. So yeah, it's closed in the middle of the night so they can disinfect trains. And as soon as we get past this and you don't have to disinfect a train, then we'll be in a different place. Also remember, you know, we're good at always seeing the downside, and there's been a lot of downside lately. If I said to a New Yorker, we've been arguing about cleaning the trains for decades, and the trains have been dirty for decades, right? Then it became a level of how dirty. If I told you that we were going to get to a point where we were going to disinfect the subway car. Now, to disinfect the subway car means every newspaper, every coffee cup, everything has to be out of that train. You can't have a napkin in that train. Homeless people have to be off the train. If I had told you that 10 months ago, you would have said impossible. It is impossible to do that in New York City. In my 62 years, I've never seen that, ever. And that's what we're now doing. Well, to disinfect trains, you have to close a couple of hours a night. Yeah.
But will they come back?
Yes. Yes. If you don't have to disinfect a train every night, then yes.
Governor, do you think that it's a possibility you would actually delay phase 3 for New York City? And you mentioned these complications being the enforcement in New York City of large gatherings. Are you saying Mayor de Blasio isn't doing enough? What should the NYPD and Mayor de Blasio be doing? There has been some controversy about how the NYPD was enforcing wearing a mask, not social distancing, etc. And then if you could also talk about the mountain behind you, how it was made.
I made it. I carved it myself. I'm a sculptor. Did you know? Yes, it's in the Italian. Yes, I am an artist. I've taken my artistic skills, where before I would just do drawings and some light painting. Now I've increased that to sculpting. I did it in my garage. It's made up of a blend of paper mache, cement, styrofoam, clay, and plaster. It's my own family recipe. My grandfather used to sculpt with it. None of that is true, by the way. But it is. Sounded good, didn't it? Tell the truth. I almost had you for a second. I had you with that Italian sculpting thing. It's made out of styrofoam. But it is proportionate to the increase and the decline. That is proportionate. And I wanted to show, look, first of all, I wanted to show New Yorkers what we did, what they did. I did nothing. I wanted them to see what they did and remember what we went through and remember why we don't want to go back there again. And that is how I saw it through this whole thing. You know, I would show you guys a curve every day, right? It was a curve, and we would talk about a curve, flatten the curve. It felt to me like we were climbing a mountain. And you couldn't even see the top of the mountain because the top of the mountain was like in clouds. And nobody could tell you where the top was. So it's climbing up a mountain. Every day is hard. Every day is a steep incline, 40 deaths, 50 deaths, 10,000 cases. Every day is a difficult, hellish day. Well, how high is this mountain? How high do we have to climb? Nobody knows. The mountain is as high as you make it. What does that mean? The mountain goes up until you flatten the curve, because you're designing the mountain by your actions. I mean, just think about how bizarre this was. So we climb up, 42 days, we're able to flatten the curve, we hit a plateau, and now we're coming down the other side. Well, how long is the descent? Nobody knows. It depends how New Yorkers react and how New Yorkers respond. And see, every line on that chart, that was a day. That was a day. That was a number of hospitalizations, a number of deaths, every day. And what we did today determined the number tomorrow. And we had to go through this not knowing where it ended. 400 people died today. Well, what's going to happen tomorrow? We don't know. We'll have to see. When does it stop? We don't know. We have to see. And New Yorkers climbed that mountain and they flattened that curve. The early projections from all the models, we had 18,000 people in hospitals. You know what the early models said? 120,000 people in hospitals. That's what the early models said. 120, 130, 140, 160. Well, how far can we get that down? Nobody knows. Depends on how you act. We went from 120,000 projected hospitalizations, 18,000. God bless the people of New York. I will never forget what they did. Literally saved tens of thousands of lives. Remember what we did, and we don't want to go back there. We don't want to go back there.
So would you delay potentially phase 3 in New York City? And what should the NYPD and Bill de Blasio be doing to enforce no mass gatherings, wear your mask, etc.?
Yeah, I don't want to. We have been on schedule with the entire phased reopenings. And the other regions are all ahead of New York, right, in terms of reopening. And we've done the reopenings, we followed the data, and the data is all still down, right? The infection rate is down all across the state. We're going to enter phase 3. The indoor dining piece is just one component of that, and that's something that we want to study. But we are on track for phase 3. This indoor dining piece, I do want to make sure we study, again, in light of everything else. If it was just indoor dining, we've done a lot of work on the air filtration system. With the filters can actually, I think, make a significant difference. But if it was just indoor dining, it would be one thing. But it's indoor dining, and you have the congregation problem, and you have the viral spread across the nation, which I think is really problematic for us. We are a state that is a hub. It's more of a problem for New York than probably any state in the United States. And that's why I implore the president to get into the game. First, as an American citizen, I want to protect those other citizens and give them the support they gave us. Second, for the economy, if we don't get this under control, the economy is going to get worse. And third, on a parochial level, they will come here. It is a matter of time, but they will come here. And the virus came in through our airports once before. It will come through again.
Governor, given some of the places that are seeing hotspots, a huge level of spread, a lot of them are suburban, a lot of them are rural, does it make you reevaluate at all your initial assessment that density was the main driver of New York City's big outbreak?
Well, we never said anything was a main driver. It was the main driver in New York City. In retrospect, now that we have the facts, Dr. Fauci said this, CDC head said this, the main driver was the virus came from Europe. And it was the greatest miss by the federal government of all time. China virus, China virus, China virus, China travel ban. Forget the China travel ban. It was in Europe. And they literally have traced our strain of the virus back to Europe. January, February, March, 3 million people come through our airports from Europe. And then you have the density and the public transportation and everything else. But more than anything, we just didn't know. Nobody said, screen people coming from Europe. Nobody said to the people of New York, watch when you go have a meeting with people in Europe. Watch if you have guests who are coming from Europe. It was just a total miss by the federal government. That was the main point. I gave you the 7 deaths today. 8 deaths is the 3-day average, right? Let's take one more. I'm sorry, did I answer your question?
Partially.
Suburban rural tends more to come, you see that more in clusters. You see that in the Westchester cluster, you saw that in the New Rochelle cluster, you see that in Montgomery County now, you see that in Oswego, where when you have a flare-up, you can normally trace it back to a cluster, but it just shows you how dangerous one person can be. I'm sorry.
Yeah, just to piggyback off of what the other reporter asked you, I was curious if you're any more open to allowing the city to borrow funds for operating expenses now that the mayor has said he wants the financial control board to model potential loans.
Yeah, the whole thing is, what is the loan? How do you pay it back? And what is fiscally responsible? You know, borrowing in and of itself is not a great thing, but it's not a bad thing. The question is, how much? How do you repay it? What do you think is going to happen with the economy? You know, there's a big question mark on how fast the New York City economy comes back. There's a big question mark on how fast the national economy comes back. With this virus spread, worse than Europe in this country, that is a serious question. How fast does the national economy come back? Then how fast does the New York City economy come back? And we have the same question all across the state. How fast does the Nassau economy come back? How fast does the Buffalo economy come back? And what do you think the revenues are going to be? And what I'm focused on, what can we do to actually stimulate the economy coming back faster? Because if you just wait for the economy to come back, it's going to be a long few months before businesses really ramp up, before people really feel comfortable going to places of density, going to a Broadway show, going to a packed restaurant, going to a packed bar, going to a convention at the Javits Center or in a big hotel ballroom. So that is a very large question mark, and you have to know that answer before you have any reasonable judgment of what you're going to be able to pay. Okay? Thank you all very much. Yeah, I'll check on the exact date for you.
And that was the update from the Governor, Andrew Cuomo of New York. Welcome, everyone, here on coronavirusnow.com. Always giving you the updates from across the country as they are happening while we do wait for some more live events to come. Let's show you just a little bit more.
We can take our masks off now? Yeah. We got plenty of distance in here. Well, good afternoon. I want to thank Dr. Antonacci for having us back at Lee Health. I was able to have a round table with some of the doctors and some other folks in the hospital, and got a really good update on what's going on here in Southwest Florida. What we're seeing, today, obviously a lot of news saying a huge number of, quote, cases. Really nothing has changed in the past week in terms of we had a big test dump. We've been testing 10 to 15% have been testing positive for really the last week. And that's a huge change from where we were at the beginning of June when we were basically 3 or 4% in terms of the positivity statewide. And so the number of cases, if you tell me the positivity rate, if I'm going to get 75,000 test results like we did today, you're going to get a certain number of cases. If I got 35,000 like we did earlier, obviously you'll get less. But that's really what we're seeing in terms of an increased positivity rate, which is one of the major factors that's driving the quote cases. The last week of May, the positivity rate statewide was about 3% of all test results that were coming in were positive, and so that was very good. I mean, obviously we saw the cases go up in March, throughout April, then start to decline, and then the positivity once we got into May, was really low and steady for all of May and then into early June. We started to see a little bit of an increase in the positivity that second week of June. Some of that was driven by some hot spots around the state, but then some of it was driven, particularly in the last 2 weeks, by a lot of community transmission, particularly from the younger demographic. I will talk about that in a minute. So that case positivity, particularly in the last week, has trended up. It started creeping up the second week of June, but then the last 2 weeks has gone up. We obviously liked where we were, throughout all of May and early June in terms of the positivity better. We're also just seeing more cases in addition to the positivity. We are doing more tests. The last week of May, we would get about 24,000 test results a day. The last 7 days, we've gotten 45,000 test results a day. So that's a pretty good clip in terms of getting test results in. And of course, if you have a stable positivity rate, the more tests you do, obviously the more cases you'll discover. If our positivity rate was back down in the 3, 4, 5% range, we would definitely be getting more cases today than we were in May, just simply because we're testing more. So higher positivity, more number of tests. And then really probably the most significant change we've seen is a radical change in the median age of people who are testing positive. When we started at the beginning of March, really starting to test, the median age was in the 60s. Half the tests positive were people 60 or over. Started going throughout most of April and May, usually in the low to mid 50s. And then really in the last 2 to 3 weeks, you've seen a dramatic decline. First it went to like 38, 37. Now it consistently is 33, 34, 35. And so if you have a day where you have a median age of 33, it means half of the positive test results that come in are under that age. And so you're talking about a lot of people in their 20s, in particular, early 30s. And then even the ones who are above that median age, we're seeing a lot of people in their late 30s and in their 40s. Now, those groups, by and large, are going to be much less at risk for really serious consequences, as we know with this virus. In the state of Florida, we've had, I think, about 86% of all the COVID-related fatalities have been in the age group of 65 or older. and there have been more COVID-linked fatalities over the age of 90 than there have been under the age of 65. So by and large, when you're talking about folks 55 and under, but certainly 35 and under, you're talking about a much less of a risk group. Now, of course, if you have significant conditions, this is something that could certainly aggregate that. But that is really what we're seeing. And the community transmission is being driven by that 18 to 35-year-old group. In fact, the positivity rate for 15 to 44, so a little bit broader than that, is getting close to 20%. So that's a lot different than where we were at the beginning of June. And if you go from June 1st until now, the number of cases from 25 to 34 have almost tripled just in less than a month now. So that's a really, really big group of folks. Part of, I think, the message is most of these people are asymptomatic. Most of them, if they do have symptoms, will be so mild that they would not even need to seek medical attention. But you are somebody that would potentially be able to spread the virus to more vulnerable groups. And so we want to send the message to folks, in the younger demographic to understand that while this may not be affecting you negatively at the minute if you're carrying it, by passing it along to folks who may have some health issues or may be advanced in age, that really could affect them very much. And so we just want to continue to remind people that. When we started doing things in March, the goal, remember, was to, quote, flatten the curve. We wanted to preserve the healthcare system and its resources from being overwhelmed by the results of the virus. And, Florida was able to do that. I mean, we were predicted to have hundreds of thousands of hospitalizations by the third week of April. We had a small fraction of that. What that is, now, when you flatten the curve, you don't have less infections necessarily. You just spread them out over a longer period of time. But I think what it's allowed us to do, and I think Larry can talk about it as well, is we're in a much better position to be able to handle what would come down the pike. Remember, in March, there was a question about whether there would be enough PPE for folks in hospitals to be able to do. PPE is much better shape today than it was in March and April. In March, we didn't even know sometimes you wouldn't even be able to test people. The tests weren't widely available. They were usually only reserved for people that were symptomatic and that were older. Well, now we have mass testing. Obviously, that's one of the reasons we're seeing a lot of positive cases in the younger asymptomatic group, because you don't have to have symptoms to go get a test. Well, hospitals can test anyone coming in. When someone comes in for a procedure, if they're going to be hospitalized for something other than COVID, they're still being tested for COVID. And so you have the ability to do that in a way that just wasn't present in March. There's also better treatments, better ways to deal with patients. I think the physicians have learned a lot. You do have things like remdesivir that's being used that I think is proven to have some positive effects, which is very, very good. And then it's also given us time to do even more to protect residents of long-term care facilities. So here at Lee Health, they have one of a number of facilities around the state, which the state has really worked to help set up in conjunction with systems like Lee Health, as well as with other skilled nursing facilities, to have COVID-only nursing facilities, so that if you have an outbreak at a long-term care facility, not all of those patients will require hospitalization, but if they're contagious, you don't want to leave them in the nursing home and then make the outbreak worse. So you have a place here at Lee Health. There's other places around the state where those folks can be put and have a safe place where they'll be able to be isolated, and that's a really, really good thing. So we do have that, and so it's certainly way better shape in terms of handling this than we were at the time. We've heard a lot about social distance over the last few months. Well, I guess most of the last few months. There was a couple weeks period there where people weren't talking about it when you had some big gatherings out there. But, to me, given what's going on with the younger demographic, seeing how you have more spread amongst people under the age of 40, it's really important for folks who may be in some of those vulnerable groups to really understand that you're seeing more community transmission amongst the younger groups. Most of them are probably not going to present with symptoms, and certainly not with very serious symptoms. So continue to be vigilant, continue to avoid crowds, continue to avoid contact with folks outside the home as much as you can. Most folks and the seniors in Florida have done a great job of doing that. Now, obviously, as we got into May and we had a very low caseload, low positivity, got into June, COVID kind of fell off the headlines. I think people were naturally just wanting to more get back into a normal swing of things. Well, now you still want to be vigilant, particularly with a lot of younger carriers out there. So that is something, if you're 65 or older, if you're medically vulnerable, please take the steps necessary to limit that type of close contact. But I'd also say for those who may be in the low-risk groups, understanding that it may be circulating among some of your friends, you have a responsibility to be careful if you're in contact with somebody who is more vulnerable. The state and Department of Health, we've been stressing avoiding the 3 C's, which are closed spaces with poor ventilation, crowded places with many people nearby, and close contact settings such as close-range conversations. And obviously, if you have all those, if you're at a private home, packed in, no outdoor air, a lot of people shoulder to shoulder, and then a lot of close contact touching or talking, that is going to be a bigger risk for transmission. Now, one of the things you're seeing throughout the country, really from coast to coast in the Sun Belt, is you're seeing more cases, particularly amongst young people, throughout the entire region. And I don't know exactly why that region as opposed to other places, but I think part of it may be as it gets hotter, people are going to want to go indoors more and be in the air conditioning. And the air conditioning is not going to be your friend when it comes to the virus. The virus can do much better in an enclosed, air-conditioned space than they're going to be doing in terms of outdoor activities. And so outdoors is your friend, the sunshine's your friend, the heat and humidity is your friend. So as you're doing different things, please keep that in mind. We've also, at the beginning of May, when we did phase 1, advised all Floridians that if you can't socially distance, wear a mask to protect yourself and those around you, and then particularly if you're in businesses that are face-to-face, that have close contact, it's important that you're doing that to protect yourself and others. Continue to practice good hygiene. Wash your hands with soap and water for at least 20 seconds. And of course, if you're sick, stay home. Don't go to work. Don't go out and expose other people. And FloridaHealth.gov has got a lot of information on that. But at the end of the day, we're seeing really big positive test results from our younger, less risky demographic in terms of the effects of this, but a lot of asymptomatic carriers and obviously could be asymptomatic transmitters, and that's what I think the concern is, particularly for our vulnerable population, that seeps into some of those folks who would be more vulnerable to the virus. But I want to turn it over to Larry, let him make some comments, and then obviously we're going to hear from some of our physicians.
Thank you, Governor. First of all, I want to thank Governor DeSantis for being here with us today. We really do appreciate his attention to the pandemic here. Here at Lee Health, we have been seeing increased cases both in our hospital and our testing. Our positive test rate has been about 13% across the board since we began, but in the last week or so, it's been over 20%. And the demographic is definitely shifting to a younger demographic, with our average age being around 40 now instead of being much older early on. So we're definitely seeing those cases. We have adequate capacity in our hospital right now, where we have 1,300 staffed beds and 1,600 licensed beds. Of interest is that if you look at our COVID positive patients that are in the hospital, only about 20 to 25% are actually requiring ICU care. So our ICU capacity is fine, our ventilator capacity is good, and as the Governor mentioned, our PPE stockpile is much better than it was early on. So we are really trying to drive home the message of social distancing and mask wearing. You know, this community had incredible resolve early on, and we were able to flatten the curve in a very dramatic way, as the Governor mentioned. But I think we're getting complacent. As I go around the community, I see a lot of people not wearing masks. And although you may be 25 and feel that you're bulletproof, You have parents and grandparents, and I bet you know someone who is overweight or diabetic or has heart disease or has lung disease, and they are at risk. And the fact of the matter is you're going to put them at risk. So we really are trying to deliver a message, trying to get to the hearts and minds of the people in this community of why it's important to wear a mask. And if you're not wearing a mask, tell us why. We want to know why you're not. Because for us, it's about really putting resources towards education to the public to let them know why it is important and how we can make a difference. And as we see this increase right now, we can flatten it again just like we did it before. But it's going to take effort. It's going to take the community to rally around this effort and do this. So that's my message to the public today is please wear a mask when you're in a crowded area, practice social distancing, good hand hygiene, all the things we've been talking about for months now. And with that, I'm going to turn it over to Dr. Homolka.
Thank you. And thank you, Dr. Antonucci and his staff, the leadership over the past 3 months during these trying times, and Governor DeSantis for coming down to Southwest Florida and to Lee Health, especially for meetings with us, and discussions over the past several months have been helpful. Last time we were here, we had come up with a plan to open up elective surgeries that were closed. And thanks for the nursing, physicians, ancillary staff. We put those plans into action, ramped them up over several weeks to the point where we're doing a lot of elective surgery now, not quite 100%, but we've made a long way. And I think most patients are very happy. They feel very safe. They're very confident. And I think going forward, hopefully we'll get to where we were before. And I think patients should just realize that safe place to come and feel confident in their care that they're going to get here and that they'll be safe when they're here. And hopefully we'll get to a normal or a new normal very soon.
Thank you. Dr. Mahalik.
Thank you very much, Larry. John Mahalik, orthopedic surgery. Thank you again to Governor DeSantis for his leadership through this trying time. I just want to mirror Dr. Homolka's comments about how things have changed at the hospital and also in our private healthcare offices. So in the private healthcare offices, also in the hospital, just expect that when you see your healthcare practitioner, you're going to be asked to wear a mask. You're going to be asked to socially distance in our waiting rooms, in our lobbies. When you come to those facilities, please expect that you won't be able to bring extra people with you to your visits so that we don't unnecessarily crowd too many people into a smaller space and potentially prevent even further spread. Certainly you're going to be screened for any symptoms you may have or any comorbidities that might put you at risk. And then just to mirror what Dr. Homolka had said as well about the elective surgery side, we still treat all patients that are going to have elective surgery as if they are potentially infected. So patients are asked to wear masks. All the healthcare workers wear masks. We all practice good hand hygiene and make sure that we make the lowest risk possible to the patient and to the community so we can continue to provide important health care. One of the messages we tried to spread last time was that the impact of the virus is far beyond the number of cases. If people don't seek proper medical care and aren't able to have timely care, then people suffer in other ways that may be more serious than the virus itself. So just wanted to put that message out there that it's still, even though there's a rise in cases and there's a rise in positivity, that it's safe to come to your doctor's office, safe to come to your healthcare facilities, and seek care in this safe environment. Thank you.
Thank you. Dr. Stovall.
Hi, good afternoon. Governor, thank you for coming today. Thank you for your support of our facility. And Dr. Antonucci, thank you for your leadership as well. As a member of the Infection Prevention Leadership Team and part of the Incident Command Center, I can tell you that we started off all of our meetings throughout this entire pandemic with two goals in mind. We have to provide the care that our community partners need. We need to be sure that we're there for our patients and their families. And in order to do that, we have to care just as much about the people that work in our system, the medical staff that work for us and the medical staff that work with us, as well as our own staff that we employ here. So our goals are to keep everyone safe. And the best way that we can implore you to help us do that and to partner with us is to do the things that Dr. Antonucci spoke about. We can all be a risk to someone else, and while we may not feel bad, we can be a risk to those people around us. And so we're asking for responsible actions. We want you to live your life, not in fear. This is a new normal that we've all had to get used to. So we don't want you to be fearful. But we do want you to take those things that we know will help lessen disease and flatten the curve like our governor has talked about. So thank you for your part in helping us to keep our healthcare workers and your neighbors healthy.
Great. Well, I want to thank Lee Health again for being here. It's great to be in Southwest Florida. And just to underscore what Dr. Antonucci said about there was a great job done really all throughout the state of Florida. March and April had a tremendous May, very low, steady as she go positivity, low caseload, and even really into the first week of June. And then the last 3 weeks, we've seen it change. Well, I think now this is back in the news. I think people understand. And look, it was natural. It wasn't much. I mean, I would do press events in May. I would never be asked about coronavirus. It was about all these other things. Now it's something that so I think people just naturally just assumed it was behind us. Viruses don't necessarily just go away, and so I think we're seeing that now. So we have an ability to just do some very easy things, just be very vigilant, and I think it'll really make a big difference. And with that, take some questions.
Governor.
Sure.
So the experts, first of all, Morgan Reiner with Wink News, good afternoon. The experts sitting next to you at this very table and across the country, across the world, agree that masks save lives. They stop the spread of the disease. Why not mandate it?
Well, I don't think Larry is saying to mandate it. I think he's told me he thinks it's something that we provide education. We did an advisory at the beginning of May, and we've advised that that's something that could make an impact. At the same time, to do police and put criminal penalties on that is something that is probably would backfire. You have seen some localities require it. And they're going to have to figure out how they're going to use kind of the long arm of the law to enforce it or not. A lot of businesses will require it when you're going in, and that's fine as well. But a lot of what we're seeing, I think, with like the younger people, if they're partying at somebody's house or something, they're probably not wearing masks. I mean, let's just be honest with that. And so you really would need to to change the behavior there, which I think would be great, but at the same time, it's a little bit different. I think the businesses have done a good job when people come in, creating a safe environment, and I think a lot of customers are going to want to see that, so they have every incentive to want to do it. So, we're going to continue to put out the messaging, we're going to continue to put out the guidance, and we're going to trust people to make good decisions.
And then,
another question here. Sarah Girard with Wink News. Do you, like the president, think that the economic impact, like unemployment and the stress this is putting on people, is actually more dangerous than the virus itself?
I mean, I wouldn't even put it in those terms. I mean, we know a lot more about the virus now than we did at the beginning of March. We understand, if you look at, Florida, the incidence in terms of mortality and morbidity is dramatic in terms of the ages it affects versus the ages that typically have much lower impacts. And so my view has been, and that's why we've done so much with the long-term care facilities. Some other states did it a different way. I think the way we did it has been successful. That's why we're doing all these things to have skilled nursing facilities that are COVID only, to be able to have a safe place for folks to be able to isolate so that they don't infect other nursing home residents. That's why we've messaged really since the beginning of March to the folks who are advanced in years, 65 and plus, those who have underlying conditions, to avoid crowds and understand that close contact could put you at risk of contracting the virus. And I think that's really the way to go. Having people working is a good thing. There's not been any there's not been major outbreaks linked to very many businesses. I think a lot of it's been social. Now, you have had agriculture outbreaks, but that's not because they're working. It's because a lot of them live very close together, and so the close confines are good areas of transmission. But, we went to phase 1 at the beginning of May, and we had the best COVID results we've ever had all through May and the beginning of June. I mean, positivity was low, the cases were low, so things were going really well. It showed that you could do things economically and continue to keep your eye on the ball with the virus. I think just what's happened since in the last few weeks is I think it's more just, people want to be social, they want to interact, and that's why you're seeing it so much with the younger folks who quite frankly, aren't much less risk. I mean, and they want to interact and they understand the risks to them, so it's caused some spread there. But I think that the older folks have still been very vigilant, very cautious, and have really taken efforts to protect themselves. And I think that that's what they should be done.
What about the impact on bars?
Like what? What did Texas do?
Well, Texas is pausing their reopening. They've added more limitations at places like bars and outdoor gatherings.
Did you see what the DBPR secretary did this morning?
I did, absolutely. But
Okay, well, so Texas did that, and then they just did that. So what else has Texas done?
well, look, there's a Twitter hashtag right now with people in our community all over the state saying they're asking for you to resign because you haven't done enough. So there's a lot of concerns in this community. And, whether or not, I'm asking how you're planning to address that. Because right now, all I've seen is that you're asking people to wear masks and keep distance and stay vigilant. And all that's fantastic, but there's a lot of real concern in our community right now. So I'm just trying to get those answers.
Right, and so one of the reasons why we're coming here, one of the reasons why we're showing, what we're doing, is because we want to continue to advise folks of where we're seeing the issues in terms of the transmission, which is in the younger demographic, which is in the social situations, we believe, which just naturally occurs. You did see major action taken by DBPR, and that you didn't admit that until I told you about it. And then you've seen other things that are going to continue to be done. These nursing facilities that we've done. Larry, what do you have? 50 patients there boarding them, mid-30s. That's huge to take action to protect our most vulnerable. We're going to continue to take action to protect those who really are the ones who are vulnerable to this virus, and we're going to continue to do that. And we've stepped up our ability to do that since May, and actually even since June, because we've brought more of these facilities on. That's what you want to do to keep people safe. But I want to see the positivity rate go down, but at the same time, an individual case, to me, I've said from the beginning, is not the most important thing, to look at, because as you see the cases shift younger, that's not going to be as significant clinically as if you have nursing home outbreaks or outbreaks amongst elderly who are going to be more vulnerable.
Governor
Sorry.
with Fox 4 News. I just have a quick question. Piggybacking off what the DPVR did, are we going to see more measures, whether it's scaling back capacity at restaurants?
No. So here's the thing. Not the phase one, when people follow the guidelines, we've not had any problems. You've not had any issues. The reason why DBPR took it is because you had people that weren't following it. There was widespread noncompliance, and that led to issues. And so folks just follow the guidelines. We're going to be in good shape. When you depart from that, then it becomes problematic. And so I think that that's been clear from the beginning. Remember, beginning of May, we went to this. You didn't see any problems. Very, very good, solid May. Beginning of June, now you've started to see more. But part of that is less business than it is social interactions.
Governor. So we've been talking to.
I've been dealing with NBC2 here. You said that we want to trust people to make the right decisions, follow the advisories, wear masks. But you'd also said that people haven't been complying with the guidelines. Younger people aren't wearing masks. Can people be trusted to do the right thing and wear a mask voluntarily?
So I think that I think when people saw this fall off out of the news, May wasn't as big, at least in Florida, people weren't talking about it as much. Then you had 2 weeks of protests where nobody was talking about it really. It was like coronavirus was no longer here. I think that people looked at that and decided, let's kind of, we're back to normal. Let's kind of go back and do our thing. And I think now people understand that, you still need to be able to do the basic social distancing and just take the basic precautions to be able to protect yourself, but particularly your family members. I mean, that's really something that's very, very important. And, there's been areas where, for example, we had a 10-person gathering mandate, a limit, a prohibition. in place statewide until, I believe, June 4th. Were there gatherings bigger than 10 people going around? Did you ever see that? Yeah, I think you did. They're still in place in South Florida. I know you've seen a lot of big gatherings there. And so the idea that you're just going to mandate and selectively prosecute people, I don't think that that's necessarily going to work. I do think what will work is, consistent messaging, letting people know what they can do to help protect themselves and to protect others. And then you obviously can have local folks, if they want to do different ordinances. Quite frankly, there's parts of Florida where it just wouldn't make sense. I mean, because you don't have the same cases. It's not something where the incidence is as high, and I think it would present some problems. You've also had some sheriffs come out saying they won't enforce any types of those mandates. So I think at the end of the day, we advised it almost 2 months ago. We've continued to do it, and I think that's the better approach than to try to prosecute someone criminally for it.
Governor,
Do you have any reaction to the quarantine measures that have been put in place by other states for people traveling from Florida to, say, New York, New Jersey, Connecticut? Do you agree with those measures? Or are you concerned it might hurt tourism because people might not want to come here?
Well, look, I mean, when we did that from New York, I mean, we were in a situation where most of the people fleeing there were going to southern Florida. So it wasn't just doing it for my health. I think we were doing it because, we were concerned that was going to accelerate the outbreak in southern Florida. Obviously, we don't have as much concern about that. I think the virus has run its course in New York. And so that was why we did it. I mean, they got to do what they got to do. But I'd say our situation here, is much different than what you were seeing in New York City. If you compare the fatality rate per capita between Florida and New York, I mean, they have 10 times more fatalities per capita than we do. We are testing a lot of people. Obviously, we're getting a lot of younger asymptomatic people testing positive. But in terms of the disease burden, it was much different there than it is here. Now, obviously, we want to continue to work to have fewer folks in that younger demographic test positive. We are working on that. I know folks throughout the state are working on that as well. But that's a different problem, I think, than what you saw earlier. And I think they did a thing with the Vice President, Dr. Birx, today, talking about what's going on in the Sun Belt. And just pointing out, we've seen a lot of dramatic case increases. We've not necessarily seen, as dire clinical consequences as you saw in those areas. And she made the point that it is a little bit different. So, but we are very much in the fight, as we've been the whole time. We have great capacity with our healthcare system. I mean, not only here, what Larry has around the state, very, very good. They're well positioned to help people, if they need help. We have the adequate PPE. We have mass testing. Anyone that comes in the hospital can get tested now. The treatments have been a lot better. And, we've done even more to protect the most vulnerable in our long-term care facilities. And so much better position now to be able to help folks to the extent that they would need help. But obviously, we want to make sure that we're taking the measures like they did the first time going through March and April. And at the end of the day, folks understand the issue now. They understand it's back. They understand that it's something that we've got to deal with. And I think a lot of people are going to want to do that. So I really appreciate folks like Lee Health, what you've done to put forth a very strong, consistent message to the community. And we're going to continue working with them and other folks to make sure that the message continues to get out and that folks will, will heed some of the advice. A lot of this stuff is very simple. These are not earth-shattering actions that need to be taken. A lot of simple actions can go a very long way, and particularly for folks, who may be in those younger demographics, it can make a big, big difference. All right, thank you.
Governor, I have one more question.
Good afternoon. I'm Kevin Captain, Community Information Director for Volusia County Government. Today, you'll hear from Heather Edwards, the Information Specialist for Volusia County Economic Developments Division, Jeff Hussey, the Deputy Fire Chief for Volusia County Fire Services, Captain Tammy Malfers, Public Information Officer for Volusia County Beach Safety, and Patricia Boswell, the administrator for the Florida Department of Health in Volusia County. First, on behalf of County Manager George Rechtenwald, Volusia County government strongly urges all residents and visitors of Volusia County to wear a mask when out in public, when you're at work in a business, or if you're a patron of a business. You play a very important part in the prevention of the spread of COVID-19. Ultimately, it comes down to personal responsibility, and that means wearing a mask when it's appropriate. Along those lines, I'd like to tell you about a county-wide campaign that will launch on Monday. And to do that, we have several public information officers and public agency officials as a consortium of what we call the Public Information Network, or PIN. I'll ask them to join me now. The PIN group is an organization
And welcome everyone here to Fox News Now on Fox 10 Extra, and of course coronavirusnow.com. Live look at downtown Phoenix there in the distance as we get you going on this Monday. 2 hours of nonstop coverage from around the country regarding COVID-19 and other top stories of the day. I'm your host, Mike Page. Thank you so much for joining us. Happy to be back here with you on the News Now set as we take you really coast to coast with the very latest numbers that we are seeing with the COVID-19 pandemic. Let's show you the Johns Hopkins map right now and what we are dealing with here at this moment. Total confirmed around the world, 10.1 million cases here in the U.S., just under 2.6 million cases, and unfortunately 125,000 deaths associated with this pandemic here in this country. Here in Arizona, we have 74,533 confirmed cases, just under 1,600 number of deaths being totaled right now. Now, the new cases today really won't tell the picture of just how much we are seeing widespread here in Arizona, because according to AZDHS, there was a problem with one of their lab partners not submitting their daily report. So we're expecting a very high number tomorrow. Only 625 cases reported today because of that lab partner not being able to submit all of their data here today. So we'll be on the lookout for those numbers fresh tomorrow as well. Here's what we have on the agenda for today. At any moment right now, we are expecting a White House news briefing. We should be having that at the top of the hour, and it looks like I'm having a little problem, everybody, with my switcher here. So let me hold on. There we go. Little weird one here today. The switcher's not being the best here, but we do have a White House news briefing coming up in just a little bit. We will feature that for you as soon as we get it here for you. In the meantime, let's go out right now. Dr. Mike.
Dr. Mike Srigliano with Penn Medicine joining us from Philadelphia. Good to see you on this Monday, Dr. Mike.
Always a pleasure, Thomas.
You know, I don't know what to make of these numbers here. Only 2 states are reporting a decline in new cases compared to last week, Connecticut, Rhode Island. I mean, is it time to hit the pause button on some of these states reopening, Dr. Mike?
Well, we're the only industrialized nation, according to some reports, that are seeing the record numbers of increased cases of COVID-19 and numbers of deaths. We're not doing something right, Thomas, and I was fearful of this. We're tired of this. Everyone is tired of it. My son had a baseball game on Saturday, and I saw everyone out there. Some were socially distancing, some weren't. No one was wearing a mask. And it makes me very, very nervous that we're going to go back to where we were in March. And so that's a big concern. The virus is not going away. We're just really tired of it, and I get that. But that doesn't mean the virus is going away. It's not. We have to take this very seriously.
Well, what's the consensus? I mean, where do we go from here? Where are we in this fight?
Well, I think we're really stagnating. We're not moving forward. What we're seeing is a recurrence, if you will, a resurgence of cases in many areas. And what we need to do is to take a step back and realize that we're going to do more harm than good if we just open up. Remember, the two reasons why waves occur. People get tired of the routine. People are tired of the economic stresses. And finally, we don't have a good treatment. We have treatment now that seems to be quite effective for severely ill patients, dexamethasone, remdesivir, for those who are hospitalized on ventilators or on supplemental oxygen. But as of right now, Thomas, we don't have a treatment for people like me if someone initially gets sick, or how do we prevent it? We're still waiting for that vaccine, and that may not be here until January.
And looking at community transmission, many states were reporting that it's being driven by 18 to 35-year-olds, that particular group. Is there still a sense of invincibility, or are there mixed messages here?
Well, I don't think there are mixed messages. The messages are you can't get together in large social gatherings. You have to wear a mask. You have to socially distance. And by the way, young people can get very sick, in addition to the fact that even if they don't get sick, they can be asymptomatic or have mild symptoms.
But when I say mixed messages, Dr. Mike, I mean, we hear from some who are saying, some of our leaders who are saying, young people, you don't have as much to worry about, and others who are saying, yes, you do. That's what I'm talking about, mixed messages.
Yeah, the mixed message there is it's either correct or incorrect messages. And the message not to wear a mask, the message to it's okay to get together, those are messages that are not correct. So we can call them mixed messages, but in my opinion, Thomas, bottom line is there's only one message, and that is we have to socially distance. We have to wear masks and be aware this virus is not going away. It's getting worse. And so we need to deal with this. We need to be real about it. We need to know the fact that the virus kills people. The virus is not going away for summer vacation. And if we don't take it seriously, we're going to be back, if not already, where we were in March.
Yeah, and we don't have a clear view, if you will, of the infection rate here. The head of the CDC last week, as you know, said for every case that's reported, there are actually 10 other infections that would calculate to roughly 20 million Americans infected. What will be the true gauge of knowing that this virus is under control, Dr. Mike?
Well, Thomas, you're already seeing in a number of states, in Texas, Arizona, an overwhelming, a surge of the hospital systems. To me, that is an indicator that we are in trouble. When we have so many patients ending up in the hospital on ventilators, remember the ventilator thing? In New York and New Jersey, we went through that. We had shortages. We were trying to get them. We had shortages of everything. And now we're seeing that in other states like Texas and Arizona, California. What we need to do is realize that if we don't deal with this, that is going to happen. And that, to me, as a healthcare provider, is an indicator that we're not doing the right thing, that we are not protecting our citizens because we are now overwhelming healthcare systems, and we're going to end up in big trouble like we were in March.
And I think after a while, some people are just tuning the information out. So here we are a couple of months in, and there still seems to be some confusion, Dr. Mike. So let's review, if you will. I want to go over some of the key points. And the first one being is, how is this virus spread?
Thomas, the best way to think of how this is spread, a major highway, if you will, would be from the mouth, speaking, coughing, aerosolized virus. That's the main conduit for transmission. The country roads are touching surfaces. And so that, and a lot of people have this misnomer that, yes, the emphasis on that has gone down a little bit, but it's still possible to get the virus. Because what happens is the virus is on a doorknob or some inanimate object, you touch that and then you touch your eye or your lips and then you get the virus. So a lot of people think, oh, I don't have to worry about touching things. That's not correct. It's just less important than wearing a mask and preventing that aerosolized transmission.
So let's talk now about the symptoms. I know there were a couple of new symptoms added late last week. What are they?
Well, basically, the newest symptoms are congestion of the nose. You can have diarrhea or bowel symptoms, and these add to all of the other ones. A loss of taste or smell. I've had numerous patients with that complaint. You have fever, chills, muscle aches. You have sore throat. You have cough. All of these things can be pointing to COVID-19. And so if you have any symptoms at all, you need to get in touch with your healthcare provider, because at least in my way of thinking and in my practice, everyone that has anything gets tested. And that includes the molecular test. That's the swab or saliva test to see if you have the virus.
We hear the words incubation period. What exactly are we talking about when it comes to incubation?
Most people develop symptoms or develop a clinically significant infection after about 4 days or so, and that can last up to 10 or 11 days. So if you are inoculated, if you will, if you come in contact with the virus, then there is a lag time. And the trick there is that early on, you may not get a positive result with a test. So the timing is very important, and I've seen this. Some people will get tested very, very early on, be negative, and then we recheck in a week or so, and they come back positive. So there is an incubation period.
So at what point do you seek medical treatment?
Anytime, Thomas, you have any symptoms, I would advise everyone out there to contact their healthcare provider. There are plenty of people, whether it be telemedicine or in-office visit opportunities, to get the care that you need. And to be honest with you, Thomas, since March, I've been in my office every single day. If someone calls and they have symptoms, I don't see them in the office, I immediately set them up for one of the tests. And that way they don't expose other people, they don't expose my staff. And if the test is negative, then we look further to whether they have a sinus infection. And in the fall, we'll see whether they have the flu.
Mm. So once again, to circle back around, Dr. Mike, who's most at risk here? Who's most at risk?
Well, the Centers for Disease Control have come out with numbers of patients and those types of patients that are at highest risk. Obviously, the older you are, the higher the risk. They did away with that cutoff of age 60 or 65. If you're getting older, you're at risk. If you're pregnant, you're at risk. Obviously, if you're immunosuppressed, if your immune system is not up to snuff, if you have diabetes. Now, interestingly, Thomas, high blood pressure was on the list of high risk factors, but now it's more of a possible risk. So what I think is happening is that people who are older, people who have diabetes, people who have obesity tend to have more incidence of hypertension, high blood pressure. So that was the de-escalation, if you will, with regards to hypertension. But if you have diabetes, you have obesity, you have asthma, you have sleep apnea, you have immunosuppression, you're at high risk.
I want to take extra precaution. A question I see a lot, I'm sure you hear a lot, Dr. Mike. Will a vaccine eventually wipe out this virus?
Well, I think, Thomas, a vaccine will help us. I'm not sure that it will wipe out this virus. I think this virus is probably here to stay on the planet, circulating the planet. But what we're hoping for is that with widespread immunization, we will accomplish two things. One, we will reduce the mortality rate. People will still die, just like with the flu, but less. Number two, herd immunity. The more people that have immunity, whether through actual infection or through immunization, will then reduce the numbers of people getting the infection. And then you throw in case tracing, and tracking people that have the virus and who they were in contact with, then we're able to really sequester. We're able to make sure that anyone who is positive is isolated, and with herd immunity, the impact of that will be much less.
I know a vaccine is still down the road. Will this vaccine, once it's available, be safe for everyone to take, or are there certain groups, much like the flu vaccine, who would be exempt from receiving it?
Well, Thomas, I think that what we're seeing right now is an indication that if you have a personal preference or there's some reason why you don't think you want it, I would be hard-pressed to say that is endangering not only you, your family, your loved ones, but all of us. And so I'm looking forward to the day when I can have this discussion with patients that are hesitant to do it. Now, obviously, there are going to be people who can't get a particular vaccine. Either they have a reaction to it, they have a history of certain medical conditions, whether that be Guillain-Barré, which is a response to vaccines that can occur very rarely, but they are in the minority. The majority of people will be able to get this vaccine, and it will be effective. I am hopeful.
Who should be testing right now for antibodies, Dr. Mike?
Well, Thomas, boy, there's a lot of controversy about antibody testing. We are hearing more and more about the inaccuracy of many of the tests. And remember, the initial guidelines and the initial emphasis from the FDA was to allow everyone to jump in, even if they weren't evaluated for their accuracy. Well, many of those tests were very inaccurate, to the point where some tests were not even 50% accurate. So that, coupled with the fact that antibody tests, even if it is legitimately positive and shows antibodies, we don't know yet whether it protects you long-term, whether it's 3 months, 6 months, 9 months, or a year. We don't know. So the antibody tests, I think, give people a sense of security, in many cases, a false sense of security, because then they feel like they are immune, and that's not the case yet.
Yeah, and you could need several tests down the road. All right, Dr. Mike, our daily advice on staying safe?
Well, Thomas, we're kind of, I feel like we fumbled the ball. We recovered it, but we lost 20 yards, okay? We need to get back on the program. We need to take this seriously. We need to re-emphasize with our young people that it is not okay just to go back and start your life over again. We need to take this seriously. And I'm a very optimistic guy, but I have to tell you, Thomas, I'm a little worried about where we're at. I think the next week or so will tell us, as Dr. Fauci said last week, are critical. It's going to tell whether we go back or forward.
Yeah, got to pick the ball up and keep on running. Our face mask, maybe our helmet. Dr. Mike Sirigliano with Penn Medicine out of Philadelphia. Great to see you, Dr. Mike.
Thank you, Thomas. You stay safe, my friend.
You as well.
Okay, everybody. Well, we are awaiting at any moment right now a White House news briefing. We'll have that for you as soon as we get that going here for you live on coronavirusnow.com. We appreciate everyone joining us worldwide, as always, bringing you the top stories and headlines from all over the country right here. Welcome back, everyone, here on News Now on Fox 10 Extra and, of course, coronavirusnow.com. Taking a live look at the White House briefing room. We are expecting that briefing to get going at any moment. As soon as that happens, we'll bring it to you right here on News Now. I'm your host, Mike Page. Thank you so much for joining us here on this Monday edition of News Now. While we do wait for the briefing to get underway, let's show you right now a little bit of an update from New York City, the mayor, Bill de Blasio.
Protect them. Protect their safety and health, make sure they have the basics to get by, their families have the basics to get by. While we restart our recovery, our economy, while we bring our livelihoods back, we have so much to do in this city to help people and bring back the vibrant life of this city. But right now, our singular focus has to be on those four basics. So I say this in general, and I say it because today is the day before our budget deadline. And we have been working for weeks now with the City Council on next year's budget. And to say the least, this has been the toughest budget that we've had to do as administration here at City Hall. We're in a whole different situation, in fact, than New York City's ever faced in our history. A healthcare crisis, an economic crisis, a disparity crisis, a budget crisis, all wrapped into one and on a massive, massive scale. So we keep coming back to the fact that we've got to focus on those basics: health, safety, food, shelter. But while we've been trying to do that, we have been dealing with an extraordinary loss of revenue. $9 billion has evaporated in the course of the last few months. Revenue that used to be plentiful because of such a strong economy, it's gone. So what does that mean? Billions of dollars of cuts have happened already in our city budget. More cuts coming because we have to live within our means. Now, I want to note that while we, New York City, has been doing everything possible to address this pandemic, to protect people's lives, to keep our hospitals together, to magnify and maximize testing, to get people food, 1.5 million meals being delivered every single day, all the things that this city is doing, we are doing alone. We asked repeatedly for the federal government to help us with the stimulus. It hasn't come, and there's no sign when it will. We have been the epicenter of this pandemic, and yet the federal government cannot manage to get New York City the help it needs, nor so many other cities and states. So the federal government side has been, in so many ways, missing in action. I went to Albany over the last few weeks, asked for help to help us through this incredibly difficult time with long-term borrowing. I want to thank the State Assembly. They were ready, willing, and able. The State Senate, however, has not acted. And I'm certainly disappointed, and I think New Yorkers are as well. But we're going to persevere. We're going to move forward. But it's not going to be with a vision of let's endlessly cut everything, because we know what that means. It will hurt human beings if we have to keep cutting and cutting. It will hurt families. It will hurt our workforce, the people we depend on. Their families depend on them. Austerity is never the way to go. We have to find a way forward that includes continuing to focus on what matters most in our city. And we'll do that with everything we possibly can as New York City. But again, at some point, if Washington doesn't act, if Albany doesn't act, then we end up in a very tough situation. So as we're in negotiations with the City Council, as we speak, what's clear is we will have to put into our budget labor savings. And I hope and pray we'll find a way to address this situation with labor unions, and especially hope and pray that Washington will act on the stimulus. But we're going to be ready for any eventuality and make sure we're going to serve New Yorkers no matter what. Now, at the same time, we have an unprecedented opportunity to change some things. And there has been a very intense, detailed, focused discussion over the last month on how we change policing, how we focus more on young people and the needs of communities, how we address disparities, how we redistribute. And I have to tell you, it's been a very productive conversation. So over this weekend, City Hall, here at City Hall, my office presented to the City Council a plan that would achieve $1 billion in savings for the NYPD and shift resources to young people, to communities, in a way that would help address a lot of the underlying issues that we know are the cause of so many problems in our society. I'm excited to say that we have a plan that can achieve real reform, that can achieve real redistribution, and at the same time ensure that we keep our city safe. And we make sure that our officers are on patrol where we need them around this city. So that's something that I think is so important to the future, to strike that balance the right way. Reform, justice, redistribution, but always safety. Now, at the same time, we want to shift resources more and more into young people in particular, into youth centers. We want to shift resources more and more into public housing. So the plan we presented has over $500 million in the shift in capital funding to youth recreation centers, to NYCHA developments, to help where the need is greatest. Look, we can do this, we can strike the balance, we can keep this city safe. So negotiations continue. I think they've been very productive. I'm very hopeful where we're going. But I wanted the people of this city to know where I stand and what we believe we can do for the future of this city. And while we're talking about reform, while we're talking about the future, I want to talk about a very troubling situation and one that reminds us of what we need to do more in the future. We have to look at the entire criminal justice system, and that means our jails as well. That means our Department of Correction. You know, we've made a lot of changes. We have the lowest level of incarceration since the 19...
All right, folks, we are going to step away from this, take you to the live event right now, just happening. White House news briefing underway.
Comes crumbling down. Anarchy in our streets is unacceptable, and anger is not enough. You have a president committed to action. The DOJ has arrested over 100 anarchists for rioting and destruction of federal property. The DOJ has also charged 4 men in federal court for attempting to tear down the statue of Andrew Jackson in Lafayette Square. The FBI has over 200 open domestic terrorism investigations ongoing. AG Barr has created a task force on violent anti-government extremists led by the U.S. Attorney's Office in New Jersey and the U.S. Attorney's Office in northern Texas. With 200 Trump-appointed judges confirmed, the rule of law will be upheld. Democrats at all levels, federal, state, and local, have done nothing. Senate Democrats blocked bipartisan police reform. Minnesota's Democrat governor failed to urgently deploy the National Guard. It took President Trump for that to eventually happen, his suggestion and the ultimate descendants into chaos there in Minneapolis. 3 Democrat Minneapolis council members voted to abolish the police while they themselves were getting a private security detail. That's quite rich. Democrat mayor of Seattle called the CHOP zone, the autonomous zone, the summer of love. It is anything but that, with 1 dead, multiple shootings, and desperate pleas for help unanswered by business owners and others. 11 people were shot in 12 hours this weekend in the Democrat-run New York City, and 61 people were shot in Democrat-run Chicago, and 15 fatally killed. A Democrat state, a Democrat city. President Trump stands against defunding our brave police officers, caving to mob rule, and cancel culture which seeks to erase our history. Let's be clear. The rampant destruction of statues is not a part of any ideology, but this anarchy is aided by failed Democrat leadership. And as President Trump has tweeted, these statues, quote, are great works of art, but all represent our history and heritage, both the good and the bad. It is important for us to understand and remember, even in turbulent and difficult times, and to learn from them. So let's stand for law and order, for peace in our streets, and against anarchy. This is President Trump's vision for the future. And with that, I'll take questions.
Chris. Thank you, Kaylee. I know you said that President Trump was never briefed on these reports about the Russian bounties and whatnot, but can you say that he was briefed today?
Look, I'll say this, that the U.S. receives thousands of reports a day on intelligence, and they are subject to strict scrutiny. While the White House does not routinely comment on alleged intelligence or internal deliberations, the CIA director, NSA, National Security Advisor, and the Chief of Staff can all confirm that neither the president nor the vice president were briefed on the alleged Russian bounty intelligence.
But has he been since briefed, since all of these reports came out?
So let me back up and say this, that there is no consensus within the intelligence community on these allegations, and in effect, there are dissenting opinions from some in the intelligence community with regards to the veracity of what's being reported, and the veracity of the underlying allegations continue to be evaluated.
And one more question, if I could. Is he upset that this intelligence was reportedly shared with the British government, but not him?
I have no further comment on that, other than to just point you back to the two assertions that I made previously.
Kristen.
Thank you, Kaylee. How did the president not be briefed on the Russia bounty story? Was he out of the loop by his own intelligence community?
No, as I noted, there was not a consensus among the intelligence community, and in fact, there were dissenting opinions within the intelligence community, and it would not be elevated to the president until it was verified.
President Trump tweeted overnight, "Intel just spoke to me." What specifically does that mean? Who spoke to him? Did that person, in fact, give the president a full briefing in that conversation?
So I have no further details on the president's private correspondence.
Tell us who's coming to the White House today and who's going to brief those lawmakers.
So what I can tell you about that is that last night, the Chief of Staff, Mark Meadows, called both Senator McConnell and Congressman Hoyer and said that he would be briefing 8 members from the committees of jurisdiction. So there was a bipartisan invitation extended, but no further details other than that.
Is that briefing going to happen today, Kaylee?
Yes, it was ongoing at the time when I came out here, or at least it had started, I think, 30 minutes prior to me coming out here.
But they're going to come to the White House. I just want to be clear about what's happening. Members of Congress have come or coming to the White House?
Yes. Caitlin.
Okay, I have 2 questions. One, isn't it concerning that there was even a hint of credibility to this report that the Russians were offering to pay Taliban-linked militants to kill American troops, and the president was not told about it? Has the National Security Advisor or anyone explained why they didn't think it rose to the level that the commander-in-chief should find out about it?
So intelligence is verified before it reaches the President of the United States, and in this case, it was not verified. I would note this, though, when the president, there's no stronger advocate for our servicemen and women than President Trump. He never hesitates to act when there is a threat to our servicemen and women. For example, in Syria in 2018, when dozens of Russian mercenaries were killed in retaliatory defensive U.S.-led strikes. So when our adversaries have directly targeted U.S. or coalition partners, the president has not hesitated to act, but this was not briefed up to the president because it was not, in fact, verified.
So I understand it has to be verified, but not everything in his daily briefings or in the presidential daily brief that's the written document is airtight. They let the president know about what they are hearing. That's why it's intelligence. So why would that not have been something that rose to that level if, we're sharing it with other countries?
The National Security Council and the intelligence community constantly evaluate intelligence reports, and they brief the president as necessary.
Okay, so my other question is, if this does be borne out to where the president believes that it is true, what is he going to do to hold Russia accountable? And is he still going to invite Vladimir Putin to the G7, G8, whatever he's thinking of having in the fall?
I won't speculate on whether this intelligence is verified or not verified, and I won't get ahead of the president on further actions, but I would just point out that no one
officials are not disputing that this is not true.
No one,
There not disputing this.
There are dissenting opinions within the intelligence community, and I can confirm with you right now that there's no consensus within the intelligence community on these allegations. And further, I would just point out, I won't get ahead of the president on actions, but with regard to Russia, this president has been extremely strong on Russia, imposing sanctions on hundreds of Russian individuals, expelling dozens of diplomats, closing 2 Russian consulates, withdrawing from an INF treaty, and several other actions.
Disputing it in the intelligence community.
I have no further notifications for you other than to tell you there's no consensus and there are dissenting opinions from some within the intelligence community.
You don't think this report is true?
I'm telling you this, that there's no consensus in the intelligence community and that the dissenting opinions from some in the intelligence community exist. Darlene.
Thank you, Kelly. I wanted to go back to the tweet the president tweeted yesterday and then removed. This morning you said that he didn't hear the phrase white power in the portion of the video, and that when it was signaled to him that that was there, he took the tweet down. So does the president retweet other people's tweets and videos without knowing the full contents of what he's retweeting?
No, he did not hear that particular phrase when he tweeted out the video. And
listen to the video before retweeting it?
He did, and he did not hear that particular phrase.
Also, given your opening, do you have any comment on Mississippi taking steps to remove the Confederate emblem from the state flag?
I would say that that's a decision for Mississippi to make, and it's commendable that they took this action in a lawful manner and took the appropriate steps rather than trying to tear down statues and monuments.
Thanks, Kaylee. One follow-up on the Russia and then one on another issue. Does the president have a specific message for Moscow given these reports?
A specific message for Moscow? No, because he has not been briefed on the matter. As I noted, there's no consensus among the intelligence community, and there are, in fact, dissenting opinions.
All right. And on a separate issue, Jacksonville, Florida today apparently is issuing a mask order. That, of course, is where at least part of the RNC will be held later this summer. Has the president's thinking about wearing a mask changed at all, given that order and given the increased coronavirus cases in Texas, Florida, Arizona, and elsewhere?
So I talked to the president before coming out here. It's his choice to wear a mask. It's the personal choice of any individual as to whether to wear a mask or not. He encourages people to make whatever decision is best for their safety, but he did say to me he has no problem with masks and to do whatever your local jurisdiction requests of you. Yes.
Thanks, Kaylee. There have been reports that some American service members actually were killed as a result of this Russian bounty. What information do you have on that?
Look, again, I'm pointing you back to the fact that there's no consensus within the intelligence community. And I would also note that for those of you that are always taking the New York Times at their word, they erroneously reported that the president was briefed on this. He was not briefed on this, and neither was the vice president. So before buying into full-fledged a narrative from the New York Times that falsely stated something about the president, that you would wait for the facts to come out. And note, once again, there's no consensus in the intel community, and in fact, there are dissenting opinions from some within it.
So you say that he wasn't briefed. Does that mean it wasn't in the PDB either?
He was not personally briefed on the matter. That is all I can share with you today, is that both the CIA director, the national security advisor, and the chief of staff can all confirm neither the president or the vice president was briefed.
Okay, I have a coronavirus question as well, please. Secretary Azar said that the window is closing. This is, cases are on the rise. This is a very serious time. Obviously, the vice president held a briefing on Friday. What is the president's message to the American people, and why aren't we seeing him publicly talk to the public, encourage them to do things to stay safe?
I would note that there was a whole coronavirus task force briefing on Friday where all of these questions that the American public had were addressed. We're encouraged to see that fatalities are coming down, that this Sunday, I believe, we had our lowest fatality rate since, I believe it was March 22nd, so late March. What that signals to us is we're catching people in the communities. The people who are being infected tend to be those, as Vice President Pence has noted, half of those testing positive are under the age of 35. This means we're catching people in their communities. We're aware that there are embers that need to be put out, but these signs of a decreasing fatality, increased and enhanced therapeutics that we've identified, 4 of them, dexamethasone, convalescent plasma, and remdesivir, and one other, that they are working. Remdesivir in particular reduces hospital time by 1/3. So these things make us uniquely equipped to handle the increase in cases that we've seen. Yes, Brian.
Kaylee, there's a national conversation going on right now about the proper place of symbols of the Confederacy, statues, memorials, names, and the president has repeatedly inserted himself into this debate. And I think a lot of people are trying to understand what his view of memorializing the Confederacy is and the proper place for the Confederate flag. So a couple questions. One, does President Trump believe that it was a good thing that the South lost the Civil War? And then 2, is he interested in following NASCAR's example and banning the Confederate flag at his own events?
Well, your first question is absolutely absurd. He's proud of the United States of America. Second, with regard to our statues, Americans oppose tearing down our statues. There's a Harvard-Harris poll released just last week that shows 60% of respondents said the statues should remain, and 71% said local governments should block groups from physically destroying the statues. So he stands on the side of preserving our history.
The question is actually about the Confederate flag at his rallies. Is he interested in banning the Confederate flag at his rallies?
That would be a question for his campaign, but look, this president's focused on taking action, on fixing problems. It's why he had his executive order just a few weeks ago to keep our streets safe and secure. That's where his focus lies, and I think that those who are tearing down statues, they do appear to have no ideology when they're tearing down statues and defacing statues of Matthias Baldwin, an abolitionist, Hans Christian Heg, who died fighting for the Union Army during the Civil War. A memorial for African American soldiers who fought in the Civil War was damaged in Boston, and a monument to fallen police officers was vandalized in Sacramento. This is unacceptable. It's why the president took strong action. It's why he has an executive order saying those tearing down statues will be punished to the fullest extent of the law. It's why 4 people will charge. He will not stand for lawlessness and chaos. He stands with the 71% of Americans who say there is no place for tearing down statues, as these anarchists are doing across the nation.
Christian. That it's okay to display the Confederate flag at his events?
Christian.
Yeah, thanks, Kaylee. I got a couple. First off, the president's been talking about this big infrastructure push. I'm curious if we're ever going to get a look at the proposal that DOT has been working on. And then secondly, curious if you could give us a little info on how the Phase 4 negotiations are going. Do you get a sense that Congress is open to the back-to-work bonus that the president said he's in favor of?
I don't have any updates for you on Phase 4 or infrastructure, but the president has mentioned for the last 3 years he's very keen on Democrats coming to the table and working with us on infrastructure. He's keen on in a Phase 4 seeing a payroll tax holiday, which helps low-wage workers and those who need it most. These are real effective measures that could help the American people, but the onus is really on Democrats to come to the negotiating table.
Well, is there any indication that this is going to be different than infrastructure in February? I mean, that was roundly denounced by all the Democrats.
Yeah, I won't get ahead of the president or those negotiations. Stephen.
Thank you. I have 2 questions. First, about the statues. I covered pretty closely the Trump inauguration rioting trials, and those all ended in essentially jury nullification, and no one was convicted. And I was wondering if President Trump is concerned about the possibility that the same will happen with the people who were charged before for trying to topple the Jackson statue, particularly given his personal role helping apprehend suspects.
Look, that'll be a decision for the courts to make and for juries to make, but the president is very keen on seeing these actions brought to justice, because tearing down American monuments and defacing federal property and defacing the Lincoln Memorial are not things the American public want to see, as noted with that 71% poll.
Got it. And my second question is, over the weekend, President Trump retweeted a contrast of his presidency and President Obama's, and there was a chart of the different things that President Obama did and President Trump did, and one of the differences was President Obama approving the extrajudicial killings of Americans overseas. There was a little bit of confusion earlier in President Trump's presidency about his position on that. Are you able to clarify whether he opposes that?
Look, I would just say this. The president will always point to the difference between his record and that of President Obama, which is what he was getting at with his tweet. You had on one hand in the Obama-Biden presidency the weakest economic recovery since World War II. With President Trump, we got to the hottest economy in modern history. With President Trump, you saw ISIS defeated. With Vice President Biden and President Obama, the so-called JV team of ISIS became the varsity team and overran 2 separate countries. So the president will always draw contrast with President Obama, and those are just 2 of the many, and he was drawing a contrast in that tweet. Blake.
Thanks, Kayla. I have 2 questions on COVID-19. First off, remdesivir, we found out today the pricing of it going forward for roughly a 5-day trial, $2,300 for government-backed programs, $3,100 in the commercial marketplace. Does the White House, does President Trump approve of that pricing, of that price point, considering there's been some criticism as to whether or not that's too high?
So, Blake, that's a really good, important and substantive question that I think deserves a good answer to. And first, the wholesale acquisition costs or the federal supply schedule is about $3,200 for a course of remdesivir. But remdesivir is an inpatient drug drug done by infusion, and because it is an inpatient drug, the patient would be very unlikely to see the cost of the drug and to pay the cost of the drug, because the way that hospitals get reimbursed for inpatient drugs is that they are paid flat fees for admission. And as Secretary Azar explained to me, this means in layman terms that hospitals have to eat the cost of treatment used. But if they buy remdesivir for, let's say, $3,200, which is the wholesale acquisition cost, and that remdesivir drug saves that patient time in the hospital, they only spend a third of the time in the hospital as a patient without remdesivir. That would mean that the hospitals are actually profiting because they're getting the patient out early. So that it basically all comes down to saying that the patient will not see that cost.
With the price point.
Right.
And then secondly, just picking up what Jeff had asked about masks. You said the president had no problem with masks and that individuals should do whatever their local jurisdiction requests. However, the HHS Secretary Alex Azar said this weekend, quote, "We've got to practice social distancing. We've got to use face coverings when we can't practice social distancing." So if individuals are going into an area and social distancing cannot be practiced, should they listen to the local jurisdiction in which face masks might not necessarily be mandated, or should they listen to the HHS Secretary who says wear a face mask?
So the CDC guidelines they are recommended but not required, and the president would encourage everyone to follow the orders of their local jurisdiction and CDC guidelines.
Thank you. So one question follow-up and then a separate issue. I just want to be clear, there are congressional leaders who are being briefed on the Russia situation, but the president has still not been briefed on the situation?
Look, this has been asked and answered. The president is briefed on verified intelligence.
And how does he know, if he hasn't been briefed, how is he certain that Russia didn't put out these bounties?
The president is briefed on verified intelligence, and again, I would just point you back to the absolutely irresponsible decision of the New York Times to falsely report that he was briefed on something that he in fact was not briefed on. And I really think that it's time for the New York Times to step back and ask themselves why they've been wrong so often. The New York Times falsely claimed Paul Manafort asked for polling data to be passed along to Oleg Deripaska before having to issue a correction. In June of 2017, the New York Times falsely wrote all 17 intel agencies had agreed on Russian interference before having to issue a correction that it was only 4 agencies. In 2017, February of that year, New York Times published a story claiming Trump campaign aides had repeated contacts with Russian intelligence, which even James Comey has said was almost entirely wrong, New York Times. New York Times published a column in March of 2019 by a former Times executive editor that asserted the Trump campaign in Russia had an overarching deal that the quid of help in the campaign against Hillary for the quo of a new pro-Russian foreign policy. That's what we call the Russia hoax, which was investigated for 3 years with taxpayer dollars before ultimately getting an exoneration in the Mueller report. It is inexcusable, the failed Russia reporting of the New York Times, and I think it's time that the New York Times and also the Washington Post hand back their Pulitzers.
Why hasn't the president condemned white power, Haley? Why hasn't he condemned that tweet?
And that was the White House news briefing in full right here on coronavirusnow.com. Welcome back, everyone, here on Fox 10 Extra and worldwide on coronavirusandnow.com. Taking a look here locally in the Valley, what we can expect on this 10-day Foxcast. A little bit different today, 97 degrees, not seeing that 107, 110 degrees like we were a little bit last week. But you can see that we have a, well, can't even say it's cool down. 97 degrees is still hot, but it's going to be windy today. Then you can see as we get closer to our holiday weekend, July 4th, going to be a hot 110 degrees, and next week looks pretty much the same there as well. Hi, everyone. Mike Pace here. Thank you so much for joining us here. We have a little bit more time on this 10 o'clock version of Fox 10 Extra. Let's show you just a little bit more going on right now. New York City, Mayor Bill de Blasio.
That's something everyone should be proud of. We had 180,000 fewer arrests in 2019 than the last year of the Bloomberg administration. By driving down unnecessary arrests, we're driving down incarceration. And of course, we're going to close Rikers Island and end that bad history. But there's still an outstanding issue, and it's solitary confinement, also known as punitive segregation. Look, we ended it already for young people, and New York City led the way in this nation in addressing the fact that we should not have young people in solitary confinement. We all remember the tragedy of Khalif Browder, and we acted on the lesson of that tragedy. He did not die in vain. But then we saw another tragedy recently, Layleen Polanco. Layleen Polanco should not have been in Rikers to begin with. Layleen Polanco should not have been in solitary confinement, and Lord knows she deserves justice. Her family deserves justice. The transgender community deserves justice. We have to right the wrong. We can't bring her back, but we can make change so that no one else goes through such a tragedy. There has been accountability. 17 correctional officers have been disciplined, 4 suspended without pay, and this is just the start of the disciplinary process. But we need to make changes immediately in how people who are incarcerated in our jail system are handled, and we need to make sure they are safe. So effective immediately, people with underlying medical conditions will not be subject to punitive segregation or solitary confinement. There already have been some prohibitions in place, for example, for serious mental illness or pregnancy. We're expanding the list. There's a list on your screen right now. Every medical condition you see on your screen would be a cause for a prohibition of any individual being put into solitary confinement. That's important. We're doing that literally starting today. But we have to go farther. So let's take the next step. Let's end solitary confinement altogether. We have proven that we can keep jails safe with much less use of solitary confinement, punitive segregation. Now, there's a lot to do because the jails are still not safe enough. Let me hasten to make the point. We have a lot to do to create more safety for people who are incarcerated and for our correction officers and employees alike. But we know there are ways we can do this without punitive segregation. So I'm appointing a 4-person working group, and they will get to work on a plan to end punitive segregation, to end solitary confinement in New York City once and for all. 4 members of the group will be the Vice Chair of the Board of Corrections, Stanley Richards, the Commissioner of Corrections, Cynthia Brand, the President of Just Leadership USA, Deanna Hoskins, and there will be a representative from the union that represents our corrections officers, COBA. This group will have a simple mission, a simple mandate: find a way to end solitary confinement and tell us all the things it's going to take, because it will take other measures and new approaches and innovations to keep everyone safe. I'm expecting a report back in the fall with whatever recommendations are there, and then we get to work on making it happen, because we can make this change in New York City. Now, I'm going to switch gears in a very big way. I want to go back to the health front. I want to go back to talking about the coronavirus, the issue that pervades everything we talk about. So we're going to go over the indicators in a moment, and the good news is our indicators, our health indicators, continue to be strong, continue to be positive. Phase 2 has been going very well in New York City. And that means as we see progress, we're able to do more and more things to help New Yorkers. And here's a nice one. We're going to be able to open up the barbecue areas in our parks for this coming weekend, for the July 4th weekend. So folks can enjoy barbecuing. I want everyone to remember to be safe, still practice the appropriate social distancing, still wear the face coverings, but it's time for barbecuing to come back in our parks, and they will be opened in the coming days for this weekend. And again, that's because of the hard work that so many of you have put in. The New York City story is pretty damn good when it comes to the comeback we're making from the coronavirus, the continued progress in fighting back the virus and keeping us healthy. The rest of the nation, I don't need to tell you, is looking more and more troubling. And that is causing us to think about each step we're taking and to examine what we're seeing from around the country. So a number of cities and states, unfortunately, have been moving in the wrong direction, and we do see a nexus to a particular problem. We all love indoor dining, but we also see problems related with indoor dining. So in East Lansing, Michigan recently, 85 patrons tested positive for the coronavirus, all linked back to a single restaurant. In Texas and Florida, we've obviously seen, it's gotten a lot of attention, record number of cases, clusters being tied back to bars and restaurants. California had made great progress. They're now unfortunately slipping back, and they are changing the rules regarding bars and restaurants. So we're paying attention to this lesson. My team spoke with the governor's team yesterday, said we're increasingly concerned. I know they are as well. We are now going to re-examine the indoor dining rules for phase 3. The rest of phase 3 is moving on pace for Monday, July 6th, this coming Monday. But the indoor dining element is now in question. We're going to work it through with the state, figure out how we want to approach it. If we want to pause that piece for a while or modify it, we'll have more to say in the next couple of days because we want restaurant owners to have that information right away. But the most important thing is to keep us healthy and safe and not allow a resurgence. So I've said all along, there'll be ups and downs, there'll be modifications. This is now, after steady progress, a point where we're saying, look, in this one piece, we may need to slow down and think it differently and approach it differently. But what is clearly working is outdoor dining. And I think the big message I keep getting, I've talked to our healthcare people about it, is outdoors is working across the board, meaning the disease does not spread anywhere as much outdoors. Face coverings are working. Outdoor dining is working. We want to double down on outdoor dining. So we talked about the outdoor dining that will start to open up on our open streets. Now we want to go farther with the open restaurants program. Now, right now we have 6,100 restaurants who have already applied and gotten that certification to go over just the last 2 weeks. So they can do the outdoor dining. It's been such a hit. It's been so positive. It's bringing people back to work. We want to go a lot farther with it. So we're going to reach out to every single restaurant that qualifies but has not yet applied and help them to apply. We're going to work with BIDS. We're going to work with the Hospitality Alliance, Chambers of Commerce, everyone. Let's get every restaurant into outdoor dining. Let's maximize their revenue, bring back their workforce, but keep it outdoors primarily while we figure out the indoor piece. We also want to remind all the restaurant owners, please, it's been a great success so far, but be careful with the outdoor dining areas along the street. There are specific rules of how to keep them safe and a specific approach you need to take to make sure there's separation from the traffic. We're going to send inspectors around and ambassadors around to talk it through and make sure restaurant owners really get that part right, because it's going great. People love it. It's super productive, but we have to keep it safe. Okay, let's talk about our indicators. Number one, daily number of people admitted to hospitals for suspected COVID-19. The threshold is 200. Today's report, 51. Daily number of people in health and hospitals ICUs, threshold of 375. Today's report, 297. And most important, percentage of people testing citywide were positive for COVID-19, threshold of 15%. Today, again, 2%. So we're holding at that number, which is really, really good. Quickly in Spanish, este presupuesto será el más difícil de nuestra administración, pero vamos a proteger la salud, seguridad, comida y vivienda de la ciudad. Vamos a seguir demostrando que la seguridad y la justicia van de la mano en esta ciudad. Y lo vamos a hacer todos mientras seguimos combatiendo al virus fase por fase. With that, we will turn to questions in the media. Please let me know the name and outlet of each journalist.
Hi, all. Just a reminder that on the phone today, we have Small Business Commissioner Doris, Chair of the Board of Correction, Jennifer Jones-Austin, and Senior Advisor, Dr. Jay Varma. With that, I will start with Marcia from CBS.
Good morning, Mr. Mayor. How are you on this day before the budget?
Day before the budget. Marcia, you and I have been through a lot of budgets together. I'm okay. How you doing?
Okay, so one of the questions I had was this. You apparently have struck out in Albany in terms of trying to get
Welcome, everyone, here on News Now, Fox 10 Extra and coronavirusnow.com. It is 11 o'clock here in Arizona, 2 o'clock for all our friends out on the East Coast. Live look right now at downtown Phoenix there in the distance as we get rolling here on the next hour on Fox 10 Extra. I'm your host, Mike Page. Thank you all so much for joining us here worldwide today. We always do appreciate you joining and bringing you the top updates from across the country during this COVID-19 pandemic. Let's show you right now the look of the Johns Hopkins numbers that we are seeing on the COVID-19 dashboard map. 2.5 million cases here in the U.S. Unfortunately, 125,000 deaths associated with it in this country. Now let's go out to Governor Andrew Cuomo out of New York, giving us an update on what he is seeing in the trend lines in New York.
Europe, that got hit first before us, we didn't know it, but the virus went from China to Europe, came to New York from Europe. That's why we had that big spike. But America now trails Europe in the recovery from coronavirus. The White House has been saying reopen fast because that's good for the economy. And we have to get the economy going. Yes, we have to get the economy going, but reopening fast was not good for the economy. What has been happening is when that virus spikes, the market goes down, not up. This was not a smart policy to rush reopening. It did not help the economy. It's the exact opposite. The volatility, the instability, the concern about the path of this nation has roiled the markets. And at the same time, from a public health point of view, the number of deaths is increasing. IHME, the model that the White House follows, just increased by 10,000 their death prediction, number of people who will die. Why? Because they're extrapolating out from the increase in infections and the increase in hospitalizations. The White House has been saying, well, it's up to the states, it's up to the states. But the president didn't really leave it up to the states. The president has been pressuring states to reopen quickly. Liberate your state, liberate New York, demonstrations that I've been dealing with all across the state, pressuring governors to reopen. The denial by the federal government of the severity of this virus was followed by the federal government's abandonment of responsibility. If you don't believe it's a problem, you don't try to find a solution. And that's what happened with the federal government and coronavirus. They never believed it was a problem, so they didn't believe they needed to solve it. The key barometer in all of this has been testing. Everybody said that from day one. Every federal official, every state official. Get the testing up. Get the testing ready. How many testing sites across America has the federal government set up and operated? 41. Well, is that a lot or a little? Well, for comparison, you know how many sites we have in the state of New York? 750. Federal government has put up 41 sites, FEMA and HHS, that they operate. How can that be? Because from day one, they told you they didn't believe it was a problem. They started day one, it's like the flu. If it's not a problem, you don't try to solve it. And they didn't try to solve it. And as a matter of fact, they have been advocating from day one, reopen the economy, reopen the economy. And now we see the results. It just plain hasn't worked, and it has been a failure. Will Rogers, when you find yourself in a hole, stop digging. Not a New York quote, but it's right. Where are we in New York? We've been smart. We didn't do this politically. We followed the facts. We followed the data, and it works. We have the lowest level of hospitalizations since this nightmare began, 853. Amen. We have the lowest 3-day average death total. We're down to 8 deaths yesterday. We remember the 8 in our thoughts and prayers, and we don't want to lose anyone in this state. But you look at where we are compared to where we have been. You remember at one time we had 800 deaths per day. Today we have 8. We do more testing than any state in the United States. We did 46,000 tests yesterday on a Sunday, and the infection rate was 0.8. When you're below 0.1, that's our goal. And 0.8 is lower than it was some points last week. You look at all the different regions, the numbers have been good all across the regions that are opening, going through phased reopenings. The numbers are all constant. You look at New York City. Within New York City, we study the boroughs because there's a wide variance in the infection rate. It tends to be worse in the outer boroughs, but you can follow that day by day, and that's good. We have a very elaborate tracing system so that when we find a positive case, we trace it back. That has been working very well because we have found traced back to clusters of cases. Westchester County graduation, where there was a young man who apparently came up from Florida and attended a graduation that generated 13 cases. There's an aluminum factory in Montgomery, 500 employees, 74 positives. Washington County, a slate quarry, 12 cases that we traced back. Oswego Apple Factory, 82 cases. This is actually good news. It means the system works. You find the positive, you trace it back, you find the common denominator, and that's how you stop the spread. You look at our curve compared to the rest of the country, you see the rest of the country is going up and we're going down. As we continue to test, we continue to trace, we have the data, we're continuing on our reopening plan. Phase 4 is ready for Western New York tomorrow, so we're excited about that. In New York City, we have complications that we are studying now. New York City is currently in phase 2. Phase 3 would begin on Monday. But there are issues that we have to think through. One is there's a lack of compliance with social distancing in New York City. You can see it in pictures. You can see it if you walk down the street. You can see the crowds in front of bars. You can see the crowds on street corners. It is undeniable. That is partially the responsibility of citizens not to do it. It's also the responsibility of the local governments to enforce compliance. We ask everyone to comply, but we ask the local governments to enforce the compliance. And I've said from the very outset of this to all the county executives, all the mayors across the state, look, the state is more than doing its part. The responsibility for the local governments, help with testing, help with tracing, but do the local compliance of the socially distanced and mask wearing. That is a complication in New York City. The other complication is the spread across the nation is also problematic for us. We are not a separate country, New York. Some people think we are, but we're really not. And we're not an island, right? People from the other states travel to New York, and New York is a hub. If other states have a high infection rate, probability is they're going to wind up increasing the spread and the infection in New York. We learned that the hard way. Why did New York have that big spike when we started? Why was New York so different from every other state? Because the virus came from Europe. When the federal government was telling us the virus was in China, it had left China, it went to Europe. We had 3 million people come in from flights from Europe, January, February, March. That's where the virus came from in New York. Likewise, we're bringing the rate down. Other states, it's going up. People get on planes in the other states, fly through New York, fly to New York. Probability is they're going to bring the infection. One of the issues we're working on in New York City, indoor dining has shown that it has been problematic, that a virus spreads in closed indoor areas that have air-conditioned systems. So we know that indoor dining has been problematic. Outdoor dining has worked very well all across the state, New York City included. The state's going to be reviewing the data and consulting with stakeholders in New York City. I've started speaking with restaurant owners, business owners about the risk-reward on indoor dining. We've been speaking with Controller Scott Stringer, who raises a lot of good points about the risk of indoor dining. The Speaker Corey Johnson, the same thing. The mayor, the same thing. So I'm talking to business owners about it. We're going through the data, but this is a real issue. Our reopenings have worked very well. We're not going backwards, we're going forwards. A lot of these other states actually have had to go backwards. They started to reopen and they had to stop. But we want to study this issue primarily New York City on indoor dining. And we'll have a final decision by Wednesday, so people who operate those types of businesses will know what we're doing. But the increasing viral spread across the nation is also a problem, especially in New York City. New York City is where most of the flights come. New York City is where most of the travelers come. We have offered help to any state that is experiencing a spike. We have personnel who know this better than anyone in the United States. We learned it the hard way. We have equipment. We have testing capacity. So any state that needs help, we stand ready. I will never forget how good this country was to New York when we needed help. And the door swings both ways in life. Relationships work both ways. When I asked for help, we had 30,000 people from across the country, healthcare professionals, who volunteered to come to New York. At our peak, I mean, that was an amazing sign of generosity. So we don't forget as New Yorkers, and we'll be there for other people. A few additional announcements. The Video Music Awards are going to be held Sunday, August 30th at Barclays Center. There are air filtration devices, air filters, that can actually help with the COVID virus. And NASA has studied these. There are HEPA filters, which are high-efficiency particulate air filters, that can actually filter out the COVID virus. The COVID virus is 0.1 microns. There are HEPA filters that can filter out 0.01. So any malls that will open in New York, large malls, we will make it mandatory that they have air filtration systems that can filter out the COVID virus. For many of these systems, it depends on what filter you install, called the MERV rating of the filter. But they have different filters that filter out different size particles. And they have filters that can actually filter out and catch the COVID virus. For large mall reopenings, which we haven't done yet, but we're going to make this mandatory. I would recommend, the state recommends, for all businesses and offices, they explore the potential for their air conditioning, air filtration system, adding a filter that can filter out the COVID virus. We have been looking at this issue because you look around the country and you're seeing malls, you're seeing air conditioning systems, indoor spaces that have been problematic. And we think this offers promise. Also, I'm a Queens boy, and I want to remind New Yorkers that fireworks are dangerous and fireworks are illegal. Fireworks are illegal. Some nights in New York City, it sounds like the Wild West with all the fireworks going off. I've never heard it like this before. They're disturbing, they bother people, and they are dangerous. And children, people get hurt every year. It is illegal. You can't do it. It is illegal. And the police department needs to enforce the law. But the state police are going to start a fireworks enforcement detail. We're going to try to prevent the fireworks from coming into the state in the first place before they get distributed. And I want to thank the state police, and the first deputy is here and the colonel is here. The primary supplier for New York State is the state of Pennsylvania. Not the state itself, but fireworks companies within the state of Pennsylvania. And we're going to be focusing on that route for the transmission of the fireworks. We'll also be helping local governments deal with this issue, but I need the local governments in this state to take it seriously. I know there's a lot going on a lot of levels, but this is illegal and it's dangerous, so we have to stop it. And to the president, because if we're going to turn this around in this nation, it's going to take the White House. And to the president, I say today, if you want to help stop COVID-19, then they should start telling the people of this country the truth. And this truth starts with how large a problem this is and how real a threat COVID is. It's the leadership to stand up and tell the American people, look at the increase across the country, look at what's happening to this country vis-a-vis other countries, look how it's hurt the economy. It is a real threat. And to start simply, the president can do two things. First, sign an executive order directing everyone to wear a mask. How we're at this point as a nation, and we still haven't done the simple, easy, minimal step of saying you must wear a mask when you are in public. And the president doesn't have to pass a piece of legislation, doesn't have to call the Congress. Just sign an executive order saying wear a mask. We did it 2 months ago in this state. The other states are just starting to do it now. States that were recalcitrant, governors who said, we don't need to do this, masks don't work, all the political nonsense we heard. Now they're doing a 180, and you have the same states now wearing masks. Let the president have the same sense and do that as an executive order. And then let the president lead by example, and let the president put a mask on it. Because we know it works. We've proven that it works in the state of New York. And the president can still be New York tough and New York smart and united and disciplined and loving. I want to show you one other thing. that makes the point. For a second. This come down or does it go up? This, do we know what this is? This is the mountain. What is the tallest mountain in the state of New York? Mount Marcy. This is the mountain that New Yorkers climbed. You know, I keep showing the curve. This is the curve. It's actually proportionate. We started on day 1, and the numbers kept going straight up for 42 days. 42 days, New Yorkers dealt with that increase. Why did we have the spike? How did we get to day 1? Because the virus came from Europe and nobody told us it was coming from Europe because the federal government didn't know. We dealt with it. We paid the price. And we dealt with that spike and we climbed right up the mountain. We got smart. New Yorkers stepped up. We wore masks. We socially distanced. We closed down. And we stopped the curve. We plateaued. You look at the projections, they all projected that this spike would continue killing tens of thousands more people. New Yorkers came together and they turned the curve. And then we plateaued on day 42, and then we had to reduce the infection rate, and that decline went from day 42 to day 111. This was the trajectory of COVID in our state. We don't want to climb this mountain again. We don't want to climb this mountain again. And that's why the phased reopening, staying smart, staying disciplined, and that's why the spread across the country, that if that spread comes to New York, we could have to do this all over again. That's why we put in place quarantines. That's why we're offering help to all the other states. That's why we're saying the president has to step up, because doing this once in life is enough. We don't need to climb another mountain. One mountain was enough. We don't want to climb a mountain range. One mountain is enough. We don't want to do it again. Questions?
Governor, several more states might be added to the quarantine in the next few days. Has there been any concrete data on how many out-of-state visitors are already subject to quarantine, or how many have perhaps even been fined for your executive order?
Let's just remember how the quarantine works. It does not name a state, any state. There's nothing to do with politics. There's nothing to do with I like Minnesota, I don't like California. It's an equation. It's a set of numbers. If your infection rate is above X, then when you come here, please quarantine, just because we don't want the infection to spread, and you don't want the infection to spread. I do not have numbers for you, Zach. We just put it in place, but as soon as we get numbers, I can get them to you.
Governor, the outbreak in Chappaqua, what's your level of concern about that outbreak? The school district there says they followed all the protocols and had them in place. The superintendent put out a message to the community saying, unfortunately at the event and despite police presence, numerous individuals failed to follow our protocols. So what is the takeaway from this experience?
Look, you know, there are certain facts that are undeniable. A mask only works if you wear it. It only works if you wear it. Socially distancing only works if you do it. And then there are two ends of the equation. I've asked New Yorkers numerous times to comply, and by the way, the compliance rate has been fantastic. It has been fantastic. You look around Manhattan, you go to any city in this state, I will bet you it's 95% of the people are wearing masks. And just think how extraordinary that is. No state is doing what New York is doing. California just went to masks as mandatory mask wearing a couple of weeks ago, literally. I think it was even last week. We were doing this 2 months ago. And this is a different kind of behavior. It was never done before. I laid out the facts to New Yorkers, and they did it. God bless them. God bless them. And they've saved lives. But 95%, it's the 5% who don't do it because, for whatever reason, social distancing, except the 5% who don't do it. Local governments need to do the enforcement. They need to do the compliance. I talk to mayors all day long, and I make this point. Well, compliance is difficult. Why? Well, because people don't like to wear masks, and then we have to tell them to do it, and they don't want to do it. I understand. Enforcement of compliance is difficult. But it's the law. And look, I said, blame me. It's my law. I'm guilty. Let the police go up to someone and say, I'm sorry, you have to wear your mask. It's not the mayor. Governor Cuomo says you have to wear the mask. Blame me. But they have to enforce the compliance because it only takes one. All these clusters, it was one person. 1 to 13, 1 to 80, 1 to 70. New Rochelle, Chappaqua in Westchester. We learned this lesson in Westchester. It was one person in New Rochelle. We had the first hotspot in the United States. One person led to hundreds of cases. One person. So 95% is great. Yeah, but one person in that 5% can infect dozens. That's why the local governments have to be diligent on the enforcement.
Governor, if any dining were
Luis?
not be allowed, is that something you're thinking about as being long-term, indefinite until there's a vaccine? Or would it be something maybe not allowed during phase 3, but maybe allowed during phase 4?
You know, Luis, it depends on the combination of factors. And again, nobody has been here before. So literally, this nation, this state, you're figuring it out as you go. My MO has been get all the information you can, study the other states, see what's happening, and then make a decision. It's not just indoor dining alone. It's indoor dining in New York City, where you already have issues with high congregations. You already have issues of people clearly violating social distancing. And you now have an added factor of viral spread all across the nation and a high likelihood that those people will come to New York City. It's that combination of facts that is precarious. And we don't have a decision. I want to take today, tomorrow, talk to everyone. We'll announce a decision on Wednesday. But all of these decisions are just for that period of time. You know, anyone who says, well, what's it going to look like in 2 weeks? What's it going to look like in 3 weeks? I wouldn't believe any of those answers. You have to look at what is the viral spread across the country, What's the viral spread in New York City? We trace it every day. But it would be all of these are short-term measures.
And in terms of the New York City budget, the state budget allowed the state government to borrow billions of dollars because of the emergency. It allowed the MTA to borrow billions of dollars because of the emergency. What's the difference between allowing New York City and the MTA or the state government to borrow billions of dollars because of the emergency?
Well, you have a couple of issues. First, any municipality in the state that runs into financial trouble, who pays if a municipality gets into trouble? The cities are created by the state, right? They're created by state law. If a city or a county runs into financial trouble, the state steps in. New York City went virtually bankrupt in the 70s. The state had to step in. Yonkers, a city in Westchester, was virtually bankrupt. The state had to step in. Nassau County was virtually bankrupt. The state had to step in. Erie County, where Buffalo's in Erie County, was virtually bankrupt. The state had to step in. So whatever you allow the municipality to do, the state is ultimately going to be financially responsible. So you allow a locality to borrow. If that is imprudent, then it's going to be a state liability. So the state borrowing, it's our responsibility and we would pay. A city borrowing, it's a state responsibility ultimately if it goes bad. What all these localities have to figure out, and what we're trying to figure out is, I want to borrow X. Well, how do you pay it back? And when do you pay it back? And what do you think the revenues are going to be next year? And what do you think the revenues are going to be the year after? And how fast do you think business activity is going to increase? How fast do you think businesses are going to be back at full capacity and residents are going to be back at full capacity? So it's a very complicated economic equation. And then you have the big question of what is the federal government going to do and how much are they going to provide? You want to make a point?
Yeah, if I could just add, the debt that the state allowed ourselves to take out during the budget was short-term debt. So when the federal government moved the tax filing date from April to July, it deferred billions and billions of dollars for New York. And so we took this out as a way to get through to July, because as a result, we had to move the state tax date. So this was a short-term situation for New York State, and we've committed to paying it back by the end of the fiscal year. So this is not talking about long-term, so we're talking apples and oranges. And on the MTA wasn't given carte blanche to do borrowing. They were given the ability to issue debt. However, it has to be approved by the New York State Budget Director and by the MTA board, and they have not issued any debt to date. So there was a backstop, and there's fiscal watchdogs who are going to make sure that anything that they do, that it's being done fiscally responsibly. So they're not similar situations.
Governor, around day 42, you talked about why we were so dependent on PPEs coming from Asia and China, and you charged the let's take care of it home. There's now concern that our prescription drugs also coming from Asia and from Japan. Have you had any conversations with any of your fellow governors along the Northeast region about seeing what we can do to address this problem forward?
Yeah, we have had conversations, but we didn't form a regional coalition yet on the drugs. You're right, it is an issue. We have done state purchasing. We have municipalities within the state where we do cooperative purchasing for the entire state. But you're right, it's a national problem where it's not just PPE, gowns, masks, et cetera. It's also the availability of pharmaceutical drugs, and it's something we're looking at.
Governor, more of the city economy is reopening every day. There are more and more workers who are worried that 24/7 subway service won't come back ever. It'll make their commutes worse. They'll be stranded late at night. Would you guarantee that full 24/7 subway service will come back?
Yeah, we always said that when we were stopping the subway service for several hours in the middle of the night, right? When you say 24/7, sounds like it's not a 7-day system. It operates 7 days. It's closed from like 1 a.m. to 5 a.m. Do you remember the hours? 1 a.m.
1
to
a.m. to
5.
5 a.m.
1 to 5. So yeah, it's closed in the middle of the night so they can disinfect trains. And as soon as we get past this and you don't have to disinfect a train, then we'll be in a different place. Also remember, you know, we're good at always seeing the downside, and there's been a lot of downside lately. If I said to a New Yorker, we've been arguing about cleaning the trains for decades, and the trains have been dirty for decades, right? Then it became a level of how dirty. If I told you that we were going to get to a point where we were going to disinfect the subway car. Now, to disinfect the subway car means every newspaper, every coffee cup, everything has to be out of that train. You can't have a napkin in that train. Homeless people have to be off the train. If I had told you that 10 months ago, you would have said impossible. It is impossible to do that in New York City. In my 62 years, I've never seen that, ever. And that's what we're now doing. Well, to disinfect trains, you have to close a couple of hours a night. Yeah.
But will they come back?
Yes. Yes. If you don't have to disinfect a train every night, then yes.
Governor, do you think that it's a possibility you would actually delay phase 3 for New York City? And you mentioned these complications being the enforcement in New York City of large gatherings. Are you saying Mayor de Blasio isn't doing enough? What should the NYPD and Mayor de Blasio be doing? There has been some controversy about how the NYPD was enforcing wearing a mask, not social distancing, et cetera. And then if you could also talk about the mountain behind you, how it was made.
I made it. I carved it myself. I'm a sculptor. Did you know? Yes, it's in the Italian. Yes, I am an artist. I've taken my artistic skills, where before I would just do drawings and some light painting. Now I've increased that to sculpting. I did it in my garage. It's made up of a blend of paper mache, cement, styrofoam, clay, and plaster. It's my own family recipe. My grandfather used to sculpt with it. None of that is true, by the way. But it is, sounded good, didn't it? Tell the truth. I almost had you for a second. I had you with that Italian sculpting thing. It's made out of styrofoam. But it is proportionate to the increase and the decline. That is proportionate. And I wanted to show, look, first of all, I wanted to show New Yorkers what we did, what they did, what they did. I did nothing. I wanted them to see what they did and remember what we went through and remember why we don't want to go back there again. And that is how I saw it through this whole thing. You know, I would show you guys a curve every day, right? It was a curve, and we would talk about a curve, flatten the curve. It felt to me like we were climbing a mountain. And you couldn't even see the top of the mountain because the top of the mountain was like in clouds. And nobody could tell you where the top was. So it's climbing up a mountain. Every day is hard. Every day is a steep incline. 40 deaths, 50 deaths, 10,000 cases. Every day is a difficult, hellish day. Well, how high is this mountain? How high do we have to climb? Nobody knows. The mountain is as high as you make it. What does that mean? The mountain goes up until you flatten the curve because you're designing the mountain by your actions. I mean, just think about how bizarre this was. So we climb up, 42 days, we're able to flatten the curve, we hit a plateau, and now we're coming down the other side. Well, how long is the descent? Nobody knows. It depends how New Yorkers react and how New Yorkers respond. And see, every line on that chart, that was a day. That was a day. That was a number of hospitalizations, a number of deaths, every day. And what we did today determined the number tomorrow. And we had to go through this not knowing where it ended. 400 people died today. Well, what's going to happen tomorrow? We don't know. We'll have to see. When does it stop? We don't know. We have to see. And New Yorkers climbed that mountain and they flattened that curve. The early projections from all the models, we had 18,000 people in hospitals. You know what the early models said? 120,000 people in hospitals. That's what the early models said. 120, 130, 140, 160. Well, how far can we get that down? Nobody knows. Depends on how you act. We went from 120,000 projected hospitalizations, 18,000. God bless the people of New York. I will never forget what they did. Literally saved tens of thousands of lives. Remember what we did, and we don't want to go back there. We don't want to go back there.
So would you delay potentially phase 3 in New York City? And what should the NYPD and Bill de Blasio be doing to enforce no mass gatherings, mask, wear your mask, etc.?
Yeah, I don't want to. We have been on schedule with the entire phased reopenings. And the other regions are all ahead of New York, right, in terms of reopening. And we've done the reopenings.
I think that they did a...
All right, everybody, we are now going out to Florida. Governor Ron DeSantis giving an update there.
At the same time, as the budget was coming due, we started to see the economic effects of the coronavirus pandemic, which has changed the trajectory of the nation's economy and obviously the economy here in Florida, and has, of course, affected the budget balances. And so as we were looking at the budget, my goal was to try to safeguard the historic achievements that we were able to do while also realizing historic savings so that we could put Florida on a more solid fiscal foundation. And so that's what we did over the last many weeks, going through a lot of different provisions of the budget. So the legislature approved.
Welcome back, everyone, here on Fox 10 Extra, coronavirusnow.com, taking a listen to Governor Ron DeSantis out of Florida as coronavirus cases surge in that state. Let's listen.
Level of reductions, this $92.2 billion approved budget provides significant support for education, the environment, infrastructure, child welfare, and more. And I would note that given Florida's population growth, it is a decline in per capita spending over last year's budgets. So while these actions total over $1 billion, roughly half of that is general revenue, half is trust fund balances. They will be set aside for whatever needs may arise in the coming year. Of the $1 billion in total vetoes, and I think this is important because everyone understands the circumstances have changed. When we did our budget back in the fall, we were operating under a certain set of assumptions. And we always knew that we could see an economic downturn, but I don't think we necessarily forecast the economy simply stopping for a time. So we were operating under a certain set of assumptions. The legislature was as well. As the reality changes, I think we all have to recognize that none of us are going to get everything that we want. And so I thought it was important that I was stepping up to the plate on that as well. So of the $1 billion in vetoes, over $550 million are vetoes that I included in my governor's recommendations in the fall. And this includes vetoing the $20 million Job Growth Grant Fund, which is a great tool for a governor to have to be able to use. Of course, once the coronavirus pandemic hit, I stopped spending money out of the balance previously, so that's about a $25 million reversion, and then we're vetoing the $20 million for this year, which is something that's important. I want it, but at the same time, sometimes things just need to be put on pause. So we anticipate nearly $800 million of funds reverted by state agencies for the current fiscal year, bringing total unallocated general revenues for the next fiscal year to $2.3 billion. Florida's reserves are also bolstered by the Budget Stabilization Fund, which is about $1.7 billion, the Lawton Child's Endowment Fund, about $800 million, and $1.5 billion in unallocated trust fund balances. So in total, Florida stands with $6.3 billion in total reserves, which we may need to absorb the revenue losses that we have experienced due to COVID-19, while also leaving the state ready to weather any storm that the economic recovery may throw our way going forward. And that, of course, does not include federal dollars from the Federal CARES Act, which we have also used and will continue to use. When I announced my budget at the beginning or at the end of 2019 for the 2020 year, we focused primarily on a couple things, one of which was teacher salaries. We wanted to take Florida from the bottom half of the country in average minimum salary to the top 5. It was not an easy fight. There was a lot of folks that didn't want to do that, and I'm just pleased to say that we were able to get $500 million to increase the average minimum salary in the state of Florida for K through 12 teachers, as well as including money for salary increases for teachers who are more seasoned and other eligible personnel. So we are now in the top 5 for average minimum salary, and I think that this is really a historic achievement. I want to thank the members of the legislature who supported this really key initiative. We also have other key initiatives regarding K through 12, workforce, higher education, all trying to prepare our students for the future. We do have the highest funding ever for K through 12 schools with an increase of $137 per student. $100 million for mental health programs in our schools, which is a $25 million increase over last year's funding, an additional $22.8 million for a total of $1.3 billion in state operating funds for Florida's colleges, and an additional $44.4 million for a total of $2.7 billion for Florida's universities. And we did not increase tuition, which I think is very, very important. Budget also maintains important funding for practical skills-based education opportunities, including workforce initiatives and computer science education, $10 million to cover the cost of training and to provide bonuses to teachers who hold educator certificates or industry certifications in computer science, $10 million for the pathways to career opportunities.
All right, everybody, we are switching gears, taking now out to a live briefing from New Jersey. The governor there speaking now.
And he had the pleasure of working alongside his son Joe, with whom I had the great honor of speaking yesterday, for 16 of those years. He is being remembered as a hardworking family man and one of the truly nice guys, and a man who remained young at heart, riding motorcycles till he was 70 years old and playing games on his phone, rooting for the Yankees, God willing they'll play again, and listening to music and very often singing along with it. Lewis is now reunited with his beloved late life Carmela, who he lost to cancer 12 years ago. And he leaves behind his children, Lewis, Joe, I spoke with Joe yesterday, and Lisa, and their spouses, grandchildren, Ashley, Benjamin, Carrie, Christopher, Gina, Frank, and Alyssa, and 5 great-grandchildren. He's also survived by his sisters, Connie, Annette, Gilda, and Eleanor, and numerous nieces and nephews. He will not be forgotten. Lewis, we thank you for your career of service to our nation, the township of Bloomfield. May God bless you and watch over you and your family. So, as we remember 3 extraordinary lives lost, Carlos, Maria, and Lewis, and as we remember all who we have lost, may we also be reminded of why we cannot let up in fighting this virus in every way we know how, by social distancing, by washing our hands frequently with soap and water or using hand sanitizer, by wearing something over our face. Tomorrow we will remember more of those who we have lost, and we'll do so again the day after tomorrow. And just remember, the face covering doesn't do you any good if it's not covering both your nose and your mouth. A face covering is how you protect others, especially if you are asymptomatic and have not gotten tested. I cannot put it any other way. This war is not over. We are still fighting, and right now we cannot fall into complacency. In fact, keeping up the fight is even more important now to prevent us from backsliding. Over 3 months, we showed that we can work together for the common good. No state has done better than New Jersey. For 3 months, we have pulled together as one New Jersey family, first to flatten the curve and then to bend it down. We cannot let up. We must continue to drive it into the ground. We cannot think that because it is the other states that are now facing what we were facing a few weeks ago, that we're in the clear. We have to keep pulling together. We have to keep up with our common sense practices. Someone last week tweeted at me the following, and I quote the tweet, "At first I hated you for everything you put in place due to the virus, but after suffering a death in my family, I just want to thank you for everything you have."
And we are back here on Fox 10 Extra, taking a live listen right now. The governor of New Jersey giving an update.
Don't have to go through what Julie has gone through in losing not just one, but both of her parents. And if we can prevent just one more family from having to live through the grief of losing someone from COVID-19, especially now that we know what we need to do to protect our loved ones, our friends, and our communities, then it will, in the final analysis, be worth it. So keep it up. We will win this. We will win this together. And as I turn things over to Judy, folks are born and folks die in the state, actually, as we've mentioned on many occasions, in completely unrelated to COVID-19. And I want to give a shout out to my late friend Al Iverson, who died over the weekend in Montclair, New Jersey, to Rosemary and his family. He was a giant, and our thoughts, hearts, and prayers are with you. With that, please help me welcome the woman who needs no introduction, the Commissioner of the Department of Health, Judy Persichilli.
Thank you, Governor, and good afternoon. In late March, as COVID-19 cases continued to increase in our state, the department issued guidance allowing expectant mothers to have one support person alongside them during this life-changing event. This individual could be the patient's spouse, partner, sibling, or another person she chose, but it was limited to one person. Recognizing the role of doulas as an essential part of an expectant mother's care team, today the department is issuing an executive directive exempting doulas from limits on support persons throughout the woman's hospital stay. Doulas support healthy pregnancies by providing culturally appropriate social and emotional support to pregnant women throughout their prenatal period, labor and delivery, as well as their postpartum period. Research demonstrates that support from a doula is associated with lower cesarean section rates, fewer obstetric interventions, fewer complications, and the improved health of mothers and babies after delivery. Support persons and doulas will be screened for symptoms and undergo temperature checks prior to entering the clinical area and every 12 hours following. Once in the labor and delivery unit, they will be extremely limited and will not have access to other areas of the hospital. Additionally, all pregnant patients must be tested for COVID-19 when they present at the facility or prior to admission for labor and delivery. As many of you know, doulas have long been engaged to support women during pregnancy, delivery, and postpartum. They have been integral to the administration's effort to increase outreach, support, and services to women, particularly of color, to improve health and birth outcomes. And more importantly, they are an essential source of comfort and strength for a mom-to-be and her partner. With this new directive, expectant mothers will have additional physical and emotional support at what can be a joyful but also a stressful time. Moving on to my daily report, as the governor shared, our hospitals reported 978 hospitalizations of COVID-19 patients, with 225 individuals in critical care, and 82% of those patients are on ventilators. Fortunately, there were no new reports of multisystem inflammatory syndrome in children since Friday, so the total remains at 47 cases in our state. The children affected have either tested positive for active COVID-19 or had antibody tests that were positive. The governor reviewed the new cases and deaths reported today. In terms of deaths, the breakdown of deaths by race and ethnicity is as follows: white 54.1%, black 18.8%, Hispanic 20.3%, Asian 5.6%, and other 1.7%. At the veteran homes, the numbers remain the same, and at our state psychiatric hospitals, among a census of 1,240, one additional patient has tested positive. The daily percent positivity as of June 25th overall in New Jersey is 1.92%. The northern part of the state, 1.46%, central 1.95%, and the southern part of the state, 3.53%. So that concludes my daily statistical report. Stay connected, stay safe, stay healthy, and get tested. Thank you.
Judy, thank you, and great news on doulas, so hats off to you and the team. With that, let's turn to Colonel Pat Callahan for anything he's got on his docket. Pat, as always, thanks for being here and for your leadership.
Thank you, Governor. Good afternoon. With regard to compliance over the weekend, the same gym in Linden was cited twice for an EO violation. As I had said last week, Linden Police Department and local health officials would be monitoring that gym. The gym owner voluntarily remained closed and locked up today, which we were happy to report. On a separate note, I'm glad to report that Trooper Sierra from that wicked dump truck accident on the turnpike was discharged over the weekend and is recovering at home, doing well, and that's all I got, Gov.
Amazing. God bless that guy. I had, as I mentioned, a great conversation with him, so please give him our best. Perhaps he'll be running next spring's 5K with you and me and the Attorney General if we get back to running races. Matt, we're going to start over here. Before we do, we will be together at 1 o'clock, Dan Bryan tells me tomorrow. And we'll be with you this week, unless you hear otherwise. My guess is we'll be moving it around a little bit, at least on Wednesday in terms of timing. A couple of things I wanted to say that are somewhat in Judy's lane and somewhat, Pat, in your lane. First of all, I've been asked this question about asking folks, strongly advising folks to self-quarantine and get tested if they've been in a hot spot. Is that some kind of retaliation? It has literally, it's never occurred to us. It's never come up in our conversations. Again, repeat, we have lived through hell in the state to get to where we are of the rates of transmission and spot positivities. Everything we do is to keep that progress up. And so this is simply, frankly, I never thought I'd say these words. If I could build a wall around us or around our region, I would. But we can't, and so we have to rely on personal responsibility and the right behavior, the common sense for the common good. And by the way, we do nothing but pray and root for the states. I don't care what their political stripe is. There are states right now that are going through hell, the same hell that we went through, and they have nothing but our prayers and support that they're able to do the right things and get through this as quickly as possible. It is pretty clear, some things we've talked about now for weeks, it's pretty clear it's not just the case in New Jersey, it's the case everywhere. Outdoors is an easier mark than indoors. Social distancing actually matters. Staying away from everybody else if you don't feel well matters. Getting yourself tested, particularly when you have capacity as we do, matters. Wearing face coverings really makes a difference, particularly for those around you. Washing with soap and water. Those are basic precepts that have been proven time and time and time again to be the foundations for a healthier, a better public health reality, which, as we've said, leads to a better and stronger economic health reality, and it's in that order. And what those states are going through is no different than what we've gone through. We were going to show up and name and shame a couple of places, and we decided not to, but we will do that probably sooner than later. Even when you're outdoors, Judy and Pat, you can't have situations, and again, I'm not going to name them, but there are bars, and we all know them, even outdoors, where people are packed on top of each other. That's not the spirit, folks. That's not what we're asking for. Keep your distance. And by the way, too few face coverings, I have to say. Keep away from each other and keep your face covered. There's no political statement you're making. You're making a statement that you're smart and you're doing your part to deal with this. And whenever it is that we get inside, we had a very robust discussion as we made the decision this morning to delay indoor dining. It's also important that whenever we get to that we have the indoor bar configured properly. I think, Judy, you made the point, frankly, that's as big a risk on the inside as the indoor dining piece. If anything, maybe even a slightly bigger risk because your ability to social distance is more limited. And so we want to make this perfectly clear. Whenever it is we do go inside, the bar is there exclusively to serve drinks to people who are seated at a table. It's not there to congregate in the bar whenever it is we get there. We know that inside is dangerous and hard and challenging, including indoor dining, sadly, but even more challenging and more dangerous is congregating at an indoor bar on top of each other. We just can't let that happen. So I wanted to make sure I got those points out there. With that, Elise, we'll start with you. Good afternoon.
Hi, good afternoon. Questions on two topics. Are casinos still going to reopen on July 2nd as planned? And regarding the furloughs agreement, in explainers posted to its website, the union said the coronavirus crisis was more disastrous than the Great Recession and would last for longer, and yet it told members that they won't have to, quote, sacrifice as much as they did in 2009. The union also said it won a no layoffs agreement through December 2021, quote, no matter what happens with the economy. Is this a fair burden and risk for taxpayers? Have you boxed yourself in on labor costs if the economy takes another hit in the next 18 months? Thank you.
Elise, on casinos, if I didn't say this already, I meant to. Casinos will open on limited capacity on July 2nd. And let me just sit on that for a minute. Matt Plakins joined us. He can hit the second question. I've not seen the posting, so I will defer on that if I could. But by the way, I think we should all be prepared for this thing to come back. So this is not a forever and always. I hope it is, by the way, a spot positivity rate of 1.92, but I'm fearful it isn't. We have made a decision, and I feel, as much as it brings me no joy, I feel comfortable in the distinction that actually sitting, sedentary, close proximity, even with social distancing, ventilation as it is indoors, and by definition not being able to wear one of these over your face is a game changer. And if you look at the other inside things that we're allowing to go forward, a casino, library, museum, to pick three, face coverings are absolutely mandatory, required, and you don't have quite, if not nearly the same sedentary, close proximity reality that you do with indoor dining. Again, accepting that I've not seen the post, and that I will just say to you, we're not out of the woods yet. I'll ask Matt to comment if he could. Matt, welcome.
Thanks, Gov. I haven't seen the post either, so I can't respond to the specifics said there. What I would say is we worked very hard with the union to structure this agreement such that we could take advantage of the CARES Act supplemental unemployment benefits, which expire at the end of the month. That's something that wasn't in effect in 2009. So in that sense, it's true. The deal does have more days in terms of total furlough days than they had in 2009. I think it's also important to note that we have 10,000 fewer employees today than we did in 2009. And as we're going through some very complex furlough plans in light of the agreement, the operational impacts of this are not easy to manage, but obviously the departments are doing the best they can under the circumstances.
Thank you. Thank you. Nikita, good afternoon.
Good afternoon, Governor. So I have a couple of questions. First off, I thought that you'd like to know that your ballot has reached the Monmouth County Board of Elections. But despite that, we're still getting problems with computer glitches and other delays associated with processing ballots. We're told that the backlog in some places for processing ballot applications is now as long as 4 or 5 days, with clerks literally under the gun at this point. Is your confidence still high in this regard? Is it acceptable if voters receive their ballot after July 7th? And would you be open to using FedEx or some other private firm that can guarantee next day delivery if you come basically down under the wire? And will you order state and county election officials to work on July 3rd and 4th if they need to get ballots out of the door? And then the Motor Vehicle Commission says they are unaware of problems related to voter registration. Now, I don't know that you would know why members of the Natural Law Party, which has been defunct for 16 years, saw their registration jump from 296 to more than 7,000. But if you have a guess, I would love to hear it. And then finally,
let's make this your last one if you could.
Yeah, this is the last one.
Unless you have a PowerPoint presentation, in which case I'll come around and sit out there and watch it for you.
So Monmouth and Princeton dropped Woodrow Wilson's name from a couple of their buildings and their schools, and you stopped using his desk. I'm wondering, do you think that there should be a discussion about Rutgers possibly renaming itself because Henry Rucker was a slave owner?
I was going to ask whether or not you're going to give me credit for having swapped my desk out, but you were made aware of that, I assume, through your colleague. I'm glad to hear my ballot made it. That's good news. Further proof that I voted. Again, I've got no observations on the specifics of the glitches or delays. I don't know that FedEx is going to be involved, and I have not made any decision on making people work on July 3rd and 4th. So I don't have any crisp answers. But if you do have specifics, as we've said to many of you folks, if you know something we don't know, bless you, get the information to us, and I promise you we'll follow up on it. Were you connecting the motor vehicles with the party that you referred to? Sorry,
So my understanding and our understanding is that there's some sort of glitch with voter registration at the MVC when it gathers data when people get a new license or what have you. Through that process somehow, we're not sure of the specifics, but
okay.
People are being registered to parties that don't.
To that party. Okay.
That party and others that are similarly defunct.
We're going to have to follow up. Dan, will you help me out there? I've got literally no insight on this. I applaud Princeton in all seriousness. I did swap out my desk at the end of the week, and Princeton renamed its School of International Affairs over the weekend, and I applaud them for doing that. I think we've had this conversation before on Wilson, on Columbus. I've not been asked the question on Rutgers, so that's something I'm not going to speak to specifically, but it seems to me we ought to be able to get to a better place if there are symbols, statues, names that somehow separate us as a society, somehow offend people. And slave ownership has got to be on that list. Bigoted, racist behavior has got to be on that list. And as I mentioned with Columbus, I don't see any reason why we can't, on the one side, if the statue offends folks, that we can't address that, and at the same time still feel great pride in our Italian-American heritage and find other ways to celebrate that. So I'll come back to you on Rutgers. I've not ever been asked that question, but that's a general sort of precept for me, a general frame would be that. Thank you. Dave, nice haircut.
Thank you, Governor. Joanne gets the credit for that.
Okay.
Let's see here. Is there concern that the pause for indoor dining could actually crush many of the restaurants that are in this industry? I know that they've talked a lot about, barely hanging on. They were looking forward to this. Obviously, there are concerns, and you've made a decision here, but what will it take to green light indoor dining? specifically less knucklehead behavior, less sloppiness? How are we going to measure this? And do you think this would be days or weeks? And then last topic for question here, now that the CWA deal has been done, can you give us details about specifically how much money does this save the state budget in the short term? Are the savings worth the concession of agreeing not to lay off workers through the end of 2021? And what is the state's understanding of the layoffs portion of the agreement? I guess this is similar to the question that was asked previously by Elise, but at the time where, you know, we don't really know what's going to happen with the economy, is there a concern that by guaranteeing nobody's going to get laid off, that this puts an unfair burden on the private industry? And finally, are you concerned about having workers furloughed over the next 4 weeks or so, right at the same time when many agencies like the MVC are reopening? Thank you.
I'll start, Dave, and ask Matt to come in and join me. Am I concerned about the livelihood, the viability of the hospitality industry? Absolutely. Period. I have a bigger concern about people getting sick inside establishments, reigniting a wave, and then devastating both those establishments as well as our economy. So we haven't put the sign up lately. Public health creates economic health, but sometimes that sucks, and this is one of those moments where you'd love to be able to have it both ways. We just don't feel that we can take that step responsibly, and I think Judy and Pat and the rest of us, Tina, would agree. What are we looking for? Well, the things that have really concerned us, Judy's seen, without getting into where, but Judy's given us some data on rates of transmission that have been spiking in this region outside of New Jersey based on indoor activities, indoor dining. The raging in other states in the country right now, and the prospect that could come back in here through the back door. We have seen our RT bump up, basically sitting at around 0.7 plus or minus, and then for the past week and a half, mid to high 0.8s. You can almost extrapolate that was going to go up another bit, and it gets over 1 at that point. I haven't said this in a while. Paul Mulshine asked me this probably now 6 or 8 weeks ago. But if you look at the models that Judy and Tina and their team follows, at any moment in time, making a decision to shut down or to keep shut down, and seeing the implications of that 2 weeks later versus taking a step to open up and looking at the different reality in terms of transmission is dramatic. So I don't think it's a matter of days, but it's a matter of weeks. And again, we have enormous sympathy, but the alternative here is worse and unacceptable. Matt, could you comment on anything related to Dave's questions about the savings are, we think, north of $100 million, and that's meaningful, and we need every penny of that. Beyond that, any color?
Yeah, I think I addressed some of it earlier, Dave. With respect to the operational impacts in the next month, it's obviously a challenge. The departments are working intensely to put together plans to minimize the operational impacts, and we are hopeful that we'll be able to manage it through the next month. And we think this is a fair deal for the state, and we think it's a fair deal for the workers of the state, who are also residents of the state overwhelmingly. So it represents a culmination of a long negotiation, and like I said, I think it produces substantial savings for the state and a fair deal for all parties involved.
By the way, it is not as though we sit here with a smorgasbord of happy choices on a lot of these decisions, so thank you. Sir, do you have anything? You good? Okay. We good? You're good? Matt? Matt down here? Sorry, you were good, sir, right? Yes. Okay. Hey, Matt.
Hi, Governor. On Friday, the largest hospital chain in the state relaxed its visitation policy. Hackensack Meridian Health allows one visitor at a time. Curious if the state authorized this or provided any guidance on how visits should resume. Governor, with the caution on graduations that you just gave, are you considering backing off the 500-person limit for July 6th for outdoor gatherings? Curious what sort of crackdown, if any, could any of these violators of the restaurants, outdoor dining expect? And how does hitting pause on indoor dining affect weddings and banquet halls? Is there any effect there? And just lastly, Governor, I'm curious, have you at any time eaten inside a restaurant since you signed an executive order that would prohibit indoor dining?
Hold on. Sorry, on indoor dining. Okay. Judy, you want to take number one, Hackensack allowing visitors?
Yeah, I think it was the EO 145 did identify, along with elective surgeries, visitation requirements, which allows a visitor. We did just recently discussed at the department that there seemed to be some confusion because it was embedded in another guidance, so we may put out something individually just for visitation, hopefully this week.
Indoor dining is, Matt, connected with, sadly, with banquet halls. That was one question you asked. Other than me eating indoors, which I'm going to jump on with both feet in a second, but you had something else in there?
It was about you giving the caution on graduations. Do you have any reservations about the 500-person limit coming up for outdoor gatherings?
We're not changing that at this point. And again, those are outdoors. And we're asking, and folks have there was one school district that was trying to do otherwise, but for the most part, people have been overwhelmingly good about that. Beginning July 6th, so a week from today, and the limits were, at least as of this moment, we're comfortable with, but again, it's outdoors, social distancing, etc. Not only have I not eaten indoors, other than in my house, but I just want to talk about the irresponsibility of, not your question, because I'm thrilled you asked it, the irresponsibility of folks sending a post around like that, and then elected leaders actually tagging onto that and talking about hypocrisy. First of all, not only did I eat outside with my wife, daughter, and her friend on Saturday night, we sat in the driving rain, and I ruined everything in my pockets, including my wallet that I've been holding on to for many years. In fact, I can show you there's not much in it, but this is a brand new wallet as of today. I tried to salvage my wallet over the weekend. It was not salvageable. But here's where I've got a thick skin, or you wouldn't be, you wouldn't be in this line of business. So I have no issue as it relates to me, but here's where I have the issue. So if someone out there implies that, hey, even he's doing this, so that means you can do it. If one person gets infected as a result of that, or if one person goes to the hospital as a result of that, or God forbid, as Julia has lived through, someone's life is lost as a result of that because they know that that's not true, that's blood on their hands, man. I don't know how you can live with yourself. So folks, I would just say this, I don't care if you agree with me on politics. I don't really care what you think of me personally. I think you probably know that by now. This is for the greater good, everybody. This is to behave responsibly, to do the right thing. Okay, so forget about the cheap shots. Don't do something if there's an implication, if there's an unintended consequence that somebody could get sick as a result, because that would be really bad and really stupid. So Matt, thank you for asking that. Dustin, good afternoon.
Good afternoon. Well, you signed the Senate President and NJEA bill that offers teachers new health insurance plans and is expected to save hundreds of millions of dollars a year, and as well as the bill that passed today for police departments to share internal affairs and personnel files. On voting, county clerks have told us they weren't ready for an all-male election and hope that if you make the decision that November will be all-male, you'll make that call in the next few weeks. Can you comment on that? And then as far as the Woodrow Wilson stuff goes, can you just explain how you made that decision and the timing of it with the desk? Woodrow Wilson's racist views and policies have been pretty well known for years. And how do you square that gesture of getting rid of the desk and something like marching in the Black Lives Matter protests, with plans to cut funding for anti-bias training and other programs at the core of the national movement for racial justice. Thanks.
Thank you. I won't comment on the specific bills, but if the first bill is Chapter 78 reform, which I think it is that the first one you asked about? It's something conceptually I've said for 5, 6, 7 years, maybe longer, that conceptually we're behind. And transparency, we're big believers in. I think Pat's been a leader on that, but again, I'll leave those as a general comment. I believe I understood the question here. We won't make a decision on what November looks like until we have a good look at what July 7th looked like. So there's no decisions there made at all, and you're probably not surprised by that. We want to see how we do here, and not just make that call on July 8th either, to Nikita's questions over the past couple of weeks, to really have a chance to do a postmortem. As you all know, we've extended, or as you may recall, the amount of time between postmarking on the date of election and when you can count the ballot, which is now a week. That's up from 3 days. Listen, I think the country is having a reckoning, and Woodrow Wilson and his legacy is being swept up in that, as it should be. And so I actually have been going to work forgetting, honestly, that the plaque is on the front of the desk that says it was his desk. A desk is a desk. And I thought it was very responsibly raised. And as soon as I could get a replacement, which was not as easy as I thought, I got one, and I think that was the right thing to do. And I remain honored that I marched in both Hillside and attended the vigil in Westfield. The battlefield right now is strewn with mandates and programs that we can't fund. And it's across the entire spectrum of things that we hold dear, including some of the examples that you laid out. We just don't have the money. And so we need the Senate to move forward on allowing us to borrow, and that's where the focus should be right now. The Assembly has done that. I applaud them. There has been, I think there's decent progress with the Senate, but we got to see, we got to see it actually happen, and it needs to happen soon, because it's going to take us a while, just by nature of the federal program, to go through the process to actually bond and raise that money. And then it's not either or. We also are going to need direct federal cash assistance, and that need is going up and not down. And you're starting to see the narrative melt away, not surprisingly, that this was a legacy state issue or a northeastern state issue or a blue state issue. It's an American issue, and it's a smart thing to do from every perspective, both political parties, et cetera. And we need both. And if we get both, we'll be able to fund those programs. So we're ready. We want to fund them. There's a whole range of programs that we're desperately hoping to get back to be able to fund and put up in the up and running, but without the ability from the Senate to borrow, or the Congress and the White House to give us a bill that has direct cash assistance, we won't be able to do that, and that breaks my heart. It shouldn't be that way. So I'm going to have a quick sip and mask up Judy's, all right? I want to thank Judy and Tina for not just being here today, but for everything. Pat likewise, Jared, Matt, Dan, the whole squad. Julia, it's an honor to meet you like this. I hope that at some point, once this passes, as I mentioned to you on the phone yesterday, we have the chance to meet with our families. But it's an honor to meet you, and God bless your mom and dad, and thank you for Sherry for coming along with her. Don't you work for the state police? Yeah, that's what I thought. So you get the boss here to my left. But God bless you, and again, God bless your mom and dad. To each and every one of you, thank you for everything you're doing. Please bear with us. This is not, you don't take decisions like the one we took today on indoor dining easily. One thing I didn't say, other than getting completely, when I say soaking wet, I mean soaking wet on Saturday night. Mother Nature's been generally good, and I'll tell you what's been really good is that municipalities have worked with restaurants really creatively to allow much bigger footprints, whether it's in parking lots, sidewalks, between buildings. Do it safely, by the way, that's important. But the footprints of outdoor dining have been really creative and have grown dramatically. And increasingly you're seeing some more over the top here, which is great. So let's keep that up, folks. That can hopefully offset some of the pain that preventing us to get on the inside as soon as we would like. But no state's done what we've done, and to each and every one of you out there, it's all on you. You've been extraordinary. But we can't let up. We're seeing Arizona, Florida, Texas, parts of California, South Carolina, Oklahoma. Keep them in your prayers. Keep vigilant. Let's make sure that doesn't reemerge here. Keep doing the right thing as you have been doing. God bless you all.
Capacity absorb this. And I just want, again, to take a moment. All of these months when we did the stay-at-home order, we didn't sit on our hands. We worked aggressively not only to engage with our county health officials, as I noted at the top of my remarks, but also to engage them with purpose and intention, and that is to really assess what our needs are in this state to work our way through the first wave of this pandemic. And remember, we're in the first wave, and then to prepare for a second wave, which many experts believe will come later into the fall. That included making sure we had a healthcare delivery system that included alternative care sites, included hospital beds, and plans, protocols, and procedures to significantly increase our capacity within and around the system, not only in terms of physical capacity, but also human capacity. We had this team referred to as the Health Corps. We identified personnel and appropriate protective gear and worked to really build out a robust framework for our planning purposes. In this slide, you'll see reflected our current capacity as it relates to hospital beds in the state, just shy of 75,000 hospital beds in the state of California, 73,867 to be precise. And by the way, that number changes on any given day for a myriad of different reasons. We currently have, you saw from the previous slide, represented 4,776 individuals that are COVID-19 positive cases. So that represents about 7% of the total hospital system capacity. Also referenced on this slide is the total number of admitted patients, just across the spectrum of patients that are in the hospital system, which is currently about 58% of total capacity. So you get a sense here, 30+ thousand or so bed capacity that we have in this state, just within the hospital system alone. In addition to this, we have the protocols, plannings, and the processes that we are able to turn on these alternative, we call FMS sites, these federal medical station sites, and these other alternative care sites, which we've talked about over the course of the last many months that we have procured and identified all up and down the state. Seton Hospital in Daly City as one example, the Arco Arena, Sleep Train Arena up here in Sacramento. All of these are examples of those alternative care sites that have now capacity and we could turn them on in pretty short order. ICU admissions, again, we focus on positivity rate. We focus on hospitalizations. We also focus on ICU admissions. You can see, not surprisingly, hospitalizations went up 43%, ICUs tracking with about 37% increase over the course of the last few weeks. You'll see on this slide that represents about 13% of the entire ICU capacity in the state of California, though currently a lot of ICU beds are being utilized for non-COVID-19 patients. If you just look at the total number of beds available today as a snapshot, we are utilizing about 39% of that capacity of available beds are represented rather in the total number of COVID-19 patient cohort. If I confused you, let me step back and say that again. total number of ICU positive patients versus the total number of ICU beds in the state is 13% are now COVID positive of our ICU capacities. But of the available ICU beds, roughly 39% have been absorbed because of COVID-19 positive patients. So it gives you a sense of the capacity we have in our system that will allow us to work our way through and manage the increase in the transmission of this virus, including, by the way, the ventilators that are available today, over 11,577 ventilators that are available today for use as part of our critical care capacity. So numbers are going up, but our ability to manage and absorb also is significant. And so I just want to, for the purposes of full disclosure, tell you the challenges, but also tell you what we have done to meet those challenges head on, in addition to try to mitigate the spread so that you see less blue on this pie chart and more orange moving forward. As it relates again to the approach, I'll repeat, it is a dimmer switch. Diverse cities, diverse counties, different parts of the state experiencing different challenges for different reasons. Let me, well, in a moment, Dr. Galley will come up and explain, rather than me, what those different reasons are. You may see increases in certain counties, maybe primarily because of spread that exists, for example, in a state prison. Other parts of the state in a federal prison, and that increases the total number of cases in a county. Others have more generic community spread, which is just people mixing and not, in every case, wearing face coverings and not practicing the social distancing. Each county, different conditions. So when you look at the numbers, you have to get in under the hood on why those numbers are increasing. And again, that's the approach. There's a more sophisticated approach than we have time to express or explain here today. But approach is a dimmer switch, and that approach is different in each county. Final words from me until I ask Dr. Galley to come back up. As I've said on multiple occasions, we monitor daily, county by county, the conditions on this dashboard, and we're making that dashboard public. We announced last week some of the efforts to truly be as transparent as we possibly can be in terms of our modeling approaches and in terms of providing you real-time look at where your county, where your community may be. So we're actively monitoring all 58 counties in the state of California, but we're now targeting our monitoring in 19 counties. And by the way, when we went into the weekend, on Sunday, we had 15 counties we were monitoring. We added 4 more counties today. We added Solano County, we added Merced County, we added Orange County, and we added Glenn County to the targeted engagement list. So now we're 19 counties, and Dr. Galley will attest, now that represents about 72% of the population in the state of California. 72% of the population represented in 19 counties that have targeted engagement with our state health officials. And as you see from the slide reference here, again, 7 of those counties, we are now adopting this dimmer in terms of their reopening. But with that, let me now bring up Dr. Galley to explain this slide in terms of what local conditions mean and how they drive our response. And I'll come back up, finish up, and, of course, answer any questions. Dr. Galley?
Thank you, Governor. Good afternoon. I wanted to remind you a bit about how we are looking at our support and work with various counties around ensuring that their epidemiology, that is really just to say the data that we're watching closely around cases and availability of things like hospitalizations and limited hospital capacity in order to ensure that counties have the level of support they need to manage spread, and then to think about, as the governor discussed, the ability to further dim or go back with certain sectors. So just to remind you, we're watching closely elevated disease transmission. So what does that mean? That we want no more than 25 cases per 100,000 people in a county reported as a case over a 14-day period. We're also looking at a test positivity rate less than 8% over the 14-day period. So as the governor is discussing the overall climb across the state, from the mid 4% to the mid 5% over 14 days of test positivity, we're looking at that county by county as well. We also want to know that we have increasing hospitalization or have enough space in our hospitals. So watching very closely each county's census, that is the number of people with COVID positive diagnoses in hospital beds. So ensuring that that 3-day overall average of the number of COVID positive hospitalized patients is no more than 10%, signifying when it crosses that 10% threshold that day over day, many, many more COVID positive patients are needing hospitalizations. And then connected to that is ultimately our ability to care for people in the hospitals. When we see less than 20% of ICU beds are available in a county, or that less than 25% of the total ventilators a county has are available, we get concerned. And that's what helps us look at counties and basically places them on the county monitoring list so we can begin that targeted engagement. As the governor said, in California, a state this size with this many people, we're really experiencing COVID-19 in quite different ways across the state. Sort of looking at 3 different counties, starting in the north with Sacramento County, where we are here. With our close work with Sacramento County leaders, they have identified that family gatherings, getting together with family members, maybe outside, probably inside, not following some of the guidance around face coverings, staying socially distanced, likely led to outbreaks within families that led to the rise in cases and then the rise in hospitalizations that we're seeing in Sacramento County. An over 40% rise in hospitalizations over 3 days in Sacramento County alone. Moving further south to San Bernardino County, a different story. This one due to local jail outbreaks, SNFs, skilled nursing facility outbreaks, as well as community spread. This sort of hybrid scenario in San Bernardino has had that county experience quite a significant rise in cases. And then looking at Imperial County again, we sent entire team of senior leaders down again this weekend to augment that ongoing work that the governor highlighted last Friday of the engagement with Imperial County, and really looking closely not just at the border with Mexico, but also the border with Arizona, understanding how factories and farms play into disease transmission, and then how that spills over into community transmission, similar to what we see in Sacramento County within households and at family gatherings. So again, emphasizing that each county, each part of the state needs a different solution to getting control of COVID-19 spread. And our team at the state, working closely with officials at the county level, are crafting those solutions and determining what can be done in advance to recommending and even requiring moving back. To continue on that theme, we look at this in 3 progressive areas in terms of enforcement and effective community action. We're looking to help support counties in stabilizing their data as the first category. This is emphasizing education and public awareness, ensuring that our messaging is reaching those populations that are experiencing the highest rates, those most vulnerable, and then looking to pause any further new sector opening. Once a county moves to the next level of concern, we start doing things like you saw over the weekend, right? Closing a specific sector, looking at what sort of additional technical assistance and support we can provide a county, looking at those sectors that close, understanding what they might do differently when they reopen again, and then establishing strike teams at the state, not only in Health and Human Services through the Department of Public Health, but inviting a wide array of agencies and departments to support those counties in improving those conditions so we can avoid moving into what we think is the alarming rate of spread, where we, of course, continue all of the things we were doing initially, but then we look very closely with elected officials, health officers, at considering requiring a return to stay-at-home order. And the only county so far, as a result of the really high rates of test positivity, the number of patients and people we were moving out of the local hospital system into the regional and statewide hospital system out of Imperial, we're asking them to return to the stay-at-home order today. So with that, I'm going to turn it back over to the governor. Thank you.
Thank you, Dr. Galley. So bottom line, and we've reinforced this on many, many occasions, there's different transmission dynamics that persist and exist in every part of the state. What Dr. Galley was referring to as it relates to that differentiation is also a recognition that the critical need to mitigate this transmission also requires enforcement. And it is incumbent upon all of us to do what we can to lead by example as individuals by wearing face coverings when we can't practice physical distancing, social distancing, but also as business leaders to protect not only your workers, but to protect your customers. We will be stepping up our enforcement in the state of California. There's many mechanisms to which you can enforce. At a state level, there's some tools. At the local level, there are even more tools. Again, locally, that enforcement is driven by decisions, the county health officers, by elected representatives. At the state level, we made comments last week, and I'll reinforce them here today, in relationship to the budget that I'll be signing later this afternoon that stipulates $2.5 billion of COVID-19 related and realignment related dollars to the counties that will stipulate certification as it relates to capacity to enforce these health orders. It is incumbent upon all of us in the state of California to take seriously these rules and these regulations and to enforce them. And I want to just encourage our partners, and they have been incredible partners up and down the state of California, to do justice and to help us mitigate the spread and the transmission of COVID-19 by enforcing these rules and regulations, not punitively. Again, it's not a ready, fire, aim approach. It's a ready, aim, fire, meaning we want to work with people and be responsive and responsible to help support their needs, particularly small businesses. I deeply understand that, intimately understand that as a former small business person. Help educate on the rules and procedures, but moreover, remind people. We put out over 30 sectoral guidelines in the state of California that lay out how to safely reopen. We've been so fixated, and I cannot impress upon folks this point more. We've been so fixated on the when, not as responsibly focused on the how to safely reopen. 30-plus sectoral guidelines we put out. We worked with industry to put out procedures and processes so we can safely, health and safety, a framework of focus to reopen the economy in a way that can mitigate the spread. If people are flaunting those rules and regulations or disregarding or throwing out those guidelines, we want to continue to work with our county officials and local officials to help us enforce that. So we put aside this $2.5 billion of state money in this budget to encourage and inspire more enlightened health behavior, enforcement behavior to help advantage the health and safety of the population in the state of California. And also, we have regulatory and code capacity to enforce, and OSHA and others in particular have a unique history and unique capacity to enforce. Any small business person been on the receiving end of some of those notices know exactly what I mean. Again, I don't want to do this in a punitive mindset, but we have to keep people safe, because what we don't want to see happen is a few bad apples that are flaunting and exploiting the situation and making the rest of the industry, making some of their competitors look bad. And so we've got to, I think, do more to be more responsible individually and within sectors of our economy. And so we've got the tools, capacity, to do more effective community enforcement. And again, we're going to be doing just that. Let me just briefly just mention a few other things that are top of mind. It certainly were deep focus over the last many months, but primarily in the last few weeks. There's been an increase in the number of cases in certain prisons in our prison system in the state of California. You may recall a few months ago I brought up some concerns around Lancaster Prison, Chino Prison, some other prisons in the state of California where we saw an early outbreak of COVID-19. In many of those prisons, we were able to mitigate the spread, and we've seen a diminution in terms of total number of inmates that are currently positive and total number of staff members as well. The entire CDCR system, the California Correctional System, has 2,589 individuals that have tested positive, inmates that have tested positive, just shy of 2,600. One prison in particular is of concern, it's generating appropriate level of interest, as it should, and that's San Quentin. In San Quentin, we currently have 1,011 individual inmates that have tested positive. And by the way, those are numbers that came in this morning. People are being tested in real time. Test results are coming back in real time. So that's a dynamic number. So entire system, about 2,600 people. Remember, you've got about 113,000 prisoners, 113,000 inmates, rather, in our correctional system. We currently have about 2,600 that have tested positive for COVID-19, but 1,011 have tested positive just in San Quentin. And so that is our deep area of focus and concern right now. A number of months ago, did a number of things that got a little attention, perhaps you may not be so familiar with it, to quote-unquote decompress the system, meaning to provide space and provide more flexibility within our correctional facilities to allow people to more safely move about and to mitigate the spread of this virus. From the intake center that we capped for a period of time to changing the way we were doing transfers between the prisons, obvious concern about transferring someone that may be tested positive, and that's exactly what looks like occurred at San Quentin. I'll get to that in a moment. But we did that in addition to looking at people with sentences that were almost concluded. And we looked at those sentences within 180 or so days, and we said, look, you're going to be released in 180 days. Those of you that have real plans, those of you that have a place to go, those of you that can connect with our system, probation parole system, and have actual plans in place, we're going to move you forward a little bit sooner. And we did that for a cohort, what we refer to as non-nons and non-sex offenders, meaning it's a criteria to screen out those that are the highest risk if they are released. But again, these were sentences that were already being concluded. Roughly 3,500 people went out of that system in a very orderly way along those lines a number of months ago. We are working with many advocates in the courts and others. We have identified an additional cohort of over 3,500 additional prisoners working through a similar process. And accordingly, and not surprisingly, looking at the medical conditions of many of our prisoners, those that are most medically vulnerable. And I said this a few days ago when talking about San Quentin last week, that San Quentin has about 42% of its prison population that is deemed medically vulnerable. For many different reasons, that's the case. So it's a large percentage of the total number of prisoners in San Quentin that are in this area of concern. That said, we are working to work through the medical screening and move people as quickly as we can, but as safely and, more importantly, responsibly as we can. Let me be specific about that. We have 110 individuals that we've identified for that protocol and early release within 180 days, non-nons, non-sex offenders that we have screened. The challenge is only 40 of them have a place to go. And so the question is, do you make a bad situation worse by releasing someone that's not ready to be released because they don't have a place to stay? They don't have a place to go. They don't have plans in place. It's not an excuse, quite the contrary. It's an imperative that we work to keep our inmates safe and our staff safe in these correctional facilities. And I just want folks to know we are working overtime to do just that. I'm pleased and I'm very grateful. Members of the California legislature will be doing an oversight hearing, and we'll be talking a lot more in the next few days about the details and strategies and plans. But it's just an example of some of the work we have to do and some of the concerns we continue to have as it relates to the spread of this disease. Different settings, different criteria, different conditions, different challenges that present themselves on a daily and a weekly basis. So we are monitoring, not just monitoring that situation, we are actualizing plans to move people, and we are doing it as responsibly as we humanly possibly can. And I just want folks to know, advocates for urgency, to know your voices are being heard, for family members or loved ones in those facilities, to know your voices are being heard, and know that we are committed to meeting our responsibilities within CDCR, and moreover, as we release prisoners, the impact that will have outside of our system as well. So I just wanted to highlight that, update you a little bit on San Quentin. Broader overview about the dimmer switch, broader overview on some of the progress we have made in the state and some of the concerns that continue to persist throughout the state of California. I'll just end as I tend to on a daily, weekly, monthly, it seems like most of 2020, with this following. Please wash your hands, practice the hygiene that we know can mitigate the spread of this disease. Please physically distance when you can. When you are out and about and you're coming across people in lines or out on the street, just do your best to keep that safe distance. And where you can't, where you now must, please wear a face covering, a face mask. It is incumbent upon all of us to take advantage of this non-pharmaceutical intervention that can truly mitigate the spread of the disease, that can help keep you safe, that can keep other people safe, and then, more importantly, also sends a message that we're not out of this by any stretch of the imagination. We still are in phase one, or rather first wave of this pandemic, and we have a lot more work to do. Final point, by the way, point of personal privilege, because it's important. We have been very successful in the state. Close to 250 million masks now are in our inventory. In fact, in excess of 250 million masks are now in the state inventory. Hundreds of millions we want to get out in the next weeks and months. We've sent out tens of millions of masks, N95 masks, not just procedure masks and surgical masks. I just want folks to know we have been blessed with receiving this unprecedented inventory in the last few weeks, and so much so, I've mentioned this on a few occasions, we've sent 17 million of those masks to other states to help support their efforts as well. And so we announced on Friday that we're going to be distributing for free masks within sectors as we reopen our economy. Part of reopening the economy safely is having face coverings for workers and encouraging face coverings for customers. We are providing free masks as well. And so when we talk about a mandate, we also are mindful of our responsibility to help support people when we do mandate something, and working with our manufacturing industry, working with retail, grocers, working with farm workers and other representatives across the spectrum. We are distributing millions and millions of masks. In fact, 35 million masks were just sent into 3 sectors of our economy. We announced that on Friday. Tens of millions more will be forthcoming. With that, look forward to any forthcoming questions you may have.
Patrick Healy, NBCLA.
Guy Marzorati, KQED.
Thanks,
Governor. I'm wondering if the state is considering any changes to its policy around transferring inmates between prisons in the state, and also wondering if you agree with some of the calls from some North Bay local and state representatives for the federal courts to replace the federal receiver overseeing medical care.
Yeah, no, as I mentioned just a moment ago, we have already mitigated the transfers within the system going back a number of months. There was, unfortunately, there was a cohort of prisoners that were transferred from Chino Prison. It looks and it appears to be the case. Again, we're still getting through the complete investigation, so I want to have that as a caveat of consideration for people run with it, though it's been reported there was a transfer from Chino into San Quentin that unfortunately was tested but was transferred and nonetheless turned out to be positive. The receiver, and the question you're asking, just to explain it to others that may be watching, wondering what a receiver is and what you're even referring to. A number of years ago in the state of California, because the incapacity for this state to address the medical needs of its inmates, the federal government intervened. This goes back a number of administrations, many, many years ago, and basically took over the function of the health care delivery within our prison system. And the receiver, in this case, was instilled, who makes those determinations, makes those decisions. But to be fair, makes those decisions and determinations in partnership with many different players. So I'm not of the opinion that some are about the individual receiver at this stage. This is an incredibly daunting and challenging responsibility, and we're just uncovering in real time an understanding of what specifically happened regarding that transfer from Chino to San Quentin. But nonetheless, one thing lacks, any ambiguity whatsoever, and that is over 1,000 prisoners have already tested positive in San Quentin prison. And we have formalized strategies and plans, including the prospect of using Seton Hospital, one of our alternative care facility sites, if we have to transfer many, many patients into the hospital system from San Quentin. So all those processes and protocols are being put into place, have been put into place, and are being worked on in real time. Again, we'll be making announcements probably on a daily basis, not just a weekly basis, as it relates to further efforts in this space.
Alexi Kosif, SF Chronicle.
Hi, Governor. The unemployment rate in California remains higher than nearly every other state in the country. And I'm wondering if you think this is a reflection of California's, slow efforts to work through the backlog of unemployment claims at EDD, or if there's other unique circumstances that that make the economic recovery here slower and more challenging.
Yeah, I don't think it's in relationship to the frame of your question. I think it's foundational. In the state of California, we tend to do better in the good times, tend to do a little bit worse in the bad times as it relates to the macro economy. California was experiencing 100-plus days ago record low unemployment, 121, I believe, consecutive months, 119 or 121 consecutive months of net job creation, bond rating, the highest it had been in 2 decades, and enjoying record reserves and enjoying, once again, a significant and sizable surplus, which we estimate at the time roughly $6 billion. The budget I'll be signing later this afternoon addresses a $54.3 billion shortfall and also deals with the reality, as you correctly state, 16.3% unemployment rate in the state of California. So we're doing everything in our power with our economic workforce, or rather economic recovery and workforce development task force with some of the best and the brightest minds in small business and more broadly social justice and industry with just depth of experience, their perspective, their leadership demonstrable in this 100 individual cohort of leaders to help guide us to an economic development, economic and workforce development and recovery plan. And so we are committed to that. We're resolved to that. We were very pleased. I'll be pleased to sign a budget today that helps, it waives the costs associated with incorporating as a new business startup for the next year, provides tens of millions of dollars of additional small grants and loans to loans to small businesses, many that fall through the cracks that don't get SBA support or the PPP support and the like. We have a lot of work to do, but I'm very confident in our resiliency, our capacity to recover as a state.
KPBS.
Governor, why just close bars? You mentioned they were areas of concern. Through contact tracing, are you finding that bars are areas where a lot of people are contracting the virus? And then in terms of Imperial County, I know their stay-at-home order is still in place. How do you want them to be more restrictive, and does that tie back to enforcement?
Yeah, I mean, at the end of the day, look, the local electeds will make a formal decision. We want to give them cover making the right decision. If they don't, we will enforce the decision to pull back and have a stay-at-home order. And that's done on the basis of working very collaboratively, and as I said, including this weekend where 3 cabinet secretaries went down, including Dr. Angel herself, went down and visited with their health officer, their CAO, which is their city administrator, had really robust conversations, very positive conversations about how we can help support their efforts and mitigate spread. As you know, for weeks and weeks now, we've been providing other tenets of support, but we believe working with their health officials that pulling back to the stay-at-home order is advisable at this moment in order, again, to mitigate the spread of this disease, to help support some stabilization in their hospital system, as well as address their positivity rate, which I noted in the state over a 14-day period, it's 5.5%, 23% as of last week in Imperial County. So that's an example of collaboration, partnership, support, technical assistance, and resources. Look, as it relates to bars, what we did is we reached out to state health officials all up and down the state. They made a number of comments about what they're seeing in their communities as it relates to spread. We talked about community spread in some areas where that was most self-evident, most problematic. Other issues related to congregate facilities, I referenced prisons a moment ago, others as it relates to still challenges they have in senior and adult daycare facilities. We also heard a lot of consternation and concern from health officials about family gatherings. I mentioned that a moment ago, and that's just people letting their guard down, bringing up Uncle Bob, Aunt Susie over, and all the cousins over. And while you start with all the best intention, maybe people show up with their masks. They immediately put the mask down in order to have a drink, eat some food, and all of a sudden, cousins get a little closer. The kids are jumping on top of you. Aunt Susie's now pulling you off, and then makes a mistake to kiss you goodbye and says, "Oh, I didn't mean to kiss you goodbye." You know, all the normalcy of life, love, family, relationships, and you let your guard down, and we're seeing a lot of that, and that's a point of real concern from the health officials, specific to your question. And bars were referenced by a number of people, and no one's naive. Look at some of the images. My phone is filled with images of people taking photos of some of the bars over the weekend saying, how could this help with community spread? It's only going to make things worse, not better. You're in a bar, you're moving around, you're drinking, your mask's off, you're close to other people. We're seeing that in other countries. You saw, for example, in South Korea, some infamous examples in South Korea as they were making real progress. They had to pull back on bars and nightclubs, which they were specifically able to track. So our health officials, county health officials, identified all of these areas as hot spots. Again, each county is different. Each county is seeing something different. But in the aggregate, based upon that feedback, based upon evidence of spread, based upon the concerns, we went forward with these 15 counties where we have mandated and or advised the closure of these bars.
Taryn Luna, LA Times.
Governor, the requirement on bar closures allows bars to remain open if they serve food, which we know many do. It also allows bars to contract with food trucks or other food vendors to remain open. So if someone wants to go out and drink in public, they still can, as long as they order a plate of fries with their alcohol. So what practical effect does this have on preventing the spread of the virus?
Well, I'm going to have Dr. Galley answer that. I know a thing or two about this business, as you know well, and so You're describing exceptions, not the rule, and to the extent we expect compliance and we expect better behavior and that we are committed to enforcing compliance, as I've been very clear moving forward, I think we can mitigate the stress and that concern. But Dr. Galley, who's very familiar with LA County in particular, and moreover, in relationship to this guidance that he helped draft, can answer more specifically.
Thank you, Governor, and thank you for the question. We looked closely early on at restaurants that also serve alcohol and then bars as different, bars being places where primarily you are there to drink alcohol. We are targeting this intervention around the bar closure at the second group, bars, where food is not the primary driver of the business. In those locations where you might have a restaurant with a bar where you can sit down and not just have a drink but order food, this does not apply in the same way. So we tried to clarify in that guidance. And again, we are seeing as the result of these actions and our data whether further steps need to be taken across the state in certain counties, and we will be in constant contact with our county partners to understand how this might impact what they're seeing and experiencing in their communities and how this plays out in their data. So just to clarify again, that bars where primarily alcohol is consumed, you may be able to order some food there, but that is not the primary purpose for gathering or being a patron at that location, versus restaurants where you're primarily there ordering food. You may do that at the, quote, restaurant bar, have a drink as well. Those are different in how we handled it in this guidance.
And Dr. Galley's point in this guidance, let me be forthright with you. We are considering a number of other things to advance, and we will be making those public as conditions change, and we will make public at, we believe, the appropriate time based upon our feedback and engagement with local health officers. So what Dr. Galley was saying, this is a dynamic process, not a static one, and changing environment, changing conditions, changing data will present itself a new set of facts that will allow us to process those facts, make some determinations as it relates to augmenting the orders and advancing perhaps even more restrictive ones as may be necessary.
Kathleen Ronayne, AP.
Hi, Governor. Back to bars. So I understand the point that you're making that counties each have their own sort of unique circumstances, but it sounds like we made the decision to close bars not because we're tracing outbreaks there, but because they are public health officials consider them to be the highest risk spaces. So if we know they're high risk spaces, why aren't we closing them statewide? And then secondly, some advocates today called for relatives to be able to visit loved ones in nursing home facilities if they follow appropriate safety protocols. They say that people in these facilities are literally dying from isolation. So what needs to happen to allow the resumption of visits in nursing homes?
Yeah, no, a perfect opportunity. Dr. Galley's been working on that issue as well. Let me look, as it relates to factors across the state. I began this presentation, I'll end it, by making the point that there are different dynamics that play out differently in different parts of the state. And so based upon the data, based upon the dashboard we put out, based upon the criteria Dr. Galley referenced today, the criteria of 14 days on this watch list, 3 to 14 days where we have concern, we will process 19 counties representing 72% of the state population. We are now advising related to the bar closures or mandating, as is the case in those 6 counties plus Imperial, the 7th. But certainly your point is operable, but only when the data bears out that we should advance it. With that, let me ask Dr. Galley to talk about skilled nursing facilities and the issue of spending time with loved ones, particularly near the end of life.
Thank you, Governor, and thank you for the timely question. Happy to report that on Friday, we had an all-facility letter go out through CDPH giving guidance on exactly how visitation in skilled nursing facilities can occur in a lower risk way. We recognize the need and frankly, the demand of loved ones to be able to not just visit, but participate in the care and nourishment of those family members in skilled nursing facilities. This has always been an asset to the facilities, the families, and the residents to continue on the road to better and improved health and happiness. And over the period of COVID, the last few months, we know it has been very hard to see that diminished and altogether forbidden while we try to contain spread. We do feel like we're at a point where it can be done in a safer way. So that is the purpose of having that facility guidance out. And I hope that over the days and weeks to come, that in a lower risk way, that we can begin to provide visitation to certain family members to not just see loved ones, but to support the care that they need. Next question.
Final question, Lucas Albert, Wall Street Journal.
Hi, Governor. It's a two-part question. One is, for a county to kind of come on the radar of state health officials for a higher level of positivity percentage, what is that percentage that sort of is crossing the threshold? And the second part is specifically related to LA County. The decision to open bars, which I believe was on June 19th, the week prior to that, the positivity rate was 12%. And similarly, when you opened restaurants there, positivity rate was 13%. Was that too high? Did things move too quickly in that county, perhaps?
Yeah, so this is an opportunity to go back to the slide regarding local conditions driving our response and what the criteria in terms of elevated disease transmission, hospitalizations, limited hospital capacity. Dr. Galley can walk back through this slide and ways of directly answering your question. Doctor?
Again, thank you, Governor, and thank you for the question. I'll just remind you that we have, from the beginning of the county monitoring process, coupled with the attestation process for counties to declare that they have both the level of epidemiologic data that is in good shape, plus the preparedness information around PPE, hospital capacity, testing, contact tracing, that together counties were in a position to decide when to move forward. The state had given clear guidance on the how. In the case of any county that gets onto the county monitoring list, I want to say that being on the county monitoring list also brings with it additional attention and focus, additional assistance, some additional resources and services at the state level, and really galvanizes the response at the county level in order to try to stay in front of and make sure that spread does not increase so rapidly. In the case of Los Angeles County, they were one of the later counties to be able to attest, in part because of their initial level of transmission, as well as the need to take some time to create that preparedness that we know is essential. Since that time, obviously across the state, we have seen an increasing number of cases, and we expect that at those local conversations between health officers, health departments, local leaders, they're making the decision to move forward with certain sectors. Our decision this weekend to look closely at those counties that have been on the county monitoring list for at least 14 days, requiring that they close the bars, is a move to be focused on those areas where we know spread or transmission is not only increased but sustained, and looking at high-risk areas where mixing is frequent, contact tracing is difficult, such as bars, as places to not just take a pause but to move backwards so we can stay in front as much as possible of transmission of COVID-19, not just in those counties and across the states. We have learned with Imperial County that not only is the hospital system in the county important, but the regional and statewide system to support increased increases is equally important. So that look at county by county has implications statewide, and we will continue to look at it not just at the county level, not just at the regional level, but statewide in order to make and support good decisions at the local level and the state level.
And it's just an important point Dr. Galley's making, and you heard this almost become a mantra. When we put out guidelines, it does not mean go. When we put out sectoral guidelines, it's a document that says how we believe you can responsibly and safely reopen. It absolutely does not attach to when. There is some sense and perhaps a little ambiguity in terms of some of the reporting that I've read out there, that the state makes that determination. You just heard Dr. Galley express to the contrary. Local county health officers with their county elected officials make that determination as to when they are prepared to safely reopen. We provide the technical assistance through this attestation process of what we expect in terms of the criteria. We post that criteria, and then we monitor progress towards the stated goals. As Dr. Galley said, and I got to give them a lot of credit, that local health officials, county and LA's own Mayor Garcetti were very, very focused. As a consequence, did not move as quickly as other counties to the attestation process or as quickly through the phases as other parts of the state. I just want to acknowledge that because I have great respect for local decision-making on the front end and recognize the deep responsibility we all have to monitor and not be complacent at the same time, to provide supports as we continue to do to those that need those supports. So with that, I just want to thank all of you for supporting the cause of giving us this chance to update you on where we are relates to this pandemic. I will remind everyone the imperative and importance of individual decision-making, and the sum total of those decisions will determine the fate and future of the spread of this disease. Please practice physical distancing. Please, when you are in cohorts mixing with strangers, people that are not part of your household, please wear a face covering. It's a mandate in the state of California. No sign of weakness, only sign of strength, wearing a face covering. And also know, from that perspective, we want to strengthen our resolve, and that's why we have applied this dimmer switch to certain sectors within our economy, and certainly will hold out that if we do not see a mitigation of the spread, that we'll consider to doing more. With that, I also want folks to know we have a lot more work to do on contact tracing, in addition to providing the kind of supports to these cities and counties. And I want to just preview that in a couple days we'll be updating you on our stated goals July 1st on our contact tracing, give you a sense of where counties are, how our platform is operating, how robust and effective our training protocols have been, and what cohort we have up and running. And so just know that that will be forthcoming in the next day or two. And we're trying to figure out exactly when that presentation comes out based upon all the other challenges that we are facing as a state. So with that, thank you all, as always. And let's do our best to mitigate the spread. We'll get through this, and we'll come out stronger than ever. But that amount of stress and anxiety will be determined on our ability to meet this moment head on by wearing face coverings. Take care, everybody.
Getting more details from the governor there of California as they talk about handling their surge of cases that they've been having. Also, we just wanted to mention here in Arizona, we did also see a surge in these last few weeks, and our governor is going to be addressing that later this afternoon. We're just under 2 hours away from that press conference that's supposed to be happening 3 p.m. Arizona time, so we are going to be carrying that right here on our live stream, but also on our Facebook page and on fox10phoenix.com. While Newsom was wrapping things up, we did have Connecticut getting things started, giving updates on their COVID-19 response. So we're going to jump into from the beginning and go listen to what the governor and officials have to say about Connecticut's numbers. Remember, he just was part of a joint press conference last week with the governors of New Jersey and New York as well, talking about some of those restrictions from people from other states traveling to their state. So we'll be interested to hear what they have to say about their current numbers and more details on that travel restrictions that they do have in place. So once again, going to head out to Connecticut right here for you on Fox.
Going on around the rest of the country. The next slide, I think, is one you've seen before. It just goes to show that the total hospitalizations are going down. And as I've implied before, you look around the rest of the country, there are 4 states where the numbers are going up. There are 4 states where over half of all the new infections in the country are in Florida and Texas and Arizona and California. And there are a lot of reasons for that, one of which may have been how they did their reopening. The red lines here you see on our total hospitalization slide is indicative because they tell you from the peak back on April 22nd, our total hospitalization's gone down. Since we first started our major reopening on May 20th, our numbers continue to go down. That's because we reopened carefully. We only reopened when our metrics are headed in the right direction. The next slide is just a way to tell you a couple things. One, I told you our hospitalizations are now down at 99, under 100. But that is now the number is so low, you can't count on that number continuing to go down. You can see that the number of people being hospitalized, the admissions line, that in yellow, we get this out every couple of weeks, has been going down, but more or less flattish over the last couple of weeks. Most of our improvement in terms of net hospitalizations, because the number of discharges has gone from, 80 or 90 back on May 30th down to whatever that is, 20 or so right now. And that number is continuing to go less as we have fewer and fewer people hospitalized. One of the things we had confidence in was really important for our whole reopening was to make sure we had plenty of capacity in our hospitals in case there was another surge, the likes of which we're seeing in a number of those southern states right now. And right now, we do have plenty of capacity. I think our ICUs, our intensive care units, are maybe 50, 60% occupied. So we have plenty of good capacity there. One of the things we've thought about is, as you look at those highly infected states where the hospitalizations are going up, not just the positivity rate, what's going on there? Because we thought these were younger people, and because they're younger people, they're much less likely to be hospitalized. But we had our meeting with Vice President Pence today and the rest of the COVID task force, and it did point out because so many more young people are testing positive, we now have a bigger cohort of them who are obese, diabetes, have pre-existing conditions. So now you even have some younger people going into the hospital. So don't stay on your guard when it comes to this. And by the way, now the number of seniors in these other states is being hospitalized is going up as well. I tell you all this because I'm paid to worry. I also tell you this because I said early on in this pandemic, you hope for the best, but we plan for the worst. And we look what's going on in particular those 4 southern states. But as they said in the Pence task force today, remember, Ohio is ramping up, Wisconsin, parts of Wisconsin are ramping up. So it's not simply related to just those southern states. What went on in those big 4 southern states? Why at risk? 1, perhaps they opened a little early. 2, they are beginning to close down now. You'll see that Texas has said, 1, they're going to close down all the bars that have been open for a month. Well, as you know, Connecticut never opened up its bars. Sorry about that, but I think it was a good move. 2, they're reducing their restaurant capacity back down to 50%. Ours is at 50% right now, and strongly recommend if you can get an outdoor seating, that's where you want to be. I was interested that for the first time, Texas said in any municipality that requires it, you must wear a mask when you're inside. This is something that Connecticut has done from the beginning, made sure that if you can't socially distance and you're not outside, you must wear that mask. And so I'd like to think that a lot of these other states are coming to where we've settled on, which has kept our positivity rate much lower than it is in other parts of the country. And again, a special shout out to our neighbors, our neighboring states who have also been maintaining what they got to do. And I do get anxious because there's a very narrow margin for error. And when I hear the governor of Arizona say in just 2 weeks, our positivity rate went from 4% to 14%. That's the hockey stick. It reminds you of what risk there is. You know, last week we announced that we were going to team with New Jersey and New York in terms of a quarantine. We didn't want a lot of people flying in from those highly infected states. I think that was the right move. I was reminded looking at Chappaqua, New York, right across the border from southern Connecticut, where a young high school senior was celebrating in Florida, came back to her graduation, and before you could say it, there were 4 people infected, then more than that infected, and they had to track and trace and what stores they went into. So it just reminds you there's a very narrow margin for error, and thank goodness to date Connecticut has been on the right side of that. What else? I can tell you that also in the task force, they pointed out the number of layoffs. State and local government, 585,000 people have been laid off from state and local government across the country in the month of May alone. And that's why it's so important, as we pointed out, again, all the governors, bipartisan, red and blue states, give us some certainty in terms of what we can expect in terms of aid to states and localities, what we can expect in terms of testing, what we can expect so that Miguel knows exactly the budget he has, so that teachers know how they can get back to school safely. And one thing the Vice President pointed out was we are making some innovations in terms of testing as well. And this I'll leave you with because it's something that Connecticut has been working on since March. It's the wastewater surveillance as a leading indicator. That is, we're able to take some samples from the wastewater and test that, and you can get a broad indication of what's going on in New Haven, for example. As one of the WAGs said in the meeting today, the wastewater surveillance test has passed the smell test. And what that means is we'll be able to do that type of a testing analysis in nursing homes, universities, and we're going to roll it out to all of our municipalities. And by doing a test out of that wastewater, we'll have an indication, 5 days plus of what you can expect in terms of hospitalizations. So far, so good on that. That plus overall pooling, where they take a group of tests and put them in one and do that batch. So even though we're not doing 100,000 tests, we've done about 50,000 tests in the last week. Due to methodologies like this, we'll be able to see what the community spread is by community a lot more aggressively. And for that, we're very thankful. I think, with that, let me just open it up to questions. As I said before, Paul and Josh, and Miguel is here to answer any questions. Miguel Cordona, we rolled out formally our 50-page report on what we're doing in terms of our K-12 education reopening. It's going out to all the superintendents. It's going out to all the major stakeholders. And we look forward to their comment and as we refine this over the next few weeks. Max?
News 8.
Good afternoon, everyone. Governor, before I ask you about screening people that are entering Connecticut from hotspots, for Commissioner Cardona, if you can speak about the challenges that you face in bringing the students back, in particular, when you talk about flexibility and being open to making adjustments on the move as everything transpires?
Thank you for the question. Definitely, we know that this plan is going to be guided mostly by our health data in the state of Connecticut, and we're working closely with the Department of Public Health to make sure that our plan is responsive to the needs of Connecticut. So we submit the plan today with the understanding that the plan is only as good as the paper it's written on, unless we're able to adjust based on what the needs are in Connecticut, and that's what we plan to do.
And Governor, with respect to screening those entering the state from hotspots?
Yeah, what we're doing as part of the quarantine plan, you remember the states that have more than a 10% positivity. We've reached out to all the airlines, we reached out to the travel agents. You maybe saw we've got the signage up, and not just Bradley, but Kennedy and LaGuardia and Newark as well. And what they're telling people is if you come in from one of those states, you must quarantine for 14 days. If you're an essential worker here for business, go get yourself a test so that you can have that piece of paper that shows that you have tested negative, and you can come up and get to work quickly. Right now, we're getting the numbers back from the airports and seeing how that has impacted traffic, and I'll be able to get back to you on that, I think, within a week. But it's really important as we look what's going on in our states around the rest of the country, not our regional states, but the states around the country, that we limit the back and forth there. And I'll tell you, Texas, by the way, had put in place a stay-at-home order. So it's not just us saying you're going to be quarantined if you come to Connecticut. It's also Governor Abbott saying we recommend to Texas you stay at home.
Is there a chance those people could be screened right at the airport?
That's something we're looking at.
Channel 3 Eyewitness News.
Yeah, I'm still kind of making my way through the document that was released, but I did notice that there will be arrangements made for families to continue the online learning if they choose. But I was wondering how that might affect staffing, because I imagine a teacher will be dedicated to teaching in class. Would they be responsible for the online learning as well?
Yes, the option for families to continue with remote learning, if that's what they feel most comfortable with for their children, will be available. How that looks in districts, we'll be developing a plan for that and supporting districts. We know that there's not always one approach that's best for all communities, so we're listening to how districts consider this and work with them to try to share best practices there to mitigate not only the distance learning and making sure that students have the opportunity to learn remotely, but also balancing the responsibilities of teachers who will also have students in front of them.
And is there an outline for how sports could resume in the fall?
Yes, CAC has developed a document that they've shared that we can also reference in our plan and future editions to give parents and families an understanding of what the plans are for sports in the fall.
News 12 Connecticut.
Hello. The rental eviction moratorium has been extended, but I'm speaking to people who represent tenants who say there's not going to be enough money in the rental assistance program, and some landlords say if their banks aren't in Connecticut, they're not really getting any forbearance on their mortgage. So obviously it's a big situation. There's a lot of people who may owe several months of rent. What happens next in terms of this issue?
Yeah, we'll be rolling out our plan for the rental support. We'll be increasing the amount of money, working with landlords so landlords can work with their tenants and make sure that over a reasonable period of time, people have a chance to get back on their feet and certainly can stay in their home without worry of an eviction. We'll let you know on that tomorrow, I think it is.
NBC Connecticut.
Hi, Governor. Matt Austin with NBC Connecticut. My first question was for you. When you look around the country and see what's happening, does that impact at all the schedule for the Phase 3 reopening here?
Yeah, Matt, I sure look at that very carefully. As I said before, we've never opened bars, certainly not indoor, and we thought about that for Phase 3. I probably would say I'm rethinking that, looking at what's going on in other parts. You know, we thought about increasing occupancy on things like restaurants. We're down at 50% for indoor. But again, Texas just lowered themselves down to 50% for indoor. So as I look what's going on in Texas and Arizona and Florida, we definitely will take that as an indicator of what we want to do in mid-July.
And my second question was for the commissioner. We heard from several unions last week who had concerns about going back full-time. They thought some type of part-time would work better in terms of class sizes. What was your response to those concerns?
Well, you know, we've been working closely with our partners, including the teachers' unions and superintendents and boards of education, to try to get the best thinking out there. And this is the first step. We're going to move forward. You know, I'm pleased to share that just last Thursday, the American Academy of Pediatrics supported in-school learning because they feel that when looking at risk factors both inside and outside of the schools, that states should consider a plan that brings students back to schools. We know there's a lot of work to be done ahead, and we're looking forward to continuing the partnership with our teachers to make sure that the plan not only is safe for students and staff to re-enter, but also one that builds confidence in the educational process moving forward.
Yeah, can I just add to that? Because that's a very good point, Miguel, you made about the American Academy of Pediatrics. It sort of reinforces a lot of the key assumptions that Miguel and his team had. You know, they emphasize, number one, anything that gets the kids back in the classroom is a plus, and do that safely. They worry about the social isolation of the kids who have been sort of more alone over the last 4 months. You know, as Miguel said, any parent or any child that doesn't feel comfortable going back into the classroom, we're going to make accommodations for them to stay at home. But the American Academy reinforced anything we do to get people safely back in the classroom ought to be a priority. They went on to say, look, how far apart necessarily your desks are is definitely secondary to A, wearing the mask, and B, cohorting, which was sort of a key parameter that you know, Miguel put into our plan as well. So I was really, you know, pleased that the American Academy sort of reinforced a lot of what we're trying to explain as we work with teachers and parents and students.
Fox 61.
Good afternoon. This question is for the commissioner. I noticed in the document that was sent out that there is a section for special needs students. We've been hearing from a lot of parents who are concerned about the special needs students going back to school, especially, you know, those kids who can't wear masks and feel uncomfortable with the PPE. What's being done to make sure that their needs are met if they do come back to the classroom?
Right. You know, students with special needs, we've heard from many parents, from folks that work with our children with special needs, and the impact of distance learning on our students with special needs is one that we take very seriously, and we want to make sure that we can provide the best opportunity for them to return to school. And we recognize that with special populations, we have to make sure that we have special accommodations, different levels of protective coverings, and different strategies to make sure that we can successfully meet their needs in the building. However, as with any other student, because special education students are regular education students first, we want to make sure that they're afforded the same choice that other students have with regard to where they receive their instruction, whether it's in school or at their home.
And another question for you, or even the governor, with all these different modifications and the learning both in the classroom and online, has there been any talk among the districts and the different school districts about hiring on more teachers? And is that something that's going to be in their budgets, which I'm sure are already stretched thin?
Sure, yes. We're asking districts to work to develop plans with input from teachers as well, to see what needs there are in their districts. And then we're asking in very short timeline to try to identify what the needs are, to see how we can use some of the funding that we have available with regard to the governor's education funds or any of the CARES funds that we have to support those districts in greatest need. We recognize that a lot of this will require some planning first, and I just want to acknowledge the work of the superintendents this afternoon moving forward to try to turn around a plan for their communities sooner than later, and then communicate that information to us so that we can communicate with to the governor and his team.
Thank you.
WTIC 1080 News.
Hi, one of your regional partners, Mr. Governor, New Jersey Governor Phil Murphy, decided not to reopen restaurant dining rooms now. Is that a bad sign of where this is going, that New Jersey is not even going back there?
Well, we opened indoors about almost 2 weeks ago, 50% capacity. So far, I think it looks like we're in a very good position. I respect what Phil did, looking at Texas and some other places, said maybe we'll hold off. I think we're in a good place right now. If you can eat outdoors, eat outdoors.
And with the raises going into effect around the state July 1st, how bad is that for the state budget, and how gloomy are things looking?
Well, it's a hit to the state budget. You know, our managers are all taking a freeze. You've seen the same thing going on at UConn. We've inherited some contractual requirements when it comes to our state employees, and we're obligated to honor that contract. Overall, our budget, we're in better position than any of our peers because of the rainy day fund, because we kept open manufacturing and a lot of other big pieces of our economy. If Congress comes back in July, which is what the Vice President anticipated, and do something on the next supplemental, as I implied before, what they're going to do for state and local aid, what they're going to do for testing, we should be in good shape, provided the economy slowly gets back to normal operating capacity by the end of this calendar year. But as you've heard me say before, if we take a second hit, if November comes around, if there's a second surge, then Connecticut and the country is really going to have to look hard at those budgets because we're going to be in a tough position. Let's not let that happen.
CT News Junkie.
Thanks, Max. Regarding the school guidance, Commissioner Cardona, define what temporary means for parents who are temporarily withdrawing their children from a school building but still want an education.
Sure. So temporary means that we will open our doors to students when their families are comfortable sending them to school. We haven't put a period of time, or they may say, I'm interested in considering it later, maybe in the beginning part of the school year. I think it's important to note, though, with this question, Christine, that, as we adjust class sizes and as we try to balance the planning of both distance learning and in-school learning, a process has to be put in place to make sure that we bring students in and make sure that class sizes are reasonable. So it's an option for parents, who are letting them know that it's not a requirement for the whole year.
And so when will the plan or the specifics of the plan for the blended learning be done?
I'm really pleased to share that tomorrow we're going to be launching Connecticut Learning Hub. This is something that a month and a half ago, 2 months ago, we didn't even have on our radar, but we knew that having content was critically important. So you'll see, as part of the plan, we have a section on academics, and the State Department of Education is going to be launching tomorrow a platform where students, families, districts can access high-quality content for students that do elect remote learning to supplement what districts might already have, free of charge to districts. So that work is underway. We're going to be launching it tomorrow. More information to come on that when we launch.
And if a student tests positive in a school, will the school be closed, and how will that be reported to parents?
Yes, there is a clear communication on what that's going to look like in our plan. We link to CDC guidelines, which have a flow chart on what it looks like. It's important that we're consistent throughout the state with how we respond to that. And in that link, it explains more specifically what communication will or will not happen in terms of how it's communicated. And as far as closures are concerned, it's really important that we follow the same protocol throughout the state. So those are guided by the recommendations in the CDC.
Hey, Christine, could I just add to that? The reason we're trying to keep these different groups self-contained, these cohorts, the 5th grade class doesn't hang out with everybody else in middle school, is in part so that we can quarantine just a particular class as opposed to the whole school if there was an infection to be found.
Thank you.
The Associated Press.
Good afternoon, Governor. Good afternoon, everyone. Commissioner, I was curious, do you know, has there, I'm sorry, I lost my question here. Has there been a survey at all regarding how many students do you think might not be returning to the classroom, and also maybe how many teachers might not be returning to the classroom? Sorry for the confusion.
That's a great question, and thank you for asking it. Yes, we have a survey ready to hit send. We're giving districts an opportunity to process the plan, and we are prepared to send information survey to districts so that they can communicate to us what the percentage of students and staff are not going to be returning. That's really important in the planning part of it, and we do have a plan in place to try to get that information as soon as possible.
Okay. And Governor, you said you hope to make some kind of decision regarding phase 3 in mid-July. What do you need to see by then to make a decision to hold off on reopening other venues or easing some of these restrictions on capacity limits?
I think I would certainly look at what's going on in those states that are on fire right now. I'd look at not only the metrics here in the state of Connecticut, but what's going on with our neighboring states as well, be that Massachusetts, New York. Just because we are part of a region, we don't just control our own destiny in that sense. So I think we usually spend 2 to 3 weeks between phases just to get a better idea. So we'll be able to make some announcements on that right after the July 4th weekend.
And have there been any issues so far with the quarantine? Have you been able to stop large groups from coming in from out of state? Just curious, maybe any details.
Well, I was talking to Bradley Airport, and they haven't been able to get me the numbers yet in terms of number of people on the flights coming in from Dallas or coming in from Miami or South Carolina. I can't figure out how they couldn't get those numbers, but we're going to get those numbers for you very soon and be able to see what impact our quarantine has had and see whether we need other protocols to make them stricter.
Thank you.
Boceto Media.
Hi, everyone. Question for the Commissioner. Next has some in school or air circulation. According to the National Air Filtration Association, I get attached from the state areas other state pending school.
All right, you got that, Miguel.
I'm sorry, I couldn't hear the question. It broke up.
We will come back around. Hearst, Connecticut Media.
Thanks, Max. Hey, could everybody mute, please? We're getting echo. Hey, Governor, how would you describe the degree of discretion local school boards have in this mandate or whatever your plan?
I think in terms of implementation, they have an awful lot of discretion. I think Miguel's been pretty clear in terms of what we're thinking about in terms of cohorting, what we're trying to do to get people back in the classroom. We're going to do this survey that he pointed out in terms of we get a better idea of how many kids are going to be in the classroom, how many are going to be remote learning. That will give us an idea of what the space capacity is. But then when it comes to how you do that, every school is going to do it their own way. Is that about right, Miguel?
It is, Governor. I think, what we wanted to do is provide some guardrails that we develop with a lot of input from our partners at DPH, Department of Public Health, and those are the guardrails that are going to guide the development at the local level. We know local leaders know their communities best, local boards know their communities best, but we are asking districts to plan for fall reopening where students are in the building. We know that because, as I said earlier, the data will determine how things move. We need to be prepared for all scenarios, and we're asking districts to plan multiple scenarios.
Thanks. And Governor, you were just hinting at a possible increase in the rental assistance. The Housing Committee was meeting today talking about the state's historic segregation. And I'm wondering that in the upcoming special session, if the General Assembly decided to take away some local zoning power, would you support that in an effort to combat systemic racism?
I think it's premature to do something like that, especially in a special session, especially when you don't have broad public hearings.
Okay, and could I ask Josh a quick question?
You got it.
I'm interested. Thanks, Josh. So we're under 100 hospitalizations. It's great. Is there talk of lending some of our ventilators out to states that need it? Has that come up yet?
It's something we've talked about, and we can certainly look at if the need arises.
So at this point, you haven't heard of a need then?
Not at this time.
Thank you.
Try again with Boceto Media.
Hi, Commission has some age or 38. How can the state government if children ages virus?
Somebody, if I may, I'm sorry I couldn't make out the question. Feel free to email it to me or send it to me through another form, and I'll do my best to answer it on the air during the press conference.
We'll move along next to the Hartford Current. The Hartford Current. Connecticut Public Media.
Good afternoon. Governor, you mentioned the hospitalizations. That's been kind of one of our key metrics we've been watching fall, and you said that that's something that will most likely rise because it is so low now. So what metrics should we be watching to see if there are going to be any changes to, indoor dining, gyms being closed? Is there a hard number you guys have, an infection rate that might close some of the things that are open now?
Yeah, hospitalization is important, especially when it comes to hospital capacity, ICU and hospital beds in general, to make sure we have capacity there if, God forbid, there was an Arizona-like surge here. And as you point out, the positivity rate is so important right now. It's not simply a matter of how many tests you've done, but the percentage of people who test positive. That tells us a lot about community spread more broadly in the community.
Move along next to the Hartford Current.
Hi, thanks. Some technical difficulties. Governor, you'd mentioned last week that you were considering creating testing sites at transportation hubs like Bradley. What's the status of that plan?
Well, we're talking to some of the airlines tomorrow to see what their appetite is. It's a little complicated in terms of who does it, how it gets paid for, et cetera, but it does make a certain amount of sense. I know how, Maine, you bring a certificate that shows you've tested negative, but let me get back to you on that.
Thank you.
The Connecticut Mirror.
Governor, I just want to clarify something. When you talk about phase 3, are you saying that even if Connecticut's metrics meet your standards, based on a careful approach, other states may dictate a delay?
I don't know about dictate, Paz, but obviously if I saw something in Massachusetts or New York that was very disturbing, it would certainly give me pause. And what I see in Arizona, Texas, and Florida, it shows you that things can change very quickly.
Okay, but it's not just Connecticut metrics that will inform your decision. Is that fair?
I think that's fair, but look, overwhelmingly, our state tends to walk in parallel with some of our neighbors, so I think you'll find them aligned.
Okay, a question for the commissioner, I guess to you as well, Governor. When you talk about the importance of having these grades as standalone cohorts, are you saying that if one kid tests positive, that you're not going to have to order a 14-day quarantine of an entire class?
The CDC guidelines provide very clear direction with regard to how things are handled. And it's also very highly recommended in CDC that these decisions are made with local health department input. Every situation is a little bit different. Every case is a little bit different. So while there's consistency in what's expected, depending on whether there are siblings or what type of contact the student has had, it could change whether it's a classroom or a larger group of students that are quarantined or sent home. And it usually recommends the closure a short period of time for this information to be gathered in the school. So the CDC guidelines, which are linked on our plan, provide much more information.
Thank you.
I have two questions from Boceto Media. We'll start with the first one for Commissioner Cardona. Connecticut has some aging school buildings with poor circulation. Knowing that, how can the state guarantee parents the safety of their children of this highly contagious virus?
That's a great question, and one that we have been talking about, and one we've been discussing not only here at the agency and looking at CDC guidance on that, but also partnering with our OPM, which also handles the building construction projects and school buildings. So we have information for those districts on ventilation systems and strategies to make sure that fresh air is circulating through, and that is included in our guidance. But we're also making available to all districts the consultation of Casas Diamantes, who is the person at the state level that has a really good understanding of facilities and how to maximize airflow in facilities.
And the next question, will temperatures be taken prior to entering the school bus and school buildings? Will there be a bus driver assistant to help control the spread?
We're recommending that in cases where students are not able to keep where there are a lot of young children on the bus, or there are buses that have high capacity, we're recommending that districts consider placing monitors, especially to get students acclimated into the process of where to sit, assigned seating. And while we're not requiring temperature checks, districts may choose to do that, and we are asking, and there's a section in our plan that discusses or that communicates the expectation of parents to do checks regularly before sending their children to school. At the end of the day, that's going to be the best measure. If your child is sick or showing symptoms, keep your child home and be prepared to keep your child home for multiple days if that's the case.
The Waterbury Republican American.
Thank you, Max. Governor, quick question on the travel advisory ban. Where do things stand with your talks on an exemption for folks that can document that they have tested negative prior, I believe you've been referring to a 72-hour period, and if there is no agreement with New York and New Jersey, would you consider taking unilateral action here in Connecticut?
Yeah, let me get back to you on that. It makes a certain amount of sense for me, especially those essential workers who are already sort of exempt from the quarantine because they got to come up for business in, military or something. We're trying to work on that together with the 3 states, but it definitely makes sense to me, Paul.
And a reader question for you also. How long will the recommendation stand for older or immune-challenged workers and individuals to work from home and stay at home and reduce their travel to the minimum necessary?
Look, I think immune-challenged older folks, I think we're going to still maintain a strong recommendation that you stay close to home. We're seeing around the country, while their younger people are showing infections and being able to infect others, still you know where the period of the greatest risk is. So I don't see that changing for the near term.
Okay, in terms of the school reopening plan, the plan refers to recommendations and requirements. How will the requirements be enforced? How will the state make sure that school districts are complying? Is this going to be sort of an honor system, or is there actually going to be inspections and paperwork being filed?
We are going to be receiving the plans from the districts, but quite frankly, districts have a board and they have a leadership structure there, and their goals are the same as ours, to ensure health and safety to all the students and staff. And we anticipate that while we are sharing and communicating best practices and being very clear about what the expectations are, the plans that they have available, we're asking that they also be shared online so that all families have it. We're also asking districts to identify a person as a liaison that can serve to hear any concerns of compliance that might be lodged with families or even staff members that see something that they don't feel follows the process that was outlined. And I think that's a more authentic way to assess whether or not districts are following the plans. At the end of the day, we're all in this together, and we have to make sure that we're all vigilant and we're all following the plan that is established.
And what are the, I was trying to find some sort of recommendations and guidance regarding teachers who are older and have concerns about potential exposure. I'm not quite sure I saw anything in it, but I will admit that I've just been kind of reading through it as we go here. So. Yeah,
I mean, it was just released a couple hours ago, so you gotta pass there. Yes, there is some guidance in there. I mean, we want to give districts the opportunity to accommodate as best you can for folks that are in our districts that may have comorbidities or may have higher risk factors. But we're recognizing also that might not be possible for all. So we're going to engage with our teachers to try to, and our district leaders to try to find possible solutions to this. This is a challenge that we recognize. It may be that some teachers can focus on the remote learning part of it, or can assist in ways that limits contact. But we know that to reopen schools, we're going to have to look at a lot of things that they're not quick answers, and that's one of them. We're committed to working with our teachers and our districts to make sure we find the best possible outcome for our learners.
Thank you.
All right, let me conclude by reminding everybody what I heard from every governor today. Wearing the mask is more important than ever. Thankfully, Connecticut has been a leader when it comes to wearing the mask. So Max and I have created a little contest around the state to see who can come up with the best statement about the importance of wearing the mask. And today we'll give you two of our contestants. The first, posthumously, is Freddie Mercury. Many of you remember him from Queen, at least those of a certain age. No mask on your face, your big disgrace, spreading your germs all over the place. We will not sing that song, but that's Freddie Mercury's submission. And Max, the other submission is by Gino Oriana.
All right, folks, we are going to get out of this Connecticut briefing, take you out to Los Angeles County right now for an update there happening live on coronavirusnow.com.
Limited and precious resource. And in the near future, even with the more limited use of intensive care that we're using for patients with COVID-19 versus what we saw at the beginning of the pandemic, we are likely to fill our available ICU beds in the very near future. Please know that does not mean that we are out of ICU beds today. We track ICU bed availability on a daily basis, and as reported by hospitals across the county today, there are still approximately 200 open ICU beds today in the county. And I'll speak in a few minutes about additional steps that hospitals can take to further increase ICU and other beds. In terms of ventilators in our hospital system, we project that we have an adequate ventilator supply for at least the next 4 weeks. This shortage of hospital beds can be met by changes within hospitals themselves, which is known as hospital surging or implementation of hospital disaster plans. And I'll address that in just a minute. Finally, on the next slide, we look at what mortality rates could look like in the coming weeks. Although I know we've all been heartened by the recent declines in the number of reported deaths from COVID-19, our model suggests that we are now, very sadly, likely to see an increase in mortality in the weeks ahead. You can turn off the slides. Shifting now to a discussion of how hospitals are preparing for this potential increase in patients. Let me first begin by saying the obvious. The best place to treat patients who require hospital-level care is in a hospital. This is what hospitals were designed for. They have the underlying infrastructure that is needed to care for acute-level patients, and that is where patients should be cared for, if at all possible. Alternate care sites present a host of challenges in treating patients who require acute-level care. Hospitals can surge to accommodate additional patients than what they're caring for today, and they do this in two main ways. First, they reduce elective admissions through canceling elective procedures or elective surgeries, so that they can make room for patients who have COVID-19. They also work to expeditiously discharge patients who no longer require an acute level of care. These steps, depending on the hospital and what their patient mix is, can clear 20 or 30 or sometimes even 40% of the beds to accommodate additional patients. Second, patients have the capacity to add typically 20% and sometimes more beds above their normal capacity and can take steps to open these beds should the needs arise. This includes the ability to both flex bed types between different types, for example, flexing med-surg and ICU beds, and also adding beds into non-traditional locations, like in the emergency department or in recovery room areas. At DHS hospitals specifically, we are tracking important data to understand when hospitals need to implement these surge plans, and we're also adding new clinical staff, including nurses and respiratory therapists, to be able to take care of patients. DHS also includes the county's Emergency Medical Services Agency, which works with all hospitals, both public and private, on implementing their surge plans and adding capacity and being able to balance out supply and demand across the county. It also has an active role in distributing supplies and ventilators and works closely with the state on the distribution of state and national stockpile resources. Hospitals, both public and private, are prepared to cancel elective surgeries and procedures if they need to, and to implement other aspects of their surge plans in the days and weeks ahead. The second thing then to take away from today is that the hospital system within Los Angeles County is prepared, but please know that these resources and the dedicated staff that work in them are very precious. We want to avoid the need to surge at all costs. The way to do that is the same tools that we've shared that Dr. Ferrer just went through. It's about wearing your masks, following the health officer orders and the reopening of businesses, and following the other guidelines that you've heard. Reopening can give a false sense of security and safety. We are not reopening because the virus is gone. Instead, we all know that safer at home is not sustainable. People need to work. They need to support their families. They need to engage in activity that supports their mental health and so much more. But the reality is that in doing all of these things, we all interact with people who are infectious but might not appear sick. This is why it is so important for everyone to wear their facial coverings and to respect physical distancing whenever possible. To wash your hands, clean surfaces, quarantine and isolate when called for, and if you are particularly vulnerable to serious infection, if you're elderly or you have an underlying health condition, it's even more imperative to stay at home if at all possible. I know we all want to go back to normal, but we're nowhere near that. And if people continue to let themselves believe that reopening means it is safe to not follow these public health guidelines, then today's data should show how wrong that thought could be. Remember that 1 in every 140 people in Los Angeles County are likely infectious. Last week, that number was 1 in 400. Spread is increasing, and in the course of your daily life, it is highly likely that you will be exposed and around someone who is infected. We have all seen many people outside without masks. This careless activity puts all of us at risk, especially those who do not have the privilege of teleworking from their home and have no choice but to leave in order to make a basic income to support themselves and their family. We need to support local businesses, but for all of the businesses, please follow the public health guidelines that the Department of Public Health has put out and explained. It is up to you and to all of us to do what we can to reduce transmission across the county. That, I'll turn it over to Lori for questions.
And ladies and gentlemen, if you wish to ask a question, please press 1, then 0 on your telephone keypad. You can withdraw your question at any time by repeating the 1-0 command. And if you are using a speakerphone, please pick up the handset before pressing the numbers. Once again, for questions, you may press 1, then 0 at this time. We'll go to Colleen Shelby with Los Angeles Times. Your line is open.
Hi, thank you for taking my questions. First, wanted to know how you're determining which restaurants and businesses inspectors are visiting, given the amount of increase in cases kind of stemmed to those areas. Also wondering if you could say which business was recently shut down due to over 100 infections. I believe that Barbara Ferrer mentioned that earlier this morning on a call, and was wondering if you could offer any more details about that.
Sure. Dr. Purr?
Yeah, thanks a lot. There are over 40,000 restaurants, so it's a good question about, how we select restaurants. It really is somewhat random, although we certainly are looking at our database about places where there may have been citations that were issued in the past. Mostly what we're trying to do is get to every single part of the county so that everyone has an opportunity to hear from us and get direction from us. At this point in time, we visited, I think, well over probably 3,000 restaurants as part of sort of the technical assistance side of our house. We also do regular inspections. So I want to say the inspections at restaurants also continue, and we use that as an opportunity, obviously, to educate and at this point to help people running those businesses or operating those businesses come into compliance. I'm going to have to look up at the name of the business that, in fact, was ordered to shut down. And I believe that kind of information will be posted by us. So if it's not posted today, it should be posted by tomorrow. So we'll take the next question.
We go to Hal Eisner with Fox 11 News.
Yeah, hi, Dr. Ferrer. Thank you very much for taking my question. You talk a lot about families getting together. Not a great thing to do right now, I gather, but July 4th is right around the corner, and I'm wondering, one, about your advice with regard to July 4th, and about beaches, if we're going to be seeing some kind of curtailment of people being able to be on the beaches because of concern over people gathering.
Yeah, thanks so much. I too appreciate that, this is a big holiday weekend and would love to spend it with close family and friends. I strongly advise against it. This is going to be a different summer, and this is going to be a different July 4th celebration for all of us. As you noted from what Dr. Galley presented today, 1 in 140 people are infected with the virus, walking around not knowing that they're infected. So your chances go up every time you're around people that are not in your household in terms of your ability to become infected, and then obviously your ability to infect others. So this is a time to still stay within your household as much as possible. Many of us are going to work again, so we already have an additional set of exposures because we're at work. I just be really mindful that if you can find ways to connect with people, again, using technology, that's the best thing to do this weekend. And obviously, being outside is always a lot better than being inside. So, we have beautiful places to walk, beautiful places to take a picnic, but you should have that picnic with members that are in your household. And take solace in the fact that, we're all going to do it this way, this July 4th, in hopes that by next July 4th, which I see as totally possible, we're celebrating in ways we're much more accustomed to. And your second question about the beaches is a good question. We are working, obviously, with the beach mayors and with all of our supervisors to look at all of the options for finding ways to stay safe over the July 4th holiday. And as you note, we've said from the beginning, we have to use every single tool we have to make sure that we're containing the spread of the virus. And we'll be working with all of our partners to make good decisions so that people can stay safe. And I just want to remind us, this is temporary. You know, this is not forever. This is not even for another year. This is a temporary a set of temporary steps that we're asking everyone to take because we have seen these dramatic increases. We need to get this back under control so that we can remain on a recovery journey. We'll take the next question.
We'll go to Lauren Lister with KTLA 5 News. Please go ahead.
Hi, thank you for taking my question. Obviously, now bars are closed, but I'm curious if there are any other areas of the economy, any other sectors that have reopened that you're eyeing for potential closures. Of course, you just cited some concerning trends with restaurant compliance. Or if not closures, are you considering amending the health orders with additional safety protocols for any sectors or businesses?
Yeah, thanks so much for the question, a great question. You know, the first, I think, order of business right now is for everyone to come into compliance with the existing directives. The existing directives actually offer us all a lot of protections, but people need to implement them, and then we all need to play our part and do what we're being asked to do. You know, I see, and I know you see, you know, troubling videos of people refusing to wear face coverings when they're around other people, you know, refusing to adhere to the rules at a counter when they're trying to order takeout or at a store, and that's just not going to help us get through this. So the first thing is for everyone to please do what's already on the books. If we do this right, we will get back on track without having to revisit the closing of any other sectors. Nobody wants to do that. None of us like going back. But it's really going to take all of us at this point, every single one of us, to help us make sure we can stay on this path and not have to look back at other sectors. You know, if I'm reporting that we have, you know, still, you know, 35% of our restaurants 3 weeks after opening that are struggling to come into compliance with the directives, that's not a good thing. It's time to come into compliance. It's time to make those extra efforts, and it's time for us to all support the efforts that are needed to help us with the recovery journey. Thank you.
We'll go to Rosemary Kim with NBC America. The line is open.
Hi, thanks for taking my question. So we've seen younger people congregating in these type of social situations, and now that a big factor of that, the bars are closed, do you expect to see changes in positivity rates, especially among the younger population? And also, if we don't see the changes, how likely is it of a more widespread shutdown?
Yeah, thanks for that question. I mean, the positivity rates have already gone up for younger people between the ages of 18 and 40. So we're now at 42% of all of the cases being in that smaller age group, and that's been a shift. So we're already seeing that increase. I'm going to ask everybody who's a young person. I know this is so hard. I know that people are desperate to be with their friends. You've got to figure out ways to connect with your friends that don't create any risk for you and for other people. And that means staying socially distanced, keeping your face covering on, and please not being in any situations where you're going to be in a crowd. It's just not safe right now. As hard as it is to do this, it's not safe, and it makes it, as Dr. Galley noted, it makes it take that much longer for us to be able to continue on a recovery journey that we all want to be on. So now we'll take, we have time for one more question?
So
that is from the line.
Yeah, now actually, we've got it here. I would now like to take a question from a special in-person guest. Dave Lopez from CBS KCAL is here in person today, observing physical distancing and safety measures in recognition of his last day reporting on LA County. Dave is retiring after covering Los Angeles news for 48 years with 42 years at KCBS 2. We thank you, Dave, for your energy and enthusiasm to cover the news over the years and for your true dedication to providing newsworthy stories. So with that, go ahead and ask your question in person.
Well, thank you very much.
Yeah, yeah.
Thank you very much. I feel like I'm leaving, the fire in the middle of before it's out. But my big question is, here?
Yeah, go ahead.
Thank you again. And again, it's been wonderful. I don't want to steal the show from anything, because this is the story. Are we at such a critical stage that this is a make or break week? Can we see beaches? Can we see other businesses slow down? If we still get almost 3,000 positives a day, I mean, how critical is this? And obviously, people are not listening.
So, Dr. Furr, that's a good question for you, and that's a good way to end the news conference. I think that's the most important question right now. Go ahead.
Yeah, we can't sustain this rate of increase on positive cases. We just can't. We have to get it back down, or we have to level off. You can imagine what happens with 3,000 cases. We call all of you, and you all have been in contact with 1 or 2 or 3 or even 4 people. And that means that every day now we're contacting thousands and thousands of people to tell them that they need to isolate and quarantine. And all of those people have had opportunities before they get our call to infect other people. So this train can be a runaway train if we don't put the brakes on it. But we can put the brakes on it. We've done right before. We just have to get our heads back into this sort of new normal that we're living in so that we can go ahead and continue on our recovery journey. And now we'll turn to remarks in Spanish. Thank you, Dave.
Thank you, Dave.
Awesome reporter.
All right, folks, we will then be transitioning right now from Los Angeles County. Let's go to New York right now. Fox 5 coverage.
From Fox 5 News, this is Good Day New York.
Areas are doing an about face and rolling back its reopening. The tri-state continues to bounce back. In New Jersey, indoor malls are reopening today. Fox 5's Reagan Medji is live at Garden State Plaza in Paramus this morning, right off of Route 4. I'm so happy about this. Tell us all about it, Reagan.
Well, I can tell you that my credit card is in fear when those doors open at 11 a.m. And not only here at the Westfield Garden State Plaza Mall, but also the Short Hills Mall. If you're a shopper, that is music to your ears. Obviously, there are a lot of restrictions in place. Things like wear that face mask, social distance about 6 feet, and also do not shake hands. But while things are starting to slowly reopen here in the tri-state area, that's not the case for other spots across the country.
Another big step forward for New Jersey as malls unlock their doors today. The general manager of Westfield Garden State Plaza in Paramus says he's excited for the 11 a.m. reopening and adds frequent sanitizing is one of several safety measures in place.
Through the use of technology, we'll be able to monitor how many people are entering the center at a given time. And in addition to that, we'll be providing line queuing at each retailer space that require it. So that we can monitor how many people are in the store.
But as the Northeast starts getting back to a new normal, cases are surging in at least 30 states. Health and Human Services Secretary Alex Azar sounding the alarm, saying time is running out for the U.S. to contain the spread of coronavirus.
The window is closing for us to take action and get this under control.
Right. In California, a major reopening rollback. Governor Gavin Newsom ordering Los Angeles and 6 other counties to shut down all bars, also urging 8 other counties to issue local health orders mandating the same. This happening just 2 weeks after the businesses were allowed to reopen. In Texas, one of the states seeing a huge spike in cases. Governor Greg Abbott saying COVID-19 has taken a very swift and dangerous turn. In early May, businesses started reopening. But on Friday, bars and restaurants were shut down amid the spike in cases. In Florida, beaches in Miami, Fort Lauderdale, and Palm Beach will be closing for the 4th of July weekend to avoid a further spread as cases spike in the Sunshine State. Governor Ron DeSantis says caution was thrown to the wind, and so we are where we are. He adds interactions among young people are driving the surge. All this as numbers in the tri-state are still improving. Connecticut showing a decline in cases from last week. And in New York State, Saturday's death toll from the virus dropped to 5 people, the lowest number since the pandemic began in March, in what was once the epicenter of the crisis in the United States.
And here in New Jersey, Governor Phil Murphy saying over the weekend there were 30 new deaths and about 354 new cases. But talking about these malls, yes, they open at 11 o'clock today, this morning, until 7. But then the next step for the state of New Jersey on Thursday. Things will also start reopening like amusement parks, water parks, and boardwalk rides, all in time for the 4th of July holiday. We're live in Paramus. Reagan Maggi, good day in New York. Laurie, back to you.
All right, Reagan, thanks so much. 7:06, and it was another violent weekend in the city. 11 people were shot in under 12 hours. In Harlem, an angry mob hurled bottles and curses at officers responding to calls of shots fired. Fox 5's Kayla Mamalak has more now from One Police Plaza. Good morning, Kayla.
Laura, good morning to you. And yeah, over a 9-day span, police say there were 83 shooting incidents citywide. That's roughly 3 times more than the same time period last year. The violent surge in gun violence coming alongside a surge in violence against police. An inflamed crowd in Harlem hurling bottles at an NYPD patrol car Sunday morning. Police say the officers were responding to calls of shots fired when this violence erupted. The incident is just the tip of the iceberg, according to the NYPD's Chief of Department, Terrence Monahan.
Other crimes are down, but the violence, the shootings are up.
June has been a violent month in New York City. As of Saturday, police say there have been 503 shootings.
To coronavirus concerns, but for a cause, the Queer Liberation March for Black Lives Matter and against police brutality.
What I love the most about this turnout is that it's showing a lot of solidarity for like one singular movement. So I love that there are people who are advocating for trans lives, for Black lives, for women, for people everywhere. I feel like this is what needs to be done.
The crowd grew by the thousands, then made its way peacefully through Lower Manhattan and then up to Washington Square Park in Greenwich Village. By the time they reached the famous arch at the end of Fifth Avenue, their numbers had grown to more than 20,000 people. There were signs with the names of transgender lives lost to violence and many expressions of concern and support. For hours, the event was peaceful, the signs and size of the crowd getting their message across. Towards the end, there were some tense moments with police after one man stood on the hood of a police car. Some participants shouted at police as they moved through the street.
Marchers tell us that this powerful partnership between the LGBTQ community and the Black Lives Matter movement is bringing the demand for human rights to an entirely new level. In Washington Square Park, I'm Lisa Evers, Fox 5 News.
8:14, the big question on the minds of students, parents, and even teachers. Will in-person classes resume this fall? And if so, what are they going to look like? Well, Friday, New Jersey's Department of Education, in conjunction with Governor Phil Murphy, laid out a framework of guidelines for districts to reopen schools in September. But it does leave a lot up to the individual districts to actually determine how they're going to implement these rules. Joining us this morning to offer a little bit of clarity, maybe a lot of clarity, the Commissioner of New Jersey's Department of Education, Lamont Repollet. Doctor, thank you for being with us.
Good morning, Laura. Thank you for having me. Good morning.
You know, I think there's a lot of parents that are still pretty nervous about the notion that their kids are going to go back into a classroom when we see spikes all across the country right now. But you say we're ready.
Yes. Well, the parents, that's a natural feeling. You know, as parents, you want the best for your students. But I think that, Governor Murphy, his approach towards this pandemic has really been amazing in regards to our metrics, right? You look at the metrics. So now it's time for us to go back to school. I think it's time for us to go back to the brick and mortar. However, our plan talks about in-person instruction in the fall that will look totally different. So the normalcy is that our students will go back to social interaction, in-person instruction, but it's gonna look different, right? Our behaviors have changed over the last 4 months, and we're going to continue that behavior. And health and safety standards are at the forefront of everything that we do.
So So there's a framework of the guidelines that then each district, there are 577 districts?
Yes, over 600 if you count charter schools and Renaissance schools.
Okay,
yes.
so then they can decide how they want to take the guidelines, use some of them, all of them, variations of them, right? And they have to present it to you, right?
Yeah, so in our plan, we created minimum health standards and guidelines. So therefore, there's a baseline, and we expect them to start at that baseline and add on. Based on your resources, based on supplies, and based on just your capacity, you can go beyond those minimum standards. And we encourage that, right? We encourage and we recommend if you're going to check temperatures to have some type of scanner, but we don't require that. So it allows the flexibility of our district. As you stated, we have over 600 plus districts, Lori, and it's kind of hard to have one size fit all in New Jersey when local rule is the rule of the day. So therefore, our plan gives flexibility to our district. It really has an emphasis on health and safety and safety standards, but it's really equitable too. We look at equity because we want kids to come back to school. Our kids are special needs students, and then our students that are at risk, they need those supports and those services. And I think it's important that we have a balance of in-person instruction and also some remote learning.
So how do we handle in the classroom as far as it goes, desks are concerned? What about the bathroom use, PPE, sanitizing, temperature checks that you said? I know that it's encouraged for kids to wear a mask, but not mandatory, but it's mandatory for the teachers and for other staff members.
With our health and safety protocols we have in place, we actually require in our plan to have our districts create a restart and recovery committee with different stakeholders in the community, so they can actually kind of address and talk to those certain situations and those operational issues. And you're talking about having board policy on screening and PPE. So we ask that the Board of Education and district leaders and the community members, students and parents come together and create this team. And inside each school, we ask that you have a pandemic response team that's going to look at all these risk mitigations that you're talking about, like classroom. Just like the CDC guidelines, we really require 6 feet when it comes to social distancing. However, we understand based on some of our buildings and the capacity that we may not be able to achieve 6 feet. However, we do require that those students must have a mask. However, we also ask that you configure your room to maybe have the desks facing each other, not each other, but facing away from each other, making sure you have enough spread. If you have barriers, if you could put a barrier in between. So we allow in this plan to be real creative and to really look and think beyond just the minimum standards of what you have, and to be able to create, there's a lot of different resources within our guide to be able to support anything that you're trying to do.
So I told you, my kids are a product of Tenafly school system, and thankfully everything went fine. But I think that if I was a parent right now, and if I didn't want Alex or Nikki to go to school, and I wanted to opt out, would I be allowed to? And would I face any kind of penalty as a parent? Would my child face any kind of penalty?
No, so we don't use the word opt out. I think that's more so opting out, meaning you don't want to attend school, period. With our plan, we ask that our district leaders be mindful of people's anxiety, be mindful of adults and maybe some of the faculty members, their health, safety. So and then any of those students that may be at risk. So that's why the hybrid approach allowed for people to ease into that, right? Because it's a new normal, new reality. So therefore, we kind of expect you're going to have some remote learning and you're going to have some in-person instruction, and therefore you're going to have to be able to build the trust within the parents and the community that you have a safe learning environment. And I think once that our district leaders provide a safe learning environment, you're going to see more people going back in or opting in, I would say, and say opt in. Because if you understand, school is a benefit to having a brick and mortar school. And our students need the socialization. They need to be able to interact, not just with their peers, but also with some positive adults.
And I understand that if there's a reinfection, you'll go back to remote learning. By the way, I guess it's congratulations, you're moving on to Kane University as the president. So thank you, sir, for being with us, and let's fingers crossed it all works out.
Thank you, Lori. You have a great day.
All right. Same to you. Going to go off. That is to avoid large gatherings at those particular sites. Joining us now, Susan Tercero, the executive producer of Macy's Fireworks. Susan, great to have you on. Good morning to you.
Good morning, Lori. Thank you for having me.
So I was telling you what, like 4 weeks ago, 5 weeks ago, and the mayor having his press conference, and he says, yeah, they're going to go off. We are going to have the 4th of July fireworks. Was that a surprise to you?
Well, it wasn't a surprise to us, but I think right at that moment, we weren't entirely sure how we were going to pull it off. You know, I think this fireworks display usually takes about a year in advance to plan. So to try and pull this off in a matter of a little over a month or so was challenging, but we did it.
So what is it going to look like, sound like, feel like this time around? You're going to have a series of smaller displays.
Well, smaller only in duration. So the fireworks display itself actually goes on for about 25 minutes. You know, it's multiple barges. At that, usually every year we encourage a lot of people to come out. So that's why we tell everybody exactly where to go and where to be and when they're happening. But this year, you know, in light of the recent circumstances, we're really trying to find a way to still bring fireworks on that scale, just to multiple points across the city and in smaller time frames, and then to not really give too much away as to where it's going to be. But we did just get here recently that there will be notifications geo-targeted to each of the locations, just to sort of prepare residents in the area.
How are you doing those notifications? Who are you notifying?
It's going to come from the city.
It's going to come from where?
From the city, from the mayor's office.
Oh, okay. So how do you notify? Who do you notify, though?
From what we understand is that, like I said, it's geo-targeted as it pertains to probably, you know, any NYC communications.
Oh, okay.
So it's probably going to come as a notification on your phone.
All right, because as you know, recently, because there's been no real official news of when there's going to be a display. There's been a lot of people that have been using illegal fireworks. There's been a lot of injuries involved, even with young children. There's been a lot of complaints from people around those areas because of the noise factor. So what will distinguish, how will we know what's legit, what's not legit, and timing is everything?
Absolutely. You know, I think what's really unique about the Macy's displays is that they are commercial grade fireworks. They go about 1,000 feet up in the air. And in order to do that, you have to fire those from very specific locations over very high visible waterways, high building locations. So it's not like we're going to go to a residential area and start firing off fireworks as people have been seeing. This will be an area that traditionally has held fireworks, or an area that is, like I said, from a higher point on a building.
So as we lead up to the 4th of July, is the actual 4th of July display going to be larger than the other ones? Will it be like the crescendo of it all?
Well, I think it'll be the crescendo in that if you think about things that we've not done before, we'll have a finale that will surround the Empire State Building. So what I would say for everybody, if you have a view of the Empire State Building, great. Stay home safe at your home, because you're going to see part of our finale to the show will occur in some form or fashion off of that. But really, the best way to view it on the 4th is to sort of watch all those pieces to come together on our televised broadcast.
I'm reading here. It says Macy's will prepare the display in a total of 11 days, during which 28 licensed pyrotechnicians will unpack and install 7 containers filled with 14 tons of fireworks. I mean, this is on a whole nother level, right?
Absolutely. Well, you know, that's the great thing about it is this is still our show. We just broke it up in a way that is more manageable for New Yorkers, and so that we are not encouraging the millions of people that typically come out to see our show.
Is it also going to be synchronized with music? I mean, I can think of, like, you know, Neil Diamond, all the people you've had in the past who have performed along with the fireworks displays. Is it going to be music? Is anyone going to perform? Are we going to see that kind of?
Yeah, when we get to the 4th and when it's broadcast, you will be able to see. It'll actually go in line with the synchronization of the score. Unfortunately, this year, because of the way that we have to spread it out, you won't be able to hear that score while you're watching them. If you're watching them live, but when it pieces all together, definitely you'll be able to hear that beautiful score.
Oh, something to look forward to. So it starts tonight.
Yes.
Where? Can you tell us where?
No, I cannot tell you where. But don't worry, you'll know we're there. there. You'll know we're coming. You will definitely be able to distinguish the Macy's fireworks from any other show that's been going on.
All right, Susan Tessero, always great to have you on Good Day. We'll be looking forward to the displays. All right.
Thank you. Happy 4th of July.
Happy 4th of July. Yes, now to talk about what causes the neuropsychotic complications, Dr. Oz. Good morning, Dr. Oz. This is really scary, and I've heard that it sometimes can mirror people who have dementia.
You know, I got interested in this topic more because there was a very beloved ER physician at my hospital, New York Presbyterian Columbia, who committed suicide. And her family, especially her father, who's a physician, argued that she'd never had issues before, but she got COVID-19 while taking care of patients. It changed her, and it created psychiatric issues that led to her demise. And her behavior had changed dramatically afterwards. Now it turns out, and this is a big gathering of patients from the United Kingdom, that neurological and psychiatric symptoms are common. And it shouldn't have shocked us because we know that blood clots were happening. They should happen everywhere, so they do. It turns out that about 57% of the patients they looked at had ischemic strokes. These are people who had symptoms already, so there's something going on, but there are probably many more people who don't have obvious defined symptoms who probably have these issues as well. But here's the other thing. About 40%, 4 in 10, had altered mental status, believed due to encephalitis, so inflammation of the brain. And I'm sure that happens a lot more than we appreciate because we don't put COVID-19 patients in MRI scanners. It's too difficult to put them there. So we don't even look at their brains. And as we begin to get more serious about the longer-term side effects of having had COVID-19, these mental issues are becoming more, they're going to be more prevalent. Listen, every virus we know affects the brain of this nature. 1918 influenza did, H1N1 did, SARS did, MERS did, HIV even has an inflammation process in the brain in some patients. So we need to be more aware of the possible effects.
Does it stay with the patient? Is there treatment for it?
Sometimes it gets better, sometimes it doesn't. Usually, thankfully, if it's an inflammation process, when the encephalitis gets better, the brain recovers and you're back to normal. If you've had a stroke, obviously it's not so predictable, but the human brain has remarkable resilience. It can be rehabbed much more than we appreciate. But I'm just warning folks because they may have these elements happening, not realize it. If a loved one starts behaving a little weird after they've had COVID-19, get them looked at because this might be explaining what some people, like this beloved ER doctor's family witnessed, potentially could have avoided a problem.
You know, Dr. Oz, we've been talking about the surge in people going out and buying their own fireworks for their own 4th of July display, and a lot of injuries across the board. It's a big concern.
I'm talking about it in the show today. CDC reports unintentional injuries are the 3rd most common cause of death. And you know, it's not always what you think. These fireworks, they get up to 2,000 degrees. I mean, 2,000 degrees, you can melt metal with that. Think of what it does to your face. And you say, oh, how about those sparklers? Even those small sparklers, they're hot. A lot of the injuries are caused from that. Independent of fires in your home, inadvertent issues. Frankly, I'm really upset about the fact I can't sleep at night anymore because there are fireworks till 2 in the morning all over Manhattan. But the bigger issue, of course, is people hurting themselves and not realizing these things are much more dangerous. And as we approach the 4th of July, I want everyone doubling down. I mean, you talk to folks in your life who are maybe doing these fireworks and warn them that they're putting everybody at risk.
Yeah, there's scary stuff. And the surge period that we're seeing in so many different states all across the country of people who reopened and everyone wanting to feel that normalcy, sitting close to their loved ones or friends without a mask.
Yeah, I mean, folks are upset. I get it. They're sloppy, which we can't afford that right now. But this is really a major crisis in the South, but it's one that we can surmount. We don't need to shut these states down. We need to do what Europe is doing because they've got 1/10 the number of cases that we have right now in this country. But to be smart about this, we have to realize that masks are about kindness. That's what it's about. It's not about me, being on the right one side of the political aisle versus you, or me rebelling and revolting against you. Whatever you're going to do, make sure you do it outside, wear a mask, and embrace wise rules rather than making more rules. Because I think the nation itself has got a 2-week window. Let's not throw that away.
Dr. Oz, did something special happen 35 years ago?
The best thing in my life, the wisest decision I ever made was to marry my wife, Lisa, who's a big fan of yours. So she's watching Fox 5 right now. She doesn't know I'm saying this, but honey, I love you dearly. And I know that you hear me say this to people, but I really dearly mean it. My life would not have been in the technicolor that it has become because of you. God bless you. I would have lived in black and white. Everything's better with you.
Oh, that's so sweet. And I love Lisa, too. So what's the secret? What's the secret to a happy marriage?
My father-in-law told me that I should give it on the small things. So when big issues happen, I know what it feels like.
And how are you guys going to celebrate? Anything today?
We have all kinds of celebrations, but the most important thing is, you know, when we fight, we always settle it. Like every family, you're going to create arguments, and today we promise not to fight.
That's so sweet. And the beautiful children that you have and beautiful grandchildren, all reflection of the love you all have for each other. So happy anniversary. Enjoy.
God bless.
All right. See you tomorrow. Thank you, Dr. Oz. And if you want to stay up to date on the coronavirus, download our Fox 5 NY News app. You can also stream Good Day and never miss a moment of the show. Just search Fox 5 NY in your app store. We first got to know Danica McKellar as Winnie Cooper on The Wonder Years. Well, now 3 decades later, hard to believe, the actress has become an educational advocate who started McKellar Math. It's a website that explains math in fun and easy ways. By the way, she is also a New York Times best-selling author. Her 10th book is out tomorrow. It's called The Times Machine. Learn multiplication and division like yesterday. Danica McKellar joining us this morning from Los Angeles. Good morning, Danica.
Good morning. How are you?
I'm doing great. So used to you sitting here on the Good Day couch.
I know. I miss it. I hope, you know, everyone keeps saying this is the new normal. I hope it's just like the new temporary. It's not, you know, I'm really looking forward to all of this being over. I'm sure I'm speaking for everybody watching.
I know. We all.
It would be nice. Yeah.
We all hope it's temporary. So let's talk about this new book, because we know your love of math and how encouraging you are, particularly to young girls. So many times, if a young girl is good and can excel in math, sometimes they hide it. Sometimes they're almost ashamed.
I know. There's a lot of issues with girls. You know, growing up, we are sort of led to believe, and just through society, just all those little subtle cues that girls aren't going to be as good at math as boys, and so we have lower expectations. And then if we are good at math, then there's this fear of being shunned socially. It's so bizarre. So yes, I've got a mission. McKellarMath.com. You'll see books ages 0 to 16. The middle school and high school books are all really directed towards girls. The younger ones are co-ed. But I mean, boys use the books too. My point is to show girls you don't have to choose between being fabulous and popular and fun. Wear makeup and do your hair if you want. But keep your brains, you know, studying math. It's going to make your brain sharper. It's going to make you better able to handle any dream that you have in life.
And you
be
can.
better equipped.
Yeah, you know, so many times people say as we're going through school, oh, you know, I just need to get through this. I'm not going to use it, you know, other than like trying to figure out a tip or something. But you do because it can help with problem solving in other issues of life.
Well, first of all, your finances. You want to raise kids, boys and girls, who are good at their finances and who aren't afraid of the APR on their credit card statement or to understand how the mortgage actually works. You want to have a certain comfort level with numbers, and so you don't want them to be afraid. So and also, yes, relevance in math. Beyond finances, there are tons of things you can use math for. And even if you're studying calculus, yes, the way it sharpens your brain. There's so many benefits from math. So Math Doesn't Suck was my first book that I wrote. It's been like 12 years, I think now.
That's incredible.
It's crazy.
And you just keep churning them out.
Encouraging. Yes. Well, you know what? I did middle school and high school, and then I was asked to start younger, and so I did. So I started with Goodnight Numbers again a few years back, and the latest one, The Times Machine. This is for multiplication and division for 3rd and 4th graders, and I teach it using comics and cartoons and silly stories. And one of the things I'm really proud of in this book is the help for memorizing multiplication times tables, which is why it's called The Times Machine. I come up with like stories and poems and really ways of bringing it to life. My main goal for all these books, beyond just encouraging kids in general, is to make really dry, boring stuff easy and fun. And particularly these days, you know, parents are in an unprecedented way.
It's tough.
They become their kids' educators in an unprecedented way, and parents need support. And the math looks different than it did when we were growing up.
Oh, yeah.
So I've got like some new math translation guide for grown-ups in the back of this one. And do not open this math book.
And Danica, also, you're bringing a little Christmas magic in July on Hallmark?
Of course. I mean, that's what we do on Hallmark Channel. We got to bring the Christmas.
So what is that?
I think Christmas at Dollywood kicks it off, I believe, July 10th. Well, tonight, I think, is Hallmark Movies and Mysteries kicks off. And one of my movies, Christmas at Grand Valley, with Dan Lauria, who played the dad on The Wonder Years. That's airing
And You
tonight,
Find Love, of course.
Of course. And then July 10th, Christmas at Dollywood, where, yes, I got to work with Dolly Parton.
You also produced that, didn't you?
Yes, I did. Yes, that one actually came from the fact that Dolly Parton's wonderful organization called the Imagination Library chose one of my math books, Goodnight Numbers, it's here somewhere, as part of their program, where they give books, they make low-cost versions of popular kids' books and give them to kids who normally couldn't afford books. They chose Goodnight Numbers as one of them, and so a relationship started between me and Dolly Parton and her people, and I was like, you know what, let's do a Christmas movie where we bring that into the mix. And so a big element of Christmas at Dollywood is this Imagination Library. So it's exciting how all these things sort of come together.
It all falls together. And then it'd be great if we ever saw a reboot of The Wonder Years.
I know. You're not, well, you know, so Christmas at Grand Valley, which airs tonight on Hallmark Movies and Mysteries, Dan Lauria, who played the dad on The Wonder Years, he plays my dad in this. And so that's kind of the closest we've gotten to a Wonder Years reunion so far. You're not the first person to ask about that.
I didn't think I was. Danica McKellar, always a pleasure to have you on. The new book, The Times Machine, is out.
And I want to say one more thing. For homeschooling parents, check out my Instagram bio. I homeschool my child. He's 9 years old. I've been homeschooling him his whole life. Check out, I've got tips on the highlights on my profile page on Instagram. Tons of tips to help you guys school your kids at home.
All right, great tips. Always a pleasure. Thank you.
Stay
safe, healthy, all that.
You too.
It's been 5 weeks since George Floyd was killed, and for many, his death ignited fury and anguish. It also has protesters taking to the streets in cities all over America and around the world. But calls for change have not gone unanswered, and in some cases, those changes have been pretty swift. Crystal Young is here now with the story. Crystal? 5 weeks. Hard to believe, huh?
Absolutely. It's been 5 weeks. It seems like a fast 5 weeks. George Floyd died on May 25th. So now, in the wake of all of that, protesters are calling for an end to racial injustice. And with the Black Lives Matter movement, it looks like we are beginning to see change. Take a look.
The death of George Floyd kicked off national protest and raised a lot of questions about race and equality in America. Protesters called for change, and it looks like change is underway. Adidas announced it will be investing $120 million towards black communities in the U.S. over the next 4 years. Spanx is donating $100,000 to Black Lives Matter, and Lululemon is making a $100,000 donation to the Minnesota Freedom Fund. Cosmopolitan Magazine's beauty director, Julie Wilson, says she believes it's a reflection of the changing times.
For a long time, brands that were, catering to the black community were seen not as chic, not as luxury. I think that there's also a healthy dose of racism, and that, they didn't want to cater to the black community. They didn't want their brands to be touted by black people. They didn't want to be seen as urban.
Fashion designer Aurora James was one of the first people to publicly call out the beauty industry. She founded the 15% Pledge, a nonprofit organization that asks retailers to commit to dedicating 15% of their inventory to black-owned businesses. On June 1st, Sephora became the first of 4 major brands to take her up on the challenge. A national outcry is also affecting more subtle forms of racism. For years, people of color were forced to deal with locked-up beauty products, a practice that Walmart recently admitted was wrong. Now they've promised to unlock those cases. In a statement, Walmart said, "We are taking steps in our stores to ensure that no hair, beauty, or personal care products for communities of color are kept in locked displays or shelving units." Following the announcement, Walgreens and CVS made the same promise.
It's a big step for these companies to admit that that's wrong. There are no numbers to back up that these products were being stolen any more than any other products. But it points to criminality in the Black community and just plays into this systemic racism that the country is now having a reckoning with.
Several companies are changing mascots and logos that have long been criticized as racist. The Aunt Jemima brand debuted in 1889, but now its owner PepsiCo is removing her image from packaging and changing the brand name. But rebranding doesn't come cheap. Alan Adamson is a marketing expert.
Yeah, it's going to be very expensive because they bought that brand many years ago because it was recognized by so many people and in so many people's pantries that it was a no-brainer just to grab it. And now if you take off the point of differentiation, Aunt Jemima or Uncle Ben's or whatever the branding piece is, and are left with a pancake mix or a rice, you have much less value. Not only does it have to taste good, but is a company doing the right thing? Are they a brand that I want to support? I want to vote with my pocketbook.
After PepsiCo acknowledged Aunt Jemima is based on a racial stereotype, Mars Inc. announced its plans to change the name of its rice brand, Uncle Ben's. Although marketing experts agree, real change starts in the boardroom.
Bringing diversity into the company is more complicated because it involves changing personnel, hiring people. It's just a more daunting task for them because if you have multiple people looking at a problem through different lenses, from different parts of the world, from different perspectives, you're going to get a more inclusive brand. That just takes more time.
From the fashion and beauty industry to the products we eat and drink, Americans are demanding change, and they're getting it.
If you don't nip some of these issues early on, by the time you act on it, it's so overwhelming, the negative publicity, you could do real damage to your business.
Now, I should point out that although Aunt Jemima was not a real person, several of the relatives of two of the actresses that portrayed her in the 1920s and 30s actually oppose the brand changing the name. They say it erases her from history, but clearly there are a lot of people who disagree. Lori, back over to you.
Yeah, it's interesting. I was listening to an interview with Dan Gaspee, who is the husband of the late B. Smith. And both of them had long ago gone to manufacturers about Aunt Jemima, saying that no Black woman wanted to be called Aunt Jemima, and the derogatory term of it all. So they were, champions early on in trying to get something like this taken care of.
Yep, I heard that debate too. A long time ago, they were told Aunt Jemima would never change its name. That brand was here to stay. But we see what a lot of protests and movements have done. So change is happening.
All right, Crystal, thank you.
You're welcome.
Action Park was the amusement and water park in Vernon, New Jersey, open for almost 2 decades. With a reputation for danger. Well, a new book is out. It's called Action Park: Fast Times, Wild Rides, and the Untold Story of America's Most Dangerous Amusement Park. It's a memoir by Andy Mulvihill, whose dad opened Action Park in 1978. Well, Andy is joining us this morning with the tell-all book. If you weren't there and missed it, he certainly paints an amazing picture of it. Andy?
Oh, you're so kind. Thank you so much. It's great to be on.
Oh, it's great to have you on. Listen, I've only heard about the lore of Action Park, Accident Park, Class Action Park, but it's a place of endearment, I think, for you.
Well, it was a place that I kind of grew up with. People in where I grew up, they had shore houses or they would go to the beach. We would go to Action Park as kids. There were 6 of us. And my dad brought us up there and put us to work, and it was an incredible experience.
So your dad was actually like the founder of Action Park, right?
Yeah, he was a guy that had bought a ski area and it was sitting there empty in the summer. And he said, I got to do something with this. And he actually invented the whole place. He started one of the first water parks in the country. And he was all about doing something incredible. He didn't want to do something anybody had ever seen before. So he went out and he found the craziest guys he could find to build the most radical rides and just to really entertain people, to give them an unbelievable thrill.
And by the way, you were the first human to try out the cannon loop. How old were you?
Cannonball loop. Oh, I think I was probably about 17. It was when I was playing high school hockey, and I thought as I was going up there that day, I better bring my hockey stuff. I don't know what he's going to have me try today. So there's this ride that's actually a 360-degree loop water slide. It was set up in the parking lot, and somebody had to test it. I said, I'll give it a shot. And oh my God, it was unbelievable. Scared the bejeebus out of me.
You and probably a lot of other people. There was also the Bailey Ball. Said during the testing, it went off the track into traffic with people inside.
Yeah, there was a guy named Mr. Bailey who had this idea of putting a man and a ball on a ball, and he built a track from the halfway up the mountain down the mountain, and the ball was put in the track. But what happened, it was the first day it was being tested, and it got really hot that day, and the glue came apart, so the track fell apart when we were testing it, and the ball got loose, and rather than going back and forth, it went straight down the mountain.
Oh my gosh.
It was unbelievable.
You know, it seems as if when I speak to people who have went to Action Park, there's a lot of love for it, and you feel like you didn't do something right if you didn't walk away with a bruise or a scar or a bump or something happening to you.
You know, it was a participation park. It wasn't like a typical amusement park. You controlled the action. I mean, you could drive a race car, a speedboat, go down a toboggan, but if you wanted to take it easy, like in skiing, if you want to go down the bunny hill and go slow, you can. But if you want to go down the steeps or ski in the trees, it's a thrill, but there's risks, and you can get a little beat up. And that's the kind of place it was.
Yeah, like the wave pool there. I think you had some fatalities there, right?
You know, that was really tragic stuff, really, really tragic stuff. We did everything we could to try to keep the place safe. But when you get that many people together, putting them real active, things can happen.
Hulu, and you know, we had someone on several months ago talking about a documentary. I know that Hulu is also developing a half-hour comedy series, though, about the park, based on the book, right?
You know, when we were writing the book, my agent said, let's circulate it in Hollywood, and we did. And my God, I got an offer, then another offer. I got 10 offers. There was a bidding war to be able to put this story on the big screen. So Hulu and 20th Century ended up being the guys that got it, which is really neat because those are Disney companies. And my dad always hailed Disney as the gold standard. So I'm real happy that he was able to, we're able to have that happen.
I mean, you look at the longevity of the park, 20 years. I mean, that says a lot. I'm not sure what, but it says a lot.
Well, you know, my dad, he taught me a lot. He taught me about persistence, and he willed the place into existence, and he willed it to keep going. He just kept on coming up with great rides, and what really kept it going is the people, because people loved it. They would come back more and more every year, and it grew and grew. It really was it was a phenomenon.
Well, the book is called Action Park, Fast Times, Wild Rides, and the Untold Story of America's Most Dangerous Amusement Park. Andy Mulvihill joining us this morning. Thank you, Andy. Thanks for sharing some of your memories, and people can get the book and learn the rest.
Absolutely. Hey, look, with this lockdown, this is a great escape. Jump into this book, read it, and you'll be taken away and really experience what it was like in the 80s and one of the wildest places in the world. But thank you so much for having me.
You're welcome. Read it and be injury-free in your home. Thanks, Andy. Have a good one. With a career that spans 3 decades, R&B superstar Brian McKnight has sold over 25 million records and has garnered 17 Grammy Award nominations. His 20th studio album, it's called Exodus. It's out right now, and I'm thrilled to have him with us. Good morning, Brian McKnight. Great to have you on Good Day.
Oh, it's so great to be here and to talk to you this morning.
Your 20th album. Did I hear a rumor that this is going to be your last album?
This is the last album of original material. I think I've said it all. 20 is a nice round number to sort of to let it go. And I'm really looking forward to the next chapter with my wife and I, and waking up every day and going, you know, what do you want to do today? Whatever makes you happy. And then we just do that.
All right. Can we talk about your beautiful wife, Leilani?
Yes, we can.
Oh, my gosh. Okay, so she really put down some rules for you before you got anywhere with her, right? No kiss, no nothing.
Well, it wasn't stated quite that way, but this is the way it worked out. She wanted to get to know me. She didn't care about who I was or how many Grammy nominations I had or if I had sold out the Hollywood Bowl during our time dating. She was like, look, this is me. And, you know, if at some point in the future I decide to be your girlfriend, that's when we'll hold hands.
How did you meet?
We met at a fitness convention in LA back in 2012.
Oh, and it was love at first sight?
It was definitely love at first sight. I knew that the day that I met her, that whoever I had been earlier in my life that was over. All of that was over and it was forgotten. And everything from that moment forward was about being the best man I could be so that this woman would want to spend her time with me.
I think of all of your music, how romantic it is. So is it just like an evolution of, I mean, clearly that's where your core is, that you're a romantic guy. But how do you come up with topping one album with the other?
That's the thing. I never was a romantic guy. I always wrote songs just based on writing songs. I didn't have a subject for any of that music that I'd written before. But every song I've written since I met Leilani has been about her and about our life. And the day I met her, I knew she was the one, because that's the first time I ever felt my heart actually beat for the first time. I didn't think I had one. And it's really been, it was a light switch to just change, because I knew that I was nothing until I met her.
I know that you really wrote a very poignant song about your friend Kobe Bryant as well, and also honoring Gianna and the friendship that you had. Talk to me about that.
All right, everyone, just want to say thanks for being here with us. We do have Arizona Governor Doug Ducey joined by other health officials giving an update on the COVID-19 surge in the state of Arizona.
Good afternoon, everyone. Thank you for being here today. I want to begin by saying I talked to healthcare leaders from around the state on Friday, and they told me some incredibly moving stories about our frontline workers, our doctors, our nurses, our hospital staff, everyone that works in healthcare, and all of our caregivers. So I just want to reemphasize to all of them how grateful we are for what they do, how much we appreciate their hard work and commitment, especially at this time of incredible stress, and how much we value them. And I know everyone in the room likely knows a doctor, nurse, caregiver, somebody who works for a hospital. Please also extend your appreciation. These folks are the heroes on the front line today for the people of Arizona, and I'm grateful for everything that they do. I also want to say I'm thankful to the people of Arizona. I've asked for a lot of patience, and I'm going to ask for some more patience as we go forward. This pandemic is incredible in terms of the sacrifices that it's asking all of our citizens to continue to participate. Our numbers continue to increase in Arizona. They're going in the wrong direction, and we're going to take some additional actions today to contain this virus and get back on track. And to do that, we will have to persevere, and it's going to be for some time into the future. Remember, you are safer at home. The virus is widespread. So if you don't need to go out, don't go out. I know there are many last Friday, Saturday, and Sunday that didn't go out. You are safer at home. So if you need to get something done, get it done, get home. personal responsibility and responsible behavior can go a long way to slow this virus. Here are Arizona's latest numbers. I'm saying they are going in the wrong direction. I want to share with you the brutal facts of our current situation today. We have 74,553 COVID-19 cases. On average, we have 2,857 average new cases per day. And we have lost 1,588 Arizonans. So my heart and condolences go out to all the families of Arizonans who have lost loved ones through this crisis. And we're going to do everything we can to protect people in this state going forward. This is a dangerous virus, and we need to slow it down and contain it. Also, this is a global pandemic. It's affecting all of our states. And Arizona is not alone right now in terms of where we are on record cases and record hospitalizations. You'll see that most of the record cases and record hospitalizations are the West and the South. We were able to visit with the coronavirus task force this morning. Dr. Deborah Birx, Dr. Anthony Fauci, Cabinet Secretary Azar. Dr. Birx is actually in New Mexico today. She was in Texas yesterday, and she'll be in Arizona tomorrow to talk about additional measures that we can take here in our state. And we're grateful for their partnership and responsiveness. This is a graphic from the New York Times. 29 states have seen increases in COVID-19 cases over the last week. In Arizona, we are seeing an increase higher than many of these other states. There are only 4 states in the U.S. that are on the decline. So the time of additional action is upon us. This is new reported cases by day in the United States. You can see the steep spike, the flattening, and a beginning of decline, and they are on the rise again. And we want to do our part in Arizona to bring this number down. This is our weekly COVID-19 cases by age. One thing that Dr. Birx mentioned this morning is we are seeing a different spread of the virus at this time in the United States and Arizona versus what we became so familiar with on the East Coast in March and April. We're seeing increases in young people. And in Arizona, that's making up a large portion of our new cases. If you look at the blue demographic here, that's ages 20 to 44. And that's a much larger number of cases and an increase in those number of cases. We know statistically that these folks were not in harm's way from what we saw in terms of mortality. But we have new information because of these cases today, and it's a message that we need to get out far and wide in the state of Arizona. Now, if you look at hospitalizations, we've had a lot of focus at this table about making sure that we care for folks that are in our most vulnerable category, and that's someone who is elderly with comorbidity, at high risk, or underlying chronic health conditions. And that is the largest part of our hospitalizations at 40%. But I want you to look at the 22% that are hospitalized that are age 20 to 44, okay? If these folks who are in that category have comorbidities, and Dr. Birx pointed out specifically obesity and diabetes, you are at high risk as well. So we want to slow the spread of this. We want to stop the spread. If you have not gotten this yet, you can avoid it, and we want to make sure that you have all the care and resources if you are in one of these positions inside our hospital. And we also want to make sure if young people get it, oftentimes they are going to recover. But they can also share it with mom or dad or grandma or grandfather. And that's a message we need to amplify. I want to go through the numbers in Arizona specifically. I've already mentioned they're going in the wrong direction. This is the gating criteria that we've used, but today Arizona is remaining on pause with additional steps to slow the spread. We last met on Thursday, so don't expect a huge change in these numbers. Our COVID-like illness is up in emergency rooms. Our COVID patient hospital bed use is up, and our percentage of positive tests is increasing as well. On symptoms, we want to see a downward trajectory in both influenza and COVID. We're not. We're seeing it going in the wrong direction. If you look at the gold line, that's the flu, influenza-like illness, and the flu is behaving like the flu traditionally behaves. What's different is COVID-19. They call it a novel virus for a reason. That's unique. It's going in the wrong direction, and it's climbing. It's something we have to pay attention to. In terms of cases, we want to see a downward trajectory for a 14-day period or a downward trajectory in positive tests. This is where we are. Now, I don't know how well you can see this on your screen, but if you look at the cases, the first case happened in Arizona. This was here in late January. We declared a state of emergency on March 11th, and we saw cases, but no real increase in cases for weeks and weeks and weeks. And if you remember, stay home, stay healthy, stay connected, that ended on May 15th. You can see for 2 weeks, pretty steady, and then we've had an increase in cases for the weeks following. So from the actions of really slowing that spread down, slowing the virus down, a 2-week lag, and now we're seeing the increase in cases. And I want you to see this so you can see that we can take some of the steps that we took to turn this in the other direction. And it really just re-amplifies the message that you are safer at home. This is our percentage of positive tests. The blue mountain represents the number of tests that we have and the increase in tests. The gold line shows the positivity of tests. Again, headed in the wrong direction. So we've got more tests. We have more positive cases. And an increase in positive cases demonstrates that we have more spreading of this virus. So we're going to test more so we can isolate who's necessary, slow things down, and reduce the cases and positivity. So what we'll want to see is the blue mountain grow in terms of tests that we conduct, and the gold line bend down to lower positivity. Hospitals. We want to make sure we can treat all patients without crisis care. These are our hospital beds in Arizona. Gray represents availability. Blue represents inpatient beds in use for something other than COVID-19. And gold represents COVID-19 patients. So you can see an increase in the use of hospital beds and an increase in the number of COVID hospital beds in Arizona. Now, this does not include the beds that we have prepared for surge availability if necessary. This is just our current hospital capacity without factoring in surge capacity. This is our intensive care unit, ICU. If you get extremely sick, we want to make sure we can care for you. You can see the availability in gray. You can see blue is other than COVID-like illness, and you can see the increase in COVID-19 cases inside our ICU facilities. This doesn't include surge capacity. If you remember, we went and did the press conference, much different than this press conference, on April 9th at St. Luke's. So we have been preparing since March, April, and through May for what is upon us in Arizona right now. And we are prepared for what is coming. This also is a graphic that will show you that we've pretty much been, in terms of ICU beds, flat in terms of non-COVID-19 patients and increasing in COVID-19 patients in Arizona. Ventilators, we've got a lot of availability on ventilators, although we do have an increase in terms of COVID-19 patients using them, but we have plenty in our stockpile if necessary. I want you to know we're working very closely with our hospitals and our hospital leaders. They've been responsive, and we've worked to ensure that we can build capacity within this hospital system. We've done that through communication, partnership, relationship, and executive order. I want to thank Peter Fine at Banner Health, Linda Hunt at Dignity Health, Robert Gray at the Mayo Clinic, Todd Laporte at Honor Health, Bob Trenchell at Yuma Regional, Steve Purvis at Valleywise, that was formerly MIHS, and Judy Rich at Tucson Medical. I was able to visit with each of them, hear their thoughts, talk about our situation in Arizona, and I also want to thank them for their very good recommendations on how to contain this spread going forward. I'm going to turn it over to Dr. Christ, and I want to thank Dr. Christ again. She's leading our healthcare public health effort for her hard work and her team's hard work in Arizona, and talk a little bit about our hospital relationship in Arizona.
Thank you, Governor. So we've been working very closely with our hospital partners, the chief medical officers, the chief clinical officers, as part of the Crisis Standards of Care Plan, which is a plan that was implemented in Arizona at the end of 2014, beginning of 2015. We have a state disaster medical advisory committee. So this consists of members of hospitals, of healthcare coalitions, the medical boards, the nursing boards, groups of experts that come together. That group on Friday recommended implementing the crisis standards of care, which is really the framework so that facilities can be prepared if they need to have if there's a reduction in the type of resources or their ability to be able to provide care at that specific facility. So these standards, it was recommended that we implement that. ADHS, as of this afternoon, will activate the crisis standards of care. This will encourage our hospitals. We are recommending that they activate tactics to address space, to get their surge beds up, to make sure that they've got staffing and resources as necessary for that hospital's current situation. This is being put proactively into place so that hospitals who are on their own individual trajectory can implement these standards if necessary. We're asking them to prepare for surge and to anticipate fully staffing their hospitals. For those that do determine that they are in a crisis level, that they cease all surgeries except non-emergent essential surgeries and procedures that do not impair the care of other patients. We've asked them to activate their hospital incident command and do that on an increasing frequent basis. And then to make sure that they're establishing regular communication with their local health jurisdiction or their local public health department. Thank you, Governor.
Thank you very much, Doctor. Let's talk about testing in Arizona and our focus on testing and the information that it shows us. In Arizona, we've done over 677,000 tests. On the diagnostic or PCR, over 500,000 have been done, and over 166,000 on serology or the antibody test. We'll continue to focus on testing and increased testing. It's important. It gives us the information that we need. We're building capacity around testing. If you do want to get tested, and we'd like you to get tested, go to azhealth.gov/testingblitz. So we simply cannot let up. This is a time for us to put on a full course full court press is a state. We can't be under any illusion that this virus is going to go away on its own. Our expectation is that next week our numbers will be worse. It will take several weeks for the mitigations that we have put in place and are putting in place to take effect, but they will take effect. So over time, we'll see reductions and not increases. That's the goal. It will not happen overnight, but it will happen. And if every Arizonan will join in this and follow these steps, we'll slow this spread, we'll save lives along the way, and we'll see it reflected in this data. Of course, our objective is to protect lives and to protect livelihoods. And when in doubt, we are going to err on the side of protecting lives. We are going to err on the side of caution to make sure that we can deal with this pandemic in the state of Arizona. The objective is to slow the virus. The virus is not going away at this point in time. There is no cure. There is no vaccine. We want to slow it down. We've done that before, and we can do that again at this time. We need to do that again in this time, and we want to protect the most vulnerable. And the better we communicate and people realize how contagious and dangerous this virus is, the better able we will be to protect lives and protect our most vulnerable. The best way you can do this is to wear a mask. Mask up. I want to remind Arizonans to please wear a mask. I want to thank our local leaders for their communication on this with mask wearing across our state. We're also going to make sure at the state level with state resources that everyone has access to masks in our state. By the end of this week, not only will we have that program in place, every one of our correctional facilities, from correctional officers to inmates, will have a mask, and our inmates, upon release, are given 2 masks so they can begin their time in public wearing a mask. And the increased masking is working. This is the IHME modeling. Sometimes it's been on target, sometimes it's been off target. It projected in Arizona with mask usage on June 28th, yesterday, we'd be at 3891 in terms of cases. We hit that. We were at 3858. And they project, if you look at that descending line, with the continual use of masks, the decline that it will have in cases in the state of Arizona. So this gives us hope. It gives us a target and a plan. I think we all know this and understand it. If we'll hold ourselves accountable to doing it, it will make the biggest possible difference in the spread of the virus in Arizona. And I'm asking every Arizonan to do their part. I mean, as we know more about this, it really makes sense that this idea of physical distancing, of washing your hands, of staying at home where you are safer can make the difference in terms of slowing this spread. It's common sense, it's personal responsibility, it's good habits, but we're not going back to normal anytime soon. This is the way to protect the most people in our state. Let's make sure it's part of our routine. I also want to talk about a number that I don't think has ever come up at this press conference. It's a number that's on discussion with the White House Coronavirus Task Force. It's one that's been topical also on the governor's conference calls. It's called the, if you look at that symbol of R, lowercase t, you pronounce that, epidemiologists call that R0. And that shows the average number of people who become infected by an infectious person. What you want that number to be is less than 1. If it's less than 1, you're slowing the spread of the virus. If it's more than one, you're increasing the spread. And I've talked a lot about states that were hit first and hit hardest and hit before us. New York certainly received a lot of attention, and we learned a lot from what happened in New York. Massachusetts was in that same juggernaut of virus spread, and Charlie Baker helped me, the governor of Massachusetts, helped me understand some of the things that they did to get folks to understand how to get this below 1. And I want to show you where Arizona is today. We're at 1.18. Okay, so we're 18 basis points over 1. It wasn't that long ago that Arizona was under 1. And for those of you that want to check more into this stuff, that's the website at the bottom of the page, the //rt.live. You got to put both the slashes in or you'll go to the wrong website. And you can look interactively at where Arizona is, where every other state in the nation is, and you can see that it wasn't that long ago we were beneath 1. Okay, that's where we need to begin to trend again. That allows us to slow the spread and in time have other alternatives in terms of therapeutics, vaccine, cures, whatever our incredible medical professionals across the nation are going to bring to us. But until then, we have got to slow and contain this spread. So we brought this number down a bit in the last couple weeks. We've seen it flatten and lower. We need to bring it down further, and we need to bring it down faster. This gives you an idea of how the math works. If you have 3,858 cases on a daily basis, how quickly that can increase to 16,000. And if you want to plug in a number less than 1, or if you look at the number where Arizona was below 1, it's the inverse. You begin to see it slow and reduce, and our trends will begin to go in the right direction. And the best way to do all of this is to mask up. Remember, you're safer at home, and be responsible. The idea of physical distancing, respecting others' physical distance, is incredibly important. So the actions that we're going to take today are going to be to minimize gatherings and large congregations. Arizonans have been, by and large, terrific, fantastic, and responsible. But we have found some situations and categories where we need to take more aggressive actions, and that's what we're going to do today. Today's executive order will pause the operation of bars, gyms, movie theaters, water parks, and tubing. Effective at 8 p.m. today, with a targeted reopening date in 30 days, in order to reopen, these establishments will have to attest and adhere to public health regulations and post it for the public to see. Enforcement will be led by local public health officials and local authorities. I think we also saw the photos and videos of some of the things that were happening around our state this weekend. And the result of that has been an increase in the spread. So with this targeted approach, we know that we can pump the brakes in Arizona, we can pause, and our aspirational goal is to get these establishments reopened in 30 days with enforcement by county health officials, but we're going to be monitoring the data along the way, and we're going to do everything necessary to protect public health. We're also going to limit mass gatherings. So indoor and outdoor public events of 50 or more will be prohibited. The Department of Liquor Licenses and Control will cease issuing special event licenses, and this is applicable statewide. Cities and counties have the authority to approve larger events, but only if adequate safety precautions are implemented including physical distancing measures. New guidance for pools, again, with the focus of breaking up large gatherings. So this prohibits groups of larger than 10 from congregating together in or near the pool. Private pools, apartments, condos, and multi-housing complexes must post signage at entrances requiring physical distancing and limiting groups larger than 10 from congregating near the pool. We also want to bring as much certainty as possible for Arizona schools. Of course, our objective is to educate our kids as best as possible in the safest environment. At this point in time, we are going to delay the first day of school till August 17th. We'll continuously reevaluate this target date. We're working closely with Superintendent Hoffman with the objective to educate our children safely and successfully, and we'll continue to communicate along the way and continue to continue programs for kids in need. Also, we have great concern and love for our folks in long-term care facilities, skilled nursing facilities, and some of our folks that are developmentally disabled and have not been able to be visited by family. We want that to happen. We will resume that as soon as it's safe. So if you want to see mom or dad or noni or papa, we've got to bend this curve the other way. We've got to slow this spread. In the interim, we are going to be sending $10,000 per facility so they can purchase iPads and screens and digital devices so we can have more interactions between loved ones from home to long-term care facilities. There will be a lot of flexibility, but the objective here is that they will have devices that work, so regardless of how big the device needs to be, so that the person inside the long-term care facility can see their loved ones and communicate. And once it's safe, we have protocols for how visitations can begin again. And with that, I want to turn it over to Dr. Christ for an update on public health. Doctor?
Thank you, Governor. So again, just to go over those questions that you should ask yourself because you truly are safer at home, there are varying risks, and one of the intents of public health is to decrease risk to people. So your biggest risk is going to be around other people that you're not normally around. So you want to ask yourself, how many people are you going to be interacting with when you reach your destination? Are they going to be able to be socially distancing? Are they going to be able to wear cloth face coverings? Because if they're not physically distancing and they're not wearing cloth face coverings, that increases your risk. Engaging with new people that you may not know or know who are in their social cohort or the steps that they take can also raise your risk. And we do know that there are people who are asymptomatic or have mild symptoms and can transmit the virus to others. Can you physically distance at the location where you will be? Can you stay about 6 feet away from others? Will you be indoors and outdoors? So being indoors increases your risk versus being outdoors. The closer you are to people in your location, the higher your risk for getting COVID-19. And you want to make sure if you are high risk, so over the age of 65 or with a medical condition that puts you more at risk, that you really are thinking about that question. And if you do need to go out, that you are physically distancing. And then what's the length of time that you will be interacting with people? The longer you interact with somebody, especially at a close distance, is going to increase your risk significantly. So you just want to make sure that you're decreasing your time that you spend in close proximity with others, and it also protects them in case you might be infected and are asymptomatic or not showing symptoms yet. So we heard a lot about the troubles that Arizonans were having getting tested, not this past weekend, but the weekend before. And so we started to put different activities into place to reduce that, because we don't want Arizonans to not be able to get testing. And we were very upset with seeing what was going on. So this weekend, we increased testing in Maryvale. We partnered with Equality Health. We provided them with funding so that they could support their staff, get restrooms for their patients, and water, because we know that it's warm out there. We provided them with PPE, or personal protective equipment, for their staff. And then for everybody who got a test, we gave them cloth face coverings so that they could give them out to the patients. We also worked with CVS and Walgreens and AcosMD to encourage them to open up a site in that area. And currently we are working with ASU. ASU has a saliva-based test that they have available, and they can scale up pretty quickly, and we're looking to offer free saliva-based testing in the Maryvale area moving forward. And then one of the biggest asks that we have, this is kind of a call to action for those that have had COVID-19 and have recovered. There's a potential treatment called convalescent plasma that doctors are using to treat severe cases of coronavirus. People who have recovered may have the antibodies in their blood, so in the liquid part of their blood. Those individuals can donate that if they've, and that would be then given to patients who are having either severe or at high risk for having severe disease. So we're asking those that have had COVID-19 and recovered to seriously consider donating their blood and potentially their plasma. And then we've gotten a lot of questions about who can get tested. We have not changed our standing orders statewide. There are providers that do require symptoms. Our standing order, though, is for those that believe that they have been exposed to or infected with COVID-19. You are still eligible to get testing. We would recommend that you go to our website at azhealth.gov/COVID-19 testing. We now have 232 test collection sites on our map, and we continue to add additional sites. Some of them do require pre-registration, and we would recommend, in order to reduce the wait and to guarantee availability, go on the website and pre-register for an appointment. And then we will be updating guidance for Independence Day. So we know that a lot of people like to get together for the 4th of July and celebrate. What we are asking this weekend is that you celebrate the Independence Day with your immediate household or daily contacts. Don't expand that and have large groups either at your home or out in public. We need to protect our most vulnerable family members and friends. So if you've got grandparents or those that are high risk, it might be a great time to engage them through FaceTime or other video chat methods. And if you do have people over, try to stay outside as much as possible. Make sure that you're staying hydrated, physically distanced, and wearing a mask if you are not with your normal cohort.
Thank you very much, Dr. Christ, and thank you for all your hard work and that of your team. With that, I want to turn it over to Major General Mick McGuire. General McGuire has been serving double duty now for some time, not only leading our National Guard, but the Department of Emergency and Military Affairs, and from trying to stamp out the fires that are happening literally around our state to building our supply lines. He's been on the front line. So thank you, and give us an update.
Yes, sir. First, on the fire front, as I mentioned, only one Type 1 incident team still working, run by National Forest Service. They're down at the Bighorn Fire in Pima County in the Catalina Mountains, just north of Tucson. A couple of evacuation orders over the weekend. All the citizens were very compliant, and right now they're continuing to manage that, hopefully get that one under control. On the emergency management resourcing requests, it's been a short time, as the governor mentioned, since we last met Thursday. I am happy that Dr. Chris and her team submitted requests for staffing assistance through FEMA, and we were able to get medical assistance in the tune of about 60 total personnel to Pima County and to Yuma County to deploy into our hospital systems between Northwest Regional Medical Center, Yuma Regional Medical Center, and Tucson Medical Center. And we still have 820 of our great guardsmen on mission to support COVID-19. Thanks.
Thanks so much, General. I really appreciate all the work you're doing on every front. And but before we go to questions, I want to just say a personal thank you to the press and to the assembled media. I made an ask last Thursday that you help spread the word that you are safer at home and that the virus is widespread. I'm grateful. I know that was widely reported. I saw it in print all over the place. So I want you to know how much I appreciate it. It's going to go a long way to bend the curve in the right direction, and it's still the message. So I'm going to be saying it. The more it's amplified, the more Arizonans see this, the faster we will navigate through this to a place and position of higher safety and protection for all of the people of Arizona. And with that, Patrick, let's open it up for questions.
Good afternoon. Governor Ducey, 50 or less is what you said for public gatherings. Does that include churches? Does that include religious gatherings, worship? What are the restrictions there?
So those are public events that we were putting out there. I mean, you're safer at home is what we're saying, Peter. We want to see physical distancing. And we're going to continue to put that message out there. But those are public events, and then places of business where there was large congregation is what the order covers.
And the enforcement is by city, correct?
By local health officials, yes.
Okay. So the penalties are up to them if there are any.
Up to them, although the Department of Liquor and Licenses, of course, will be doing enforcement. Anyone that would not follow the executive order that we put out for bars and nightclubs.
And so how do the enforcements work with bars who also serve food? That's the loophole from the last time around. What's different this time around?
In the executive order, there's much clearer guidance as to how this is going to work, and it's going to limit the large congregations. And then we expect our operators that are going to be operating in terms of food service and dine-in to have physical distancing inside their establishment, along with the proper use of face coverings.
And for Dr. Chris, really quick, the testing delay today, the results being released, the data release delays, that's what I wanted to say. What happened?
So it's an electronic lab reporting file. So something happened with the file. It didn't get transmitted to the department in time to process it. So it will be included in tonight's processing. So we expect a larger number tomorrow because it will include the labs from today and the labs from tomorrow.
Howie, go ahead. Keep moving the microphone on us, Governor.
Hi, Howie.
Two things. One, I saw the order on bars. What about restaurants? Are we going to keep the rules the same for them?
No, this guidance goes specifically to bars and nightclubs and tubing. The guidance, though, in terms of physical distancing, what we've put out for restaurants is the expectation.
Okay, let's come back to bars. We were here in May when you said restaurants, not bars, and then your DLLC said, well, if you got food, and you allowed that to continue as shown by what happened in Scottsdale and Tempe. Did you screw up?
We're fixing it.
Okay.
We're fixing it, and we're going to continue to adjust depending on what the data and information is. I've had a graphic that shows us turning up or down the light and energy in the economy. I said when it comes to protecting lives versus protecting livelihoods, we're going to err on the side of protecting lives.
Okay.
We've got to break up large congregations. That's what we did so well in March, and that's what we're doing now.
Okay, then I'll just follow up on Peter's question because I want to make sure. You've always had, I guess I'll call it an exception for First Amendment protected activities. So I would assume that political rallies and churches are not subject to the 50?
The Constitution remains the supreme law of the land in Arizona.
Okay, thank you.
Yes, Governor, I just wanted to know what the
purpose of Vice President Pence's visit is tomorrow, and if you know any kind of an itinerary for that visit?
Yes, I believe things are changing, but it's basically to accompany Dr. Deborah Birx. Dr. Birx is going to Texas, Arizona. Today she's in New Mexico. Of course, you know that she's leading the coronavirus task force along with Dr. Fauci, and she's going to be in Arizona, and Vice President Pence was going to accompany her for the update on what's happening in Arizona. It's an official visit, and it's focused on health care and public health in the state of Arizona.
And then just one question for Dr. Christ. I know we have enough ventilators, that was obvious, and we have the surge beds, but do we have enough staff? And is there enough staff for St. Luke's if in fact that's needed?
So thank you, Stephanie. So we continue to work with our hospitals. We have requested our healthcare workers have been working for a very long time on the front lines, and we know that everyone is getting tired and there are a lot of patients. We have worked to request a federal medical assistance to come out and give some relief to our hospitals, as well as we are working on establishing a national contract that will provide a coordinated, centralized location where we, through the state, can provide staffing resources to our hospitals. So we are working on that, and we're almost in the process of finalizing a contract for staffing and running St. Luke's as well. We don't want to pull from the pool of Arizona nurses, so we are going with a national vendor as well for that.
Thank you.
Thank you, Stephanie.
Hi, Governor.
Hi, Jeremy.
I was wondering, with the delay in the start of the school year, what does that mean for teacher pay? Will that be less pay for teachers because they won't be working for as long as expected?
So the question I think everyone could hear, what does that mean for teachers? It's not going to mean less pay. Our objective here, of course, is to fully fund our schools, to provide all the resources and flexibility necessary. We knew no matter what or where we were today with the virus in Arizona, there would be some parents and kids that were in a position where they would not be able to go back into the classroom. What we want to do, what the objective is, of course, is to educate our children. We believe that can be done better inside a classroom. The question is, can it be done safely? But we're going to have resources for our teachers, and if we have to do distance learning again, it's not optimal, but it's something we certainly got much better at on the turn of a dime last time. There's some time, there's a lot of time between now and mid-August, but we're going to work with Superintendent Hoffman. We're going to be listening to our superintendents and parents, and we're going to have flexibility, like I've said before. I mean, we're going to be vigilant on this virus, but we've got to be flexible as long as we have this in our midst, and it's going to be for some time in the future.
Well, regarding the distance learning, I've spoken with some people in the education world who say they want to see more flexibility allowed for distance learning. It's permitted now, but they'd like to be ensured that they have the full funding per student, maybe without the requirement to have 5 days of in-person learning offered at these schools. Is that something you're considering?
Well, I'm listening to the superintendents and the principals, and I know they're listening to the teachers. I think when we released our aspirational reopening plan, it was informed by the superintendents of the public school districts. Our decisions will continue to be informed by the subject matter experts.
So might there be more flexibility offered on those distance learning options?
The objective is, yes, flexibility and resources, and we're going to say we don't want to do anything to be punitive, to punish anyone. We want to do what's in the best interest of Arizona kids and families in terms of educating them, and part of that is flexibility.
I have a
Hello, Nicole.
For each of you. Hi, how are you, Governor?
Good.
Dr. Christ, activating the crisis standards of care plan, couldn't this have been avoided? Isn't this where we did not want to go?
A lot of states actually have activated their crisis standards of care plan, so it gives the hospitals a framework that allows them to determine if they do get short of resources, how they can allocate those. The other thing that it does, though, is it also gives their healthcare workers some liability protection as well. So not all of our hospitals actually meet crisis standards of care just yet. So it was a proactive step by our hospitals.
Are most hospitals going to be moving forward with activating the plan, the scorecards, the algorithms of who gets what type of care?
Only if they get to a stage, and that would be on a case-by-case basis. So it would depend on if there was a shortage of resources of that specific kind, then they may implement that triage.
And then, Governor, healthcare professionals are telling us that your negligence in opening the state early, those are their words, not mine, have put them in an impossible position of having to soon decide who lives and who dies. How do you respond to them?
Well, the first thing I want to say is we've been focused for 3 months for what is coming at us right now. Of course, you're always hopeful that something like this is going to pass, but it is in front of us, and it's time for Arizona to act. In terms of the plans that Dr. Chris just talked of, in terms of backup and staffing that can be brought to the fore, the surge capacity that we have if necessary. It's not needed today, but we're anticipating that it will be there in the future. This is our time to act to save and protect as many Arizona lives as possible.
But if we would have followed the proper protocols to open correctly when we were supposed to, doctors wouldn't have to decide who dies.
We did. If you look back to the Stay Home, Stay Healthy, Stay Connected order, and when it was ended on May 15th, 6 weeks of asking Arizonans for dramatic sacrifice, the virus in Arizona was slowed to a crawl. We can go back to where we were in terms of slowing the virus, but in terms of what we were planning for and preparing for was if we were hit hard with this pandemic, and we are prepared.
We're going to go to the Zoom board next. Rachel Langang from the Arizona Republic. Rachel, go ahead.
Governor, do you have any regrets about how you've handled this pandemic so far?
You know, Rachel, no decision has been easy since we declared the emergency on March 11th. Every day there's been a set of problems that need solving. It has literally consumed nearly everything in state government. And all I can say, in addition that none of the decisions have been easy, is that I have made what I believe in my heart of hearts is the best possible decision to protect people's lives in Arizona and to protect livelihoods in our state. That has been the standard. I have deferred to public health along the way. And I want to tell you right now, I mean, I'm already letting you know that the next couple weeks going forward, to expect more cases in Arizona, to expect additional hospitalizations. The decisions that we're making today will allow us to navigate through this so that we can help as many Arizonans as possible. And then Lord only knows what the virus holds for us as we come into the fall. We'll want to continue to stay vigilant and flexible and, like I've said before, humble, that we want to deal with the problems as they come. We've solved each in their turn to date, and I'm confident we'll solve the ones in front of us today.
Good afternoon. Thank you, guys. To be frank here, the last 2 weeks we've seen an 84% increase in hospitalizations. You're laying out yourself that these numbers are only going to increase, and I fear that we're going to be standing here 2 weeks from now asking the very same question of why did we not take further steps today, here at the end of June? Why not implement a stay-at-home policy right now? Because you and I could go up to Prescott this weekend, and God bless the people of this state, but go outside of Scottsdale Fashion Square Park. And my concern is this weekend that we're going to go out there. Bars may be closed, swimming pools may be closed, but folks are still going out and about. For a month and a half, we have been urging people to stay at home, take precautions, but they frankly haven't, and I don't have much faith that the next week or two, again, God bless the people of the state, are going to be much different. Why not implement a stay-at-home policy right now? And the second question that I've got is, could you guys please lay out in layman's terms for this Arizona public? I was out there at Equality Health in Maryvale. Those guys are doing God's work there. We were over here at Banner where they're doing 1,000 tests a day. I know there are efforts from our healthcare providers. At the same time, thousands of people across the state do not have timely access to tests, and they're confused why. They're showing up at sites thinking they're a location. They're not a location. They're waiting more than a week to get results. People's parents are at hospitals. People's nursing home for their grandparents. There are cases there. Can you guys give in layman's terms why there is not more widespread testing and what the state needs in order to make that happen for them?
Sure. So I'll handle the first question first and then touch on the second and turn it over to Dr. Christ. We're following public health in terms of the decisions that we're making. The objective today is to slow the spread of this. If you look at where Arizona is today versus where we were on May 15th, we can get back to where we were. We need to reduce large congregate activities. That's what we've seen. That's what the actions are put in place right now. Now, I want you to know that I talked to healthcare leaders from around the state on Friday, talked about different options that were in front of us, and we're making a decision that is a targeted approach that will address the issue that's in front of us today. I'm confident, and I think Arizonans are smart and have common sense and will demonstrate responsibility.
Could it be on the table next week, a stay-at-home order?
I said I wake up every day, Vaughn, and there is an additional set of problems, and we solve them in their turn. So the humility of this is to not guess or speculate, but to prepare. Do you want to talk a little bit on testing, please?
Sure. So there's a couple of different approaches that we're taking because we understand how frustrating it is when people can't find a test and it takes a long time to get the result. So we've been working with our lab partners to get the additional reagents that they need to be able to run that, as well as the additional equipment. That just takes a little bit of time to get that equipment and to get it into the system. We're also working on bringing on large providers. So we know that we've got partners that will be doubling, such as Banner at the fairgrounds. They will be doubling their capacity. Embry Women's Health will be doubling that. We will be putting out ASU into different sites. They can run up to 100,000 tests for us on our contract. So we are working on that to get that out because we don't want Arizonans to be frustrated.
Are you aware of what that third platform that Sonora Quest says, that they're going to be able to process up to 50,000 tests? Are you aware of what that platform is, and could you inform the people of the state what that is?
So it's a new platform that hasn't, I believe, been used in Arizona before. I believe it comes from Europe, and so it's a high through output that can run quite a bit of tests at once, and there doesn't appear to be any issues with the reagents.
A timetable on that?
I don't know. That would probably be a good question for Sonora Quest.
I've asked them, so I'll let you guys do the follow-up with it.
Thank you, Vaughn. I also want to say that how important testing is. It's a real focus right now, the testing, and more testing. No excuses, but we were not at capacity on testing in May and parts of June. We have focused now on this. Arizonans, in terms of the demand, are also there. 232 sites this past weekend available for testing. The pooling that Dr. Christ attempted to put into layman's terms was something that Dr. Birx talked about this morning on the conference call, something that's going to take the United States, I believe, from somewhere from 500,000 tests on a daily basis to millions of tests, a tenfold increase. Arizona will be part of that, and it's something we're going to continue to expand.
Governor, Dr. Christ, thanks for taking our questions. I know that today you're announcing these measures moving forward. But we have spoken to a lot of people who said that the situation we are in now was foreseeable and to some extent, some of it was preventable. And I'm trying to get to the bottom of one specific decision that you made, and that was when you sort of opened the state back up, why it was that you prevented cities and towns and counties from enacting their own mask requirements. What was the goal with that decision?
So the goal wasn't around preventing masks. I mean, I think I've been talking about masks since sometime in April. The objective was more around safely and successfully reopening businesses and making sure that there wasn't confusion in terms of how those businesses reopened. We adjusted that around masks because we wanted to maximize mask use. So the idea around statewide orders, and when a statewide order is required or necessary, and I imagine there will be others in the future, it is a way to have clarity on how things roll out. With what we're learning about the virus and what's necessary, and nothing could be more important than wearing a mask and physically distancing, we've adjusted and provided that flexibility, and our mayors and county supervisors have risen to the occasion. We'll continue to do that. The decision today was informed by mayors and county supervisors. This would have been one. It would have been nice if it could have been done on a more limited basis, but we need to shut these things down statewide, and that's why you saw the executive order you saw today. And when you talk about reopening, you're going to see that flexibility that you're requesting, because I imagine it will be different in different parts of the state from rural to urban, and so that flexibility and authorities will be cascading in a way that protects public health.
And I apologize for putting you on the spot, but Dr. Chris, did you lobby your boss here to require or to allow mayors and county supervisors to require people in their communities to wear masks earlier on?
So we've been advocating for mask use since April. We know that the data showed that it decreased transmission to other people. That was in response to the local leaders actually asking for that ability.
I understand that you've encouraged it, and I've retweeted your tweets and your tweets about it, but encouraging and then allowing communities or yourself requiring the masks. I just don't understand why it was that when you open back up, that you didn't say you can open back up, but you have to wear masks, or we're going to allow mayors, county supervisors to say you have to wear a mask.
And just to clarify, Dr. Christ doesn't lobby me. She informs me on public health, and masks are a good idea.
My name is Jacques Bio. I'm a reporter with the Associated Press. This question is for Dr. Christ. We're at 84% today, and you're implementing crisis care. It sounds to me like we're going to be at 100 or over 100%. At what point do you expect that to happen in the coming weeks, that we're going to go over 100%?
It's really hard to predict, and we're hoping that the mitigation strategies will start to have an impact in the next week or two. We're encouraging by activating the crisis standards of care so that hospitals can prepare to get ready, to need to be fully staffed, to open up those surge beds in case there is a chance that we do go over their current licensed capacity.
But there's no target date you're looking at for that, any date that would be triggered?
It's really on an individual hospital by hospital basis, so it's very difficult to tell.
Thank you.
We're going to go to Zoom next. We're going to speak with Rocio Fernandez from KJCD. Go ahead.
Hi, Rocio.
If we're having a little bit of trouble there with Rocio, we'll go to Ben Giles from KJCZ. Ben, go ahead.
Hi, thank you. Can you hear me all right?
Yes. Hi, Ben.
Okay. Could you please provide some more details, a specific timeline for when all inmates in Arizona will have a mask available to them?
Many have masks right now, but by the end of the week, we have confirmation that all inmates, all correctional officers, and anyone released from state prison will leave with several masks.
We're going to go back to the room here. Zach, Crenshaw, and then we'll go to Dennis and Brad.
Hi, Zach.
Hey, Governor. Thanks for taking our questions. Appreciate all you. So the state continues to fumble unemployment claims, and soon evictions are going to start again. One mother told me today that she hasn't gotten any financial assistance yet. She had to sell her car, and that's affecting her ability to take her daughter to PCH for appointments. Meanwhile, hundreds of Arizonans, as we're going to report today, who have died are getting these debit cards mailed to them. How is DES still having these issues all these months later?
So the first thing I want to say is I'm thankful to the men and women in Department of Economic Security. They went from hardly anyone statistically being on unemployment in Arizona to over I believe at the peak, 1.5 million Arizona applications with billions of dollars going out in assistance. I know that the system has not been perfect. It's needed computer resources and capacity from additional servers. It has caught up. It likely is not still perfect, but it's much improved. And I see the number of dollars that are going out in terms of unemployment insurance benefits. So if you want to get us this Arizonans information, we'll happily fix it for them and make it easier and convenient. The other thing I want to say is unemployment fraud, unfortunately, is on the rise across the country. It's not only in Arizona. We have erred on the side of trying to help people who have been displaced and are in need. And by and large, those 1.5 million people that I named are good, hardworking Arizonans that have never asked for anything from the government and then all of a sudden found themselves with no income. And some others, a very small group, is taking advantage of that by defrauding the system, and they will be prosecuted to the full extent of the law. So on both those fronts, and then you mentioned also around renters. We're about a month away from that. Believe me, we've spent so much time talking about public health today and in the last several weeks, appropriately so. Protections are in place, and we're looking at this in the totality of where we are as a state, what's happening with the federal and state packages. We don't want to see anyone fall through the social safety net. And I would think our actions to date to stretch it and strengthen it should be evidence on how we want to protect Arizonans, and we're getting better. And hopefully, although DES will be much improved through the stresses and strains and investments that have been put into it, let's be hopeful that sometime in the future we can be working on having people safely and successfully participating in the private sector rather than government assistance.
I want to ask you one follow-up about enforcement. We've heard law enforcement, Chief Williams of Phoenix, say they prefer education to enforcement and citations. And people are wondering, if violators just don't even get a slap on the wrist, just say, hey, break it up here, folks, what will lead them to stop? So what is your message to police chiefs, your DPS director, and sheriffs when it comes to actually enforcing this?
Well, I want to thank all of our law enforcement leaders. You mentioned Chief Jerry Williams of Phoenix and the brave women and men of Phoenix PD, Heston Silbert, and what's going on with Department of Public Safety, all of our sheriffs and cops on the front line. I think the idea of communicating and educating is a posture that most local leaders have embraced. Of course, when necessary, there is enforcement. Our cops, they don't shy away from enforcement when necessary. And some of the things that we're trying to do, things that are more public policy campaigns of persuasion and best practices, like masks, in addition to the mandates at the local level, the officers have done a great job. Now, when it comes to some other things, like defrauding the government or doing something that is adverse to an executive order to slow the spread, it's not going to be so much communication and education. Hi, Dennis.
Good afternoon, Governor. Just want to ask you to follow up on enforcement. You've really not shown a lot of willingness to really crack down on enforcement. Let's take bars and restaurants, for example. For weeks and weeks, there were lots of videos showing downtown Scottsdale was packed. You kept telling us, you kept telling the public that we should be focused on the good actors and not the bad actors. Meanwhile, the number of cases continued to rise. And you're acknowledging the problem today by saying you're putting a pause on this to get those numbers down. Should Arizonans take you seriously this time, and can you guarantee there will be enforcement, not just communication, but enforcement to stop this from happening?
Well, Dennis, in the presentation earlier, you saw an executive order shutting these places down for 30 days. So I don't know how much more accountable bad actors could be held. And I want to also say that this wasn't all of the bars. This was some of the bars. But because of the information from public health, what we were able to witness, and what we saw as not possible through education and communication, became the most severe possible enforcement that we have in the toolbox.
Yeah, but
so I think that should demonstrate that when necessary, when needed, we will do what it takes to get the job done.
Well, I use that as an example. What about larger crowds? Are you guaranteeing that that's going to be cracked down? Can you guarantee that that's going to be enforced? Again, you've not shown a big willingness to go out there and enforce these measures.
I think you've seen a change in tone and direction because of the change in direction of the trajectory of this virus. So we are going to do what is necessary, and I mean whatever is necessary, to protect the lives and livelihoods of Arizonans.
And do you feel like you've done enough to communicate with the public with this crisis standard of care? Obviously, there's going to be a lot of attention on schools, the executive orders today. But the crisis standard of care is a very serious situation in the hospitals where at some point in the very near future, these health officials will have to decide who gets treatment and who doesn't, because you're going to be graded on a point system and given a color code. And if you score the wrong one, they're going to send you home because there's just no, there's no room there. Have you communicated well enough? Do you feel like you need to level with the public?
Well, I think we've got to communicate. I don't know that we can communicate enough. In terms of the communication with healthcare leaders and our healthcare facilities, I believe that the communication has been there. We're going to continue to communicate with the public. And if I wanted to err on the side of communicating anywhere, if you think about March 11th and the first executive order, it was around protecting long-term care, because one of the first things we knew in an avalanche of new information around a novel virus was it was the elderly that were most vulnerable. And if there was a message that was missed along the way, it was that young people were not in danger of the disease or the virus. We're seeing that young folks with comorbidities, diabetes, and obesity are at high risk, and how this virus is also being spread, and that it's got a high level of asymptomatic spread that makes it difficult to contract. So we're going to continue to communicate on each of these fronts, but just know with the providers in terms of access, support, and resources, that's something we're focused on every day.
We're going to go to Brian next. We're going to start to wrap up. Brian, thank you.
Hi, Bram.
Hi. Hello, Governor. A question I'm getting a lot about schools. You said at the top this is going to take several weeks to play out, and really as far as the eye can see, which is the view of many, many people we talk to. So why just say, you know what, we're going to look at opening on August 17th? How realistic is that? And maybe why not wait till the end of 2020 and say, you know what, folks, we'll try this in January?
So, Bram, August 17th is an aspirational date. We don't know what is in front of us in July and August. Of course it can change. I would think that Arizonans wouldn't think it's in the pioneering spirit that we have, that we would just throw in the towel and say, let's wait till 2021. Of course, options are on the table. But when I talk about that idea about being vigilant, being flexible, and being humble, we're not guessing. We're not speculating. We put out a date that delays the opening that's aspirational. TBD. More to follow. I don't really know what more to say beyond that.
Right. I just get schools in the routine, okay, of saying, okay, now we've got 7 more weeks, let's get ready again and see how far we can go.
Well, we've got to get ready to educate, regardless. I mean, we've got to get ready to educate. So whether that's distance learning or not, like I said, I think that's not optimal. And then the other thing is there are other services that are provided by the school in terms of lunches and nutrition. So all of that's going to be part of the planning. So regardless of what's in front of us, we still want to make sure that our kids are being educated, and if that's by distance learning or flexible other means, and then the other services that would be provided.
And I can go back to the bar, your answer to Howie's question about the bars. We knew immediately when your stay-at-home order ended, bars were supposed to stay closed, but they opened up. Why did it take 6 weeks to fix that?
We want to make sure that there's clarity around the guidance. We do want to open our economy. We just want it to be safe, and we want it to be successful. With what we saw with the numbers and the spread, we had to adjust this. And like I said, this was not all. This was some. But the only way to fix it was through executive order and enforcement.
And if I can, a lot of folks have a question about sports. Absolutely. Youth sports, high school sports, pro sports. Can you walk folks through how each of those is affected by what you're telling us here today?
So they're going to continue to be informed by public health guidance. I don't think anything has changed in terms of if a professional league wanted to play, it would be about the participation from a fan basis at this point in time. And we're working with county health officials to advise on youth sports depending on the sport.
But none of those they're all still, the council, go ahead.
The idea is where can we wear masks, where can we physically distance? This is why I'm talking a lot more about tests. Tests can help inform some of these decisions. So we want to make the best possible decisions. The objective here isn't to tell people no or you're not allowed. It's to turn the trajectory on the virus. So we want to provide some flexibility. Understand there's going to be some limitations.
Thanks very much.
We're going to go to the Zoom board next. This will be the last question. We're going to go to Mary Jo Pitzel from the Republic. Mary Jo, go ahead.
Hi, Governor.
Hi, Mary Jo.
Given that school is, in-person school is going to be delayed for a few weeks, but virtual can continue, what about children in foster care? Have you considered whether to continue the face-to-face visits that children have with their parents, or should that go back to virtual visits?
So thank you, Mary Jo. Of course, foster care has been a great concern for us through the pandemic. Our teachers are our best real-time reporters of abuse that does happen inside the home, and when teachers aren't inside classroom, they're not able to see what's happening with our children. Of course, the idea is I'm going to leave this to Dr. Christ and to Director Faust, but I would think with physical distancing, with masking, visits can continue and would be encouraged. So I want to again say thank you to the press. The communication around "you are safer at home" has helped save lives and slow the spread. And I would also like to close by saying, remember, arm yourself with a mask. It's your best defense against this virus.
All right, once again, we were taking a live listen in there to what Governor Doug Ducey had to say. Just wanted to reiterate some points for our viewers here, just saying that starting tonight, he's pausing the operations of bars, gyms, movie theaters, water parks, and tubing, limiting those groups of 50 or more. Those are prohibited. Pools are going to stay open, but of course, he's encouraging them to be limited to 10 people, also encouraging social distancing. We have more on that on our website, fox10phoenix.com. All right, so just want to say thanks again to everyone who is with us on the YouTube side, coronavirusnow.com, also on our Samsung devices. We do appreciate all of you tuning in here each and every single day. And here's a look at the latest numbers across the U.S. Of course, we were just listening to Arizona's numbers as the governor is trying to take some more action against COVID-19. But across the U.S., we do have a confirmed number of more than 2.5 million people who have been positive for COVID-19. We do have more than 125,000 deaths, and unfortunately, that number just continues to grow in states like New York, Massachusetts, Illinois, Michigan, Pennsylvania. Those are some of the ones who have been among the top for the highest number of deaths. So of course, though, population size is going to have a lot to do with those as well. Let's talk about a happy number, the number recovered. So we do have more than 685,000 Americans who have recovered from coronavirus. And as we do encourage you each and every single day, you can always go and get more on the latest COVID-19 news on coronavirusnow.com. Going to switch gears here a little bit, going to go off of the corona beat and head on over to the city of Chicago. Now, they have had a lot of different problems to deal with, including a very violent weekend. They actually had 18 people die over the weekend, 47 wounded. So the police chief did address all of that in a press conference that happened a little bit earlier here today. And so we're going to go and listen into exactly what the city is doing about this weekend full of violence.
Gun violence this weekend, 2 were children. One was just a few months shy of turning 2 years old. On Saturday afternoon, a mother and her 20-month-old son were shot in the 6000 block of South Halstead Street in Inglewood. The mother survived, the baby did not. Later that evening, an 8-year-old girl was injured when a stray bullet came through the window of her Inglewood home and grazed her on the head. Also on Saturday evening, a 10-year-old girl was inside an apartment unit in Logan Square when a bullet struck her in the head. She was later pronounced dead at Stroger Hospital. As a law enforcement professional, I can stand here and tell you that over the weekend, our officers made 22 gun arrests throughout the city. That's just over the weekend. And took 66 guns out of the neighborhoods. That's 22 gun arrests and recovered 66 guns out of neighborhoods just over the weekend. And just in the last 6 months, we seized 4,629 illegal guns in this city. This builds off the efforts in recent years, as Chicago PD has recovered 10,897 guns in 2019 and 9,659 guns in 2018. Over 10,000 guns recovered in 2019, over 9,000 guns in 2018. But that's not what I'm here to talk about. As a dad, standing alongside other parents up here on this podium, I struggle to make sense of the reckless gun violence that continues to take the lives of our young people throughout the city. What I want to talk about are the guns we weren't able to get to on time. The guns and the cowards, these evil bastards behind those guns that caused the senseless loss of life over the past weekend. And our officers are not immune from gun violence either. So far in 2020, 16 Chicago police officers have been fired upon. 16. 4 officers so far this year have been struck by gunfire. Our officers are not immune to this. Like Chief Waller said on yesterday, when is it going to stop? When we have young, innocent lives lost. We all need to be outraged, all of us, by this violence. This is not just a problem for Inglewood or Humboldt Park or any other neighborhood plagued by gun violence. We cannot compartmentalize the violence that is tearing families and communities apart. We are all part of this city. We all see its beauty, and we can no longer turn a blind eye to the violence here. I am pleading, please help us bring these murderers to justice. We are tapping every resource at our disposal to ensure these killers never have the chance to get their hands on another gun and take another life. But make no mistake, as I said last week, and as I will continue to repeat, we cannot do this alone. We need the help of the entire criminal justice system, our city partners, and most importantly, our community members, to step up and not only help us identify these perpetrators of violence, but to keep them off our streets until they get their day in court, and to keep these violent offenders locked up and off our streets. The street corner open air drug market is the pipeline to shootings and murders in Chicago. UUW arrests are the precursor to violence in Chicago. Open air drug market arrests are the precursors to violence in Chicago. Electronic monitoring and low bond amounts given to offenders endanger our residents. and flies in the face of the hard work our police officers put in on a daily basis to take them off the streets. This will make our community safer. I will continue to bring attention to the sheer number of repeat offenders who are given little to no jail time and low bonds and are placed on electronic monitoring that are not monitored by anyone and go on to commit more crimes. Like last week, Leroy Battle, who was arrested in August of 2018 for UUW and pled guilty and was sentenced to 18 months probation with special conditions. What did he do? He shot and killed 2 teenage boys on 79th and Luella on Father's Day weekend. With the help of our community members, we were able to charge Leroy Battle for these heinous crimes that robbed 2 teens of their futures. And I want to thank the residents again for their critical partnership. Open air street corners are the pipeline to shootings and murders in Chicago. UUW arrests are the precursors to Chicago's violence. Open air drug arrests are the precursors to violence in Chicago. When they have no consequence, violence continues. Full stop. We all have a duty and a responsibility to step up and put a stop to this. We cannot continue failing our children. We cannot continue robbing them of their future they deserve. I keep hearing this. I've been here 8 weeks. You're new here, Superintendent. You're new here. I will never accept, never, this level of violence. Never. Someone knows something about the murders. If you have any information, reach out to our detectives. You can also provide information anonymously through cpdtip.com. That's cpdtip.com. Silence emboldens, empowers those who continue to terrorize our neighborhoods. Now is the time to stand up and say enough is enough. For God's sake, for the sake of Chicago's children, come forward with any information you have to help us solve these crimes. I'd now like to invite up Chief Dinahan to speak on the ongoing investigations into this weekend's fatal shooting. Brendan.
Good morning. As the superintendent said, in order to solve these, we're going to need the help of everybody, including the community, because there's people out there who know who committed these acts, and we're going to need the information. So I know the superintendent already provided the website. Through our news affairs, we provide the numbers of the detective areas, again, assigned to these investigations. But in order to solve these crimes, the detectives need the information to move forward. So I'm just going to briefly kind of recap a little bit what the superintendent already stated. But in Inglewood, we had a 1-year-old child killed, and the detectives have been out there since the incident occurred, and they're trying to track the offending vehicle that was involved that shot into this red vehicle. The motive for this particular incident, we believe that they were targeting the father of the child. And a lot of times he would drive this red vehicle, and that's why they shot into this car. The detectives have already released a seeking to identify, which we will push out through our news affairs people, on a gray Infiniti vehicle that could possibly be the suspect vehicle. I'm working with the detectives now to get a video together as well to push out through our news affairs later on today to help identify this vehicle, and more importantly, the people that are inside the vehicle. Obviously, that's who we need. But the information's out there. The detectives need it at this time. And then unfortunately, the second incident that occurred not much later was a 10-year-old child over at 3534 West Dickens. And that child was just sitting inside when members downstairs, some members of a gang were just hanging out in that area. And then an opposing gang member from almost a block away decides to shoot down the alley. And once again, these bullets, you know, they're flying around and shooting over a block away. They don't hit their intended targets, but instead the bullet goes through the residence and strikes the child in the head. So once again, it's gang on gang violence. It's outdoors. It's shooting with a handgun, and the opposing gang, they know who did it. And at this point, we need the information. Once again, it was so far away that you could barely see the defendant on how far away he was from the group he was shooting at. For this incident as well, I just talked to the detectives. They do have some information on what they think are the suspect vehicle or suspect vehicles, and they are putting some pictures together, and I'm also getting a video together that we'll push out through our news affairs to help identify these possible suspect vehicles. But once again, it's not the car that did the shooting, it's the individuals inside of it. And those are the people that we need identified. And there's just no doubt in anybody's mind that we know, that people know who did these shootings. And we need people to, as the superintendent said, we got an anonymous tip line. You can call the detective areas anonymously. And we just need the information so the detectives can start moving forward and taking these dangerous offenders off the street. We have a 1-year, 10-year-old killed for no reason at all. And to get off the street quickly, and the detectives need the information. Thank you. First.
Good morning. I'm just really briefly going to talk about something that I think has been overlooked a little bit. In the past 30 days, we've seen probably hundreds of officers who've been injured in attacks during the protests, attacks at crime scenes, and just confrontations on the street that we normally wouldn't have seen were it not for this heightened tension that we're seeing throughout the country, throughout the city as well. Layer on top of that, the recovery of these guns. Every recovery of these guns that you see on the table here is really an armed conflict between a police officer and a criminal who's armed with some pretty significant firepower, as you can see there, extended magazines, semi-automatic rifles. And then layer on top of that what these officers have seen with the deaths, the murders of young children, responding to these scenes, processing detectives that are processing them as well, our crime lab personnel, our evidence technicians, and it's a pretty significant mental drain on a lot of these officers. So this weekend I became aware of several postings actually on social media from officers who have been dealing with the additional stresses that we've seen that have come over the last 30 days between the protests, the firepower on the street, and in particular the incidents involving these young children. So we're really concerned about that. We're concerned about always their physical well-being, and sometimes their mental well-being gets overlooked. So this weekend, I directed all of our command personnel to personally reach out to the officers who've been involved in these incidents, whether they've been physically attacked or whether they've played a role in investigating the murders of these small children. And I've directed them to personally reach out to them. We have a lot of resources available within the department. Sometimes there's a resistance to utilize those resources, but I've ordered our command personnel to reach out to those officers and just check on them, see what they need. Basically, what I said is recommend the employee assistance program to these officers. If you think that they really need it, order it. Their physical well-being is always forefront in our mind, but their mental well-being is sometimes overlooked, and we want to make sure that that's taken care of as well. So I'll turn it back over to the superintendent.
I'll take questions. Please go ahead. I wish I had time for political banter. I just don't have the luxury, given that the street corner open air drug market is the precursor to violence in this city, and that We need to hold violent offenders in jail longer in this city to help protect our children. I just don't have the luxury to deal with political banter.
But is it the drug market, the precursor, or the lack of investment in those neighborhoods and all the things that protesters have been asking for in the recent weeks?
On the longer term, you're exactly right. Investment in neighborhoods that have been blighted, that don't have much job opportunity, that don't have much by way of economic development, surely is the backdrop. And I would say if you dig further, poverty is a larger issue here as it relates to what happens. And I know many of you are TV media, but is there print media here from the Tribune or Sun-Times? So this probably likely part of this answer is much more for and I'll try to speak in a way that you don't have to keep up what I'm saying. So here's what these evil, murdering bastards do on the open air drug markets. They hire young kids that don't have any significant criminal history to be on these corners selling drugs for them and holding the guns and protecting them until they sell their allotment of drugs and turn it back over to these evil bastards. And they do that because these young people don't have significant criminal histories, and they're young, so when we arrest and clear the corner, they're in jail and out of jail. No one wants to incarcerate. We're not talking about mass incarceration at all when we talk about holding violent offenders in jail. We're left with clearing the corner because the corner is where the violence is centered around because it's so profitable. These corners are so profitable. Tens of thousands of dollars are made on these corners every day. And so these masterminds are not on the corner. They got these young people who are hand to mouth. They are there because there's no opportunity in their neighborhood. They're there because of the failures in many other social service opportunities that's just not available to them. That's why they're there, to feed their families. It's a bad choice. Without the help of mentors in my neighborhood, I would have been one of these kids. I grew up in a poor neighborhood. I would have been one of these kids. But my mom and my family and my school counselors and my coaches all kept me from that decision. Some of these kids don't have that mentoring, and they make that decision. And they're on these corners, and they're getting shot at, and they're returning fire. They're protecting their day's amount of drugs they have to sell to make whatever little money they make on the corner. And we're left with, as cops, arresting these young people, 15, 16, 17, 18 years old. And they get in the system. But they don't have lengthy records, so a UUW arrest is released. It is the method to the madness to have these young people with short criminal histories. They even gave them a nickname. They're called shorties. They're short in stature and they're short in criminal history. And it's an evil methodology. It's why they're on the corner, because it protects the mastermind. And it puts us in the position to arrest young people and put them in the pipeline to prison, which we don't want to do. That's not our point. So we're left with this mess as police officers because of poverty, because of no economic development, because of all the shortcomings in social services. This is the long version answer that I can't get on network TV because you only have sound bites. Not your. I'm not blaming you. That's just the TV audience. You only have so much time. You have to pay for commercials, right? So I want long version print to try to describe. We're not talking about mass incarceration. We're talking about a very complex, very nuanced criminal justice system that's not addressing the violence. These shorties are either the shooters or the victims. They are. And many of them are murder for hire to make a little bit more money to feed your family. We'll pay you a little extra to go over there and shoot this other gang. And then the retaliation starts. This is the complexity of Chicago's violence. I've been here 8 weeks. This is the complexity of Chicago violence. We must We must keep violent offenders in jail longer. They shouldn't get out early. If they get 3 years, do 3 years. New York did this. LA did this. And they're just as liberal as Chicago. Chicago can do this. We can have under 300 murders. But we have to keep violent offenders in jail longer. And you all have to tell this story. For God's sake, these young people are forced into these situations. Sometimes under duress. Sell my amount of drugs under duress. Go shoot and kill this other gang member under duress, or we're going to kill you. Police officers are stuck in the middle. We can't stand by and do nothing. We're going to do our jobs. We're doing our jobs. 16 officers were shot at this year. A squad car was shot up last week. We're doing our job. Yes, sir. More people, there's an impact of COVID. I got here right in the midpoint. I think late April is when I got here. In March is when COVID really became significant in our country. By mid-April, 3 Chicago cops died from COVID. And the shockwaves throughout this department and throughout the country were significant as it relates to what is COVID, will I take this back home to my family? And so there was a drop-off in police interactions with people, number one. Number two, because of COVID, our jail populations were affected because of the congregating in the jails. And so our jails decided to release more people so that they wouldn't be subject to the close quarters of a crowded jail. So more people were released either on bond, bail, electronic monitoring. So more people were released and less people were being held in the jail. 2. 3, our court systems are based on having juries. And because of COVID, we couldn't convene a jury. And so the criminal justice system shut down, except for Chicago cops. We kept working, we kept arresting people, and we kept recovering guns. But everything else came to a stop. And these murdering, evil bastards have taken advantage of these situations. That's why. Yes. So I'm not into food fights. I know it sounds like I am. I just can't look away when especially these kids are being killed. I just can't look away without advocating for collaboration, meeting in the middle, instead of the extremes of we can't keep any of them in jail, let's keep some of them in jail. Let us make our case, not mass incarceration, not all of them. I would have been one of those kids. So I'm not advocating for mass incarceration. I'm not pointing the finger. I've had great conversations with the state's attorney's office. I have had great conversations with the chief judge. And those conversations are continuing. And my hopes are that we make our case, for something different in Chicago by way of consequences. That's what I'm here saying. Not pointing a finger, not starting a food fight. I'm trying to make a case. Look at this table. 16 cops were shot at this year by these same evil people who killed a newborn baby. I'm trying to make the case that we have to have a different outcome when we make a UUW arrest or an open air drug market arrest. Because these two types of arrest are the precursors to violence in Chicago. And right now, there's zero consequence to those arrests. I'm sorry, she was before you. She hadn't asked the question yet, and then I'll come back. So one of the things we have been very apprehensive doing is continuing with overtime because of how we had to use overtime in the last several years, not just this year. That there's a limit to how many hours people can work. And as police officers, you know, I've been a cop 33 years. Tired cops make mistakes. They do. This is not the time to make mistakes as a cop. This is not the time to be on a job tired and make mistakes. And I'm responsible for that on the number of hours they work. I'm responsible. And I lose sleep over the decision to work them for 12 hours without a day off. So we didn't do it last weekend. I didn't do it Memorial Day weekend for that very reason as well. This weekend, we're going to give them 1 day off. So we're going to have an additional 1,200 cops every day. Additional 1,200 cops every day starting Thursday through Sunday. And we'll be deployed throughout our hot spots. We'll be working with city services. We're engaging our violence interrupters. And so it's a full court press. Our end game is arrest for the precursors to violence. So every day we're going to be clearing corners. Every day we're going to be clearing these drug corners to protect these young people from violence. But when we clear the corner, we're pleading with the court systems. Keep them in jail through the weekend. If we make arrests Monday, Tuesday, Wednesday, Thursday, we're pleading through the weekend at least. No, not for forever, through the weekend. Let's protect these young people who are a victim of their circumstances in many cases. They have no other opportunity. They're on that corner, but for mentoring, job, education. Some are personally responsible for that decision, but many are being manipulated by these evil masterminds in this drug market who are making tens of thousands of dollars a day from these corners. So long version question, but I had 2 cups of coffee, so I'm on a roll. Let's keep going. Who's next? 2 more questions, and then we're going to wrap it up. Thank you. Oh, wait a minute. Hang on. Let me try to control this a little bit. Who has not had a chance to ask a question? So she has not, and you have not. So you 2 are the last 2. Okay? Yes, ma'am.
So you talked a little bit about this already, but just going back about sort of what other help do you need in assisting with these young children who talked about their innocence, tragedies, or violence? And then I'm sort of just trying to back out what I'm hearing here from you don't want these young people dragged into the institutional justice system, and then also the longer sentences to child offenders. Can you sort of touch on those 2 points?
Sure. So what we have, and again, I realize my 2 predecessors have said similar things. I'm trying to dig deeper into this same conversation, this same debate. Hope I can move the needle a little bit on this debate. I understand McCarthy and Johnson had similar debate conversation, took the same stance with little to no movement in keeping people in jail longer that commit precursors to violent offenses. So I will say this. We don't want to arrest these young people from these corners. We don't see that as significant impact on violence because there's others that will come replace them. We realize the revolving door of this. There is an opportunity because I'm really a community policing person. We're just faced with a lot of violence. In a COVID situation, you can't get out in crowds and really do a lot of community policing right now. What we have is that ride to jail with these young people. That time, and Chief Waller brought it up to me a couple of weeks ago, we need to start mentoring these young people on that ride to jail. But we have to offer them options. In other words, if we say, get off the corner and stop the behavior of selling drugs, carrying a gun, we have to be able, as a city, to say, and let me introduce you to an option that will help you provide for your family, so that you don't see this as the only option. Does that make sense? So that's beyond policing, but it is policing, in my opinion. It is policing. And so I'm asking, and the mayor understands this, there's a lot of support around this. We just need a sense of urgency around this issue. This is an immediate impact. This is like right now solutions to these young people who we are having to arrest just to have some semblance of law and order. We can't just drive by the corners and let them do what they're doing. We have to, at some point, have an impact. And so we're not left with no plan. So the more immediate plan is more collaboration with our federal partners. As you saw last week, we had the Wicked Stones investigation come to a conclusion where several of these masterminds were taken to jail for federal charges with the hopes of long federal sentences for their murdering and selling of drugs and guns. We hope to have more of those in the midterm, not just the long term that take 1 to 2 years, but the mid-level investigation. We hadn't done that in a bit here in Chicago. We need to do a lot more of that. That was my 2-week assessment here, is that where's the mid-level investigation? Let's have some more immediate impacts on conspiracies to sell drugs, and conspiracies to commit murder, and conspiracies to be armed with weapons. That's my assessment in the 8 weeks I've been here. We need not just a street-level narcotics strategy or a long-term narcotics strategy, but that midterm, 2 to 3 months rolled up all the time with federal sentencing. But that is not what the federal system was meant to do, though. This is a stopgap measure just to meet the demand of the current violence that we see. That this is going to be City of Chicago's issue to deal with as it relates to what we are willing to accept as a level of violence in the criminal justice system in Chicago. The federal system was not meant for this, but we're going to push the envelope in this area. Yes, sir. Last question. Sure. Because we collect a lot of data, we know where our hotspots are for violence. And this is not the first 4th of July in Chicago, so we know where they have been traditionally during the 4th of July weekend. I would say this will be a little bit different than previous 4th of July weekends, given civil unrest, given COVID, and given the level of violence that we've seen because our jails and our juries and our other parts of our criminal justice system have basically not been open to full capacity for the most part. So we have the more recent data of where hotspots, where violence have occurred, and we'll deploy to those areas with the additional officers in a pre-deployment effort, if that makes sense. Thank you very much. I really appreciate it. Take care.
All right, guys, thanks so much again for being here with us. Just a heads up, we did have an inappropriate sign up here not too long ago, so viewer discretion is advised as we give you a live look here at what is being called the New York City Occupy City Hall. So just again, heads up, on the back of this girl's sign is an inappropriate word. So, but I wanted to bring this to your attention because obviously a lot of us have known and heard the name a million times, George Floyd. Now, he is the person who died while being taken into custody by Minneapolis police, and it has definitely sparked an outrage across the country. It's done a lot of protests like we're seeing live here in New York City. But there's a viral video that has been going around since this weekend. It's only 27 seconds long, so it's going to loop while I give you the story. But this appeared on Facebook Sunday night, showing a tense encounter between police and protesters. Now, in this user's footage, the squad car gets surrounded by these individuals it all starts to kind of accelerate erratically. People refuse to get out of the way. You can see then this squad car decides to speed off. Individuals were flying from the hood of the squad car, and there was many demonstrators who were obviously, as you can see, eventually thrown from the vehicle as well. So this is going to continue to loop while I give you the backstory of it. So it is the first violent encounter between police and protesters in weeks. This is prior to Sunday's incident. Interactions between the two parties had been relatively peaceful as far as what we've all been seeing. Now, there was a press conference that happened today. Detroit Police Chief James Craig said outside agitators that escalated into violent behavior, surrounded the squad car, and shattered a rear window, prompted that officer to accelerate, believing they were being shot at. It has been shared more than 13,000 times on Facebook. It's obviously drummed up a lot of commentary from audiences, but I did want to go back and show you that press conference of the Detroit Police Chief. His name's James Craig. He's addressing this situation. We're going to play it for you guys so that you can hear all of the details on what he says has unfolded since this incident.
So I'm going to walk you through as best I can the events from last night. As I begin to start our briefing, we're not even 24 hours into our investigation, but we thought it was important that we get the information out as quickly as we could. We also have a couple of videos we would like to show you in reference to last night. I know that what prompted certainly a reaction by so many was a video that was placed in social media. And so we're going to go through, show two videos. I also have still photographs of the damage to the police vehicle. So, as you know, we've gone many weeks now, protests daily. And during those protests, they were all uneventful, nonviolent, and certainly the department did and continues to support nonviolent protests. Yesterday was no different. It did start as a peaceful protest, but one thing that was eerily similar to what we saw last night was what we saw the first few nights of the protest, that clearly started out friendly, and then as the night went on, it became increasingly violent. The violence certainly was initiated by a few agitators. What we described, we know the images from those nights. Some of the, and I don't want to use the characterization as protest, because once someone begins to act violent, they move into a criminal status. And so we saw the railroad ties, we saw the fireworks, the attacks on police officers, the small boulders. But one thing that was very interesting when we look back at those 3 days of violence, there were some among the group who were clearly agitated. And what was interesting last night, the first time, as reported by a commander who did go to the scene, there was some presence of agitation by some. Again, the vast majority were there very peaceful. And so, as you can imagine, over the last week or so, the numbers of protesters have declined, and in kind we responded by deploying fewer officers. It was important to respond accordingly, given that we spent weeks with large number of officers making sure the city was safe. And we needed to get those officers back into our neighborhoods, and so we've done that. So yesterday was no different. Given the intelligence that we had, this was going to be a small protest. It started out that way, and at some point, the numbers grew to around 350. Not a large protest in comparison to some of the earlier ones we saw, but a commander who was a night chief officer, or chief duty officer, he responded to the protest location, made several attempts to try to meet with the organizer. And when he did so, he was confronted with a few who were very angry, shouted obscenities at him, and that was a clue right now that this is a very different type of protest. And again, not reflective of all. I want to stress that point because the vast majority certainly were friendly. And so as he tried to make that effort and obscenities were being shouted in his direction, he decided to back off and not try to engage further. So that was the first clue. Then at some point before the attack on the police vehicles, and it was 2 vehicles that were actually attacked, there was information that officers reported that several of the protesters were armed with hammers. Again, going back to those early days, you can see where, we knew that some protesters were armed with small boulders, railroad ties, and so that was concerning for me as we began to really start to look at what happened last night. I don't have the number of protesters that were armed with hammers, but it was reported. In fact, it went over our communications airway to advise officers who were there to use extreme caution because some of the protesters are armed with hammers. So the next thing that happened, and generally over the last weeks, we have basically shadowed the protesters just to make sure they're safe, particularly when you talk about being on a public roadway where vehicles are traveling. Our sole purpose was to make sure that they were safe, and yesterday was no different. However, on yesterday, the supervision made a decision to redirect the protesters to a more expedient route back to their start location. Right at that point, there was a lot of resistance. The agitation turned into anger, and a couple of police cars were parked in such a way to block the main road that they wanted to go down. As that happened, very quickly, anywhere between, we estimate, 25 to 30 protesters surrounded 2 of our police vehicles, 2 marked police vehicles. And as they did that, that's when what I described, the agitation, escalated into violence behavior. In fact, at different points in the video, you will hear what appears to be loud banging noises on the outside of the police vehicle. We're not sure if objects were being thrown or some of the signs they were carrying, they were using the holder to damage and hit the police car. We also know that as this thing began to continue to escalate, on one police car for certain, there was an effort to block the pathway of the police car. In fact, several members from the protest group of this 25 to 30 who were exhibiting violent behavior jumped on the hood of the car, and you can see in the one video that was in social media that the police car was slowly moving, trying to get through, and it wasn't until that same police car someone broke out the rear window. We're not certain in our investigation if it was a skateboard, although there's reports of a skateboard being used, but it took out the entire back window. And during our investigation, officers reported that once they heard the back window or rear window smash, it was very loud, they was not certain that they were not being fired upon. So it was important for them to get out of there for their safety and certainly the safety of others. So that's where you see in the video that they accelerated to get out of there in the event they were being fired upon. This is coming from the officers in the investigation. Although when you look at the video, you will not see the smashing of the window. We have forward-facing, front-facing cameras in both cars, so you'll get at least an idea of the agitated or angry state of a few. So with that, I'm going to go ahead and move into the actual video, and some of what I will say will be repetitive, but just to kind of give you an idea. So video 1 is coming from the primary scout car, I believe, and that's the one where that was depicted in the social media video. So with that, if we could start the video. And at the conclusion, I also have still photos of the damage. The sound will come on at some point. This is typical when the lights are first activated. There's usually no sign. Oh, this is the one without sound. So you see where a couple of the protesters are on their hoods. And again, this is the first car. This gentleman, he jumps on top of the hood, cover up their view. At this point, they're moving the car to move the protesters, but at some point, when the speed increases, I think the speed increased to about 25 miles an hour. That was just as the rear window was smashed out. And we're going to move forward to a place in the video where there's a female subject on a scooter. It was reported by the officers that the person operating the scooter had blocked the path of the officers several times. In fact, at one point, which we don't have video image of, she literally ran into the driver's side of the vehicle, damaging the driver's side front tire. And so, can we back that up just? I want your viewers to get a good look at the person to see if she's recognized, because we certainly want to have a conversation and investigate her for damaging property. So this is, I think there were several times, and this was well after the officers left the location where the 25 or 30 angry individuals were located. So we'll move into video 2. Now this is the second scout car. This is the one we didn't know last night, but apparently there were 2 scout cars that were attacked. As you can see, a group of angry protesters surrounding this police car as well. There's no indication that they jumped on top, and the sound should kick in on this very soon. Loud banging, that's actually angry group hitting the police car. And so this car also is trying to get out, and as he's doing so, and that was the extent of what transpired relative to this car. Again, the only damage to that police vehicle were the dents. So I'm going to give out pictures because I want you to see the still images of the damage to the vehicle. You'll see damage to the hood. You'll also see, of course, the rear window knocked out, some scratching to the side. We don't, unfortunately, have a picture of the damage to the front driver's side tire by the moped rider. So what's interesting as we continue to go through our investigative work, and again, I just want to advise everybody, we're not even a day into it, so I want to thank the professional standards team for sending out investigators yesterday after the allegations were made, and also the work that they're doing now. So there's still other video that we're combing through, but I wanted to read a text message, and I won't give you her name because we're going to try to interview her. But this is what she said in her text message. She said, "I was there and I was leaving because they were plotting to provoke the police. As I was leaving, I saw those same guys start hitting the police vehicle for no reason." So again, this agitated state that became violent was eerily similar to what we saw in the beginning days of the protests. And I want to just go back through the fact that we had deployed significantly larger groups of officers when we were faced with larger number of protesters, but also we were dealing with protests that became very violent. In this instance, we didn't have that intelligence, and so we didn't have the ability to readily deploy large numbers of officers to assist. So the officers did the right thing. They certainly left the location, and then after they left, to avoid any further harm, the protesters did left without any further incident. So at this point, I'm going to open it up for questions, and certainly we can give this. This is the one photograph depicting the rear of the scout car with the broken window. Picture 2 depicts significant dent on the hood. Picture 3 shows a scratch, not certain how or why. And so we'll give you all the pictures so that you can go through them and use what you would like. So with that, I'll take any questions that you might have. You know, I think if it was our same group of officers and how we dealt with violence during the early days, certainly it was a different response, but we had significantly more officers. It appears that the officers didn't anticipate being surrounded, although that has happened in the past. Of course, when I got briefed out by the commander, clearly my concern was, well, if you saw that there were some in an agitated state, that's usually a key factor that this thing may escalate. You know, going back to the written comment by the protester who left the location, she could see it. And we have others that have reported back to us that they saw the agitated state. It was just very different than what we've seen over the last several weeks where there was no violence. And so this was the first time. Oh, but to your specific question, you know, the first day when officers were trapped and attacked, cars damaged, we knew then that we needed to not put ourselves in a position where a group of criminals would surround and attack the car. So in this instance, they didn't anticipate it. They were just blocking the road to redirect, but they didn't think they were going to get the reaction that they got. And again, not reflective of all. We're talking about a group of about 20 to 30, and as you watch the video, clearly that group did not represent peace. Any other questions? As you can see, Kim, this was a quickly evolving situation. I mean, to warn someone to get off of a vehicle as the vehicle is trying to move, and then the fact that what's in the officer's mind? There's this loud crash or bang to the rear of the police car, and again, in their mind, as according to our investigation, they believed they could be shot at. They were being fired upon. And because of that, they had to take quick, evasive action. And when you talk about training, if you run into an ambush situation, the proper course is to get out for your safety. And that's exactly what these officers opted to do. Again, they didn't know it was, we don't know what broke the window. It could have been a skateboard, could have been anything. But whatever it was, it certainly created enough concern for the officers and their safety and to get out. In fact, what I'm also learning in the investigation is the two cars that were surrounded, when it was clear that the protesters did not want to go in another direction, they were wide enough or far apart so that they could allow the protesters to continue. But instead of them continuing, that's when you see them surrounding both cars. Again, we thought initially, yesterday, it was just one car, and it was actually two. Yes, it was the first one. And again, they responded and the speed increased. Again, if you look at the early part of that video that was in social media, it appeared as the officers were kind of slow moving, hitting their brakes, hoping to dislodge these individuals from the hood. And then all of a sudden you see the speed increase. We're estimating about 20, 25 miles an hour. And it was at that point we believed the back window was shattered out and they thought they were being fired upon. Well, I don't know about you. You said wait it out. So I think what we do, we wait it out. Oh, by the way, another important point, that as the officers were trying to move cautiously through initially, there were a number from that same group that were trying to gain access to the inside of the police vehicle where the officers were. So waiting it out, they were pulling.
All right, guys, I know we've been playing this press conference for you. We can always go back, jump into it, but I do see Garcetti is giving an update on COVID-19 in LA. Let's listen into that right here, live on News Now.
And slightly less. That's what helped us not only bend the curve, but start to push it down. Now, our infection rate is increasing again. It's estimated to be at 1.26. Not as high as when it was at 3 or more at the beginning of this, but worrying and increasing. We are closely tracking the positivity rate, that is, the rate of positives for every COVID-19 test that we do. It was as low as 4.6% in late May. Today it stands at 8.7% county-wide. In fact, 6 of the 7 indicators that we track to see what is coming around the corner are headed in the wrong direction. Only deaths continues to go down, and we know that's a lagging indicator, sometimes 2, 3, 4 weeks behind where we are today. Many of the individuals who have recently become infected, as I shared with you last week, are younger, 18 to 40-year-olds, who are now at least 40% of those infected, up from just 33% a month ago. And it remains critical that everybody, no matter what your age, owns taking control of this situation. We're also very closely monitoring our hospital capacity, because that's what we are fighting against, making sure our medical workers and our medical facilities are not overwhelmed, so that we don't lose more lives with frontline workers, so that we have the capacity to save lives if people have bad cases of COVID-19, especially our vulnerable, those who are elderly, those who have pre-existing medical conditions. Today, there are 849 beds, including 703 acute care beds and 146 ICU beds. This is fewer than we've had in a while. And while we can surge up again, and we may need to do that to build our capacity in hospitals and our convention center and other places, and we have an available inventory of ventilators today at 1,147. Again, this is in our hands, not just the hands of medical professionals. Hospitalizations are rising. They've now reached 1,732. We were averaging about 1,400, so now we've increased almost 20% above that. This is the highest number of hospitalizations since the height of the pandemic, when we were at 1,900, and our county projects that we will be at that old peak in just about 1 week. It's a 27% increase in just 2 weeks. We must not get to the place where COVID-19 overwhelms our hospitals. These projections are sobering. But I want to remind you, certain things remain strong because of you, because of the work that we have collectively done in and outside of government. Our testing capacity is among the strongest in the nation. Our contact tracing continues to grow. And our testing program at congregate living facilities has cut by more than half the number of deaths of people who are at skilled nursing facilities, because we went in there strong, and we're saving lives. Last week, I ordered more tests as demand surged at the beginning of last week to meet the demand. And in this past weekend, 18,500 people were tested. In fact, now more than 1 million people who live in the county of Los Angeles have now been tested through our centers. And now we have the capacity to test 18,700 people at 23 city and county facilities, in addition to 82 other locations like your neighborhood CVS pharmacy or community health centers that now offer testing, and of course through your healthcare providers, which we want to remind people can also do tests when you have symptoms. But whether you have symptoms or not, you can get a test through a city, county facility, and I'll remind you one more time, it's at coronavirus.lacity.org/testing. Results are coming back an average of 1 to 2 days. We are able to meet that capacity, including in the largest testing center in the United States of America that we know about at Dodger Stadium. And in addition, we've added nearly 300 City of Los Angeles employees who I want to thank for stepping up as frontline workers to be contact tracers under the supervision of our County Department of Public Health and Dr. Barbara Ferrer, who's been doing, together with her team, an incredible job tracking and tracing. As a member of the contact tracing team reaches out, it will appear on your phone as LA Public Health. Please, please answer the phone. And another thing I want to say too is some folks are not reporting many contacts. They're only saying 1 or 2 names. Maybe they fear being fired at work. Maybe they think it's going to go to other government officials and betray their status in terms of their immigration status. These things are false. We need you to just tell us so we can tell the other people who might be infected to quarantine themselves and to stop the spread. This information isn't shared with anybody. It is your health care privacy protected right. And we will continue making sure we can stop the spread together when we let those health professionals know, everyone we've been in contact with, so we can then let them know to stop this. We're making decisions always based on the latest data and guidance from public health experts, from doctors, from public health professionals. And if necessary, I've said we will always change course to save lives. Confronted by this data, it is now time for a pause. And over this weekend, the governor and his office reached out to me, asked me about whether or not we should close the bars, and I said, you have my 100% support doing that. I'd love to see more and more of the economy open up, but we simply cannot endanger people's lives. He ordered bars closed in several counties, recommended in other ones who I hope will heed his warning, and bars that had become dangerous, with many people not abiding by the 50% capacity. Mixed with drinking and alcohol, they became a lethal mix of people crowding indoors across the country. And today, the county announced that beaches, piers, and beach bike paths will be closed over the July 4th weekend, beginning July 3rd through July 6th, and fireworks displays have been prohibited to discourage gatherings. I know how much we look forward to this time of year. I know that we love seeing those firework exhibitions, but not this year. This year, we have to think about saving lives, to protect what we have in this country, to protect who we are, and to make sure that our economy doesn't take more steps backwards. Our city and county public health orders, let me review, still prohibit gatherings with people other than those you live with. Getting together with family, friends, co-workers is how the virus spreads. When we get exhausted, it gets strong. When we get lazy, it thrives. And it only takes one infected person to spread COVID-19 through your network. We've seen stories of people who decided to have that wedding because it's only 30 members of their family, but they weren't all living together, and now a dozen of them are infected. Workplaces where people thought they could just throw up between workers in a factory cardboard, and they figured that the virus didn't live there, instead of actually putting up plexiglass and distancing people in a proper way, where there's now over 100 cases. We've seen in place time and time again that folks are not abiding by many of the rules that are out there. Those who are not must take control of this moment. And I know the county is beefing up inspections. We've offered to help in any way that we can jurisdictionally to make sure that folks are abiding not by asks, but by mandates that if you are going to be open, you have to abide by. We also, to remind folks, have hit a hard pause on opening any more businesses, such as movie theaters, bowling alleys or arcades, playgrounds for children, concert halls, theme parks, and other entertainment venues. Every day, we still continue to learn more about this novel coronavirus. I read today about how it can infect the cells in our brains, and how in Wuhan, China, over a quarter of folks infected had the infection also in their brains. The spaces and places where this virus interacts, where it spreads most easily, and we know that we will always use that information to make tactical and thoughtful changes to protect public health. Gatherings with people you do not live with are not allowed, and businesses need to abide by all, and not just some of the rules. Those mandates are not a menu. You don't get to pick and choose. And where we saw on the third weekend that restaurants were open, still county inspectors say that between a third and a half of restaurants are still not abiding by all of the rules. It might only mean one or two that you have to tighten up, but for other places, by the third weekend that we are open, please don't endanger the lives of your workers, the lives of your customers, and your own livelihood. Whether you want to think about it selflessly or selfishly, we have to take control of this moment. And I know that the county is talking about taking away those licenses from places that do not abide by those rules and regulations. While the governor and the county and I can issue orders, we can change courses, fighting COVID-19 is really our collective work. It's not the work inside government. It is like the honor system for all of us. It is the strength of what we did for 2.5 months and must do again, a shared responsibility no matter your age, your religious beliefs, your political views. We have to each do our part. And you know what? I'm confident that you can and you will. But these 2 weeks, as I mentioned, will be defining. And I'd like to remind businesses that we are requiring you to take critical steps to keep everyone healthy. And if you need to refresh what those rules are, go to coronavirus.lacity.org/business and follow the protocols that are there from the county, as well as helpful suggestions on those sites. We educate, we encourage, and enforce. But as long as we keep educating and encouraging, that's where we're going to win this war. Businesses, as I mentioned, don't choose some of them. They have to abide by all of them. And as a reminder, if you have 3 or more positive cases in your place of business in a 14-day period, you are obligated as a business to report that to the county public health department. Let me restate that. 3 cases in your workplace, if you're a boss or an owner, in 14 days, you need to report that so that we can track and help make sure your business doesn't get shut down, make sure your customers don't get sick, make sure your employees don't die. That's how serious this is, so please abide by that regulation. We're seeing people flaunt these rules with institutions and businesses that are over capacity and with folks gathering in backyards. When we don't follow these rules, we are saying we don't care about lives and jobs. My central message is this: whether we continue on this recovery journey is debatable. COVID-19 is taking control, and we need to take control back. So to young people, you are not immune. You can cause great damage, but you can also save a life. We see all over social media, no masks, people partying, doing whatever. And for parents, please take the responsibility. If it's a young person or a child of yours living in your home, make sure you too are helping us in this fight. To the general public, don't get exhausted, don't let up, don't start socializing in ways that are not permitted. Especially in these 2 weeks, don't have this moment result in us restricting more of what we can do and what the economy can do as well. And to the vulnerable, my message is very loud and clear. If you're over 65 or you have pre-existing medical conditions, this is becoming an increasingly dangerous time. While it is not mandated, it is strongly encouraged that you stay home during these 2 weeks, whenever you can. If you can stay home, we can make sure that you are safe. And you've always been the most vulnerable. 93% of our deaths are the population that looks like you, that is either seniors or folks that are with pre-existing conditions or both. And we're also seeing this begin to skew as well towards low-income workers in high-density surroundings, either at work or home. We're seeing the Latino infection rate go up dramatically and proportionally is now the highest of any ethnic group. In good news, we brought down the disparity of African American deaths through the testing that we've surged, the public awareness campaigns that we've done in the Black community, where we saw initially 9% of the county population and 16% of the deaths. That's now down to 11% of the deaths. And we hope to see that keep falling while we also look at this and always look at this through a racial equity lens. To everyone else, please do your part. Stay at home these next couple weeks when you can. Cancel any plans that would have been in violation, or even if permissible, use discretion in this critical time. And to everyone, wear your face covering, keep your distance, wash your hands. And remember that we are not powerless. We've been getting help from others and help from each other. For instance, Los Angeles draws strength on our status as a global crossroads in the world. And during these unprecedented times, we've had global partners who love our city, who have helped step up. We've been there for them in the past, they're there for us now. We built bridges and relationships with other communities. Even as others talked about walls, we reached out and built bridges. And we've seen that, whether it's foreign consulates, businesses, individuals, and diasporas from the beginning of COVID-19 that have reached out to help, translating into languages, looking for PPE in other countries. And tonight, I want to acknowledge one of those partners, Vietjet Airlines, which we're hoping will be one of the companies that will be able to fly one day directly nonstop to Los Angeles, who donated 750,000 disposable medical masks to LA. And I'm grateful to the US Embassy in Hanoi and Operation USA for helping make this gift possible. This massive donation is in addition to the 200,000 masks from the Taiwanese American Chamber of Commerce, 40,000 from the Taiwanese Economic and Cultural Office in Los Angeles, and 10,000 from the Vietnamese Consulate in San Francisco. These partners are choosing to donate masks because they know that wearing a protective face covering will save lives. It has done so both in Vietnam and Taiwan incredibly well. So to Angelenos who are wearing a face covering, I say thank you. And to those who are not, I say be responsible. Make sure that you are saving a life every time you wear a mask. Through all of this, we have to remember those painful moments at the beginning of this. We have to remember each one of our loved ones and our neighbors and our fellow Angelenos who have died at the hands of COVID-19. We need to picture those medical workers on long shifts today who are scared about the weeks coming forward. Whether they clean a hospital or whether it's somebody working in a grocery store, they're wondering, what do these numbers that I'm talking about each night mean to them and their family's safety? We have to think about families who haven't been able to see each other, police officers and firefighters on the front line who haven't gone home because maybe their loved one has a pre-existing condition. We have to think about those things that moved us at the beginning of this crisis to reach beyond our grasp, to find our better angels, to dig deep even when we were suffering economically, to do just a little bit more. In other words, to lead with LA love, to find that Angeleno spirit that is in each one of us. We need to reverse the thinking that nobody around us is infectious and assume everybody is. Go back to those pods in our household. Keep our economy moving forward by not endangering the gains we have made so that no more Angelenos have to suffer economically and no more lives have to be lost. I hope that message is crystal clear tonight, my fellow Angelenos. I'm so proud of everything we have done to lead. I'm so proud of everything you have done to protect lives. Let's make sure that that means something. And let's make sure that we take control back from COVID-19 starting tonight. So please continue to do your part by staying healthy and staying safe and staying at home. Strength and love and justice to each one of you. Thank you. And with that, I'll be happy to answer questions.
And our first question comes from the line of Claudia Prosciutto from KNX News Radio. Please go ahead.
Hi, Claudia.
And one moment, please.
Okay. Hi, Claudia. You there? Did we lose you?
Relating to COVID. I'm not a public health expert, but given the big reopening after Memorial Day and the mass protests that followed, I expected to see COVID-19 spread grow. We started to see warning signs earlier this month, but you and county leaders proceeded with further reopening, and I'd like to know why. You all keep saying that decisions are based on the data. Given what we know about the data, it was clear that it would take 2 to 4 weeks to see how the late May reopening and the protests might affect the numbers. My second question is regarding the City Hall corruption scandal. Court documents and the cases filed against Weezer and others indicate the alleged pay-to-play scheme has been going on for years. You've been mayor since 2013. Do you take any responsibility for, missing, red flags about potential misconduct at City Hall? Should you have caught this since it was during your watch? Thank you.
Sure. Let me answer the first one. So, first of all, we've followed the data closely. There's not evidence yet that the protest led to much spread, though it's something that Dr. Ferrer has hypothesized, but we haven't seen any conclusive evidence there. We have followed the data, and like I said, this is way below, in most measures, the peaks that we've had. This is about new indications moving forward. And we know that right now, for instance, as we did with farmers markets, with the construction trade, there are things we can do to make sure that we don't have our hospital capacity overwhelmed. But I think all of us recognize that we could not also strangle our economic situation and the prosperity or the suffering of people here in Los Angeles. That was unacceptable. We had unemployment rates above the Great Depression. We had people who were literally hanging by fingernails onto their livelihood. And so we have to balance those two things together. But at these moments when we see indicators, and we've seen indicators begin to come up, we have to take swift action, whether that's closing down bars. I have to remind people, because everybody says, why don't you do X, Y, and Z? The state says what's permissible. The county says what is actual. And as I've said many times, you cannot be a little island in a region. If you keep certain things closed in your city and people can go across the street and work out there, they'll bring that back from a public health perspective. If they go out to dine just next door or across the county border, it will have the same effect, and public health professionals have been very clear about that. The Bay Area has done a better job, in my opinion, of acting together than Southern California, and we're seeing even greater spread around LA County, a higher rate of increase in Ventura, San Bernardino, Riverside, and Orange. Second, we've seen Los Angeles City go down to less than its proportion in LA County for the first time in the last 2 weeks of infections, and LA County go down below half of the state numbers. So I actually think LA City and LA County, through testing, contact tracing, this isn't just about what's open and not, is doing a pretty good job. But we're surrounded also by folks that we don't have walls between us. If you can go someplace else, that is a threat to our public health as well. So I hope that regional leaders will act together on these things, and that the governor will look at a region and not just say, you guys have to close, here's some that's suggested, that one is free and clear. I think an area and a region should be mandated by the state or determined by those county leaders together to move together. So, we're well below days. Remember when we had 30+%, even 40% plus increase day over day? We're at 1 or 2%. Deaths go down. We're not at the peak of where we are with hospitalization, and we can surge up more. But these are worrying enough that it is time for us to do a hard pause, to step back on bars, as the county said, on beaches, fireworks, and other things, and then to do exactly what you said, see where we are 2 weeks from now. And as I always said, we're living in the gray. Sometimes we're going to take steps forward and sometimes steps backwards. And I believe in the people who are watching this right now to be able to do what is necessary to continue forward. In terms of City Hall stuff, no. If people want to do bad, I'm convinced there is no way that you can stop them. But they should be prepared to pay the price. And as I've told everybody, I have zero tolerance for the sort of disgusting corruption that we saw in this case and any other cases. And we are all here. This is all our watch. Certainly am not responsible for this, but all of us have a responsibility to root it out. And one of the things I've called for is making sure that people can't vote on land use decisions if they've taken donations from anybody related to or connected to anybody who is before the city. That's the way to finally root out this noxious weed. There's been some good ethics rules that have made it more difficult, but that, like we do at Metro, is the way to finally get rid of that, I believe, here at City Hall. But somebody who wants to break the law, who will always find a way, no. I mean, there's absolutely no red flags that could find that. But I hope that they pay the fullest price. Next question, please.
Our next question comes from the line of Robert Kobasic. Please go ahead.
Hey, Robert. How you been?
How you doing, sir?
Good.
A couple of things. Let's start with in terms of what we will do when it comes to protests that are scheduled for this weekend. And is there going to be some type of guidance for these protests to not continue, given what Barbara Ferrer underlined today, saying that she really does not encourage large gatherings? And also, when it comes to enforcement of the closures, Villanueva is already saying that he won't do it. So how are we going to go about enforcing these closures when it comes to the beaches and other places?
So the enforcement of closures is mostly on us. Even if we said every law enforcement officer and inspector goes out there, there are 10 million people in this county. So I've always encouraged each night, as I call it, the 3 E's. Education, let people know what the rules are, let them know again, let them know again, let them know again. Encourage, where we see people who are not abiding that, whether that's a city employee saying, hey, do you need a mask? Here's a mask for you at a park, letting people know that, hey, you're out of compliance, you got to tighten things up, and then enforce as your last resort. We're not going to turn Los Angeles into a police state. It's not even the most effective way, according to all the public health professionals, to get adherence to it. So we won't hesitate in workplaces and other places who are very clearly endangering their employees and their customers, whether it's a factory or whether it's a retail establishment, to work with the county to do whatever we can to enforce those public health orders. Again, that's a county jurisdictional authority, but I've offered whatever help with our city staff that they can use, just as we're doing with contact tracers. In terms of the protests, I have not seen any guidance from the county on that. I do think that in general, the main guidance they've said is to keep your social distance and wear masks, but people still can, obviously, and should exercise their First Amendment rights. This is a critical moment not to let up with that. So I've been very proud of people doing that, but anybody who is less than 6 feet from each other, and this also goes for our public employees. People have pointed out sometimes, whether it's folks from our Department of Transportation or Police Department or others, we should all be wearing masks. We should all be keeping our distance. We should all be making sure that we abide by that so that we can protect our First Amendment rights, and we will abide by anything that Dr. Ferrer suggests on that. But again, that's something that's just that's determined by the county and by the Department of Public Health. But no, I would not discourage people from continuing to have their voices heard, but always do that extremely safely. And in this 2-week period, please use your judgment, and wherever you can, stay at home. Thanks, Robert.
Thanks, Mayor.
You got it. Next question.
Our next question comes from the line of Mary Beth McDade from KTLA Channel 5 News. Please go ahead.
Hey, Mary Beth, how are you? Can you hear me? Go ahead, Mary Beth.
One moment, please.
Okay.
Please go ahead, Ms. McDade.
Okay, thank you. Yes, Mr. Mayor, with the ramped up efforts with the tracking and tracing, I'm wondering just how many in this surge in new cases either participated in demonstrations or had a member of their family or inner circle that did, because I know at the LA County press conference today, they mentioned that it was the actions that occurred 3 to 4 weeks ago. So that's one question. Secondly, I'm wondering, why are the bars being closed when it takes about 2 weeks for the virus to show up once you get it? Bars have only been open for about a week.
Sure. So on the second part, I think it's been clear around the country that these are big public health threats. So places that had been open longer, these are already dangerous clusters where we're seeing these are regularly the places where spread is happening. And couple that with the county inspections that showed many people over capacity and not distancing, it seemed clear what was coming. So it's better to cut that off now before we wait a couple weeks and have it be even worse. In terms of the protest numbers, I keep asking that same question. I don't know if there's a scientific way or not, or if the contact tracers are asking that question, but I'd be just as curious as you so the county can help give us some guidance, and that gets to Robert's question. Look, it is a sacred right to be able to go out and to protest, use our First Amendment rights, and especially at this critical moment for racial justice, I don't want to in any way discourage that, but I do also want to give people good medical advice. And we don't have any conclusive evidence that it's led to that, but we don't know that it hasn't. So I'm hoping that that will be something that contact tracers can inquire about, can see. So far, when I've asked that question, while Dr. Ferrer said it's logical that that could happen, that's not where they're seeing most of the spread happen. Remember, those are also shorter interactions generally, and they're outdoors. Where this thrives is when you're in a workplace or a home setting for a long period of time, sometimes hours, and that doesn't seem to fit the description of protests. So It might have some spread, I don't want to dismiss that, but it doesn't seem to be the primary place where this is happening. This is happening, as Dr. Ferrer said, probably because we had one pod for a long time, right? Our household. Then suddenly many of us are going back to work, and you've got 2 pods. And then it's that third one, which is maybe the relaxing of whether we should still abide by not seeing people who are not part of our household, the backyard hangout, the place where people are going to a small party. Those 3 things together is what her best theory is why this is spreading. You combine a few different places, and again, to my point where you assumed, look, I've been talking to these people on the phone. They said they're not sick. They got a test a couple weeks ago. I'm going to assume they're not infectious. We've got to get back to the mindset of assuming people are infectious, especially when we heard that sobering number that 1 out of 140 people in Los Angeles County right now are estimated. So, you get together with 3 people, there's a 1 in 50 chance that somebody is infected. You go through a grocery store or work at a grocery store where there's at least that many people, you can guarantee that somebody probably walked through there who was infectious. So we've got to get back to a place where we make that assumption. Instead of assuming the best, we should assume the worst. Thanks, Mary Beth. Next question, please.
Our next question comes from the line of Dakota Smith from LA Times. Please
Dakota.
go ahead.
Good evening.
Hi, Mayor. I have a question about the city's finances.
Sure.
The city's Budget and Finance Committee today approved a plan to allow nearly 3,000 city employees who are eligible for retirement to receive a cash payout to retire by January. Mm-hmm. And that plan went through the Executive Employee Relations Committee, which you serve on. So do you support this plan? Is this approach better than furloughs? And if so, why?
Yes, I do. I chair that committee, so it moved to the council from a meeting that I chaired with 4 council members and myself. We approved that plan, moved it out, because quite simply it'll save money, it'll save costs, and it can perhaps lessen the furloughs that we have, so provide more service. This year, it's estimated that our separation incentive program, and yes, you get a cash payment, but then we save money by not paying your salary, will be about $60 million this year alone, and about $90 million next year. So over a 2-year period, $150 million of savings, something that we badly need in the worst fiscal crisis that we have faced. We talk a lot about the economic crisis, we talk about the health crisis, the racial justice crisis, but certainly here at City Hall, we do face that fiscal crisis, and together with our labor partners, who I want to thank, just as we did in 2008, this was a smart solution to be able to help reduce some of the furloughs potentially and save the money that we need. But it will depend on how many people sign up. So we're encouraging those who are eligible and who want to. This is a good time to do that, to right-size things and to make sure that we can preserve services, reduce furloughs for those who stay behind, and save money. It seems to be a win-win-win. Thank you. And we have one more in Spanish, I think.
Yes, our last question comes from the line of Victor Cordero from Channel 62, Estrella TV. Please go ahead.
Buenas tardes.
Mayor, buenas tardes. I'm going to ask the question in English first, and then I'll do it in Spanish really quick. I know you're busy.
Thank you.
With the possibility of, we have more cases of coronavirus, with the possibility of closing the city again, are you planning on implementing the order of safer at home again? If so, will there be more help to the people that cannot be going to work because of the order to stay at home? And third, what do you tell the people that are actually working and they don't like the idea of closing the city again?
Yeah.
Si nos puede decir brevemente, con el aumento de números de casos, ¿existe la posibilidad de que implemente la orden de permanecer en casa una vez más? De ser así, ¿habrá más ayuda económica para la gente que no puede ir a trabajar? ¿Y qué le dice a la gente que sí está yendo a trabajar y que no le gusta la idea de cerrar la ciudad?
Thank you. Well, first and foremost, none of us want to go backwards, which is why this message is so important tonight. We still are in a safer at home order, but maybe you're referring to as strict as it was at the beginning, with some of the openings being reversed. As I said, I think we've gotten smarter, and we know better how to beat COVID-19, how to slow its spread. And if we remember those basic things of keeping distance, washing our hands, wearing a face mask, and by the way, workers should know their rights at their place of work, that if they have an employer who isn't providing them with facial equipment, a place to wash their hands, all of that stuff, that employer is in violation and putting them and their job at risk. So I believe that these next 2 weeks, we can ensure that this is a pause, and besides the bars and maybe a couple other small things, there aren't any big steps backwards. Because to your second point, I don't think that the federal government necessarily is going to be there again, and the federal government forgot many Angelenos, didn't help immigrants or people married to immigrants or the children of immigrants in our city. We saw people who were part of the so-called gig economy who didn't get the same assistance as others. We have to stop COVID-19, and we have to help people economically. But I'm very proud that in a couple weeks we'll have more assistance, $100 million in rental assistance. The Angelino card is well over $20 million distributed, and we're going to keep going. And looking at help for businesses to be able to pay their employees and to be able to keep going even if folks have to stay at home. So I'll say that also in Spanish, but to those who would be opposed, I would just say, I agree with you. I don't want to close anything either, but I also don't want people to die. And that's up to us, not up to a mayor, but up to each one of us. En español, yo quiero decir unas palabras. No quiero cerrar más en la ciudad de Los Ángeles. Y tenemos el poder a continuar con la reapertura de esta economía y la sociedad en Los Ángeles. Pero necesitamos a continuar con los pasos a mantener su sana distancia, siempre a tener una cobertura facial, etcétera, para continuar en este camino adelante. Es muy peligroso para todos nosotros, y yo quiero decir a la gente de Los Ángeles, los empleados de las compañías aquí, ustedes tienen derechos. Es muy importante en sus lugares de trabajo que su dueño, que su jefe tiene las coberturas faciales para ustedes, que nosotros tenemos los recursos que necesitamos para lavar las manos, etc. Sin estas cosas, su compañía, su lugar de trabajo es en violación de este orden de la ciudad de Los Ángeles. Y por los trabajadores que no quieran regresar a un cerrado de la economía, yo también, pero estos aspectos de nuestras acciones cada día son críticos, especialmente en estas próximas 2 semanas, porque hay desafortunadamente muchas indicaciones que el número de casos, el peligro de este momento está aumentado. Pero yo tengo confianza en la gente de Los Ángeles, y en mis palabras pues esta noche tener más detalles de estas acciones que nosotros podemos tomar a proteger la comunidad, nuestras familias, nuestros trabajos y nuestra ciudad. So with that, I'm going to turn to answering that in even more detail and updating all of our Spanish-speaking Angelenos on this. Thank you to everybody tuning in. Thank you for the work that you will do. And please, please go back to that mindset that we had just a month and a half ago, 2 months ago, of what we can do. And let's get through these 2 weeks and show that LA spirit alive and well again. Muy buenas tardes, Los Ángeles, y gracias por venir esta noche.
All right, thank you so much for being here again with us on this Fox stream. We do appreciate all of you tuning in. He was making those last remarks in Spanish, so we're going to go ahead and continue to move along here. I'm actually going to play something that happened yesterday, but I think it's important to play here for you on our stream because it has to do with not only COVID-19, but also our White House task force. So Dr. Birx and Vice President Pence, who's been leading the White House task force, have been traveling around. They were in Texas on Sunday. They're going to be here in Arizona tomorrow, and I believe they're going to Florida later this week. I believe on Thursday is when they're going to be in Florida. And so they've been meeting with all of these different health officials from those states that are seeing a rise and a surge in cases. And so I did want to go back and play it, even though it came from yesterday. Again, it's important to hear exactly what the White House team is doing to help the state of Texas with their surge in cases. So we're going to play it for you guys, and thank you again for being here with us on Fox.
I want to welcome everybody with us here today, and I especially want to welcome the Vice President of the United States, Mike Pence. Thank you, Mr. Vice President, for being here today.
Thank you, Governor.
I'd like to just start by kind of peeling back the curtain a tiny bit and explaining the way that Mike Pence has been working with the governors across the United States. So we have this weekly phone call that will include the Vice President as well as Dr. Birx, but in addition to that, probably at least once a week, I'll have the opportunity to visit with the Vice President about challenges or issues that may be occurring in the state of Texas. Sometimes it's me calling him, sometimes late at night or on a weekend, talking about a need that we have or something that we need to focus on, or other times it will be him calling me. Most recently, you might remember, on Father's Day, you called me and you just wanted a lay of the land. And we got to share each other Happy Father's Day with each other as we're working on protecting fathers and mothers and children across the state of Texas. And so, Mr. Vice President, I want to thank you and thank the Trump administration and all of your great team members for what you've done to help Texas as we navigate our way through the conquering of COVID-19. Speaking of which, I do want to just share a couple of things. One is, as everybody knows, during the course of April, Texans joined together with our fellow Americans to focus on slowing the spread. And we did exactly that, and that is what led to the beginning of the opening of businesses in the state of Texas. And then after the opening was announced on April the 27th, we continue to reduce the spread of COVID-19 in the state of Texas, so much so that all the way until the 26th or 27th of May, we went to the lowest positivity rate that we ever achieved during the course of this pandemic. It was 4.27% at that time. Well, we need to understand that COVID-19 has taken a very swift and very dangerous turn in Texas over just the past few weeks. Over just the past few weeks, the daily number of cases have gone from an average of about 2,000 to more than 5,000 per day. At the same time, hospitalizations have increased from about 2,000 per day to more than 5,000 per day. And the positivity rate that just 1 month ago was at 4.27% is now well over 13%. Now, one thing I said from the very beginning, and that is that Texas will follow data in making decisions about how we move forward. One thing I declared early on is we would be looking at that positivity rate because the positivity rate shows us a measurement of the way in which there is community spread in Texas. And with a positivity rate of over 10%, I declared early on, it would be an alarm bell for Texas to take action to rein in the spread of COVID-19. And that's exactly what we began to announce this past week. Measured steps to ensure that we are taking specific identified action that can target ways in which we can reduce the spread of COVID-19. Here's what I know. What I know is that Texans working together, we were able to slow the spread of COVID-19 in April and in May. And I know that once again, all Texans coming together and working together, we will once again slow the spread of COVID-19. Texas understands the need of so many families in the state to ensure they have the ability to provide for their livelihoods. Families need to put food on the table. They need to pay rent. They need to take care of their families. We want them to be able to do that. And hence, we know that we can do both, continue to allow businesses to open while containing the coronavirus. But it does require all Texans to go back to those strategies that we mastered. Wearing a face mask, sanitizing your hands, keeping a safe distance, and remembering this, and that is, if you don't need to get out, there's no reason to go out at this particular time. If you can keep your distance from others, that's a very good, safe place to be, and that is especially true for anybody who is age 65 or older, and hence is in a more vulnerable data set. You know, one thing remarkable about Texas, and that is that despite the increase in the spread of the coronavirus, Texas still has the second lowest death rate of the top 27 most affected states in the country. We cherish the lives of our fellow Texans. We must all come together and all work together to make sure we do all we can to continue to protect the lives of our fellow Texans. And it will take these, worn by everybody, in the coming days to make sure that we will protect those lives and we will slow the spread of COVID-19. Someone who has been a partner with us in this effort, who's provided guidance, help, and support every step of the way. Someone without whose help we really wouldn't be having a successful response to COVID-19 is the Vice President of the United States, Vice President Mike Pence. Thank you for your friendship. Thank you for your leadership.
Well, thank you, Governor Abbott. Thank you for those good words. And thank you for your leadership. From the very outset of the coronavirus pandemic, the White House Coronavirus Task Force, represented here today by Dr. Deborah Birx and Secretary Ben Carson, has been working very closely with your administration. And we're grateful for the partnership that we forged. President Trump wanted us to be here today. With the developments over the last 2 weeks, with the rising positivity and the rising number of cases, with a very simple message, and that is to you, to the people of Texas, we're with you, and we're going to stay with you. We're going to make sure that Texas and your healthcare system in Texas have the resources, have the supplies, have the personnel to meet this moment. The governor and I also talked today about the vital importance of testing. At this point, Texas is testing at an enormous scale across the state, but in our briefing today, we spoke about how we can accelerate testing, accelerate the returns on testing, and we'll be carrying that back tonight to the Coronavirus Task Force as well as to our private partners, companies like LabCorp and Quest, to make sure that Texas has the resources to identify this moment. This has been a helpful ground report, and we're going to take back the specific request, Governor, that you forwarded to us and your team has forwarded. But I want to also acknowledge that all along the way, from the time that we first unveiled the 45 days to slow the spread, cases and positivity in Texas were low and steady. You flattened the curve here in Texas. It's a tribute to the people of this great state. But about 2 weeks ago, something changed. And we wanted to get a report from you directly about that and make sure that you have the counsel, the resources, and the support to meet this moment. I also want to commend the governor for your decisive action. Reopening this economy, which began in early May, is a tribute to your leadership. And the steady progress in putting Texas back to work is something every Texan can be proud of. But with the development of these new cases, as you said, going from 2,000 a day to 5,000 a day, positivity rate going from roughly 4% to 13%. We're grateful, Governor, that you've taken the steps that you've taken to limit the kind of gatherings and meeting at certain places in communities that may well be contributing to the community spread that we're seeing in Texas and in states like Arizona and Florida and California as well. Let me add my voice to the governor's voice to say when we issue the guidelines to open up America again, we laid out a phased reopening plan. Texas took that plan and implemented it here in a safe and responsible way. But there was guidance throughout that applied to all of the phases. And chief among them was that people should continue to practice good hygiene, wash your hands, avoid touching your face, and wear a mask. wherever it's indicated, or wherever you're not able to practice the kind of social distancing that would prevent the spread of the coronavirus. And we would strongly reiterate that today. I know that roughly half the state is under local ordinances. Strongly recommend if your local officials in consultation with the state are directing you to wear a mask, we encourage everyone to wear a mask in the affected areas. And where you can't maintain social distancing, wearing a mask is just a good idea. And it will, we know from experience, will slow the spread of the coronavirus. Another aspect of this that we've observed, and Dr. Birx, I'll turn it over to her in a second, is that we are seeing in Texas and in Florida and other affected states a significant number of younger Americans that have contracted COVID. It is a good thing that we know people have contracted it, not because younger Americans without underlying conditions are particularly vulnerable to a serious outcome, but because no American under the age of 35 would ever want to inadvertently infect a parent, a grandparent, an elderly neighbor, or an elderly friend. And that's what I would say, and what Dr. Birx said on Friday to all the wonderful young people here in Texas. This is a moment where you really we have to put our arms around and protect the most vulnerable among us, and particularly seniors with underlying health conditions are precisely those for whom the worst outcomes occur. And so as we deal with community spread, as we engage in the kind of steps that the governor's directed here in Texas, we just encourage particularly all of the younger Americans among us. If you have a concern, whether you have the symptoms or not, go ahead and get tested. In any event, it's a good time to steer clear of senior citizens and to practice the kind of measures that'll keep our most vulnerable safe. But Governor, again, I just want to thank you. I want to thank you for what you've done in this state. When we hear that Texas has the lowest number of fatalities of the major affected states, that's a tribute to your healthcare workers, it's a tribute to your people, and frankly, it's a tribute to your leadership. Our objective is to keep it that way. Our objective is to save lives as Texas continues to reopen your economy and help to lead this country back to work. But I want you to be clear, we know we're all in this together. And Governor, you know I'm a phone call away. This team stands ready to work with you and to work with Senator Cornyn, your great delegation in Washington, D.C. We're going to make sure Texas has what you need when you need it. And with your leadership, with the cooperation of the people of Texas, and with God's help, I know we're going to blunt this outbreak, and we're going to protect our most vulnerable, and we're going to save lives. So thank you, Governor, very much. And with that, Dr. Birx would share a few reflections on what we're seeing, and she'll be having additional briefings later today, and she and I will be traveling to a number of other affected states over the next several days.
Thank you, Mr. Vice President, Governor, Senator. It's a privilege to be here in the great state of Texas, and particularly at this medical center. I love the motto, educate, heal, discover, because that's what has happened with our COVID-19 response. It's been a privilege to work with the health team here and the governor. We talked about your opening plan, I think, late Friday night. I think you worked 24/7 too. Late Friday night, sometime the end of April, where we talked through each of the aspects of the opening plan. And it was a very serious and safe opening plan, and you can see the impact of the opening plan and how it worked out. All of May, for almost 5 weeks. And then there was an inflection point, and I really appreciate the governor and the health committees really understanding that that inflection point was around test positive. That seems to be our earliest indicator of new cases, because we have enough testing now at the community level to start finding the asymptomatic and early cases, and we can start seeing even the increase in test positive before we see evidence of increased hospitalizations. And I think that is good to know that that's an alert system that we can trust, and it's an alert system that we can trust as you begin to control this. And we've been having a great meeting with the health commissioner and your health leadership at this medical center. And I think the concern that's been raised is what is happening now is very different than what was happening through April and May, where you were having outbreaks that were quickly contained because they were in a nursing home or a prison or a meatpacking plant. And somehow over the last 15 or 16 days, it's taken on a very different aspect through Texas. And you can see it in Harris County. You can see it in Harris County primarily. You can see the rate of increase is quite enormous right now, and you can see it in Bexar County and Travis County. Dallas is more steady in its rate of increase, but I think in talking to your medical group here and to all the Texans, what we are seeing here is a increased rate of hospitalization of 20 to 40-year-olds. And I think that really tells us that there is a lot of infection in the 20 to 40-year-olds. We know that's the primary asymptomatic group. But what it tells us in that asymptomatic spread, it's hitting those vulnerable 20 to 40-year-olds that have issues with comorbidities, maybe a little obesity, a little type 2 diabetes. And so when you're out with your friends, and I want to thank the governor for his action on the bars and really appealing to every Texan to wear masks. I think we know now there's scientific evidence that masks both keep you from infecting others, but may also partially protect you from getting infected. I think that's a new discovery and a new finding. And it's very encouraging to Texans to know that you can protect one another. I know it's difficult in the 30 and the 20s and 30-something, but really just here really to ask every one of them to wear masks, every single one of them to wear a mask. And if they're interacting with their parents and grandparents, they should wear a mask then too. Because we know now how many of them are asymptomatic, and no one wants to pass the virus to others. But we see from this very medical center that you have 20 to 40-year-olds in the ICU. Now, most likely they will recover because Texas has done extraordinarily well. But we have to protect one another. And so I really came here with the Vice President to really hear what was happening at the ground level, to get a report. Because in the end, it's communities that will stop this epidemic with great state leadership. And we are grateful to be here and to learn from you all and to take that back and take these best practices. Take the best practices of closing the bars and then following the impact. By getting masks, 100% compliance in Harris County and Dallas County and Bexar County and Travis County, and really get and see that impact. We have additional tools that we didn't have just 2 months ago. We have different tools to prevent the spread with masks and social distancing at a much higher and greater level. We know now with closing the bars. But we also have better therapeutics and better care and better knowledge about how to save people's lives. So we have a different tool set to bring to the people of Texas to actually curb the epidemic and stop the spread here, as well as ensure that everyone in the hospital does well. So thank you for the opportunity to meet for your staff. Thank you for all your staff coming in on a Sunday, spending the time with me. I am deeply grateful.
Thank you, Doctor.
Great. Dr. Carson.
Well, it's wonderful to be back here. I haven't been here for quite a long time. UT Southwestern has a very well-deserved, excellent reputation. I want to thank you again, Mr. Vice President, for the tremendous leadership of the Coronavirus Task Force. It's made a tremendous difference. It's wonderful working with governors like you, Governor Abbott, who actually pay attention to data and who are willing to be flexible for the sake of the people. It makes a big difference, because some people just get into their lane and they stay there no matter what's going on. And Dr. Birx is the only person that I know who works longer and harder than the president, doesn't sleep. So we appreciate that hard work for all the people on the task force. And as a congressional representative, Senator Cornyn, appreciate tremendous contributions there as well. You know, it's we've learned an enormous amount about this virus and about this disease over the last few months. And, you know, it is an evolving process. We're learning more each day. And the important thing is that we've learned a lot about how it spreads. I don't think there are very many adults in this country who don't know about the hand-washing techniques that should be employed, about the masking, about the social distancing. The problem is people aren't doing it. And, you know, this is actually within the hands of the citizens of this country. We get to determine how long this thing is going to plague us. It's sort of like a battery, a rechargeable battery. Every time it can infect somebody, it gets new life. But, you know, if you do the right thing and it's not infecting a lot of people, it kind of dies down. So we get a chance to really affect that the way we want to. And we want freedom, you know, particularly in Texas. But, you know, you have to look at the long-term freedom. And, you know, if we beat this thing back now, we get a lot more freedom in the long run. So I think we're on the way. We just need to disseminate that information, everybody in their sphere of influence, and to be the example themselves.
Thank you, Don. Senator Hillary.
Well, let me first start, Mr. Vice President, by saying thank you for being here, you and Dr. Birx and Dr. Carson. I think this is very reassuring to the 29 million people who call Texas home, because there's a lot of uncertainty, a lot of misinformation, a lot of fear. And I think just as as a number of you said, dealing with the facts and data, we can reassure the people of Texas that we'll get through this, and we'll get through this together. So, Governor, let me just say how proud I am of the great job you and your team have done. And I've known you long enough to know that you don't make rash or emotional decisions. You do it based on the facts. And this is, as we were discussing a little bit earlier, sort of like trying to design and build an airplane while you're flying it, because things that we thought were true proved not to be so. Things we didn't know, we now know. And so that's, I think it's a big deal that you're here, Mr. Vice President. It demonstrates a commitment that you and President Trump and the entire administration are making to the people of Texas and the people of our country. But in closing, let me just say there are a couple of things I heard today that really that stand out. One is when you turned to Governor Abbott and you said, whatever you need, whatever you need. So there's not going to be lack of resources available to kill this virus and to get life back to whatever the new normal is. And I think Dr. Carson must have some Texan in his roots, because I heard him this morning say, we will dominate this virus, not let it dominate us. Mm-hmm. There's nothing more Texan in spirit than that sort of attitude, Dr. Carson. So thank you for mentioning that. And finally, I'd just say the message I think that you've heard today and you continue to hear from the Vice President, Dr. Birx, and the Coronavirus Task Force is a plan executed properly and with prudence is called for. Panic is not called for. And so that's what I see happening here across the state and across the country. We will dominate the virus, Dr. Carson, and it will not dominate us. Thank you.
Thanks, Senator. Governor, questions?
Sure. Questions?
Governor, Mr. Vice President, I was wondering, with the COVID test positivity rates rising and the hospitalizations rising in Texas and in the Dallas-Fort Worth area, why is the federal government only pledging to extend federal funding for the community test sites for 2 weeks? Why not longer?
Well, we've when we stood up testing early on, we'd established a number of federally operated sites. There were 5 states that those were still conducted in. But and so several weeks ago, we consulted with the governor's office about transitioning what I think were 6 sites out of more than 600 sites that Texas is operating with the private sector. But frankly, in consultation with the governor and at the urging of both of your senators, we'll be extending that every bit as long as Texas wants us to. This is all hands on deck. We're going to make sure not only do we continue the testing at those 5 sites, but the governor needs additional public resources to expand testing. That'll be made available. We're encouraged on the supply side that in talking with NIMKID and the team here in Texas, that on personal protective equipment, critical supplies, that Texas has believes that they have a significant and abundant amount of supplies. But we told them that as we continue to build the strategic national stockpile, as we continue to operate our efforts at the federal level, that we'll make sure and backfill anything Texas needs in that respect. At this point, I think, Governor, you informed us that you suspended elective surgery in 4 counties, but it was encouraging to hear that only 20% of patients in Texas hospital today have COVID, which means that hospitals have a great deal of ability to expand their capability here, but we'll make sure that's the case. But on the testing front, there was a fairly routine winding down of those first test sites that were operated by the U.S. Public Health Service, but that was frankly, those decisions were set into motion before we saw what was happening in these states, and we'll continue them every bit as long as Texas needs them.
Well, Jack, I'll add to that. So, beginning several weeks ago, Chief NIMKID was working with officials in federal HHS to be able to receive a handoff of those testing sites so that the state of Texas would have operational control over not just those, but the goal and the capability was going to be able to expand even more testing sites and do even more testing. So there is going to come a day when those testing sites will be handed over from the federal government to the state, with us being able to have the full capability to make sure even more testing is going to be able to be achieved. I will add this also, and that is a partner in this process is UT Southwestern Medical Center. They are working collaboratively both with us, but on their own programs, especially here in the Dallas-Fort Worth area, to do expansive testing. And so there will be no shortage of testing either in Texas or in the DFW region in particular.
Right. Appreciate the question. Thank you. Please.
Mr. Vice President, Governor Abbott said on Friday that his biggest regret was reopening bars too soon. In that same vein, what part of the national response do you wish had been different or could have been better?
Well, I'll be honest with you, I serve alongside a president who's always eyes forward. He wanted us to be here in Texas today. I'll be in Arizona and Florida before the week is out, because we want to focus on where we are today. But I will tell you, when you look at the sacrifices the American people made over all 45 days of slow the spread, I think it demonstrated the resilience and the character of this country, and frankly, of the people of Texas. And it gives us great confidence, as the governor said, that having flattened the curve before here in Texas, that with the steps the governor is taking with regard to closing bars, preserving capacity by suspending elective surgery, encouraging everyone in Texas to wear a mask, and we encourage wherever it is indicated by local authorities as necessary, or wherever anyone can't engage in social distancing. It's the right idea. We're very confident that we're going to get through this, but we're entirely focused right now in this moment, and we're going to stay focused there today and tomorrow. Got one?
You guys are a collective
Last question.
voice today on the importance of wearing a mask, and you've all exhibited that behavior. Does that need to come directly from the president, from the top? And does it undercut the message of the task force when he has implied that wearing a mask could be a political statement against him? Does he need to actively encourage Americans to wear masks, as you guys have today?
Well, the president tapped me to lead the White House Coronavirus Task Force, and part of our guidelines to open up America, again, encourage people to wear facial coverings where social distancing was not possible. So our administration is promoting the practice, but when the governor and I talked this week, we talked about the importance in this moment of calling on people across Texas to wear a mask. First, if you're in the 50% of the state that requires it locally, we encourage you to adhere to local guidance and listen to your local health officials, because they're tracking what's happening in their community every day, and the guidance they give about when to wear a mask, when it's appropriate, when it's necessary, is important. But for anyone, if you can't maintain social distancing, which is that if you're going to be within 6 feet of people for more than 15 minutes, it's just a good idea to wear a mask. And I would add, I thought Dr. Birx made a very compelling comment, and that is also say to young people, with everything we see happening here, with the rise of cases, particularly among young people, if you're going to go see mom and dad, if you're going to see any elderly friends, a good time to wear a mask just to make sure that no one would inadvertently convey the coronavirus. So it's an important message. We're here to convey it on behalf of the administration, the White House Coronavirus Task Force, and the President, and we'll continue to do that. But Governor, I want to thank you again. Thank you for your leadership. We'll be following up on the discussions that we had. I appreciate the Senator's support of the CARES Act legislation, resources, and I'll reiterate the promise that he quoted, and that is to you, people of Texas. We're going to make sure you have what you need when you need it, and we're going to get through this. When we look at the path of the coronavirus, everything the people of New York and New Jersey and Connecticut went through, New Orleans, Michigan, and then the steady state that Texas managed until just the last few weeks. We know we're going to get through this, and we're going to get through this together. So thank you very much, Governor. I appreciate it. Thank you all.
Could you briefly comment on the reports that Russia offered to pay bounties for American troops? Was that part of the president's daily briefing?
Thanks.
See you on the plane.
Okay.
Hi, everyone. I'm Frank Malakote at KTVU, Fox 2 here in the San Francisco Bay Area. I'm an anchor and reporter there. My guest is a small business expert and the CEO of Shadow, and he's got some helpful advice on how small businesses can stay afloat during these COVID-19 times. Let's say hi to Ethan Slotkin. Ethan, good morning, good afternoon.
Good morning, good afternoon. Thank you for having me.
Great to have you as well. We'll talk about Shadow out of the gate. What do you do?
Yeah, so it actually got derived from a name that one of my clients gave me. I work with entrepreneurs of all types, small business owners, new entrepreneurs, existing businesses, who bring me in for some combination of help with strategy to be able to riff and decide what the right strategy is, then also create business plans, financial models, pitch decks sometimes, basically just making sure businesses are in the best position to be able to win of all types. So,
are you busy right now?
I am busy, and it's definitely different in the scheme of what's coming to me and the kinds of problems and challenges that exist, or new ideas that exist as well. It's interesting times right now, and interesting times are designed for entrepreneurs.
Exactly. I know you've got a tip list on what small business can do, because they're the ones that are really hurting out there. And number one, I guess, is to keep an eye on your bottom line and your expenses, right?
Yeah, I mean that's a very crucial thing, regardless as a business owner. The challenge is when you're building out your financials and you're projecting your core business and how much money it's going to take to be able to survive. That's an exercise I think most business owners do in general. But what I think also the lesson that exists here, which for some people is certainly a little bit harder than for others, is we need to account for some flexibility in there as well, right? It's not that we necessarily need to account for the fact that a pandemic is going to happen, which nobody could have necessarily planned for, as much as things are going to happen. And because things are going to happen, we need that flexibility in our business model to be able to withstand that and continue on forward and evolve our businesses as well.
And part of that is laying people off, sadly, right?
Sometimes that is a necessary consequence. And I think, the way to look at it is, we need to make sure the business survives and evolves in any capacity. If the business doesn't survive and evolve, then nobody has a place to work whatsoever. And so unfortunately, that's put pressure at times like this to make some tough choices sometimes.
Well, playing out of that, like you said, no one knew a pandemic was coming. It may be a once in 100, 200 year episode in our country. I guess I've seen a lot of companies kind of pivot, being able to adapt whatever your product is or whatever your service is going to be pretty important, if not keep you afloat, right?
Yeah, I agree with you completely. And I think we've seen for local businesses, small businesses especially, a couple variants of that, right? We've seen some businesses that have migrated to more of a digital or takeout version or more kind of modern version of their business of what it was previously. We've seen others that have consolidated the kind of offerings that they have. I've seen a lot of that lately, where restaurants who have a whole menu of things are only offering a narrow version of it. Studios are only offering a narrow version of their offerings. And that also helps on the cost side of the business to narrow the cost pressure that exists and allow you to specialize on things that are truly profitable for your business and easier to manage as well.
And I think you've got to keep an ear to your customer too, because if they're heading a different direction or they're backing off whatever product or service it is, you got to listen to them, right?
I very much agree. And, I think the thing to build on top of that too is that we have to be mindful that this may be here to stay in some capacity, right? So even though it may be tough to envision that you've had a business for 5 years, 10 years, entrepreneurs are prepared for shocks, right? They're used to change always happening in their business. This is a bigger shock that exists, but I think we need to be open-minded to the fact that maybe there is new expectations, customer expectations that exist, and we may have to make a material shift in our business moving forward.
And what about not only your customer, but your competitors too, watching what they do?
I think that's a best practice regardless, to be honest with you, right? To always be monitoring what your competition is doing, and not just locally and not just with direct competition, but even indirect competition. You might get really great best practices from what others are doing, even in indirect competition space, that might help you evolve your business as well. It's great to monitor that always.
Yeah, I was going to say indirectly. It doesn't necessarily have to be you sell this product, they sell it. Maybe a company that's doing something completely different. It might catch your ear and go, wow, maybe we should do that too, right?
Yeah, I think that's totally correct. And it doesn't mean you have to fully remove yourself from the core skill set that you have. You have core skill set and core talent that exists in your business, but there's certainly ideas always to be had and creativity always to be had to evolve the core of what you do to a newer model as well.
One thing, first impressions are big impressions. And I know if you're buying a product or a service or whatever, during a pandemic, what if a company, certainly sales have slowed down and they go onto the charitable side, maybe they pivot. I know a lot of distilleries, instead of making spirits, were making hand sanitizers. Yeah. And, it may not help you in the short run, but after this is all gone, and we hope soon, people will remember that.
I think, look, we always want humanity to be a portion of what we're doing. And certainly the concept of social enterprise and humane businesses and business practices has been on the rising trend for a while at this point, but it's even more magnified now. And I think it's not even just that it's a good idea, it's become a crucial part of business right now, right? Especially for demographics of people who are monitoring that. They're buying from brands that align with their values. Therefore, I think, if nothing else that's come out of this, the magnification of how to position your brand and how it's crucial right now. You have to be very mindful about what your brand stands for.
How about time management?
Well, there certainly is a decent amount of time now for people, unfortunately, in some cases, but that provides a really good opportunity to be able to educate and learn and develop. For instance, there are many small business owners and actually large business owners, which might make small business owners feel good here, that hadn't evolved fully to a full digital offering as well, right? Now is the time that, if nothing else, you have the capacity and the tools to be able to study up on this and learn. You know, if this happened in 1995, we wouldn't have had the digital platforms to be able to develop during this time. Right now, you can go to any one of several course sites that exist and take courses on digital marketing and setting up a digital presence. You can hire people who can help you digitally. There's a lot that we can fortunately do right now in a bit of a twisted way. It's positive that it happened in 2020 and not 1995.
I know, it was 95, we would not be talking right now.
We would not be.
I would not have a cell phone. I'd have a regular phone, and we'd be, I don't know, probably had a beeper or something like that. And also, I think you mentioned too, keep an open mind. And what comes to mind with that is like Netflix. Here's a company that was dead in the water, you know, years ago. Their model was broken. They were sending out DVDs. And instead of sitting there going, woe is me, let's go do something else, they reinvented themselves. Do you see some of that happening out there as well?
I do see some of that happening. And, you know, I think there are certainly some companies and businesses that are being nimble and thinking that it may be for the short term. But I think what we also have to be open-minded about is, in your, you know, sanitizer example, right, is that could become a new line of business that could persist as well, right? People are going to have new attention to sanitary conditions and sanitizing their hands, et cetera. That could become a new line of business as well, right? So being open-minded to the fact that, yeah, the world is shifting a little bit right now, and not all for the worse. In some cases, for the better, in fact. And it might present new opportunities to expand and diversify our business, or even wholly shift it to something that could be even better.
What advice are you giving if they are your clients, or what would you say to restaurants? Because I know here in San Francisco, they have been hit so hard. I've got some dear friends that have had great Italian places for 20, 25 years. And because of rent and not knowing when they're going back and the number of tables and people they can serve, it may not be viable. What do you say to those folks?
So I think my personal opinion is I think there's going to be a bit of a split in the behavior that exists with restaurants in the future. And so I think there's going to be two kinds of restaurant formats that probably exist. I think there's going to be more of that food truck kind of model, which is very small footprint, a more takeout centric kind of model. That doesn't have that kind of large overhead and therefore can sustain the economics. And then there's still going to be, you know, request and need from people to eat out. People still love eating out and they want that in some capacity. But I think that's going to turn, because of the distancing, I think that's going to turn into more of a premium product that exists. And for those businesses to be able to withstand and survive, they're probably going to have to charge a higher price point, which means it's going to need to be a bit more of an elevated experience that exists. Until the point at which we can come back together. But as long as social distancing is a thing, capacity is limited to some extent, which means the price point has to be higher for these businesses to be able to survive. So pick a path is what I would say. And certainly most will go into that former path probably.
Well, and I saw some sort of study with the California Restaurant Association. They say over 30% of the restaurants here in California probably won't be here, you know, by the end of the year.
Yeah, it's sad because most people, you know, they love the local restaurants. I love local restaurants that are around me, and I'm seeing something similar. My hope is that that's a temporary thing. And once we have a little bit of stability in terms of the scenarios that exist and what's happening, those incredible people who are extremely talented will be able to come back in with a new concept that's even better for the modern world. That's my hope of what happens.
Yeah, well, Americans are pretty good at that, you know, moving on their feet. I'm sure we're going to see all kinds of different stuff here in the next decade. How about commercial real estate? I mean, here we are talking. I've been working from home 3 out of my 5 days a week. You know, there's a lot of people in LA, Chicago, New York, where that space to rent for their employees is expensive, and they're finding out that people are proficient from home. Hey, what the heck? We can save a lot of money. Do you see that landscape changing too?
Yeah, I definitely agree with what you're saying. I mean, I think there is going to be a bit of a stabilization towards an equilibrium there as it relates to pricing. And I do think with all these businesses, it's not just offices like you're suggesting, which are saying maybe people can work from home. It's also these other businesses that are going out of business or having trouble, like the aforementioned restaurants, studios, all these other places. So there's going to be a lot of inventory that likely exists in the near term. And so prices are going to have to stabilize and normalize for the foreseeable future. My hope is, in the nearer future, hopefully we will be able to come back together. We won't have, the spacing issues that exist, because people will still have the requirement to be with each other and work together sometimes. But the model is definitely in a bit of a shock right now, and it's going to take time to get to equilibrium at this point.
Yeah, another shocker is casinos, and you know that oh too well. Give our viewers a little background on you went to Cornell undergrad, you got an MBA out of Yale, and you helped finance part of that doing what?
Poker has always been a very big part of my life. I learned it when I was very young, when I was 5 years old, and it paid off in my case where I played and actually taught my way through both undergrad and grad school and paid my way through doing that. So I've spent a decent amount of time in casinos. Casinos are in an interesting place because historically, they're both positively correlated to both booming times and also recession times as well. People always tend to go to casinos. They tend to be pretty stable. However,